Chapter 0001, a major surgical procedure. The surgical lights in the operating room shone brilliantly, and the scalpel held by the doctor was exceedingly slender. Zheng Ren felt a pang of anxiety, despite not being the one lying on the table. He had exerted considerable effort to be present for today's operation, only to find that Dean Fu, in a gesture of respect towards the esteemed professor, had taken on the role OFA. Assistant himself, dressed in sterile surgical garb, he stood in the corner of the operating theater, unable to glimpse even a sliver of the surgical field. Wherever there is surgery, unexpected occurrences are inevitable. Zheng Ren was unprepared for the unforeseen events that could transpire even before the operation commenced. The impending surgery held significant importance. It is a rarity for surgeons to conduct live broadcasts of their operations. Those who dare to do so are typically the most esteemed. D figures in the field. Today, the First People's Hospital of Haicheng hosted a live surgical demonstration featuring the world-renowned hepatobiliary and pancreatic surgeon, Professor Mori Aikir. The auditorium, accommodating 1,000 attendees, was filled to capacity. 80% of the provincial department heads of related specialties were in attendance, alongside professors from specialized hospitals in the capital and Shanghai, all visited Haicheng to observe and learn from the live surgery. Within their departments, the directors, who often commanded immense respect, were now mere figures in the crowd, as accessible as cabbages with just a raised hand. A large red banner hung above the venue, fervently celebrating the successful inauguration of the first academic conference on hepatobiliary and pancreatic surgery in Haicheng. Instead of a long conference table, the podium featured a massive screen, while 8 high-definition projectors captured different angles, broadcasting in real time the complex procedure of a pancreaticoduodenectomy being performed in the operating room of the First Municipal Hospital. The pancreaticoduodenectomy is regarded as one of the most challenging surgical procedures in general surgery, second only to organ transplants. The surgeon is Professor Mori Wachiro from the Shuntendo University Hospital in Tokyo, a health advisor to the RB royal family, and ranked among the top 5 in the global surgicala. My community. To secure Professor Moore's participation, the conference organizers exerted considerable effort and incurred substantial costs. Additionally, the patient's family undertook extensive preparations, as this patient is the wealthiest individual in Haicheng, with 60% of the city's properties developed by his company. The presence of such a distinguished professor and the significance of the surgical procedure, coupled with the confident live streaming of the operation, became the highlight of the inaugural Haicheng Hepatobiliary and Pancreatic Surgery Academic Conference. Regrettably, Zheng Ren could not see any of it. At 9:15 a.m., the surgery commenced. Professor Mori exhibited a meticulous approach, eschewing the errors often associated with eminent physicians as he personally made the incision. The screen displayed 8 different angles, leaving no blind spots and showcasing Professor Mori's extraordinary surgical skills. Can a closure be achieved with an incision of less than 15 centimeters? Neither of us could manage it, but he is a top-tier professor. What is beyond his capabilities? Indeed, it is said that the surgery for the emperor in 2014 was performed by Professor Mori. His expertise is truly among the rarest in the world. The layers of skin, subcutaneous tissue, muscle, and peritoneum were skillfully dissected, akin to a chef expertly preparing a delicacy. The blood loss was minimal, estimated on-site by the attending directors to be only around 510 milliliters. The bloodstained gauze bore merely a few specks of red, reminiscent of flowers blooming in the snow. Yet, an unexpected event was about to unfold. As the peritoneum was opened, a chorus of gasps erupted in the auditorium. Professors from the capital and the metropolis wore solemn expressions, their eyes fixed intently on the projection screen. The malignant tumor of the pancreas advanced with astonishing rapidity, having invaded surrounding tissues and formed severe adhesions, as if fused into a single entity. Typically, to mitigate the risk of unforeseen complications, live surgeries are conducted on patients with less severe conditions. Even the most esteemed experts are not immune to errors. All are susceptible. It is irrefutable that the likelihood of mistakes is significantly lower with patients presenting milder conditions. Director Fu invested considerable effort in patient selection. The patient CT and MR images were evaluated by professors both within and beyond the province, ultimately receiving Approval from Professor Moriichiro. All specialists and professors concur that the patient was suffering from stage 3 pancreatic head cancer serious condition, yet the tumor tissue exhibited no adhesions to OS. Surrounding structures, rendering it suitable for surgery. Regrettably, fate had other plans, and everyone misjudged the situation. Upon witnessing the circumstances, beads of sweat began to form on Director Fuss' forehead, dampening his sterile cap. What could possibly be amiss? To avoid errors, a magnetic resonance imaging scan had been performed 2 days prior, revealing no significant changes compared to earlier images. Could it be that the tumor had proliferated at an alarming rate within just 2 days? Director Fu grasped the suction device, his hand trembling slightly. Professor Moriichiro appeared somewhat displeased, tapping the suction device with his curved forceps and muttering something in Japanese. Although Director Fu did not comprehend the language, he keenly sensed that one word in the utterance was baka. Professor Mori was evidently dissatisfied with him, leaving Director Fu feeling as if he had plunged into an icy abyss, his entire body growing rigid. The young translator behind him immediately adopted a stern expression, gazing intently at Dean Fu. Dean Fu, Professor Moria is quite dissatisfied with your performance. Although both your technical skills and equipment are equally subpar, I implore you to approach the surgery with utmost concentration. It had been many years since anyone had spoken to him in such a manner, leaving Dean Fu feeling quite embarrassed. And no wonder, during the War of Resistance, the greatest disdain was directed toward traitors and collaborators truly detestable. However, he dared not betray a hint of his inner discontent, forcing a smile that, upon closer inspection, resembled flattery. The condition was more complex than anticipated, yet for the world's foremost surgeons, it merely posed a challenge rather than an insurmountable obstacle. The surgery proceeded, meticulously dissecting the tumor from the surrounding tissue with patience, while blood loss remained minimal. Any larger capillaries were promptly ligated or cauterized, without exception. In the grand conference room, gasps of awe occasionally erupted. Professor Maria's familiarity with anatomical structures was remarkable. This exemplified the caliber of a leading global professor. Standing beneath the surgical lights, Professor Moria undoubtedly commanded attention, akin to a resplendent star that drew every gaze. In stark contrast, Zheng Run was entirely absent from the projection. He existed as a mere speck of dust in a shadowy corner, insignificant. Though he could not participate in the surgery, he mentally envisioned the entire procedure based on the various instruments employed by Professor Moria. If only he could catch a glimpse. Zheng Run yearned deeply within. He endeavored to shift perspectives, hoping to catch even a fleeting view of the surgical process. Yet all efforts proved futile. Suddenly, Zheng Ren felt an overwhelming brilliance before his eyes. The surgical lights began to sway, and the instruments on the nurse's station danced like ethereal spritesses. Oars, scalpels, and forceps spinning in chaotic rhythm. He felt a moment of disorientation. Could it be an illusion? But then reality struck. This was no mere figment of his imagination. It was an earthquake. In an instant, the entire room trembled, the ceiling creaking ominously as if it were on the verge of collapsing, threatening to entomb everyone within. Those engaged in surgery began to panic. Mori Ichiro, having been trained in his island nation, displayed remarkable composure. Without hesitation, he left the operating table, forcefully pushing past Zheng Run, who stood frozen in the corner. The young translator rushed over to extricate Zheng Ren from his predicament. "Get out of the way!" Zheng Run, somewhat bewildered, instinctively evaded the translator's grasp, safeguarding his sterile surgical attire from contamination. He could still sense a subtle tremor, though it was not severe. He wondered whether the earthquake had subsided or if this was merely a prelude to a more formidable quake yet to come. Stay calm. Director Fu attempted to project an air of authority, shouting, "Let the professor exit first." Mori Ichiro, as vigilant as a wild wolf, vanished after a slight quiver, resolutely opening the operating room door and disappearing down the corridor. The translator closely followed Professor Mori, and Director Fu hastily left the operating table in his wake. "Zheng Ren, you must continue the surgery," the chief urged, his legs trembling like those of a Parkinson's patient as he hastened to escape the perilous environment. "Me?" Zheng Ren nearly choked on his own blood in disbelief. He was merely an ordinary attending physician, diligent and dedicated in his practice. Yet within the rigid hierarchy of the medical system, a person of his age had little opportunity to engage in advanced surgical procedures. The most he could perform were first and second level operations, such as appendectomies and hernia repairs. However, the chief intended for him to undertake one of the most prestigious and complex surgeries in general surgery, the Whipple procedure or pancreaticoduodenectomy. Zheng Run had no intention of fleeing as a physician. Abandoning a patient on the operating table was inconceivable. Even in the face of death, he would prefer to perish at the surgical table. To flee now would be akin to a cowardly soldier abandoning his post on the battlefield. Such thoughts were both earnest and pure. Yet he was not proficient in this surgery. It seemed that he could only assist with the washing and then close the abdomen. Zheng Ren steadied his emotions, preparing to observe the stage of the operation. Suddenly, a tremor shook the room. The surgical light flickered, casting a blinding white beam into his pupils. The intensity of the light was overwhelming, more piercing than gazing directly at the sun at noon. In an instant, he felt a chill descend from the crown of his head into his body, and darkness enveloped his vision. Had the building collapsed, crushing him to death? Was this the sensation of dying? In a daze, Zheng Run heard a violent cough erupting from within his own body, accompanied by the unmistakable scent of blood. What was happening? Was this merely an illusion? A torrent of memories flooded Zheng Ren's mind, spanning from his childhood to the present, some of which he had long forgotten. Yet, at this moment, they emerged with startling clarity, tumultuous and overwhelming. Was this the unfolding of memories in the face of death? A vague thought pierced through the haze, causing his head to throb intensely. It felt as though merely a second had passed, yet it seemed as if countless years had slipped away. The ocean of memories calmed, and in that moment, a voice emerged beside Zheng Ren's ear. System binding initiated. System binding completed. Please, host, accept the novice task. Chapter 0002. The pinnacle of expertise. What? A system? Innumerable queries arose in Zheng Ren's mind. Despite his solitary existence, Zheng Ren abstained from alcohol and nightclubs. His demanding profession left him little time for leisure, which he occasionally filled with online novels. Yet, he never envisioned a scenario where the plots of such narratives would manifest in his own reality. Amidst his bewilderment, the emotionless, mechanical voice echoed once more. Host has been granted the novice perk, pinnacle experience, limited to 30 minutes. As a seasoned aficionado of fiction, Zheng Ren possessed a high degree of receptiveness to the concept of a system. At this moment, he stood isolated in the surgeon's position, confronted with the most challenging of general surgical procedures, only partially completed. Was there room for hesitation in his decision? He could not simply stand idly by and watch someone perish. If he did, what kind of doctor would he be? Zheng Ren swiftly resolved to find a means of activating the pinnacle experience. However, before he could communicate with the system, a mere thought was enough to trigger a surge of white light. Upon regaining his vision, he was astonished to find his hands moving independently. His fingers, nimble and precise, wielded a curved pair of scissors, meticulously dissecting the adhesions of the pancreatic tumor. Occasionally, when encountering a resilient area, he would deftly incise the obstruction with the sharp blade. Am I dreaming? With all his might, he attempted to regain control of his hands, only to discover, to his dismay, that they were unresponsive to his commands. Zheng Ren felt like a patient with complete paralysis, deprived of the ability to control his limbs. His limbs had transformed into machines, performing the surgery with unwavering precision. Has the system taken over my body? He wondered. Is this the possession described in fantasy novels? And am I the one being possessed? Would his consciousness gradually fade, eventually dissolving into nothingness? A torrent of questions caused Zheng Ren to break out in a cold sweat, sinking into a quagmire of despair from which he could not extricate himself. Attention, host, the system's mechanically synthesized voice resounded. During the 30-minute pinnacle experience, you will be unable to control your limbs. Due to the host's excessive emotional agitation and hormonal imbalance, temporary sedation will be administered. Soon, with the system's assistance, Zheng Ren regained his composure. Cherish this opportunity, host, the system continued. Please note that this opportunity is singular. I repeat, this opportunity is singular. He noticed that, if he disregarded the fact that he was currently performing surgery, his perspective was optimal, the very perspective he had yearned for when standing in the corner of the operating room. The surgical field of view was, of course, primarily for the surgeon. Those observing the surgery from the gallery never had the chance to witness a procedure from beginning to end with the primary surgeon's perspective. And now, Such an opportunity was presented to Zheng Ran. In the grand auditorium, chaos had erupted. The surgical broadcast had been proceeding smoothly, with high-definition projections showcasing Professor Sen Yuichiro's exceptional surgical skills from various angles. It could be said that the organizers had spared no effort in creating a flawless presentation. However, midway through the surgery, Professor Sen Yuichiro abruptly left the operating table, followed by his assistants. In the end, only one person remained standing at the operating table. His gloves were devoid of blood, indicating that a change of surgeons had occurred during the procedure. What had transpired in the operating room? Why was no one assisting the new surgeon? From the broadcast perspective, there was no indication of an earthquake, and everything appeared calm. Consequently, the audience of over 1,000 was perplexed, unable to comprehend the bizarre turn of events. Such a situation was rare, if not entirely unheard of, in the medical field. If a surgery proved too challenging or exceeded expectations, a surgeon might open the patient up for examination before closing them again. Clinically, this technique was referred to as an exploratory laparotomy. Although the patient's condition had deviated from expectations, Professor Sen Yuichiro's surgery had been progressing smoothly. Why abandon it? It was inconceivable, irresponsible, and a blatant disregard for human life. As Zheng Ran, now standing in the surgeon's position, resumed the surgery, the clamor intensified. Were they not going to close? How can he continue the surgery without any assistance? Using a patient for practice during a live broadcast is utterly depraved. What is going on at Haiqing First Hospital? This is utter chaos. A professor from the capital city exclaimed in anger. The moment those hands began to operate, countless doctors were stunned and began to protest. They had anticipated a flawless demonstration surgery, but instead, unexpected events had unfolded one after another. However, the protests soon transformed into stifled gasps, filled with a multitude of questions. 8 high-definition projectors were broadcasting the surgery in real time, presenting every detail to the assembled doctors. Can scissors be used like that? He's using blunt dissection with his fingers to separate the adhesions on the pancreatic head. Is he not afraid of tearing the pancreas? There's an abnormally proliferating tumor-feeding vessel there. How did he spot it? Exclamations and questions erupted in the auditorium. No one provided answers. And even those who muttered inquiries to themselves soon fell silent. Operating alone, without assistance, and with only a scrub nurse to assist, the surgeon was performing the surgery even faster than Professor Sen Yuichiro. Laymen watched the spectacle, while experts observed the details. Everyone present was an expert. Even the directors of surgery from county-level hospitals, who could not perform a pancreaticoduodenectomy, could discern that the current surgeon possessed refined and exquisite skills and an unparalleled understanding of anatomical structures. The level of expertise that had previously astounded everyone with Professor Sen Yuichiro now seemed insufficient. No, it was not merely insufficient. The gap was at least an order of magnitude greater. The auditorium was silent. Minutes later, the tumor's adhesions had been dissected to the inferior vena cava. This was the most critical point. The inferior vena cava was approximately 3 centimeters in diameter and less elastic than an artery. If it were damaged during the dissection of adhesions, it would be irreversible. The patient would inevitably die on the operating table due to massive blood loss. Typically, in such a situation, the surgeon would choose to abandon the surgery and inform the patient's family with regret that they had done their best. However, the hands on the projection did not pause for a moment. With a pair of scissors, they began to dissect the outer membrane of the inferior vena cava. A professor from the capital city stood up abruptly. He seemed unable to believe his eyes. Although the view was already clear, he took a few steps closer to the screen. Impossible, he muttered. Dissecting the outer membrane of the inferior vena cava requires special instruments. How can it be done with a pair of blunt scissors? He actually completed it. This is impossible. The elderly professor, his hair streaked with gray, trembled slightly, either from nervousness or intense concentration, muttering to himself. Dissection, resection, anastomosis, lymph node dissection, all the movements were concise and precise. In 26 minutes, the surgery was completed. Warm saline solution was used to rinse the abdominal cavity, and the closure began. The hands did not even check for any overlooked bleeding points, as if they possessed unwavering confidence and were incapable of making any mistakes. In 29 minutes, the abdominal cavity was closed, and the surgery was over. The elderly professor from the capital city stood in astonishment in front of the screen, his hands clenched into fists, his palms drenched in sweat. Merely watching the half-hour surgery had exhausted all his energy. As a leading expert in hepatobiliary and pancreatic surgery in China, he understood the significance of what he had just witnessed. He could not do it, Sun Yuichiro could not do it, and no one could do it. Yet, such a perfect surgery had been presented before his very eyes. It was simply incredible. Chapter 0003. Skill Tree. The 30-minute pinnacle experience had broadened Zheng Ren's horizons. As soon as the time elapsed, a wave of weariness originating from the depths of his soul washed over him. He yearned to lie down and fall asleep immediately. However, Zheng Ren knew that it was imperative to refrain from doing so. Go home, study the system, he thought, his mind consumed by this sole objective. With only a scrub nurse and an anesthesiologist remaining in the operating room, Zheng Ren exchanged greetings with them and hastily departed. Unable to spare time for a shower, Zheng Ren quickly changed clothes, hailed a taxi, and returned to his cramped apartment. Although real estate prices in Haicheng were not as exorbitant as those in the capital or Shanghai, they were still substantial for a provincial capital. With Zheng Ren's current salary, he would never be able to afford a house outright. He was an orphan, having grown up in an orphanage since childhood. Upon gaining admission to university, he barely managed to sustain himself for 5 years through the benevolence of kind-hearted individuals and the annual first-class scholarships, ultimately securing both his degree and diploma. However, his sheltered existence came to an abrupt halt. Financial constraints compelled him to resolutely decline the opportunity for a seamless transition into postgraduate studies and instead seek employment at the First People's Hospital of Haicheng. No matter how industrious he was, his salary and bonuses were limited, forcing him to share a modest room with others nearby. Returning to his cramped quarters, Zheng Ren felt utterly drained. Yet, he was not inclined to rest. An insatiable curiosity clawed at him like a restless kitten. With closed eyes and a focused mind, his consciousness drifted into a mysterious realm. Verdant hills, crystal-clear waters, and fresh air invigorated his senses. This was an entirely different world. Surveying his surroundings, Zheng Ren found himself in a valley, facing a thatched cottage adorned with a lifelike statue of a white fox at its entrance. The statue was so vividly detailed that it seemed poised to spring to life at any moment. Between Zheng Ren and the cottage lay a small pond, its waters pristine and transparent. Was he dreaming? He felt somewhat disoriented. Welcome to the system space. Please claim your novice task reward. A cold, mechanical feminine voice resonated. Zheng Ren listened intently. The voice emanated from all directions, rendering it impossible to discern its source. As the words faded, the space before him shimmered slightly, and an antiquated wooden box materialized. Was this the system reward? He grasped the box and weighed it in his hands. It was crafted from ordinary wood and not particularly heavy. Zheng Ren paused, noting that the mechanical voice had not continued its prompts. Presumably, he was meant to claim the reward. Taking a deep breath, he solemnly opened the wooden box. A radiant light burst forth, and the mechanical voice returned. The talent system is now active. The host receives a novice reward, 5 experience points and 1 energy potion. The brilliance, akin to a shooting star, soared from Zheng Ren's hands and gracefully landed upon the nearby grass. A translucent panel hovered before him, clearly indicating that his general surgery skill level stood at 325 points. Was this the skill tree? Zheng Ren observed closely, noting accompanying tier explanations: primary level, 0, 100 points, intermediate level, 101 to 300 points, advanced level, 301, 1000 points, expert level, 1001 to 5000 points. Further tiers, including master, grandmaster, and pinnacle, remained grayed out, suggesting they were not yet accessible. Zheng Ren contemplated that the primary level roughly equated to a newly graduated resident, while the intermediate level represented an attending physician. His general surgery skill had surpassed the intermediate threshold, reaching an advanced level, likely reflective of his years of accumulation. He was particularly intrigued by the standards of master, grandmaster, and pinnacle. If the pinnacle experience represented the utmost level, then Professor Maria Ikir's abilities must lie somewhere between grandmaster and master. This realization prompted a bemused reaction from Zheng Ren. A globally esteemed professor was not even deemed to be at the pinnacle level. The system's requirements appeared excessively stringent. If only he could attain. A fervent desire ignited within him. Yet, as he reflected on the arduous 5 years of study that had only yielded 325 skill points, he recognized the daunting distance to the expert level, much less the grandmaster or pinnacle levels. His highest skill in general surgery was at the intermediate level, while other competencies, such as radiology, internal medicine, and physical examination, languished at the primary level, with experience points barely reaching the intermediate threshold. The weakest was obstetrics and gynecology. With only a few skill points, he resolved to bolster his general surgery skills. After a moment's contemplation, he directed all 5 experience points from the novice reward into his general surgery proficiency. The shimmering numbers confirmed that his skill level had risen to 330 points. Zhang Ren meticulously examined his surroundings and attempted to venture further. He soon discovered that the active range for intermediate skills was limited to approximately 100 square meters, encircled by an invisible barrier isolating this small space. The cold, mechanical voice of the system had not returned. "Is there any other task?" Zhang Ren inquired tentatively. He received no response. The space fell into an eerie silence, and he could almost hear echoes. How peculiar. Didn't typical systems announce subsequent tasks to facilitate the host's continuous growth? This was contrary to the conventions of online novels. Yet, the air here was remarkably refreshing, gradually calming Zhang Ren's emotions. He took a deep breath, nearly succumbing to oxygen toxicity. It seemed he had grown accustomed to the haze of pollution, and now that the oxygen levels were normalized, he found it somewhat overwhelming. Amused by his own predicament, Zhang Ren soon felt fatigue wash over him. It appeared that the pinnacle experience had drained a significant amount of his energy. Should he try the energy potion? The thought flickered briefly before being extinguished by Zhang Ren. Such an action would be too extravagant. Relying on sleep for recovery seemed far more prudent. In a fleeting moment, his consciousness returned to the real world, his mind swirling with the day's peculiar events, and he quickly drifted into a deep slumber. Abruptly, Zhang Ren was roused from his profound sleep by the jarring ring of his mobile phone. Reacting instinctively, he sprang from his bed and swiftly answered the call. Answering emergency calls around the clock was a requisite skill for any young surgeon, and Zhang Ren had mastered this aspect of his skill tree. "Zhang Ren, what kind of absurdity have you been up to today?" came the hoarse, furious voice of Director Liu from the general surgery department, his ire palpable. Zhang Ren could almost feel the spittle flying through the phone, splattering onto his face. "Director Liu, what seems to be the problem?" Zhang Ren inquired calmly. "You know perfectly well what you've done. Undertaking a surgery beyond your level of authority, disregarding directives from your superiors, is a pancreatoduodenectomy something you are equipped to perform? You are responsible for any consequences that arise." Director Liu had seemingly forgotten his earlier assurances to Zhang Ren during the surgery when he had encouraged him to continue. Consequences? A smile crept across Zhang Ren's lips. What a farce. His pinnacle skills would undoubtedly yield no issues. "You'll report to the emergency department tomorrow, as per Vice President Fu's directive." With that, Director Liu abruptly ended the call, denying Zhang Ren any opportunity for rebuttal. Zhang Ren felt a twinge of disappointment rather than anger at Director Liu's abrasive demeanor. It seemed the unreliable system had vanished, and when he revisited the previous space, he found no changes whatsoever. Was this the end of his surgical career? Despondency enveloped him. Chapter 0004. Super system functions though disheartened, life must go on. Raising his gaze, Zhang Ren was startled to see the time. He had slept for over 10 hours, awakening to find it past 6 o'clock the following morning. Had Director Liu truly called him at such an early hour? As he pondered this, his phone rang again. It was Yang Lei, a good friend from his department. In his voice bore an anxious tone. "Zhang Ren, you won't believe what transpired yesterday." What happened?" After the surgery, Professor Moria Ikir was infuriated, berating Vice President Fu like a child. "However, you're the one who ends up taking the blame. Vice President Fu wants to dismiss you. Fortunately, Director Pan from the emergency department stood up for you, confronting Vice President Fu." "What does the emergency department have to do with this?" Zhang Ren asked. Recognizing the name of Director Pan, a retired chief from the military hospital who had been rehired at the First People's Hospital of Haiqing. Known for his fiery temper and straightforward demeanor, Zhang Ren wondered if he had learned something. "Still, you've been reassigned to the emergency department," Yang Lei continued. "By the way, who finished the surgery yesterday while you were in the operating room?" At that moment, Zhang Ren began to piece together the events of his pinnacle experience and the subsequent day of unconsciousness. It seemed that Professor Moria Ikir, feeling humiliated, had simply walked away. Given the magnitude of the oversight, someone had to take the fall, and they had tightly sealed the information, ensuring that no one knew it was Zhang Ren who had performed the surgery. It's not that nobody knows. It's likely that Director Pan is aware. Otherwise, he wouldn't have directly confronted Vice President Fu, defending me across departments. "I'm uncertain myself," Zhang Ren responded, after a moment's contemplation. He couldn't confess that he was the one who performed the procedure, as it was merely a one-time, unparalleled experience, and attempting it again would undoubtedly reveal his limitations. potentially leading to embarrassment. With the system at his disposal, he felt no urgency, hoping for its swift reactivation. After concluding the call and completing his ablutions, Zheng Ren proceeded to work. Upon arriving at the department, he was immediately greeted by Director Lu's stern visage. Engaging in a verbal altercation with Director Lu was not in Zheng Ren's nature. True to his name, Zheng Ren embodied the qualities of a gentleman, and resorting to shrewish behavior was beneath him. Furthermore, he would never reveal the truth of the previous day's events, having not even confided in his closest friends, let alone divulging it publicly. He firmly believed that the day he would surpass Director Lu through his skills was not far off. Zheng Ren chose to disregard Director Lu, greeting his colleagues before heading to the doctor's on-call room. After arranging his belongings in the locker, he placed his white coat, stethoscope, percussion hammer, and a selection of professional texts into a plastic bag and departed from the Department of General Surgery. What transgression had Zheng Ren committed? The atmosphere was oppressive, and his colleagues dared not inquire. It wasn't until Zheng Ren's departure that Director Lu, with a scowl, returned to his office, prompting a junior nurse to cautiously question those nearby. It said that during yesterday's surgery, he violated protocol, and Professor Mori Yuichiro was displeased, resulting in this. An experienced nurse divulged. Such a kind individual. How could this be? Refrain from distributing unwarranted compliments. I suspect Dr. Zheng is in serious trouble. You're unaware that Vice President Fu berated Director Lu for the entire night, with particularly harsh language. Unbeknownst to Zheng Ren, he descended in the elevator and arrived at the emergency department, directly opposite the hospital's main entrance. This was a 5-story building, originally intended as a standalone emergency facility, where all patients requiring immediate medical attention would receive treatment. However, the demanding nature of emergency medicine made it difficult to retain physicians. Even when administrative measures were employed to compel them to stay, doctors often chose to resign. This situation was not unique to Haicheng First People's Hospital, but was prevalent nationwide. Without doctors, even the most advanced facilities could not sustain a thriving emergency department. Consequently, only the ground floor of the emergency building housed emergency medicine, surgery, gynecology, and pediatrics, while the upper floors remained vacant. Assignment to the emergency department was akin to being exiled to the remote Siberian reaches of the former Soviet Union, a sentiment shared among physicians. Zheng Ren harbored no resentment, confident in his possession of the system and unwilling to engage in petty squabbles. Upon reporting to the emergency department, he discovered that Director Pan was absent. The head nurse informed Zheng Ren that Director Pan had appointed him as the chief resident, responsible for surgical clinical duties. Zheng Ren's suspicions were confirmed, indicating that someone was indeed aware of his involvement in the surgery, presumably Director Pan. Oh, so Chief Zheng is an attending physician? Before Zheng Ren could even retrieve his locker key, a sarcastic voice emanated from nearby. Zheng Ren recognized Dr. Yuan Li from the emergency department. Although he didn't frequent the emergency department, he knew who Yuan Li was. However, their acquaintance was superficial. Dr. Yuan, I passed the exam last year. Zheng Ren replied with a smile, displaying his amiable nature. So, you, as the attending physician, will have to guide me in the future, Yuan Li said. Leaning against the doorframe of the emergency surgery room, his tone increasingly peculiar. You're the senior colleague. There's no need for such formality, Zheng Ren responded, feeling a headache coming on, as he was ill-equipped for verbal sparring. No, Director Pan has decreed that you are now Chief Zheng, Yuan Li said, clearing his throat and spitting on the floor. Tui, Yuan Li, mind your manners, the head nurse interjected, unwilling to witness a conflict between Yuan Li and Zheng Ren in Director Pan's absence. Head nurse, how old is he? Why should he be the chief resident? I passed my promotion exam 3 years ago and still haven't been appointed, Yuan Li exclaimed, agitated. Take it up with Director Pan. Dr. Zheng is new here. Rest assured, there won't be a fight, Yuan Li said, casting a disdainful glance at Zheng Ren. Boy, care to compete? Next patient, we'll both take the case. Conduct the interview and physical examination as we see fit. Then, we'll have the patient undergo tests, and we'll both offer a diagnosis. If your skills are lacking, don't blame me for disrespecting Director Pan. Seeing that a physical altercation was unlikely, the head nurse remained silent. She was also curious as to why Director Pan had delayed the appointment of a chief resident for so long, only to bestow it upon Zheng Ren. Furthermore, yesterday, Director Pan had berated Vice President Fu in the president's office, even threatening to call in 2 truckloads of soldiers to deal with him if it were a few years earlier. Although Director Pan had a temper, he was a reasonable individual. There must be a reason for all of this. Early morning was the quietest time in the emergency department, and doctors from internal medicine and pediatrics had come to witness the spectacle. Seeing Zheng Rin's helplessness, Yuan Li felt confident in his victory, thinking that relying on Director Pan wouldn't get him far. We doctors must rely on our skills to make a living. As he spoke, a young man in his late teens approached with a registration ticket. Perfect, you're up, Yuan Li said, grabbing the young man's arm and pulling him into the surgical clinic. Regardless of which department he needed to see, Zheng Rin, however, remained rooted to the spot, lost in thought. As he laid eyes on the patient, his vision became three-dimensional. The semi-transparent screen reappeared before him, with Chinese characters constantly appearing in the upper right corner. The system was still there, albeit silent. Seeing the screen, Zheng Rin was completely relieved. The words on the screen continued to expand, and Zheng Rin scrutinized them. Male patient, 17 years old, presenting with headache for 10 hours accompanied by nausea, without vomiting, seeking consultation at our hospital. Next came the patient's vital signs and various test results, as well as the final diagnosis. Zheng Rin could almost hear the sound of the words appearing, thinking, is this the system? It's like a loving father who has maxed out all my diagnostic skills. Have I become the Terminator? With Director Pan's backing, what can you achieve? We in the medical field still prioritize technical expertise. One doctor, seeing Zheng Rin standing in the corridor, muttered softly. Indeed, look at him. He doesn't even dare to conduct a physical examination. It seems he's admitting defeat. If you're not capable, you're not capable. If you're not good at general surgery, you won't be good in the emergency department either. What a coward. Yuan Li's skills aren't that great either. Go and try. It's better than being humiliated like this. Some people had initially felt indignant on Zheng Rin's behalf due to Yuan Li's arrogant attitude, but seeing that he didn't even bother to examine the patient, they began to despise him. It's not their fault. As doctors, we must rely on our abilities. Those who only know how to flatter are better off in government offices. They won't achieve anything in clinical practice. One medical accident and they'll be ruined. Under the gaze of many strange eyes, Zheng Rin felt embarrassed. He quickly reread all the information that had appeared, gaining a more accurate understanding of the patient's condition. He placed the bag in his hand on the chair at the nurse's station and said to the head nurse, the patient has been diagnosed with a cerebral hemorrhage. Not a large one, but there are risks. Please send someone to accompany him with the emergency kit during the head CT scan, and send him directly to the neurosurgery department afterward. The head nurse was stunned. The doctors and nurses in the corridor were all stunned. What was going on? Without even conducting the most basic interview and physical examination, he had judged that a patient who had walked in on his own was suffering from a cerebral hemorrhage, and a patient who had walked in on his own, looking perfectly fine. Was he joking? No wonder he was kicked out of the general surgery department and sent to the emergency department with this level of skill. A gynecologist glanced at Zheng Rin, too lazy to watch the spectacle, and turned to return to her clinic. Haha, I haven't seen such a foolish doctor in years. Yes, sending him to the neurosurgery department is just asking for a fight. There'll be a show to watch later. The others gloated. Dr. Zheng, we can't diagnose patients like this. The head nurse said earnestly, feeling pity. Head nurse, I'm not familiar with this area. Could you please find someone to send him for the examination? Zheng Rin said with a smile. Do you have my locker key? The head nurse was at a loss for words. It seemed that no matter how reckless one was, there was no turning back. Even if you were a relative of Director Pan, no, even if you were his own son. Such capricious behavior in treating patients would earn you no respect from the doctors below. Seeing Zheng Rin's unwavering demeanor, the head nurse felt a surge of anger and tossed a set of keys at him. Thanks, Zheng Rin replied, picking up his bag and beginning to tidy his belongings. Soon, Yuan Li completed the examination and, noticing Zheng Rin had not entered, issued a CT scan order for the patient, instructing them to proceed to the tests alone. This fellow is truly cowardly, scared to even enter the consultation room, Yuan Li thought smugly. Before the patient could leave, a young nurse entered, saying, let's go. I'll take you to pay and get the tests done. Yuan Li noticed the nurse carrying a first aid kit and paused in confusion. What is going on? Director Zheng said the patient is in danger and needs someone to accompany them. The nurse replied, clearly displeased, muttering under her breath. A first aid kit weighs at least 5 or 6 kilograms. Carrying it around was exhausting. The new attending physician was truly a handful, taking out their frustrations on the nurses instead of confronting Yuan Li directly. With a frown, the nurse thought, isn't this nonsense? Yuan Li abruptly stood up. Is my condition that serious? The patient asked, their face paling with concern. It's nothing serious, just fatigue leading to a tension headache, Yuanli reassured. The CT is just a precaution. Don't worry, it's nothing. After calming the patient, Yuanli waited until the nurse and patient turned the corner out of sight before storming over to Zheng Ren, scolding, "Are you even a doctor? Do you have any medical ethics at all?" Yuanli intended to take the moral high ground to deliver a fatal blow to this recently appointed attending physician. "What happened?" Zheng Ren asked, seemingly bewildered. "The patient came in for a headache. When I inquired about their medical history, they mentioned experiencing headaches after certain activities. They came in after a particularly excessive episode yesterday," Yuanli exclaimed. "It's just a tension headache due to lack of rest. The diagnosis should be a cerebral hemorrhage. The patient needs to be wheeled in for a checkup and then sent directly to neurosurgery," Zheng Ren stated calmly. "A wheelchair? Shouldn't we just the emergency department does not always witness major rescues or severe injuries?" Zheng Ren understood that his opportunities for surgery would depend on fate. By 11:30, he casually invited Yuanli to the cafeteria for a meal, while he stayed behind to assist for a while. Yuanli had been in a daze all morning and did not express much gratitude towards Zheng Ren's kindness, failing to even utter a simple thank you, and left for lunch with a blank expression. When Yuanli returned, Zheng Ren had already been in the cafeteria for some time, well past noon. The lunch rush had subsided, and the cafeteria was relatively empty. Zheng Ren filled his plate and found a corner to eat while savoring the new capabilities bestowed upon him by the system. For a physician, the functions granted to Zheng Ren felt akin to wielding unparalleled power and unstoppable force. After all, it was he who had first identified the patient with a cerebral hemorrhage that morning. What of a cerebral hemorrhage? With his extraordinary luck, he mused that he had likely reached the level of a grandmaster. Following Professor Maria Ikir to the operating room without learning anything, only to bear the brunt of any blame, was indeed poor fortune. Nearby, a few individuals were dining, all ICU doctors known to Zheng Ren. Their voices were not hushed. Even as they discussed him, one person raised their head and remarked coolly, "Xiao Su is right." An eager sycophant immediately chimed in with enthusiastic praise. Zheng Ren recognized the speaker as Su Yun, the nephew of Dean Fu and a graduate student from Xiahe Medical University. It was said he had secured a position in a doctoral program, but for reasons unknown, had returned to Haiqing. Such peculiar reasoning was beyond Zheng Ren's comprehension. Yet, being a second-generation physician, Su Yun's choices seemed justified, unlike Zheng Ren's past self, which could hardly compare. Presently, Zheng Ren felt even more inferior. Unable to measure up to Su Yun. Su Yun had long, glossy black hair, with a stray lock falling like bangs over his brow, and his large, dark eyes sparkled like flawless gems against his fair complexion. At first glance, one might deem him exceptionally handsome, easily scoring a perfect 90. However, upon a second look, an inexplicable thought arose. He resembled a young boy. Su Yun attracted attention wherever he went, whether on the streets or within the hospital. "Yun Ge, if you pursue surgery, what room is left for others?" commented a doctor who appeared to be over a decade older than Su Yun. He seemed quite accustomed to addressing him this way, devoid of any awkwardness. Su Yun let out a breath, his bangs fluttering. "Surgery? What is there to it?" He replied. "Do you know why I never pursued surgery back then? Indeed, you had already been accepted as a doctoral student under Professor Han in the cardiothoracic department. Why not continue?" Zheng Ren shared this curiosity and leaned in to catch Su Yun's gossip. Returning to Haiqing Medical University was not merely a matter of being a second-generation physician living off past laurels. "I didn't want to trouble the anesthesiologists," Su Yun stated. "Huh? What does that have to do with anesthesiologists?" Zheng Ren and the nearby ICU doctor were momentarily taken aback. Su Yun gently brushed his bangs aside. His eyes filled with a profound loneliness. "I possess the most brilliant mind and the most dexterous fingers, destined to be the finest surgeon. Yet fate has dealt me an unfair hand. It seems I was bestowed with unparalleled beauty. My extraordinary looks cannot be concealed even with 2 layers of sterile masks. Each time before surgery, when the patient is anesthetized, the dosage must be increased. Some patients even require the maximum dosage, so how can I continue in surgery?" The atmosphere around them grew quiet and heavy. Zheng Ren stifled a laugh, swallowing his food with great effort, fearful that a slip might lead to an embarrassing outburst. After a lengthy pause, the sycophant beside Su Yun finally coughed a few times and said, "Yun Ge, I believe you are absolutely right." Zheng Ren continued to suppress his amusement, wary of provoking Su Yun. It was not merely because Su Yun was the dean's nephew, but because he was the shared heartthrob of all the nurses in the hospital. If they discovered he had offended him, he might find himself operating alone, devoid of even an instrument nurse. The mere thought of being left to navigate surgery without assistance sent a shiver down his spine. What? The hospital arranged it? The nursing department assigned it? Nowadays, the younger nurses, born in the 90s and even the 00s, would quit at the slightest dissatisfaction. After all, the hospital's earnings were modest, and the work was arduous. Even the nursing department hesitated to provoke these young nurses, hence the predicament regarding their heartthrob. Zheng Ren hastily finished his meal and quickly left the table. As he distanced himself, he caught Su Yun's distant voice. Why am I so good-looking? Chapter 0007. Building 7. Zheng Ren conceded that Su Yun was indeed quite handsome. But being a doctor was not akin to walking a runway. Good looks did not equate to medical prowess. Rushing back to the emergency department, he feared that the moment he took a break, an injury would occur, and he would find himself being sewn up by Yuan Li, without any major surgeries. Even suturing would serve as good practice. Fortunately, his worries did not materialize. The emergency surgery department was surprisingly tranquil that day, with only a girl in a red dress sitting alone, sobbing on a chair. In a hospital, it was not uncommon for patients or their relatives to cry. Zheng Ren had little inclination to comfort a girl. He was more eager for trauma cases to arrive. As he passed by, he caught a glimpse of the girl, feeling a sense of familiarity. Upon closer inspection, he realized it was Xie Yiren, the surgical instrument nurse who had assisted him in the operating room that day. Hey, what's wrong? Zheng Ren inquired. Upon hearing someone address her, Xie Yiren looked up, her teary eyes appearing pitiful. Upon recognizing Zheng Ren, she burst into even louder sobs, curling her legs up on the hard plastic chair and shaking her shoulders. Zheng Ren was at a loss for words, unsure how to console her. It would take a lack of intelligence not to decipher why Xie Yiren was crying in the emergency department. He fell silent, racking his brain for comforting words. I was sent to the emergency department. After a long pause, Xie Yiren finally managed to choke out her situation. The emergency department has its perks. At least you won't have to work overtime in the operating room, Zheng Ren reassured her. But I want to be in surgery, Xie Yiren replied. What is so great about surgery? Zheng Ren, oblivious to his own yearning for the operating room, remarked, in the emergency department. You avoid overtime and have time to flirt with cute guys, watch movies, and enjoy life. Just look at how busy the operating room is, with unpredictable overtime. I don't dare flirt with cute guys, Xie Yiren said earnestly. Seeing her mood lift slightly, Zheng Ren chuckled, appreciating the girl's innocence, and decided to go along with her words to prevent further tears. Why not? At your age, it's the perfect time to embrace love. I'm still young. I don't want a boyfriend. I just want to do surgery and work overtime, Xie Yiren asserted firmly. Just wanting to work overtime. Is that too lofty? Contributing bricks to the grand rejuvenation of the Chinese nation? Zheng Ren thought her ideals were rather ambitious. He found himself at a loss for words, unsure how to respond. Suddenly, an idea struck him, and he asked, Is your family facing financial difficulties, prompting you to seek overtime pay? In that instant, Zheng Ren felt he had touched upon a deeper issue, imagining a multitude of tragic backgrounds. No, I'm quite wealthy, Xie Yiren replied, her expression adorably naive, her little nose twitching cutely. How much overtime pay do you earn in a month? I don't know. I've never checked my paycheck, Xie Yiren responded. Then do you not spend any money usually? The money from the salary card, alas, cannot purchase anything significant, which is why I seldom pay it any mind. Zheng Ren felt that he might have misjudged Xie Yiren. Reflecting on their previous conversation, he cautiously inquired, How much pocket money do your parents give you each month? They travel the globe every year and are currently in Turkey. When they left, they gave me a supplementary card to use freely, without specifying a monthly allowance. Zheng Ren felt as though he had been struck by 1,000 blows, his vitality waning in an instant. Does your family own a business? No. My family possesses 7 buildings on Shade Street, collecting rent each month. Shade Street is at the heart of the city, in the CBD area, frequented by high-earning professionals. Zheng Ren sighed. If he had 7 properties on Shade Street, he could live a comfortable life from the rental income alone. With 7 properties, why would you even need to work? Zheng Ren's curiosity piqued, realizing how his own impoverished upbringing had curtailed his imagination. It's not 7 properties, it's 7 buildings. Xie Yiren corrected him, like the Wu Mao building. A perfect hit. Zheng Ren was instantly overwhelmed. The corridor of the emergency room grew silent as he struggled to regain his composure. Then why do you come to work? Wouldn't it be better to travel the world with your parents? After a long pause, he finally asked, I just want to assist in surgeries, Xia Ran replied, her determination unwavering. However, in the emergency department, surgeries were scarce. I'm looking for a chance to work as an instrument nurse at another hospital. What an idealistic and ambitious young woman, striving for the great rejuvenation of the Chinese nation. In that moment, Zheng Ren ascribed every beautiful word he could think of to Xia Ran. Are you not crying anymore? I also performed some surgeries in the emergency department, Zheng Ren said, regaining his composure before adding, before you find a new job, why not assist me in the emergency department? Although the procedures there were mostly minor sutures. Xia Ran blinked her large eyes, pondering before summoning her courage to say, Dr. Zhang, I am here to seek your mentorship. Seek mentorship? Yes. Director Liu and the others will be performing a pancreaticoduodenectomy that takes 6 to 7 hours. You completed it in half an hour. My intuition tells me that working with you means having surgeries to assist with. Her aspirations were remarkably noble. With 7 buildings in the CBD, she only wished to be an instrument nurse. Was this akin to someone driving a Maserati for ride-sharing? Zheng Ren recalled that during the surgery, he had not paid much attention to the instrument nurse, yet she always seemed to provide whatever he needed at the right moment. She was undoubtedly skilled. Then let us have you assist me in the surgeries, Zheng Ren decided. You should report in first, and he encountered another dilemma. The emergency department lacked dedicated instrument nurses, as major surgeries were not performed there, making the allocation of labor unnecessary. Are you thinking about the head nurse? Xia Ran inquired, understanding his predicament. Yes, that has quite a headache. Don't worry, my brother has started a company in my family's property management firm. I contacted him this morning and waived 3 years of rent. The head nurse has agreed, in principle, that we can work as a team. I will only assist you with the surgeries. Zheng Ren realized that during his conversations with Xia Ran, he had been rendered speechless almost as many times as in his entire life. Was this akin to a favor for a favor? Who knows? Zheng Ren was not overly rigid. Having someone assist him in the surgeries, even if just sutures in the emergency department, would alleviate some of his burden. Then it settled. Just as he was about to convey this to Xia Ran, a sharp, jarring screech of brakes echoed from outside the emergency building. Moments later, 2 individuals appeared in the corridor, a rush of blood and urgency accompanying them. Go report to the head nurse, change into scrubs, and prepare for surgery. Zheng Ren finally awaited an emergency injury. The scent of blood invigorated him, feeling the ADP energy bonds within his body snapping, releasing vigor. Glancing at the patient, the upper right corner of his vision displayed the patient's condition. A victim, Zheng Ren, though able to endure the sight of his patient, began conversing with Xia Ran. He donned sterile gloves and proceeded to administer a local infiltration anesthesia. With deft precision, he located the small blood vessel that was bleeding. His gaze fixed on the incision as he extended his hand. A pair of curved forceps was gently placed into his palm, and the null for suture thread effortlessly fell onto his pinky finger. Xia Ran's skill in assisting the surgery could be likened to that of a master. Scissors, forceps, and a 1 needle. In the operating room, only the monotonous commands of Zheng Ren and the heavy breaths of the patient could be heard. The incision was long and deep. Each layer of tissue required meticulous suturing, for any cavity left unclosed could lead to complications such as suppuration and infection. For Zheng Ren, with his 330 points of surgical skill, this suturing was but a trifling task. As he stitched, he pondered whether the system should assign him any tasks, perhaps rewarding him with a treasure chest for completing a suture. However, his hopes were dashed as the mechanical voice of the system remained eerily silent, as if it had vanished. Feeling a tinge of disappointment, he focused intently on closing the wound layer by layer. With a number 7 suture needle, Zheng Ren reached for the needle holder, which promptly landed in his hand. Just then, a commotion erupted outside. The operating room door was forcefully kicked open, and several inebriated young men barged in. Zheng Ren cursed under his breath. Why were there so few doctors in the emergency department? Because no one wished to perform surgeries or attend to patients under such conditions. Where is my brother? Damn it, take good care of my brother. If anything goes wrong, I'll make you pay. Brother, how are you? A few sycophants threatened Zheng Ren while professing their loyalty. Zheng Ren was at a loss. Shouldn't they be showing concern for the surgeon so he could concentrate on the operation? But for drunks, especially those who were heavily intoxicated in the middle of the day, reason was a foreign concept. Get out of here. The injured man bellowed, still retaining a shred of rationality, aware of what should and shouldn't be done at that moment. Then, with a hint of apology, a touch of flattery, and a dash of unease, he added, Doctor, my brother means no harm. Please don't take offense. I'll compensate for any damages. Just please stitch him up properly. The drunken ruffians, hearing the scolding from their leader, became noticeably more compliant. After a few more curses directed at Zheng Ren, they exited the operating room, closing the door behind them. Zheng Ren sighed inwardly, the needle dropping as he expertly tied a surgical knot. The scissors that had been loosely held in his palm magically appeared in his fingers, snipping the number 7 thread. Dr. Zheng, your hands are remarkably adept, Xia Yiran remarked, having little else to do, and began to applaud. I'm accustomed to closing the abdomen without an assistant. It makes things simpler, Zheng Ren explained. Are you frightened? This is just how the emergency department operates. He attempted to reassure Xia Yiran, but before he could finish, a cacophony of shouts erupted from the corridor, followed by the dull thuds of blunt instruments striking flesh. Truly, the emergency department was an inhospitable place, Zheng Ren mused. Moments later, the operating room door was once again kicked open, and a group of burly men wielding baseball bats appeared at the threshold. Not bad. You managed to flee but still dare to return to the hospital. One of the men sneered, rhythmically tapping the baseball bat against his palm, as if preparing to unleash it upon someone as head at any moment. The patient on the operating table, startled, bolted upright, disregarding the wound on his back, and curled into a corner, embodying a frightened rabbit. Nevertheless, he assumed a professional posture, cradling his head in his arms, bracing himself for the impending blows. You too. Get out. The burly man shot a glance at Zheng Ren and Xia Yiran, his voice cold and commanding. Generally, individuals of a certain ilk in the underworld prefer to avoid harming medical personnel during their scuffles. The saying goes, in the world of the martial, one must expect to be cut. If karma truly existed, those who harm medical staff today might find themselves in dire straits tomorrow. And if no one came to their rescue, they could hardly blame fate for its unfairness. Zheng Ren had never encountered such ruthless individuals, nor had he imagined a violent pursuit reaching the hospital. Yet he had heard tales of a patient whose arm was broken and required orthopedic surgery, only for his enemies to follow him into the operating room, causing the patient to leap from the 6th-floor window in fear. The result was multiple comminuted fractures of the lower limbs, leading him directly to the intensive care unit. However, that had occurred over a decade ago, merely a story shared among older physicians over drinks. Zheng Ren did not anticipate facing such a formidable dilemma on his first day in the emergency department. What should he do? Leave? The surgery was not yet complete. Stay? Risk being beaten alongside the patient? It was a difficult choice. Zheng Ren was no saint. Yet every physician possesses their own convictions. He quickly made up his mind, nudging Xia Yiran with his elbow, saying, You should go. Xia Yiran hesitated for a moment but instinctively complied with Zheng Ren's directive, slipping out of the operating room between the hulking men, who made no effort to stop her, parting to allow her passage. I am a doctor and currently performing surgery. I kindly ask you to leave at once, Zheng Ren asserted. Unable to convey his determination through expression due to the mask, he turned to the patient. You stay. We're nearly finished with a few more stitches. Oh, tough guy, aren't you? The leader of the men revealed a sinister grin, a scar on his face resembling a flower in full bloom, more menacing in its appearance. You've been given face, don't you know that? Zheng Ren felt his legs weaken but stood firm. If he were to flee in fear now, how could he ever hold his head high again? He cared about his reputation, so he could only persist in this moment. Self-defense? A surgical knife? In the presence of such imposing figures, a surgical knife would be akin to a toy. Even if he managed to defend himself successfully, he would still face severe legal repercussions. Such occurrences were all too common, and Zheng Ren had heard many such tales. Absconding from a patient whose surgery was incomplete was beyond his moral compass. He feigned calmness, hoping for a miracle from the system. Please, leave the operating room, he implored, struggling to keep his voice steady, striving to maintain the dignity of a physician. I am in the midst of surgery. Heh, the burly man cracked his neck, the vertebrae emitting a series of ominous pops, his muscles radiating a fierce energy. The scar on his face seemed to animate, mocking Zheng Ren silently. You truly have no sense of self-preservation. Well then, you need not leave. A chill ran down Zheng Ren's spine. The system was utterly unhelpful, merely a medical aid, providing no means for him to wield exceptional strength. Even if such power were available, he would not choose it. Should he injure these men, the ensuing legal battles would cost him dearly, and he would likely be dismissed from the hospital. Self-defense? That was not an option. It was a dire predicament. He hoped he wouldn't be beaten to death. Zheng Ren glanced at the injured man huddled in the corner, contemplating how to protect himself in a short span of time. What a futile thought. Yet, if given another chance, he would still choose to remain. Little 6. Why are you so brazen today? Just as the burly man advanced toward Zhang Ren, an elderly gentleman clad in a traditional-style shirt appeared at the operating room door. Even without seeing him, the mere sound of his voice changed the burly man's demeanor. His fierce countenance twitched, struggling to form a smile, which Zhang Ren perceived as more grotesque than tears. Third Master, what brings you here? The burly man quickly turned, and upon recognizing the newcomer, he bowed deeply, speaking with utmost deference. I came to visit a friend and happened to find you causing a ruckus here. The elderly gentleman entered. He appeared to be in his late 60s, with a long beard and eyebrows, lean but vigorous, and with piercing eyes. You jest, sir. How could I possibly cause trouble? I've merely encountered a minor issue while attempting to collect a debt. Though Third Master's tone was amiable, the burly man's posture grew increasingly stooped, as if bearing the weight of a mountain upon his shoulders, sweat plastering his temples. Your involvement with small loan companies is of no concern to me. However, young man, the old ways must be respected. It is best to avoid violence and bloodshed in a place dedicated to healing, lest you invite misfortune upon yourselves, Third Master said, his demeanor serene and his tone gentle, inspiring feelings of goodwill. Yes, sir, you are absolutely right, the burly man hastily agreed. His underlings dared not even raise their heads, clinging to the walls in an attempt to minimize their presence, as if Third Master were a fearsome beast capable of devouring them at any moment. After exchanging a few words with the burly man, Third Master finally offered a faint smile and approached Zhang Ren. He bowed slightly and inquired, Might you be Dr. Zheng? I am indeed Zheng Ren. And you are? Zheng Ren felt a great weight lift from his chest. He stood awkwardly, unsure of what to do with his blood-stained, gloved hands. I am the steward of Mr. Wei. He is awake and has asked me and his daughter to express his gratitude for the successful surgery you performed yesterday. Third Master explained. We were waiting for Miss Wei to join us, but I noticed these ruffians causing a disturbance and feared for your safety, Dr. Zheng. Please forgive any perceived discourtesy. You were too kind, Zheng Ren replied, taken aback. He had assumed the patient to be a nouveau riche, lacking any real pedigree. Yet, the fact that someone like Third Master, capable of reducing a hulking man to a quivering lamb with mere words, served as a steward suggested that this family was far from ordinary. Zheng Ren made a mental note of this. Please continue with your work. We can speak further once you have completed the surgery, Third Master said, bowing slightly and offering Zheng Ren utmost respect. Zheng Ren, at a loss for words, simply watched as Third Master led the group of intimidating men out of the operating room, finally allowing himself to breathe a sigh of relief. You lie down, Zheng Ren commanded, his gloved hands, now covered in congealed blood, looking particularly gruesome. He pointed to the injured man. The injured man, who had been staring in disbelief, finally snapped out of his daze and meekly asked, Are you Professor RB? Your Mandarin is remarkably proficient. I am no professor. Merely a doctor from the Municipal First Hospital, Zheng Ren clarified. Just lie down. There are only a few stitches left. Your wound has been contaminated again, so it needs to be disinfected. This time, as the iodine was applied, the injured man gritted his teeth and bore the pain silently, emitting only a few hisses of air. Dr. Zheng, I presumed you were a foreign professor. Why is that? Because the professor Mr. Wei hired is said to be world-renowned. I didn't expect you to be so young. Zheng Ren remained silent, deftly maneuvering the needle and thread. His hands still trembled slightly from the recent scare, resulting in a less-than-perfect knot. With a sigh, he snipped the thread and began again. Even if I was mistaken, Third Master would not make such an error. The injured man rambled on, perhaps hoping to alleviate his anxiety through conversation. Though I am but a small-time player, I am familiar with the prominent figures of Haiqing. The fact that Third Master knows you suggests that I made the right choice in coming to the Municipal First Hospital. Zheng Ren, unsure how to respond, preferred not to engage in conversation. This type of interaction did not suit him. Soon, the final stitch was complete. Zheng Ren aligned the edges of the skin and announced, All right, you can leave now. As he spoke, he grabbed the used surgical instruments and carried them to the sink, using his elbow to turn on the faucet and begin rinsing them. Once blood congealed, it became difficult to remove. So the sterilization room strictly required all surgical tools to be thoroughly cleaned before being placed in the autoclave. Dr. Zheng, may I leave with you? The injured man asked tentatively, his face pale. Zheng Ren, unsure of what awaited the man outside, paused and inquired, Do you require police assistance? Certainly not. The injured man replied, forcing a smile. This was inevitable. There's no need to involve the police. Very well, Zheng Ren conceded, uninterested in delving into the customs of the underworld. As he completed the final cleaning tasks, images within the mysterious space of Zheng Ren's consciousness began to splice and edit themselves, changing rapidly and creating countless afterimages. The phantasm then transformed into a computer screen, connecting to the internet and accessing a website called Apricot Grove without hesitation, bypassing any registration or login procedures. This website served as a forum for doctors to exchange ideas and information, frequented by medical professionals. Rumor had it that some of the nation's leading doctors in various fields also browsed Apricot Grove, though they preferred to remain anonymous, never posting or replying. The video of Zheng Ren's recent suture was uploaded to the site. It was lunchtime, and many users were browsing Apricot Grove. The new post quickly garnered dozens of clicks. Such an ordinary suture. Who uploaded this? Crude conditions and mediocre technique. I suggest using subcutaneous continuous sutures with absorbable catgut next time, which might attract more views. The video is well produced, but the surgery is unremarkable. Thumbs down. Only a few comments appeared before the post was quickly pushed off the front page and disappeared into obscurity. The comments transformed into faint specks of light that flew into the fox statue in front of the thatched hut. A wave of intense fury, like a raging storm, echoed within the mysterious space of Zheng Ren's consciousness, as if some entity were unleashing its wrath. Zheng Ren, who was in the midst of cleaning the surgical instruments, suddenly felt an icy chill emanating from the depths of his soul. Abandoning his task, he felt that something was amiss with the system and immediately entered the system space to investigate. As soon as he appeared, before he could even take in his surroundings, a line of text appeared on the screen in front of him. The text appeared rapidly, and Zheng Ren was certain that his unease stemmed from the system space. System task: complete at least 10 surgeries within 3 days. The completion rate of each surgery must reach the perfect level. Below the task was a long list of surgical options. The last line was marked in striking red. Task reward: unknown. Task punishment: annihilation. Zheng Ren was stunned. Why had the normally benevolent system suddenly become enraged? Perfect level surgeries were beyond the capabilities of a mere attending physician like himself. Could even the most renowned experts in Beijing or Shanghai achieve a 100 success rate with perfect level surgeries? Zheng Ren doubted it. The task reward was unknown, but the punishment was annihilation. Did the system believe that his talent was limited and intend to cause his sudden death, paving the way for a new host? This was utterly outrageous. Cold sweat instantly drenched his forehead, temples, and back. Zheng Ren took a deep breath to calm himself. He did not doubt the system's abilities. Its diagnostic accuracy was unparalleled, making it the ultimate cheat code. Therefore, he also had no doubt that the system could silently eliminate him and fabricate a sudden death. Calm down, Zheng Ren repeated, rereading the system task. After confirming the malice, he began to search for surgical procedures. With only 3 days to complete at least 10 perfect level surgeries, Zheng Ren, faced with hundreds of options, unhesitatingly chose appendectomies. After all, as a general surgeon, the procedure he had personally performed most often was the appendectomy. Only perfect level. Zheng Ren dared not even contemplate the possibility of failure. He could only do his best. What was the use of the system? What was the use of poetry in faraway places? The system and life would still punish him, no matter how distant the possibility. As his finger hovered over the surgical procedure for appendectomy, a mirage shattered into countless fragments, which then reassembled. Zheng Ren found himself in a transformed realm, where the azure sky and white clouds vanished, replaced by an operating room with a surgical table before him. What astonished Zheng Ren the most was the lifelike dummy lying on the table, far more realistic than any medical training mannequin he had ever encountered. Task reward: practice a surgical procedure in the system space. Reward granted in advance. Please cherish this final opportunity. The cold, mechanical voice seemed to sharpen, incessantly reminding Zheng Ren of the challenge he was about to undertake. How long can I practice here? Seizing the moment when the mechanical voice emerged, Zheng Ren hastily attempted to communicate. The host is currently in a state of temporal suspension, with the flow rate of real-world time at 0. The system can maintain this state. System calculations in progress. The mechanical voice became increasingly disorganized, as if the power supply were faltering. Eventually, the voice fell silent, leaving Zheng Ren with a chilling string of numbers: 15, 6, 23, 15. This indicated that he must practice appendectomies continuously for 15 days in the system space. Zheng Ren understood that he had been granted a reprieve. This brief period was his last lifeline. With no assistants or surgical nurses, Zheng Ren was entirely alone. After contemplating for a few minutes, he accepted the reality and resolved to give it his all. The surgical knife was thin and gleaming. The practice of appendectomy commenced. The case provided by the system was straightforward. Upon opening the peritoneum, the inflamed appendix sprang forth, clamping the appendiceal artery, excising. Everything proceeded according to protocol. Soon, an appendectomy was successfully completed. Zheng Ren glanced up to see the system's evaluation appear in the upper right corner of his vision. Surgical time 15 minutes, rating good. Oh, it is merely appendicitis. Can there be any embellishment? Zheng Ren mused inwardly. However, the system was authoritative, and he had to complete the tasks assigned to him. Thus, he embarked on an endless cycle of practicing appendectomies. Various types of appendicitis and an array of innovative techniques were employed. Zheng Ren utilized every method he had learned, seen, or heard of, even making creative modifications. An avid learner, he subscribed to numerous medical journals. His imagination flourished with countless ideas. Within the confines of the system space, Zheng Ren felt as though he had entered a realm of bliss, the ominous prophecy that threatened his existence looming like a blade at his throat, compelling him to elevate his skills in performing appendectomies, even allowing him to experiment with his fanciful notions. What initially took 15 minutes for a simple appendicitis evolved into a mere 5 minutes for a complex suppurative appendicitis. Zheng Ren lost track of everything, becoming engrossed in his practice. The system's evaluations improved from good to excellent. With 2 days remaining, he had achieved a state deemed perfect by the system. Yet, Zheng Ren dared not relax. He continued to optimize each step. This was a matter of life and death, and he could not afford to be careless. As the final second ticked away, the operating room around him dissipated, and without any form of communication, he was ejected from the system space. Zheng Ren perceived that the system space had grown dim, as if a heavy blanket of clouds had settled above, heralding an approaching tempest. The air was no longer fresh, suffused with the scent of blood. The sound of rushing water reached his ears, and Zheng Ren regained his senses. Outside, time had indeed stood still, yet he felt as if he had aged 20 years. In that fleeting moment, he had performed over 300 appendectomies, completing a lifetime's worth of surgeries. He quickly cleaned the surgical instruments, placing the used packs into the sterilization bin, and then opened the door to the operating room. "Hello, Dr. Zheng," came a strong, synchronized greeting. The ruffians had vanished, and San Yi stood leisurely at the doorway, while a dozen individuals clad in black suits bowed simultaneously in salute. Impressive. The crowd nearby erupted with excitement. "Dr. Zheng, I apologize. The young lady has been unexpectedly detained," San Yi said graciously. "Do you have time this evening?" Time. That was precisely what Zheng Ren lacked. Without hesitation, he instinctively replied, "No." An awkward silence permeated the air. San Yi paused for a moment, then smiled slightly, maintaining his composure, and said, "Then I shall come to disturb you another day, Dr. Zheng." You were too kind." Zheng Ren quickly realized his faux pas. But under the system's threat, he had no time for social niceties. Missing an appendectomy could spell disaster. Steeling himself, Zheng Ren apologetically stated, "I truly have matters to attend to these days. After this period, I will be available." San Yi did not prolong the pleasantries, summoning the previously menacing Xiao Lu to apologize to Zheng Ren before departing gracefully. As San Yi and his entourage left, the emergency department's doctors and nurses surrounded Zheng Ren, inquiring about the commotion. "Zheng Ren, come to my office," a voice called out just as Zheng Ren felt overwhelmed. It was Director Pan returning. Zheng Ren quickly navigated through the crowd. "Director Pan, you're back." "Yes, let us talk in my office." Once inside, Director Pan wasted no time, sitting confidently in his armchair and asking, "Do you know what I have been doing?" Zheng Ren was momentarily taken aback by Director Pan's directness. "I went to the hospital to recruit personnel, preparing to initiate emergency surgeries." Director Pan's gaze was piercing, reminiscent of a general before battle, scrutinizing Zheng Ren. "Do you have confidence?" There were no pleasantries, no build-up. It was straightforward. In that instant, Zheng Ren developed a fondness for Director Pan's forthright demeanor. Hearing this, Zheng Ren nearly shed tears, feeling a deep sense of camaraderie. What tormented Zheng Ren the most? He needed to perform 10 perfect appendectomies within 3 days. After extensive training within the system, he felt that his proficiency had reached a masterful level or beyond. The possibility of faltering during a perfect appendectomy existed, but it was minimal. The challenge lay in sourcing acute appendicitis patients for surgery, securing an operating room, and assembling a complete surgical team, including nurses, anesthetists, and attending doctors. Postoperative care also required a dedicated nursing staff. In other words, while appendectomy is one of the simplest surgeries in general surgery, executing it in the emergency department necessitated at least 20 additional staff members. Outside the emergency department, Zheng Ren had no venue to conduct appendectomies. Returning to general surgery would yield no opportunity. Time was of the essence, and he had no chance to switch jobs. Just moments ago, he had contemplated working at an underground clinic performing quick procedures. Noticing Zheng Ren's peculiar expression, Director Pan's brows furrowed, exuding an air of authority. Zheng Ren snapped back to reality and promptly replied, "Rest assured, Director Pan, as long as the personnel are in place, we can commence surgery immediately." Upon hearing this, Director Pan's expression softened slightly. "Do you have any ideas?" "To train the team and expedite cohesion, I plan to conduct all appendectomies," Zheng Ren asserted confidently. With a resounding clap on the table, Director Pan startled Zheng Ren. "Your thoughts align with mine," he declared. "Do you know what I have been doing all day? I have been recruiting personnel from the hospital, the dean, the nursing department, and the anesthesiology department." Director Pan spoke with enthusiasm. "Dr. Zheng, I urge you to embody the spirit of hard work and perseverance, and swiftly assemble a team. Had it been any other day, such words would have left Zheng Ren feeling exhausted. Yet today, they resonated as a sweet melody, akin to a life-saving song. Zheng Ren felt an overwhelming urge to embrace Director Pan and weep. With a knife at his throat, he was expected to perform surgeries of impeccable quality. The pressure from the system was immense, leaving Zheng Ren yearning for an outlet for his emotions. "Please urge Director Pan once more. If circumstances permit, I am prepared to undergo surgery immediately," Zheng Ren expressed. Hearing this, Director Pan was taken aback. After an entire morning and part of the afternoon spent running around the hospital, he had finally gathered some clarity amidst the chaos, albeit at the cost of his own dignity. On his way back, he was still contemplating how to persuade Zheng Ren, knowing that he was the only lead surgeon in the emergency department. Given his advancing age, he could manage to fill in gaps, but performing 5 or 6 surgeries a day would surely wear him down in no time. To his surprise, matters seemed to be progressing smoothly, exceeding his expectations. Director Pan contemplated for a moment and gestured towards the chair opposite him. "Please, have a seat," he instructed. Zheng Ren then realized he had been standing before Director Pan like a soldier awaiting orders. "Young Zheng, I recognize your untapped potential," Director Pan stated earnestly. "You may face some hardships in the emergency department, but it will undoubtedly contribute to your growth. Rest assured, Director Pan, I do not shy away from hard work." Zheng Ren vowed. Director Pan had not anticipated Zheng Ren's eagerness. He had initially intended to return to counsel Zheng Ren, only to find him more impatient than himself. Youth is indeed a time of vigor and ambition, yet one must not rush. Personnel adjustments require time, and initially, we can only assemble a makeshift team, gradually refining it over time. In the grand scheme of things, fate has its own design. Zheng Ren left Director Pan's office feeling disheartened, his mind preoccupied with the daunting prospect of 10 surgeries within 3 days. If it came to it, he considered traveling to the surrounding villages to perform appendectomies on makeshift beds. However, achieving perfection under such circumstances would be an arduous task, given the inadequate sterilization conditions. Zheng Ren felt distressed and overwhelmed, as if he were on the verge of being extinguished. Director Pan stirred the still waters like a catfish, creating ripples of commotion. It had been years since the first municipal hospital had witnessed such significant activity, and soon the entire hospital was abuzz with news of the emergency department preparing to commence emergency surgeries. The general surgery and orthopedic departments were the first to be affected, as their minor surgeries were precisely the cases most frequently encountered by the emergency department. When they learned that the emergency department aimed to tackle acute appendicitis as their starting point, the heads of both the first and second general surgery divisions could no longer remain idle. After a brief discussion, they led their junior doctors to the emergency department, seeking accountability. A dozen doctors clad in white appeared in the corridor, with the 2 department heads at the forefront, flanked by their deputies, attending physicians, and clinical doctors, arranged in a triangular formation, resembling a sharp arrowhead. This scene evoked a sense of awe, a profound respect for the sanctity of life. Alas, neither Zheng Ren nor Director Pan felt this reverence. "Director Pan, I hear you are planning to perform emergency surgeries? Director Liu from the 1st General Surgery Division could no longer contain himself, harboring resentment towards Zheng Ren for being an interloper. And he entered the emergency department without so much as a greeting, launching straight into confrontation. Are you the doctors transferred here to the emergency department? Director Pan shot a sidelong glance at Director Liu, feigning ignorance. Is there anyone willing to work in the emergency department? I haven't heard anything about it. Director Liu was quick to retort. Is the general surgery department out of operations? Are you so idle? Director Pan, known for his sharp tongue, replied, You lot. Pretending to be doctors, are you so oblivious that you don't understand the situation? Who gave you the audacity to come here and cause trouble? With his finger pointed at the group of doctors, Director Pan exuded an overwhelming presence. Anyone who met his gaze would lower their head, too intimidated to maintain eye contact. Both Director Liu and Director Sun from the 2nd General Surgery Division sensed that the situation was amiss. Their two departments represented the pinnacle of general surgery expertise in the province, and they were not here to endure a reprimand from Director Pan. Director Pan, I respect the contributions you made in your years at the military hospital. Director Liu eventually regained his composure and spoke coldly. Does anyone in your emergency department even know how to perform surgeries? If an emergency patient is delayed, who will take responsibility? Oh, Director Pan was not inclined to indulge Director Liu. Do you even remember who taught you your surgical skills? And you dare question who will take responsibility? I, Director Pan, am here. Of course, I will take responsibility. Director Liu's mentor was a student of Director Pan, a lineage that few in the hospital were aware of. Hearing Director Pan invoke his seniority, Liu's expression soured. He knew he could not win this argument, for if the matter escalated, the hospital leadership could easily label him as disrespectful to an esteemed elder, rendering any justification moot. He would undoubtedly redirect his ire towards Zheng Ren. Zheng Ren, your surgical skills were taught by me. You think you can take the lead in the emergency department? Let me tell you, you are not qualified. Zheng Ren, known for his gentle demeanor, had never been one to argue or retort, but with a cold glint in his eyes and only 3 days remaining, he felt the pressure mounting. Although he found little joy in conflict, he was not afraid. Zheng Ren stood his ground, locking eyes with Director Liu, sparks flying between them. Director Liu, Director Pan, how about this? I will perform 10 appendectomies, and both of you can observe. If you find any fault with my work, I will resign immediately. Director Liu was momentarily taken aback. In his mind, Zheng Ren had always been a timid individual, someone who could barely muster a response. He was aware that one should always pick the softest targets. Thus, he refrained from directly confronting Director Pan, knowing that if he were implicated in the ousting of Pan's student, his own mentor, the former head of general surgery, it would not reflect well on him. However, to his astonishment, Zheng Ren, having just arrived at the emergency department, had undergone a transformation and audaciously made such a declaration. Not everyone can perform surgery. Anyone can point out flaws. What a narrow-minded perspective. Director Liu initially dismissed Zheng Ren, but soon a smile crept across his face. Without allowing Director Pan a chance to refuse, he declared, Excellent. You will handle all the appendicitis cases in the coming days. If you perform well, I assure you, the 1st General Surgery Department will cease to conduct appendectomies. If you fail, well. A sinister smile formed as Director Liu turned to leave, leaving no opportunity for Director Pan to object. Director Sun from the 2nd General Surgery Division pondered why Zheng Ren would stake such a bold claim, and in deep thought, he followed Director Liu out. The calm that followed left Director Pan with a sense of helplessness. Young Zheng, you may have spoken too boldly, he expressed with concern. Director Pan, if my skills are insufficient, the emergency department's surgeries cannot commence. If I am capable, I fear no scrutiny. Zheng Ren found a glimmer of hope and quickly reaffirmed, Rest assured, I will fulfill the task you assign. Guarantee? Where will you provide such assurance? Director Pan, with over 40 years of surgical experience, knew that a flawless operation was a rare feat. We shall consult the general surgery department. When the time comes for surgery, we will need your presence to ensure they do not distort the truth. Director Pan was at a loss for where Zheng Ren's confidence stemmed. But now that the words had been spoken, what could he do? With a sigh, he arranged for the emergency department's on-call doctors to identify cases of acute appendicitis or suspected cases and ensure they proceeded to the inpatient department for consultation. After making these arrangements, the two fell silent as they headed straight to the 1st General Surgery Department. Zheng Ren clearly remembered that due to the teaching demonstration surgeries, several patients with abdominal pain were awaiting examination in the general surgery ward. Upon arriving at the department, Zheng Ren bypassed the doctor's office and went directly to the ward. The system's functionality still persisted. Whenever Zheng Ren focused on a patient, relevant diagnostic information would appear in his peripheral vision. However, the text had faded slightly and become somewhat blurry. At the top was a countdown. 2 days and 22 hours remaining. Oh, the chief resident from the emergency department is conducting rounds in our general surgery department? As Zheng Ren moved from room to room, Chief Resident Qin Feng of the general surgery department wore a disdainful expression and initiated his mocking tone. Rounds across departments were a rarity, and apart from a few notable figures, few dared to do so. Qin Feng's sarcasm was palpable, and he had a plethora of remarks ready to unleash upon Zheng Ren. Zheng Ren appeared to disregard the conversation entirely, making his rounds and inspecting the patients suffering from abdominal pain before finally approaching Qin Feng. Director Qin, the patient in bed 37 has been diagnosed with ectopic appendicitis and requires emergency surgery. Qin Feng was momentarily taken aback. What he had just suggested during the ward round was intended as a jest, yet Zheng Ren had taken it seriously. Was he inviting trouble upon himself? He recalled that the patient in bed 37 was a 40-year-old man who had been admitted with right upper abdominal pain for 1 day. The ultrasound report indicated an inflammatory mass near the gallbladder, with a thickened gallbladder wall, suggesting acute cholecystitis. How could one misdiagnose acute cholecystitis as appendicitis? Did your technique come from the attending nurse? Qin Feng scoffed. The appendix is located in the right lower abdomen, not the right upper abdomen. I mentioned ectopic. Zheng Ren sidestepped past Qin Feng and approached Director Pan, accessing the workstation to retrieve the case file of the patient in bed 37. Director Pan, take a look at this patient. I believe the general surgery department's diagnosis is erroneous, Zheng Ren stated. Director Pan was rendered speechless. This was indeed a slap in the face, asserting that another department had made a mistake. Reconciliation seemed utterly impossible. The question remained whether the confrontation would lead to a physical altercation. To directly claim that the general surgery department was mistaken indicated a significant grudge. Director Pan reviewed the case and was engulfed by a sense of foreboding. Could it be that he had overlooked something? Was Zheng Ren truly incompetent? His esteemed reputation threatened to be tarnished by this blunder. All the tests consistently pointed to acute cholecystitis, and the family had consented to the surgery. They were merely waiting for the operating room to be available. How could one misdiagnose acute cholecystitis as appendicitis? Are you done yet, Zheng Ren? You've already been reassigned. Qin Feng's words were cut off by Director Liu. Isn't the patient ready for surgery? Then let's proceed and let him operate. We'll just address any diagnostic errors with exploratory surgery, Director Liu suggested. Having just experienced the urgency of the emergency department, Qin Feng quickly discerned Liu's intentions. A sly grin spreading across his face as he leaned closer to whisper, "Shall I inform the operating room to schedule it in the teaching surgery room? You can bring the leaders from the medical office to avoid any complications." Director Liu felt a wave of relief, patting Qin Feng on the shoulder. This resident was indeed worthy of promotion, displaying remarkable thoughtfulness. This time, they were determined to ensure Zheng Ren was thoroughly discredited, sending a clear message to Director Pan about his interference in general surgery. With a knowing glance, Qin Feng slipped away to arrange various matters. Meanwhile, on the Xinxin Garden website, an anonymous account began a live broadcast, detailing the patient's condition, laboratory tests, and examinations. Who was this individual broadcasting from Xinxin Garden? They must be desperate for notoriety, likely to fade away in disgrace. Did you see that? A case of acute cholecystitis being treated as appendicitis. How can someone so incompetent attempt a live surgery? The broadcast garnered attention, drawing a dozen viewers. Those who dared to live-stream surgeries were typically seasoned professionals. Yet, broadcasting an appendectomy for a misdiagnosed condition? Was this a comedy act? As initial viewers called in their friends, the audience for the live stream continued to grow. The patient's tests, name, and hospital details were all obscured, leaving the actual institution unknown. However, no one seemed concerned about that. All attention centered around the fact that this was a case of misdiagnosis. The teaching room was spacious and well-lit, with a dozen doctors gathered around Director Pan like planets orbiting a sun. This arrangement was orchestrated by Director Liu. The more they elevated Director Pan now, the more spectacular his fall would be in just a few minutes. Yes, it would only take a short while for Zheng Ren to reveal his true colors. Director Liu's decades of clinical experience bolstered his confidence. The unrest in the emergency department would soon be quelled, setting a precedent for others to think twice before encroaching upon his territory again. Director Pan, We have arranged everything according to your specifications. The surgical instruments and nursing staff are from your emergency department. Zheng Ren insisted on not needing any assistance. Is there anything else you would like to address? Qin Feng strode into the room, presenting himself respectfully before Director Pan, his tone and demeanor impeccable. The deputy director of the medical office sat beside Director Pan, wearing a peculiar expression. Director Pan appeared to be past his prime. How could he allow a mere junior attending to create such chaos over a straightforward case? Sighing, he thought it might be wise to intervene now, thus preventing future disputes. The teaching room was silent, each individual lost in their thoughts. The anesthetist signaled, and the surgery commenced. The scalpel was thin and gleaming as Zheng Ren cut decisively. Zheng Ren made a 5 centimeters incision, adhering to the standard protocol for a small appendectomy. The surgical nurse, Xierong, attentively observed Zheng Ren's movements, anticipating the next step and ready to hand him the necessary instruments. Their coordination was exemplary, showcasing professionalism. With electrocautery to control bleeding, he began dissecting with the curved clamp, methodically starting this misdiagnosed surgery. In the teaching room, Qin Feng chuckled at the screen, muttering to himself, "Such a small incision. He certainly has confidence." Indeed, it was rare to see such a diminutive cut for a standard appendectomy. This was a learning opportunity. The sarcastic commentary felt like slaps against Director Pan's face, each remark resonating louder than the last. His head bowed lower, preparing for the humiliation. The only support for Director Pan's confidence now rested upon Zheng Ren's extraordinary performance in a pancreaticoduodenectomy, which seemed almost celestial. Meanwhile, Qin Garden buzzed with even more excitement. Given that it was an online broadcast, anonymity ruled. No one knew one another, and there were no conflicts of interest, only pure academic discourse. Thus, the discussions were more direct and often harsh. A 5 centimeters incision for an exploratory laparotomy in the right upper abdomen. Does the surgeon aspire to the heavens? They diagnosed acute appendicitis. According to their assessment, the inflammatory mass in the gallbladder region is a purulent appendix. Let us not bicker, just quietly observe the master at work. This was, without a doubt, the most absurd surgery I have ever witnessed. It's a miracle that this doctor has survived to this point without being assaulted. Regardless of the chatter in the teaching room or the discussions on Qin Garden, none of it reached Zheng Ren's ears. The operating room remained tranquil as Zheng Ren protected the incision with a small piece of gauze, reaching for a curved clamp. "Qin Feng, please prepare to scrub in," Director Lu instructed, as Zheng Ren was about to use the retractor to open the peritoneum. His voice was quiet yet clear enough for Director Pan to hear. This was disdain, utterly unmasked. Zheng Ren's surgical technique, from the incision to the current moment, left little room for criticism. Any attempt to nitpick would likely lead to questions about the authority of the technique. Yet, Director Lu was resolute in his belief that Zheng Ren had erred. As Zheng Ren prepared to enter the peritoneum, Lu had arranged for his own team to scrub in. Ready to take over the surgery, this was a step he had long anticipated. Watching the scenario unfold according to his script, a smile crept onto Director Lu's face. He had no intention of participating in this surgery. Even if it were a complicated case of acute cholecystitis, he felt no need to intervene, as Qin Feng could handle it. He simply needed to sit back and use his gaze to mock Director Pan. In the Qin Garden Forum's live broadcast room, comments began flooding the screen. Wow, they are genuinely performing an appendectomy for what is clearly a misdiagnosis. Such a remarkable surgeon is a rare find. He doesn't even require an assistant. Where does his confidence stem from? A retractor? Is this broadcast a joke? If he manages to extract pus, I'll go live and consume it myself. The aspirator swiftly descended into the incision in the peritoneum, perfectly positioned to prevent even a drop of purulent fluid from escaping. As soon as it was inserted, a thick, yellow-green pus was drawn through the tubing of the aspirator. The volume was considerable, and the suction lasted for 32 seconds. In the teaching room, just as Qin Feng was about to wash his hands, he froze, and Director Lu's smile faltered. Pus. It is atypical for cholecystitis to present with such fluid. Purulent exudate is most commonly associated with acute appendicitis. Could it truly be acute appendicitis? Had everyone misdiagnosed? Unthinkable. Both Qin Feng and Director Lu were desperately recalling the ultrasound findings of acute suppurative appendicitis. Even in the case of ectopic appendicitis, there should be some indication on the ultrasound. Qin Feng stood at the door, torn between leaving and staying. He began to waver, if it truly was appendicitis. And he had washed his hands only to stand in the operating room. Would he be humiliated live? If that were to happen, it would be a grand embarrassment. In the live stream of Xinglin Garden, the comments flooded in. Incredible. They really managed to extract pus. They wouldn't rupture the gallbladder, would they? How's that brother who suggested the live broadcast? Is the pus palatable? Waiting for the live stream. Could it really be appendicitis? I have never encountered a case like this. Suppurative appendicitis, and yet only a 5 centimeters incision. What confidence? Who is this expert broadcasting live? After 32 seconds, no more pus appeared in the aspirator. Zheng Ren placed the device onto the sterile gauze prepared by Xie Yiren to avoid contaminating the surgical field. He then continued to separate the peritoneum. As the peritoneum was opened 3 centimeters, a large, dark purple mass emerged. Continuing the separation to 5 centimeters, a large, dark purple object sprang forth, congested, edematous, and covered in white purulent coating. Regardless of its form, any surgeon would recognize it at a glance. This was indeed the appendix. It could only be the appendix. It was unequivocally the appendix. The teaching room fell into a profound silence. Director Lu's smile had frozen in place, his orbicularis oculi twitching uncontrollably as if jolted. Director Old Pan straightened his back, gazing intently at the screen, his hands clenched into fists. In the Xinglin Garden live stream, the comments temporarily ceased. As if everyone had suddenly realized each fleeting comment metamorphosed into imperceptible rays of light, traversing the interdimensional space to alight upon the fox statuette within the system's realm. Gradually, the system's space ceased its distortions. Following irrigation with a tepid saline solution and gentamicin, Zheng Ren excised the final fragment of purulent debris, exhaling a sigh of relief. Observing the surgical completion rate of 97 on the transparent screen in the upper right corner, a sense of tranquility settled within him. Based on Zheng Ren's expertise, adhering to the established protocol of irrigation and closure would invariably elevate the figure to 100, signifying a flawless appendectomy. Triumphant. As the tepid saline solution was presented, Zheng Ren, with the deftness of a seasoned artisan, poured it through the diminutive incision, allowing a 20-second interval before aspirating it with a suction device. At that juncture, Xie Yiren proffered a syringe pre-filled with gentamicin, devoid of its needle. Zheng Ren meticulously administered the gentamicin into the patient's abdominal cavity before initiating the closure. The practice of leaving antibiotics in the abdominal cavity varied, with some favoring powdered cephalosporins, while others, like Zheng Ren, opted for the venerable gentamicin. A subtle distinction existed between the two, and Zheng Ren, informed by his extensive surgical experience, deemed gentamicin more appropriate for the patient's present condition. The incision was diminutive, necessitating only a few sutures for closure. Yet, Zheng Ren maintained unwavering focus, unwilling to lapse into complacency. Heaven alone knew whether the system's mandate of 10 surgeries pertained to a mere 10, or whether 10 flawless procedures were required within a larger cohort. He could only impose upon himself the burden of ensuring that each of the 10 surgeries achieved perfection. Closing the abdominal cavity in successive layers, Zheng Ren paused at the incision site. After a moment's deliberation, he requested a 3-0 absorbable suture to perform a continuous subcutaneous closure. For Xie Yiren, the procedure had reached its conclusion. Relaxing, she remarked, "Dr. Zheng, the patient is a 40-year-old male. He probably isn't concerned about scarring. I merely aspire to achieve the utmost perfection," Zheng Ren replied while suturing. "Future young female patients will be fortunate to encounter you," Xie Yiren quipped. "Indeed, for uncomplicated appendicitis, I can achieve a scarless outcome," Zheng Ren declared. Xie Yiren was momentarily taken aback. A scarless outcome? Surely, Dr. Zheng was jesting. Although their collaboration had been limited to a few surgeries, the operating room often required light-hearted banter to maintain a convivial atmosphere. Zheng Ren's pronouncements were transmitted verbatim to the demonstration room, where they were broadcast. "Unconscionable," Director Lu exclaimed, seizing upon what he perceived as a minor indiscretion. "Director Lu, are you piqued?" Director Pan chuckled. "Zheng Ren is merely jesting. Why are you so agitated? As a meticulous surgeon, such irresponsible levity is unacceptable," Director Lu retorted, escalating the issue. Director Pan, confident of his position, deftly steered the conversation from scarless appendectomies to the misdiagnosis within the Department of General Surgery. His verbal barrage drove Director Lu from the demonstration room in disarray. To employ continuous suturing with absorbable sutures for an appendectomy demonstrates an all-encompassing, flawless surgical technique. On Xinglin Garden, the comments flooded the screen. For the surgeons observing the live stream, the surgery had concluded the moment irrigation commenced. Of course, Diagnosing ectopic appendicitis is challenging. To diagnose it decisively and confidently live-stream the procedure suggests the involvement of Dr. Zhang from Xiao Hospital. Impossible, Dr. Zhang would never live-stream a surgery. Amidst the ubiquitous acclamations, viewers speculated about the identity of the surgeon, their conjectures imbued with reverence. It was an impeccable surgery, worthy of inclusion in textbooks as a model procedure. The Xinglin Garden livestream lacked audio, so the surgeons were unaware of Zhang Ren's assertion regarding scarless appendectomies. Zhang Ren severed the suture, marking the completion of the surgery with a perfect score of 100. 0015 dentures and voltaic cells after changing clothes. Zhang Ren returned to the Department of General Surgery, where Director Pan bestowed upon him a hearty thumbs up. The veteran director expressed his approval in an antiquated manner, signifying both praise and recognition. However, the expressions of Zhang Ren's colleagues in the Department of General Surgery were somber, their gazes distant and unfamiliar. "Allow me to treat you to a meal and a respite," Director Pan said amiably, patting Zhang Ren's shoulder and leading him away. However, Zhang Ren had no need for sustenance or rest. He had keenly observed that the transparent screen in the upper right corner of his vision had seemingly become clearer since the surgery's completion. He needed to ascertain a matter of life and death. Declining the invitation, Zhang Ren noticed a flicker in Director Pan's eyes. Ultimately, the director could only persuade Xie Yiren to join him for a quick bite. Zhang Ren returned to the emergency department, retrieved his mobile phone, and placed an order for chive and egg dumplings. While awaiting the delivery, Zhang Ren reclined on the bed in the emergency department's male duty room, closed his eyes, and entered the system's space. The scene remained as he had first encountered it. If any change existed, it was the gradual shift in colors. In his initial entry into the system's space, and upon being tasked with completing 10 flawless surgeries, the system's space had appeared veiled in the dust of ages. Now, however, the colors seemed to be returning, imbuing the space with a semblance of vitality. The skill tree had undergone a dramatic transformation, ascending from an advanced level of 330 skill points to an expert level of 1,005 points. Was this the outcome of the intensive training? Had his abilities truly advanced to this extent? Zhang Ren was incredulous, his heart brimming with joy. "Is anyone present?" Zhang Ren called out. No response was forthcoming. What a peculiar system. Does it not communicate with its host? To immediately threaten obliteration for failing to complete a task is utterly devoid of tact, Zhang Ren mused. After a few moments of contemplation, he could discern no further clues and returned to reality. The endeavor was not entirely fruitless. Zhang Ren surmised that the system had depleted its energy and required a means of replenishment. That means was his performance of flawless surgeries. For a physician, this notion was rather far-fetched, but Zhang Ren could conceive of no other plausible explanation. Fortunately, the day had commenced auspiciously, with the initial case being a challenging instance of ectopic acute suppurative appendicitis. Most importantly, Zhang Ren had ascertained that his general surgery skills had reached the expert level. This undoubtedly provided a junior attending physician with greater confidence. I hope for a few uncomplicated appendectomies, Zhang Ren thought. He had no desire to continually walk a tightrope, prioritizing the preservation of his own life. The emergency department's colleagues gradually grew wary of Zhang Ren's presence. Those assigned to the emergency department were often individuals content with mediocrity, either unwanted by their original departments or seeking the opportunity to work 24-hour shifts followed by 35 days of respite. If the emergency department were to establish an emergency operating room, would it not imply increased workload and responsibility? The physicians here, mostly in their 40s, were content with their passive roles, a state of affairs that neither Director Pan nor any other authority could alter. However, these concerns were not Zhang Ren's to bear. His sole responsibility was to patiently await the arrival of the next patient with appendicitis. As night descended, the emergency department became increasingly hectic. Car accidents, alcohol-fueled altercations, acute gastrointestinal inflammation resulting from overeating, alcohol-induced cerebral hemorrhages, myocardial infarctions, and a litany of other ailments presented themselves, yet no patient with acute appendicitis materialized. Zhang Ren felt a pang of helplessness. Surely, he could not pray for an increase in appendicitis cases in Haiqing City merely to save his own life. Xie Yiren had departed for home, leaving Zhang Ren her mobile phone number and WeChat contact information, urging him to contact her should a surgery arise. After assisting Yuan Li with the suturing of a few minor lacerations, Zhang Ren sterilized the incision pack. As he emerged from the operating room, the internal medicine resident on duty approached him with a look of exasperation. "Dr. Zhang, could you take a look at this? Tell me what's wrong," Zheng Ren replied. A 62-year-old female patient is experiencing intermittent tinnitus and headaches of 22 years duration. I ordered a cranial CT scan, which returned normal results. I suspect it's a case of neuropathic headache and recommended a consultation with a neurologist, at which point she began to weep in my office. The female internist, approximately in her 40s, appeared to diagnose the patient with hysteria, a condition characterized by symptoms born from mere imagination, though she did not articulate it so bluntly. The emergency department was indeed a chaotic realm, leaving Zheng Ren feeling somewhat helpless as he followed the doctor into the internal medicine consultation room. There sat a gaunt woman on the floor, her seemingly expensive attire contrasting sharply with her despondent demeanor. The individuals surrounding her exhibited decorum. It was evident that they were not deliberately causing a disturbance, but rather, the patient had succumbed to a loss of faith in life, leading to her psychological collapse. Zheng Ren scrutinized the female patient, and the words that materialized in the upper right corner of his vision elicited both amusement and sorrow. "Auntie, could you please rise?" Zheng Ren kindly implored. The woman leaned against the wall, silently weeping, her gaze distant. Beside her was a male relative, around 40 years of age, who bore a look of guilt as he addressed Zheng Ren. "Doctor, I apologize. I am at a loss regarding my mother's condition. We have consulted numerous hospitals in the capital and other major cities over the years, yet no definitive diagnosis has been made." "Oh, the diagnosis is quite clear, and the treatment is rather straightforward. Let us discuss it outside," Zheng Ren replied with a gentle smile, radiating warmth and reassurance. The middle-aged man softly coaxed the woman, eventually managing to assist her from the floor and guiding her to a hard plastic bench outside the emergency room. At that moment, the emergency department was bustling, with many individuals queuing for medical attention. The woman's desperate sobs tugged at the heartstrings of onlookers, and upon hearing Zheng Ren claim, he understood the situation. A curious spectator discreetly captured the moment on video. "Doctor, I truly apologize. We'll take a moment and then leave," said the middle-aged man, who appeared to be the son of the female patient, as he comforted her despite his own despair. "Has your mother had dental work recently?" Zheng Ren asked earnestly. "Yes. She had a tooth implanted 6 months ago," the man replied, puzzled as to why Zheng Ren had posed such a question, especially since they were not previously acquainted. "Indeed," Zheng Ren affirmed. "After the dental procedure, she began experiencing symptoms of dizziness and tinnitus, correct?" The man pondered but remained uncertain, recalling that the dental surgery had gone well, and no connection had been made to her subsequent dizziness and ringing in the ears. Could it be a side effect of the tooth implant? It seemed implausible. If there were complications, they would have sought treatment from a dental specialist long ago. "In my opinion, this doctor is simply talking nonsense," he thought, bemused by the notion that a condition deemed unsolvable in the capital or other major cities could find resolution in their coastal city. "Let me clarify. Your mother likely has metal dental prosthetics in her mouth, which are functioning as a type of galvanic cell," Zheng Ren stated with certainty. The middle-aged man was bewildered, struggling to comprehend how Zheng Ren consistently linked his mother's dizziness and tinnitus to her dental work. Was he perhaps a salesman from a private clinic masquerading as a doctor? This thought ignited a flicker of anger within him. Two metals of varying reactivity placed in a solution create a galvanic cell. This concept should be familiar from high school science, Zheng Ren brazenly explained. Though he himself had long forgotten the specifics of galvanic cells, the intricacies of metal reactivity now a foreign language to him. Nevertheless, the expression on the man's face compelled him to clarify. Consequently, the duration of the surgery is contingent upon the anesthesiologist. Thus, your mother's dental prosthetics are causing her symptoms through bodily fluids acting as a conductor, resulting in the sensations of tingling and tinnitus. This occurrence is entirely normal. The onlookers, although perplexed, regarded Zheng Ren's diagnosis with a sense of gravitas. Most were unfamiliar with the concept of a galvanic cell, yet it did not diminish their belief in Zheng Ren's competence. "I will contact the oral surgery department. You should have a tooth extraction, which will remedy the situation swiftly. As for which tooth to extract, that is at your discretion," Zheng Ren advised. The middle-aged man, albeit confused, found some merit in Zheng Ren's assertions, yet he could not shake the feeling that it all seemed implausible. The only certainty was that Zheng Ren was not a fraud from a private medical firm. Nearby, a young man, unable to enter the room, stood atop a plastic bench, filming with his phone, exclaiming, "Look, folks. The doctor claims that 2 different types of dental prosthetics in the mouth create a galvanic cell. How impressive is that? This is the level of medical care in our coastal city, Top-notch, absolutely top-notch. Let us all shout, 666, and celebrate. Zheng Ren found himself exasperated by the absurdity of the situation. The individual broadcasting the live stream appeared perfectly healthy. What was he doing in the emergency department at such a late hour? To record a live stream? Zheng Ren proceeded to contact the on-call oral surgeon while awaiting the arrival of a patient with appendicitis. Fortunately, his concerns were unfounded, as a high school-aged patient soon appeared before him. The diagnosis was clear, and the patient was admitted. Zheng Ren, accompanied by the patient's family, made their way to the general surgery department. He called Xie Ran to inform her of the surgery. Zheng Ren considered picking her up, worrying about the late hour and safety, but she promptly declined, assuring him she would arrive shortly. Indeed, she did arrive swiftly, just as Zheng Ren completed the pre-operative paperwork. Xie Ran entered the doctor's office within 10 minutes. How did you arrive so quickly? Zheng Ren inquired as he organized the case files and submitted the surgical request. Since I could be called for surgery at any moment, I didn't return to my regular residence, but stayed in the house closest to the hospital, Xie Ran explained. Zheng Ren failed to notice that she referred to it as a house rather than a home. Don't rush. You must have hurried over, he remarked. Not at all. It's a standalone house with a garage. I drove from the garage to the hospital's underground parking, and at this hour, there is no traffic. Isn't that quick? Zheng Ren's imagination was limited by his financial circumstances. He had not considered the implications of Xie Ran's words. Wasn't a house and a home synonymous? After all, this was the city center. A standalone house. Was that not akin to a villa? Earlier, Xie Ran had mentioned her family owned 7 buildings in the CBD, a concept Zheng Ren could scarcely grasp. They existed in entirely different worlds. Nevertheless, her cooperation during surgery was commendable, and that sufficed. The patient has fasted long enough. Let us change into surgical attire and proceed. Zheng Ren redirected the conversation back to familiar territory. Xie Ran nodded her fluffy-haired head obediently. Mr. Zheng, your surgical technique this afternoon was truly impressive. It was nothing extraordinary, Zheng Ren replied modestly. I saw you making the incision in the right upper abdomen. It was stunning. Xie Ran smiled, her eyes sparkling. If the preoperative diagnosis is unclear, I never operate without certainty, Zheng Ren stated firmly. Regardless, it was impressive. What is the condition of the upcoming patient? Ordinary acute appendicitis. It will be resolved in 5 minutes, Zheng Ren declared with conviction. Great. I'm feeling hungry. How about you treat me to some crawfish after the surgery? Xie Ran suggested. Crucially, the afternoon's case had affirmed to Zheng Ran that his surgical acumen had indeed been elevated. Now, he faced a straightforward case of acute appendicitis. Nothing more. His focus was on executing the procedure flawlessly, meticulously planning the surgical approach in his mind. With a mere gesture, a clamp bearing an iodine-soaked gauze pad was placed in his hand. After disinfection, the clamp and gauze were returned, replaced by a dry swab. Subsequently, a scalpel handle was deftly placed into Zheng Ren's palm with just the right amount of force. Collaborating with an experienced surgical nurse, especially one as aesthetically pleasing as this young woman, was truly gratifying. Young, affluent, beautiful, and endearingly naive. Zheng Ren, feeling invigorated, made an incision with precision, exactly 3 centimeters, as if measured with a ruler. Simultaneously, a live broadcast of Zheng Ren's surgery was underway on Xinglin Garden, following the triumphant broadcast of the ectopic appendectomy in the afternoon. The anonymous account had garnered significant attention. As soon as the broadcast commenced, hundreds of viewers flooded in. Is the master still performing emergency surgery so late? Perhaps our guess was incorrect, and he's merely a novice in general surgery? Anyone who refers to him as a novice clearly lacks both experience and intelligence. The afternoon's surgery, from the preoperative diagnosis to the intraoperative maneuvers, was of the highest caliber. He embodies medical integrity, dedicated to healing and saving lives. Let the likes of you tremble. Wow, a 3 centimeters incision. A slightly enlarged appendix would be impossible to extract. How is this accomplished? A barrage of comments cascaded across the screen, transforming into countless shimmering specks that vanished into the system space. For appendicitis, Zheng Ren harbored no desire to perform laparoscopic, even with single-port techniques. In the case of this uncomplicated appendicitis, a single-port laparoscopic approach was indeed feasible. However, even a single port required a 2 to 3 centimeters incision, no smaller than Zheng Ren's. Furthermore, the higher cost of laparoscopic surgery precluded achieving a perfect outcome, leading Zheng Ren to dismiss it outright. The patient was not yet an adult, with minimal abdominal adipose tissue, allowing Zheng Ren to confidently make a mere 3 centimeters incision. In a more obese patient, a 3 centimeters incision would reveal nothing. Incision, blunt dissection of subcutaneous tissue, muscle, and peritoneum. A medium curve was placed in Zheng Ren's hand. Upon entering the abdominal cavity, the appendix was gently extracted, resembling an obedient earthworm. Incision, suture, the entire process proceeded smoothly. Zheng Ren remained unfazed. After completing the final stitch, he removed his sterile gloves and accepted the sterile dressing from Xie, applying it to the patient. The anesthesiologist was dumbfounded. Had the surgery concluded so swiftly after the induction of anesthesia? Was the duration of the entire procedure dictated by the length of his anesthesia? The anesthesiologist on duty that evening was a seasoned veteran. In the municipal first hospital, he had encountered all manner of physicians and procedures. Yet, Zheng Ren's 2 appendectomies that day had left him astonished. It's already finished? The anesthesiologist was somewhat dazed. Indeed, a straightforward appendicitis, quite rapid, Zheng Ren replied, removing the sterile drapes and preparing to move the patient. Wait, the anesthesiologist stammered, beginning to record the surgical time, for minutes and 32 seconds. He must have miscalculated the time, the anesthesiologist thought, sinking into deep self-reproach. He retrieved his phone and opened the calculator. Sure enough, he had erred. But the time displayed on the phone plunged the anesthesiologist into contemplation, 4 minutes and 23 seconds. I've arrived. Where is the surgery at? On Qinlin Garden. In the live broadcast room, belated viewers arrived, drawn by the buzz. Appendectomies held little appeal in themselves. They sought to observe the subtleties of the procedure. Details such as blunt dissection of adhesions with the thumb and the management of purulent coatings on edematous areas. Although merely a case of acute suppurative appendicitis, professionals could glean much from the minute details. Thus, the live broadcast of this enigmatic account had attracted many followers after a single surgery. Unfortunately, you're too late. The surgery has concluded, and I've waited 2 hours. How long did it take? I received the WeChat notification and logged on immediately. But the surgery is already finished? A little over 4 minutes, I believe. A simple appendicitis is quite rapid. A 3 centimeters incision. You can watch the video replay. Although the surgery had ended, the exchange among the eager physicians continued. A physician willing to broadcast surgery on a professional website was, in their estimation, a master. Certainly not an ordinary individual. Even a moderately skilled master would not dare to do so, knowing that the internet would condemn any misstep for an extended period. They expressed ample respect for the broadcaster, with many physicians on the Qinlin Garden website shouting 666 while expressing their desire to pursue advanced studies at the master's hospital, clamoring to witness the magic firsthand. However, there was no response. The broadcaster seemed solely focused on the surgery, disappearing immediately upon its completion, leaving no trace. Zheng Ren concluded the surgery and escorted the patient back to general surgery I. Upon exiting the operating room, no family members were present to greet them. The child's parents sat on the hard plastic chairs outside the operating room, offering each other anxious reassurances, oblivious to who had emerged. Zhao Jia's family. Zheng Ren, still clad in isolation attire and draped in a white coat, pushed the trolley out from behind. Noticing the absence of family members, he found it peculiar and called out loudly. Zhao Jia's parents both started, convinced they had misheard. Zhao Jia's family, please come and assist. Zheng Ren had met Zhao Jia's parents during the preoperative consent process. Scanning the area, he spotted them sitting on the chairs and raised his voice several decibels. Dr. Zheng, the surgery. Zhao Jia's father's face paled, and his legs began to tremble. Had it been only minutes? 10 minutes at most? How could they be out already? In an instant, a flood of rumors surged forth. Perhaps a diagnostic error had been discovered during the surgery, revealing a tumor requiring further consent. Or perhaps a major blood vessel had been severed, necessitating a change in surgical approach and further explanation and consent. Either scenario implied danger for their child. The surgery is complete, Zheng Ren announced. You pull the trolley from the front, and I'll steer from the back. Zhao Jia's mother, please summon the elevator. Completed? So smoothly and swiftly? Yes, very smoothly. If you wish to see the appendix, a nurse from the operating room will deliver it to you later with the pathology results. Dr. Zheng, thank you so much. Not only the anesthesiologist and the patient's family were disoriented. When Zheng Ren returned the patient to general surgery the nurses had not even finished preparing the postoperative bed. Upon seeing the surgery's completion, the nurse, who was snatching a bite of her now cold dinner, leaped up like a startled rabbit, scurrying to prepare the bed and retrieve the cardiac monitor and other equipment. No rush, Zheng Ren said, not rebuking the nurse. It was already past 10 p.m., and she hadn't even had dinner. Only those in the field understood the hardships of clinical work. After transferring the young patient to the bed and briefing the family on the condition, Zheng Ren wrote the surgical record and returned to the operating room changing area to change clothes. He had unread messages from Xie Yiren on WeChat, indicating that she had already changed clothes and was waiting for him in the underground parking lot. Zheng Ren was truly unaccustomed to late-night meals. In general surgery, it was common to be busy until the wee hours, long after the food delivery drivers had gone to sleep. More importantly, after surgery, it was necessary to monitor the patient, leaving no opportunity to go out. This was the most significant difference between clinical surgical departments and the operating room. Mindful of the fact that the appendicitis surgery progress was only at 20, Zheng Ren called the emergency department, informing them that he was stepping out for a meal and to notify him immediately if any appendicitis cases arose. Having completed everything, Zheng Ren finally arrived at the underground parking lot. A red Volvo XC60 was parked not far from the elevator entrance, with Xie Yiren in the driver's seat. Zheng Ren had wondered what kind of car Xie Yiren would drive, whether it would be a legendary Ferrari or a Porsche. He hadn't expected her to drive an SUV that seemed entirely out of sync with her physique. You've arrived. I've arrived. Xie Yiren put down her phone, fastened her seatbelt, and started the engine. We're going for crawfish. Any objections? Xie Yiren asked. I'm easy, as long as it's quick. The emergency department might call with a surgery at any moment, Zheng Ren replied. How dedicated, Xie Yiren remarked. Xie Yiren praised, while in the operating room. I overheard some of the other sisters gossiping, saying you remained single due to a lack of funds and perhaps not being particularly attractive. Yet, it seems that this is far from the truth. Zheng Ren was taken aback to find himself the subject of such gossip, and the remarks regarding his finances and looks stung deeply. He had to concede that there was a grain of truth in their words, but the bluntness of their assessment was rather painful. With your abilities, where could you possibly struggle to earn a decent income? Running surgical procedures like a professor would surely yield more than the hospital directors here, she continued, unknowingly delivering a blow to Zheng Ren's pride. Xie Yiren, a charming young lady, was blissfully unaware of the impact her words had on Zheng Ren. As they approached a late-night eatery, she called out to place their order with familiarity, one spicy and one original. The busy waitress responded cheerfully, indicating that Xie Yiren was a regular here. Well acquainted with the staff. What flavors do you enjoy? After placing her order, Xie Yiren seemed to remember that she was not alone. Glancing at Zheng Ren with a sheepish expression, Dr. Zheng, what do you like? I'm indifferent, Zheng Ren replied with a chuckle, his gaze drifting to a nearby table. Intrigued, Xie Yiren followed his line of sight, noticing a table of 3 exuberantly enjoying their meal of crayfish. The older woman, presumably their mother, appeared to be in her mid-40s to 50s, while the 2 other women were likely in their early 20s, twins by the looks of them. The family was animated, but the mother would occasionally press her cheek against her shoulder for a moment after finishing each crayfish. Don't worry, we'll get our food soon, Xie Yiren reassured Zheng Ren, assuming he was merely hungry. Xie, could you ask one of those young ladies to come over? I have something to discuss, Zheng Ren requested. Xie Yiren was momentarily taken aback, wondering if he was feeling pressured to address his romantic situation. Perhaps her previous comments had struck a chord? Regardless, it seemed promising. After all, Zheng Ren was nearing 30, and it would be increasingly difficult for him to find a partner if he didn't tea-start soon. With the crayfish yet to arrive, she obliged and approached one of the twins, whispering softly to her. The girl looked surprised, glancing at Zheng Ren, her expression quickly morphing into one of disdain. Moments later, the young woman joined them at the table, pulling out a chair and disdainfully remarking, I've never encountered a scoundrel like you, trying to pick up girls on the street. Zheng Ren was taken aback. He had not anticipated such a misunderstanding. After all, he was merely a diligent worker, focused solely on his medical duties, devoid of any experience in courting women. Dr. Zheng is quite impressive. Do not let his looks fool you. His skills are exceptional, Xie Yiren interjected, attempting to defend him. The young woman scoffed, remaining silent while casting a cold gaze at Zheng Ren, as if awaiting his next move. Your mother is ill, Zheng Ren finally addressed the situation, attempting to shift the tone. Wait, how dare you speak of my mother? She retorted angrily, slamming her hand on the table. The restaurant patrons turned their heads, drawn to the escalating confrontation. Please, hear me out, Zheng Ren urged, gesturing for her to lower her voice. Has your mother been experiencing any jaw pain? What? The girl's curiosity piqued, wondering if this seemingly unattractive man was indeed a doctor. Zheng Ren explained, she may not be experiencing typical symptoms, but eating spicy crayfish could exacerbate her condition. Gradually, the young woman began to entertain the possibility of Zheng Ren's diagnosis. Her mother had recently visited a doctor, and while periodontal disease had been ruled out, it was suggested that her pain might be of a neurological nature. How could you possibly deduce such a diagnosis? She questioned incredulously. At that moment, her mother, having overheard the conversation, wiped her mouth with a napkin and turned to inquire, "What is it?" "Ma'am," Zheng Ren beckoned, reiterating his concerns about her health. "It could be acute myocardial infarction. Given your age, the symptoms may not be severe, but it is crucial to seek medical attention." "But it's so late. Can we even get examined?" The mother hesitated, unsure of the seriousness of her discomfort. "A simple ECG and relevant tests can provide clarity," Zheng Ren replied confidently. "I work in the emergency department at the municipal hospital. Please trust my judgment." The mother, sensing the gravity of his words, felt a flicker of anxiety. Meanwhile, the twins exchanged skeptical glances, their expressions mirroring doubt. "I'm Qianren," one introduced herself. "I'm Qianzi," the other followed suit. "I'm Zheng Ren, an emergency physician at the municipal hospital," he responded succinctly. After a brief introduction, Qianren calmly asked, "We are graduate students in critical care medicine at Huaxi University. May we ask you a few questions?" Zheng Ren felt a headache coming on. He found individuals who, despite lacking clinical experience, held lofty academic credentials particularly vexing. Diagnosing acute myocardial infarction should be Qianren began, but Zheng Ren quickly interjected as fellow students from Huaxi. "I'll clarify my diagnosis." However, the decision to follow through rests with the family. Zheng Ren was not a saint. He merely fulfilled his duty as a physician by sharing his diagnosis, without any obligation to ensure the patient sought treatment. "How can you be so dismissive?" The twins protested in unison. "I only had a few cold dumplings for dinner and performed a surgery, so I'm rather famished," Zheng Ren stated plainly. Unfazed by their complaints, "You are both medical students and should have a preliminary understanding of the situation. Whether or not you choose to act is entirely up to you. I've done my part." "What is your name?" Qianzi inquired. "Zheng Ren," he replied. "At the municipal hospital?" "Yes." "Very well. We shall go to the municipal hospital and verify whether you are indeed a fraud." Sisters must not be taken lightly. The matter of myocardial infarction is no trivial joke. It is better to believe in its existence than to dismiss it. After all, as graduate students in a prestigious medical program, they possess a certain awareness. As the sisters settled the bill with their mother, Zheng Ren glanced at the time. It had already been 46 minutes. "Dr. Zheng, are you treating patients or flirting with girls?" Xie Ran inquired curiously, scrutinizing him for a long moment before speaking. "Of course." "Oh my!" Xie Ran exclaimed dramatically, her expression betraying her inner feelings. "Those sisters are quite the catch. As a man, how could you not be moved?" "Actually, the myocardial infarction patient beside me is far more captivating," Zheng Ren replied. "No wonder you've been single for so long." Xie Ran seized the opportunity to jab. "I've realized something. You're a bit obsessive. Your inability to find a girlfriend isn't due to being poor or unattractive, it's simply because you don't want to. Though, of course, being poor and unattractive are significant factors. Otherwise, there would surely be plenty of girls around you." Zheng Ren felt he should adapt to Xie Ran's conversational style. Otherwise, constant verbal assaults would soon wear him down. Perhaps he should just stop involving her in surgeries. A thought briefly flickered in his mind, but he quickly dismissed it. What a joke. Where could he find someone like Xie Ran, young and exceptionally skilled as a surgical nurse? Youth signifies ample stamina and energy for endless overtime, while high competency greatly increases the likelihood of executing surgeries at a flawless level. How could he possibly give that up? Let us be straightforward. After all, you're merely stating facts. As the small lobsters were served, Xie Ran immediately shifted into silent mode, diving into her feast with fervor. Zheng Ren, distracted, picked at his lobsters, not particularly fond of shellfish due to the hassle of peeling them. If only someone could peel them for him. But he quickly quelled that wishful thought. Suddenly, his phone rang. Checking the caller ID, he saw it was the emergency department. Hastily wiping his hands, he answered, "Director Zheng, we have 2 appendicitis patients en route in an ambulance. They should arrive shortly," the on-duty nurse informed him. Zheng Ren felt a surge of excitement. "Hanging up," he urged. "2 patients. Let us head back immediately." Xie Ran, holding a lobster, eagerly nodded, slurping the succulent juice. Lobsters could be eaten at any time, but an all-night appendicitis case was a rare occurrence. In the surgical teaching room of the General Surgery Department at the City First Hospital, Director Liu and Director Pan occupied opposite sides, each maintaining a tense silence akin to rival tigers guarding their territory. Liu appeared disheveled and weary, his eyes bloodshot and vacant, while Pan lounged comfortably, legs crossed, reading an old tome titled Guanzai Pian with meticulous attention. The door to the teaching room was ajar when a head poked in cautiously. "Director, could you come here for a moment?" Sinming beckoned Liu softly. Liu, sitting on the sofa, appeared restless. Upon hearing Tsin's voice, he paused, feigning nonchalance as he stood, straightened his clothes, and exited, closing the door behind him. Pan glanced up, disdain evident in his gaze. "What a show." "Director, we received a call," Sinming said, pulling Liu aside to share the news excitedly. Liu was not one to sit idly by. Having fought his way through a sea of competitors to attend university and then ousting the previous director at the City First Hospital, he regarded Zheng Ren's challenge as insignificant. Upon learning of Zheng Ren's capabilities, he was astonished that a competent doctor had appeared almost surreptitiously. He immediately began contacting friends at county hospitals to seek out complex appendicitis cases. He was determined to prove that simple appendicitis could reveal no flaws, while complex cases would challenge Zheng Ren's prowess. Sure enough, within 2 hours, the phone rang. "Oh, what is the case?" A 28-week pregnant woman, initially diagnosed with acute appendicitis, exhibiting signs of a threatened miscarriage. Sinming grinned widely. The local hospital was hesitant to proceed, insisting that the baby must be preserved. Liu nodded. Appendicitis during pregnancy is one of the most challenging conditions. In this case, the patient's condition elevated the difficulty exponentially. If it weren't to put Zheng Ren to the test, no physician would dare take on such a hot potato. "Let us wish him luck." Sinming smirked. Liu nodded approvingly. "What about the other case?" A 32-year-old male patient, 168 centimeters tall and weighing 225 pounds, Sinming replied with pride. His description was succinct, yet every surgeon understood the implications. An abdominal fat layer of 10 centimeters posed the greatest obstacle to surgery. In general surgery, this type of appendicitis is colloquially referred to as digging a well. Not only is the surgical difficulty high, but the risk of postoperative complications, such as fat liquefaction at the incision site, makes it a case best avoided unless absolutely necessary. Liu's satisfaction was evident as a smile crept onto his lips. "Excellent." Sinming beamed with delight. Liu's approval made all the effort worthwhile. Ensure the patient is well protected. Be prepared to step in at a moment's notice. Liu instructed. "Also, have Director Su from obstetrics come for a consult. We must ensure the patient's safety in case of any unforeseen complications." The interplay of wit and strategy among doctors remains relatively straightforward, steeped in scholarly tradition, with few willing to overlook the well-being of their patients. Although the burden of a medical malpractice suit can plunge a physician into the depths of despair, such occurrences are rare. Perhaps this is why the medical field has yet to see a true virtuoso rise to the pinnacle of success. Ultimately, a cadre of veterinarians may dictate medical policy, and that is simply the way of fate. Rest assured, I've already made arrangements. Director Su's team is on the way. They should arrive shortly, Sinming reported. Liu felt a sense of relief. Having a capable resident by his side certainly alleviated much of his burden. He patted Sinming on the shoulder and, walking back into the teaching room with confidence, prepared for the evening ahead. Zheng Ren and Xia Yiran hurried back to the hospital. Although their late-night snack had not been satisfying, neither seemed to mind, both subtly excited for the impending night of appendicitis. The late-night eatery was conveniently located near the City First Hospital, and upon arriving at the emergency department, the night shift nurse informed Zheng Ren that the patients were being transferred from an ambulance from out of town, heading directly to the general surgery department. Without a second thought, Zheng Ren and Xia Yiran rushed to the inpatient building. At the entrance, they unexpectedly encountered the elderly woman who had previously complained of tinnitus and dizziness. Her son, upon seeing Zheng Ren, wore a grim expression. As they brushed past each other, he muttered a derogatory remark. "What a useless doctor." Zheng Ren only then recognized the son of the patient he had referred for dental surgery. "Didn't he have the extraction?" Zheng Ren asked. "The oral surgeon said it wasn't necessary," the middle-aged man, once polite, now brimming with frustration, retorted. "Do you even know how to treat patients? Why are you causing a scene in the middle of the night?" Zheng Ren felt helpless, managing a wry smile as he spread his hands. The wailing siren of the approaching ambulance grew louder. Not being an oral surgeon, he could not compel the patient to undergo extraction. Faced with such a situation, he could only suggest, this condition is rather rare. You might consider visiting Peking University Third Hospital, as their oral surgery department is quite strong. With that, he and Xie Ran made their way swiftly to the general surgery department. Sun Meng stood alert in the corridor, ready for action. Upon seeing Zheng Ren and Xie Ran approach, he couldn't resist mocking them. Director Zheng, you seem quite impressive after your trip to the emergency department. Son, save your mockery. Zheng Ren replied, eager to focus on performing 10 flawless appendectomies, which would truly validate his worth. As Zheng Ren appeared in his usual timid demeanor, Sun Meng smirked coldly and approached him, mirroring Director Lu's gesture by patting Zheng Ren on the shoulder. Zheng, I will support your work in the emergency department. If the surgery proves too challenging, just let me know, and I will step in. Thank you, Sun, Zheng Ren replied with a smile, completely oblivious to the ominous aura radiating from Sun Meng. Internally, Sun Meng chuckled, relishing the thought of Zheng Ren's dismay when faced with a case of appendicitis in a 28-week pregnant woman. However, he refrained from voicing his thoughts, instead preparing to witness the remarkable expression on Zheng Ren's face when confronted with the reality of the situation. The sound of the rescue stretcher's wheels grinding against the marble floor echoed through the corridor, causing both Zheng Ren and Sun Meng to stiffen momentarily. A rural doctor, accompanying the 120 emergency vehicle, dashed ahead, announcing, the patient has arrived. Only at that moment did he release a sigh of relief. What is going on? Zheng Ren sensed a hint of unease in the air. The diagnosis of appendicitis during pregnancy, coupled with the signs of a potential miscarriage, weighed heavily on him. The doctor from the township hospital briefed Zheng Ren on the patient's condition. Soon, he witnessed a pregnant woman with a pronounced belly being wheeled into the room. Such a challenging case. Zheng Ren mused, astonished that a condition he rarely encountered would present itself at this critical moment. To operate or not to operate. This was a dilemma that could confound even a department head. Doctor, please save my child. A young man in his 20s exclaimed anxiously as they entered the general surgery ward. Are you a family member of the patient? Zheng Ren inquired. I am her husband. Please, you must save my son, the young man implored, gripping Zheng Ren's arm. Xie Ran, overhearing the conversation, felt a surge of irritation at the man's singular focus on the child, neglecting to mention the condition of the mother. Furrowing her brows, she retreated into the doctor's office. Such scenarios unfolded daily in the hospital. With circumstances unchangeable, she sought solace away from the turmoil. Unfortunately for Zheng Ren, Sun Meng approached him once more, cheerfully stating, Zheng, you have full authority here. Don't hesitate to reach out if you need anything. Ignoring the underlying malice in Sun Meng's words, Zheng Ren wheeled the stretcher into the treatment room. The patient's medical summary and reports populated the upper right corner of his vision, presenting a complex situation. Nevertheless, he conducted a brief examination, not for diagnosis, but to determine the surgical approach. The patient was a 19-year-old woman, 28 weeks pregnant, with a small amount of dark red blood emanating from her lower body. Tenderness was noted in the right mid-abdomen, yet there was no rebound tenderness or muscle rigidity. The appendicitis was not severe, but the patient's overall condition posed significant risks. While establishing an intravenous line, Zheng Ren summoned the obstetrics resident for a consultation. His brow furrowed, recognizing the difficulty of achieving a perfect resolution. Luck would play a crucial role. The obstetrics resident swiftly arrived, fully aware of the urgency. After examining the pregnant woman, Zheng Ren gathered the family in the doctor's office for a preoperative discussion. The imminent threat of miscarriage was evident, necessitating immediate intervention to address the triggering factors. The only way to preserve the child is to remove the appendix promptly, the obstetrics resident stated. Will the surgery affect the baby? A middle-aged man urgently questioned. Zheng Ren felt helpless. To them, the child overshadowed all else. The plight of the mother seemed to be an afterthought, reduced to a mere vessel for childbirth. Generally, there should be no issues, Zheng Ren reassured them. However, upon hearing his explanation, a middle-aged woman slumped against the wall, sliding to the floor in a fit of sobs. Though no tears fell, her cries were heart-wrenching. Zheng Ren, unperturbed by her theatrics, maintained a stern demeanor, insisting that the family designate a decision-maker and vacate the office, allowing those who needed to grieve to do so, while others handled admission procedures. Now was not the time for weakness. Any delay could jeopardize the patient's care. The patient remained the primary focus, in many respects. The family's concerns were secondary. Once the atmosphere calmed, Zheng Ren earnestly addressed the patient's husband and family regarding the surgery. With each point discussed, the husband and in-laws repeatedly inquired about the child's welfare, while the patient's parents lingered in silence, expressions darkened. Faced with the reality that the city's premier hospital possessed the best medical resources, the family had no alternative. The patient's condition necessitated surgery, otherwise, the child would surely be lost. As they prepared to sign the consent form, hesitation gripped the family. No one wished to take responsibility, and their reluctance persisted. Frustrated, Zheng Ren exclaimed, "Do you want to save the child or not?" Under the intensity of his gaze and the gravity of the child's fate, the family reluctantly signed the preoperative consent. By this time, the admission procedures were completed, and Zheng Ren began issuing medical orders, contacting the operating room before changing into surgical attire. In the face of such callous familial bonds, even the operating room nurses, like Xie Yiren, who typically avoided patient relatives, felt the chill. Yet, Zheng Ren had grown desensitized through experience. The possibility of saving the child remained uncertain, but his foremost desire was to ensure the mother's safety. The dilemma of prioritizing the mother or the child was not one to ponder lightly. As for the future, it was beyond Zheng Ren's concern. As he walked toward the operating room, he contemplated the location of the pain and the surgical incision. Due to the pressure from the pregnant uterus, all cases of appendicitis during pregnancy presented as ectopic appendices, rendering the situation significantly more complex than the ectopic appendicitis he had performed earlier that afternoon. Just as he finished changing, the on-call anesthesiologist burst through the door, slamming it against the wall with a resounding crash. "How did you explain the procedure?" "The family refuses anesthesia. You can deal with it," he shouted at Zheng Ren. Zheng Ren was taken aback. "Refusing anesthesia? What is the meaning of this? Are they here for treatment or to cause a scene?" Dressed in scrubs, he quickly donned a white coat, slipping on his shoes and striding toward the operating room entrance. "Doctor, we know that if anesthesia is administered, the child may survive but be left impaired. Please, do not use anesthesia," the husband pleaded, grasping Zheng Ren's sleeve. "Are you out of your mind? I'll give you a taste of what it's like without anesthesia," Zheng Ren retorted angrily. "Who are you shouting at?" Another family member yelled. "Will you proceed with the surgery? If not, the child will not survive." Zheng Ren understood that he could only dominate the situation with sheer force of will. For this group, the unborn child was the most significant bargaining chip. Fail to save the child, and you will pay for it with your life. The patient's father, who had remained silent until now, suddenly shouted from the back of the group. Zheng Ren's heart sank as he observed the man's weathered face, once humble, now twisted with a hint of menace. He felt a jolt of electricity course through him, rendering him momentarily paralyzed. Zheng Ren had encountered many societal figures in the emergency room, yet he knew he must advocate for the patient's interests from a medical standpoint. However, faced with such accusations and threats, he felt an overwhelming sense of powerlessness. If the parents were indifferent, what was his position? "Doctor." At that moment, a trembling hand grasped Zheng Ren's. The palm was clammy with sweat, and he turned to see the 19-year-old pregnant woman, who had been silent until now, enduring her pain on the stretcher. "Doctor, I do not need anesthesia. I can endure it," she declared. Her bangs clung to her forehead, dampened by perspiration. Despite the pain, a healthy glow adorned her cheeks, and her eyes sparkled, making Zheng Ren question the veracity of her claims. Using the system to assess the patient's condition, Zheng Ren repeatedly confirmed that there were no signs of mental disorder. Furrowing his brow, he inquired if severe pain could trigger a physiological response, leading to uterine contractions and exacerbating a miscarriage. "I can endure it, I definitely can." Tears streamed down from the corners of her eyes as she pleaded, "Please, doctor." "Local anesthesia, it must be local anesthesia," he decided. Zheng Ren considered giving the patient's family a stern glare, but deemed it futile. He wished to offer some comfort to the expectant mother, but found himself at a loss for words. With a deep sigh, he shoved aside the patient's family member and wheeled the patient into the operating room. "Zheng, is this the plan?" the anesthetist asked as he saw Zheng pushing the patient inside. "It will be local anesthesia," Zheng replied. "Are you insane? What if something goes wrong with the local anesthesia? Who will take responsibility?" the anesthetist exclaimed. "And if we delay the surgery without anesthesia and a miscarriage occurs, who will take responsibility then?" Zheng countered. This was an absurd argument without resolution. The anesthetist fell silent, recognizing Zheng's resolve and his intention to shoulder all responsibility. A sense of admiration arose within him as he stepped forward to assist in pushing the patient. "How come you don't have any assistants?" the anesthetist casually remarked. "There's no one in the emergency department," Zheng replied. "Oh dear." Ultimately, all words turned into a sigh. Sin Meng had been trailing closely behind, and upon learning that Zheng Ren intended to perform an appendectomy under local anesthesia, he immediately distanced himself from the crowd. Skipping the elevator, he dashed down the stairs. Upon reaching the teaching room, he feigned calmness and called out to Director Liu, unable to wait to distance himself further. He leaned in to whisper excitedly in Director Liu's ear, "Director, Zheng Ren is going for local anesthesia." Director Liu's expression darkened momentarily. But then he recalled that Zheng was now the chief resident in the emergency department, allowing a smirk to creep onto his face. P.S. Courting disaster. As the pregnant woman was lifted onto the operating table and the angle adjusted 15 degrees to the left, the intent was to shift the gravid uterus for easier access to the appendix while minimizing stimulation to the uterus, thus preventing further complications such as exacerbated miscarriage. Preparations proceeded swiftly, with Xie Yiren already in position. Zheng Ren scrubbed in, donned his attire, laid out sterile drapes, and positioned himself as the surgeon. 0.5 lidocaine. Mixed with half a dose of propofol, Zheng stated. Propofol, often referred to as milk, is an anesthetic induction agent typically utilized in general anesthesia and continuous epidural anesthesia. Its efficacy in local anesthesia is less pronounced. The anesthetist hesitated, wanting to argue, but restrained himself upon witnessing Zheng's unwavering focus. The anesthetist pondered. If he dares to perform an appendectomy without anesthesia, what else is he capable of? He replaced the 5 milliliter syringe with a 1 milliliter syringe needle. Standing beneath the shadowless lamp, Zheng's figure appeared imposing. Each word he uttered was imbued with certainty, leaving no room for doubt. The finer the needle, the lesser the pain inflicted upon the patient. Yet it also complicated the administration of the anesthetic. As he commenced the anesthesia, his movements were both skillful and rhythmic, evoking a sense of tranquility in the anesthetist. After each dose was administered, he paused for a few seconds, allowing the lidocaine, now mixed with propofol, to take effect before proceeding. His technique was gentle yet precise, and from the patient's vital signs, there was virtually no indication of the needle's piercing pain. Impressive. No wonder he can attempt an appendectomy under local anesthesia. The anesthetist mused, increasingly captivated by the procedure. In the teaching room, Director Pan and Director Liu exchanged glances. Upon realizing the patient had pregnancy-related appendicitis, Director Pan set aside the aged tuboappendiceal manual. However, when he saw Zheng preparing for local anesthesia, anxiety began to creep in. "Director Pan, your insight is remarkable," Director Liu remarked, feeling assured of victory as he anticipated Zheng's reckless choice. He relaxed, ready to ridicule the overconfident opponent. "I haven't performed a local appendectomy in years." "Director Pan, you must have performed many during your time at county hospitals or in the military. Zheng must have learned from you. I'll take this opportunity to enhance my skills." With that, Director Liu settled into a more comfortable position, smiling as he watched the projection of Zheng Ren commencing the local anesthesia. Director Pan wished to retort, but found his mood too distracted. At midnight, an influx of accounts suddenly logged into the Zinglinuan website, flooding into a live broadcast. "Oh my, what am I witnessing? Pregnancy-related appendicitis. And he's going for local anesthesia. Is this a grand display of reckless audacity? What do you know? Sit down, you're blocking my view. I've never performed a local appendectomy. I genuinely want to learn. I hope the expert takes his time. I need to notify others to watch. Have any of you performed a local appendectomy? I haven't. I'll grab a stool and learn from the expert. Never done it. 1. Never done it. 2. Never done it. 10086. Every account within Zinglinuan represented a physician, necessitating real name verification and a practicing physician's license for authentication. The standard anesthetic method for an appendectomy is continuous epidural anesthesia, a common practice. The night owls present were primarily young doctors around 30, and astonishingly, none had ever performed an appendectomy under local anesthesia, despite their professional backgrounds. Why does his syringe contain cloudy anesthetic? I think I just heard him mention adding propofol. Is there an anesthesiologist here? What is the principle behind this audacious maneuver? I'm an associate chief anesthetist at a tertiary hospital, and I'm utterly bewildered. As the procedure commenced, a wave of confusion washed over the gathering of professional doctors. A local appendectomy was an unfamiliar technique, and it was beyond comprehension that they couldn't even recognize the anesthetic being used. The barrage of comments began to flood in. Why does he pause for a few seconds after each injection? What is the reasoning behind that? Probably to allow the local anesthetic to take effect and to minimize patient discomfort. Generally, 0.5 lidocaine takes about 12 seconds to act. Why is there a 3-second interval between his injections? Could it be due to the propofol? I'm on my knees. Please accept my admiration. Everyone, stop spamming. Focus on the surgery. Ultimately, the call for quiet was drowned out by a deluge of comments, lost amidst the sea of opinions. I recall reading that for appendectomies during pregnancy, the textbook suggests a McBurney incision to the right of the rectus abdominis. Why does Jing's incision seem a bit higher? Am I mistaken? Perhaps it's based on physical examination to ascertain the appendix's position. A 5 cm incision for mid-pregnancy appendicitis. What immense confidence. Though merely an appendectomy. The audience was thoroughly engrossed. As the operation commenced with the incision, the comments gradually dwindled. Zheng Ren made the incision, bluntly separating the subcutaneous tissue and muscle before opening the peritoneum. Each step of the procedure required local anesthetic, making the surgery proceed slowly yet steadily. The anesthetist monitored the surgery, observing the cardiac monitor, then glanced back at the operation. They had reached the peritoneum, and the patient's blood pressure, heart rate, and respiration remained stable. This indicated that Zheng's local anesthesia was particularly effective, and the patient felt no pain during the surgery. What a prodigy, the anesthetist thought. Zheng had reached the pinnacle of performance. Even a specialist in anesthesia would struggle to achieve such perfection. Was it the effect of propofol? Perhaps it should be tested in the next surgery. The anesthetist quickly shook his head, dismissing the impractical notion. He decided the small curve was captured in Zheng Ren's hand. No small curve, he said, returning it. Syringe. Xie Yiren suddenly realized that this was not the typical appendectomy she was accustomed to, but rather a laparoscopic appendectomy under local anesthesia. It was not permissible to directly clamp the ligaments and arteries surrounding the appendix. Local anesthesia was required. Having followed appendectomy procedures to the point of tedium, the sparkles in Xie Yiren's eyes indicated her newfound fascination, as if she had discovered a new toy. Intently observing Zheng Ren's every movement. After deftly administering the anesthetic, Zheng Ren picked up the small curve and began to separate the ligaments. He felt unfortunate to encounter a case of appendicitis during pregnancy at such a critical moment, and it had to be done under local anesthesia. Although he had practiced the procedure in the system space, he generally avoided such delicate operations due to their inherent risks. Fortunately, this case of appendicitis was relatively straightforward. Due to the pregnancy, the uterus had expanded, pushing aside the greater omentum that would typically cover the appendix. Had the appendix perforated, the absence of the omentum would have led to severe complications and made surgical management exceedingly complicated. The patient, whether due to timely diagnosis, her youth, or robust immunity, had an inflamed appendix that had reached its limit but had not perforated. The inflammatory exudate surrounding the appendix was also not severe. Zheng Ren began the appendectomy, ligating the appendicular artery and performing a purse-string suture on the stump, followed by reinforcement with an additional stitch. The surgery was executed flawlessly and concluded beautifully. To everyone's astonishment, both in the teaching room and the audience, there was a profound silence. After a brief pause, the chat in the streaming room began to fill with comments. The rapidity of the appendectomy, particularly given the patient was a pregnant woman, was astonishing. Even those present, who had not performed such procedures, could grasp the challenges involved in appendectomy during pregnancy. Yet, this seemingly complex case was completed in under 10 minutes. More viewers trickled into the live stream, only to witness its conclusion. Late again? Seeking consolation. You missed a billion. Missing this surgical live stream means missing a monumental opportunity in life. Wasn't it an appendectomy during pregnancy? How could it end so quickly? I just brewed a cup of coffee, prepared to watch for 3 hours. Some voiced their complaints, while others made light of the situation. Yet, those who truly understood the significance remained lost in a haze of confusion. After a minute, praises began to surface. The incision was precisely located, local anesthesia was effectively administered, and the operation was executed with remarkable efficiency. Impressive. I think I'll be up all night. I suddenly have an inspiration to write an article on selective incisions. Does anyone have recommended papers? In my view, anesthesia is the most crucial step. I don't know about you, but I've never seen a case where a patient under local anesthesia felt no pain. Though the operation had concluded unexpectedly quickly, the live stream remained active, with viewers treating it like a chatroom from years past, discussing their insights into the procedure. Some doctors expressed their intent to use the surgical footage for educational purposes, while others planned to present this case in their case discussions the following day. In the teaching room of Qin First Hospital, Director Pan sat calmly on the sofa, gazing at the now empty surgical table, smiling contentedly. Meanwhile, Director Lu's astonishment had yet to dissipate. He was utterly bewildered. Since Zheng Ren's assignment to Qin First Hospital, he had been working in the general surgery department. Director Lu was acutely aware of Zheng Ren's capabilities. With only around 100 appendectomies under his belt, it was nothing extraordinary. However, the successful completion of the appendectomy during pregnancy had dealt Director Lu a staggering blow. Could I have performed it so cleanly? He pondered. Absolutely not. Even with continuous epidural anesthesia, he would undoubtedly have chosen the textbook recommended incision above the right rectus muscle at McBurney's point. However, that would have extended the time by merely observing such details. He could ascertain that the patient's origins were undoubtedly problematic. They hailed from the neighboring counties, presenting as exceedingly challenging and intricate cases. It would be a miracle if there were no issues at all. Zheng Ren's fortune was merely coincidental. It had nothing to do with him. Director Lu had already emerged from the depths of despair, revitalized and dismissing Director Old Pan's speculations. In situations like this, as long as one is not caught in the act, denial is inevitable. Humph. Director Old Pan did not engage in further argument. Focusing intently on the images displayed on the screen, his right hand tapping rhythmically on the worn volume of the treatise on the needle. Sin Meng, pale-faced, stood behind Director Lu. He was the chief resident in the general surgery department and had never regarded Zheng Ren as a rival. In his eyes, Zheng Ren was still too young, having yet to perform any surgeries independently and thus unworthy of competition. However, today, the 3 diverse appendectomies performed thus far had unmistakably and silently conveyed that Zheng Ren's skills had surpassed his own by an unfathomable magnitude, potentially even eclipsing the renowned Director Lu of Qin. Didn't the laparoscopic equipment get to him? Director Lu provocatively inquired, his voice unrestrained, deliberately addressing Director Old Pan. The laparoscopic equipment is currently out of commission and sent for repairs. It will take a week to return, Sin Meng replied. The optimal method for performing an appendectomy on an obese patient is via laparoscopy. After conducting an appendectomy during a pregnancy, Director Lu resolutely instructed Sin Meng to store away the laparoscopic equipment, firmly denying Zheng Ren access. Director Old Pan frowned slightly, his fingers tapping on the treatise on the needle quickening. As the live forum erupted into chaos upon discerning the patient's condition, numerous IDs began to express their dismay almost simultaneously. What a fat person! How terrifying. 3 years ago, I performed an appendectomy on a fatty with a 10 centimeters thick layer of fat. Post-operative fat liquefaction required a month of dressing changes, and I still have nightmares about it. I can relate. Relatable 1. Relatable 10086. Fat liquefaction is a perplexing issue, often more troublesome than dealing with appendicitis during pregnancy. If a resident encounters a case of acute appendicitis in a pregnant patient, they can summon the director for surgery without fear of reprimand. However, if they need to call the director merely due to a patient's obesity, they must pray that the director has just won the lottery and is in a particularly good mood, or that the director is their father or godfather. Otherwise, they can expect to be harshly reprimanded. While watching the live broadcast of the appendectomy during pregnancy, viewers continuously expressed their admiration, a difficult yet rarely undertaken surgical procedure. However, appendectomies on obese patients were a common experience, eliciting a shared sense of anxiety, joy, and dread, leading to an explosion of comments that obscured the surgical field. Following the completion of a continuous epidural anesthesia, Zheng Ren commenced the disinfection process, with Xie Yiran quietly standing at the instrument table, awaiting the onset of a new battle. Once disinfected, Zheng Ren extended his hand, receiving the scalpel with confidence. The incision was made, measuring 5 centimeters. Initially, as the operating room quieted down in preparation to appreciate the surgical broadcast, the comments section erupted. Such a small incision. What does the master intend to do? Goodness, that incision is so small that one can hardly see the peritoneum. Where does the master practice? I wish to pursue further training there. All the physicians watching the live stream shared a singular thought. A 5 centimeters incision suffices for a standard appendectomy and could even be termed a small incision. Yet, For an obese patient with a fat layer measuring 10 to 12 centimeters, such a minuscule cut seemed nearly futile. Surely he intends to perform it laparoscopic. Agreed. It must be laparoscopic. Don't be foolish, young man. Do you see any laparoscopic equipment? The master is challenging human limits. Bow down, mortals, and tremble before the master. Zheng Ren did not perform a laparoscopic appendectomy, not because Qin Feng had stored away the equipment, but rather because during his training in the system space, he discovered that laparoscopy could not achieve perfection. Thus, he resolved to execute the operation using a small incision, accomplishing what other physicians deemed impossible. To mitigate fat liquefaction, the primary strategy is to minimize the use of electrocautery for hemostasis, ideally, none at all, while also avoiding contamination. Postoperatively, negative pressure suction should be employed, maintaining drainage for approximately 2 to 3 days. However, the last strategy, proven effective, was not available to Zheng Ren, as utilizing a drainage system with negative pressure would inevitably compromise the surgical perfection he sought. Fortunately, he possessed alternative methods that would likely ensure the successful execution of the procedure. After all, Zheng Ren was a man who had performed thousands of appendectomies without eating, drinking, or sleeping. Having made the incision, Zheng Ren confidently plunged the scalpel in, his movements steady and assured, the blade deeply embedded, swallowed by the thick layer of fat. This action struck the hearts of the observing physicians. Director Old Pan's brows furrowed even tighter, and once more, the comments section erupted. Is this murder? Does he possess such confidence? Regardless of prior measurements, the patient's condition will inevitably change once they are supine. This incision seems reckless. A slight misstep could injure the intestines. I am utterly astonished. I am breathless. If I do not appear tomorrow, please inform my colleagues to collect my remains. Zheng Ren remained oblivious to the discussions surrounding his incision. After withdrawing the scalpel, he requested a piece of iodine-soaked gauze from Ran to cleanse his left middle finger before inserting it. Simultaneously, his right hand wielded a long, curved forceps, probing through the minuscule incision. The surgical field was non-existent. No system, no matter how sophisticated, would dare to broadcast the internal conditions. Should that occur, Zheng Ren would undoubtedly find himself summoned for a stern discussion by the authorities the following day. Observing Zheng Ren's delicate movements with his finger and the forceps, Director Old Pan, Director Liu, and the viewers simultaneously fell into a stunned silence. No one could have anticipated such an occurrence. Before long, Zheng Ren withdrew his finger and the forceps, reaching for sterile gauze to protect the incision from any purulent contamination. It became evident that he was conducting blunt dissection of the fat layer, muscle fascia, all the way to the peritoneum. The sight of 2 pieces of sterile gauze stuffed into the already minuscule incision left the observers speechless. Not only the viewers, but even the surgeons on stage could hardly discern the internal situation. Yet, Zheng Ren's subsequent actions left everyone astounded. He once again disinfected his left middle finger, then inserted it alongside the long forceps. I simply do not know how to comment. If the first live broadcast featured such an appendectomy, I would surely have called the police, suspecting a live murder. Is this the legendary blind operation? Can someone explain this? What is the surgeon doing? This audacious maneuver has dazzled my eyes. Amidst a barrage of astonished comments, Zheng Ren procured another long, curved forceps. The 2 forceps occupied every available space, making it challenging for even a finger to enter. However, the first forceps remained within the abdominal cavity, and the newly acquired second forceps was also left there. The implication was clear to the watching physicians. The surgeon had palpated the appendix without a visible surgical field, relying solely on his extensive clinical experience, and had commenced ligating the ligaments and artery. For the first time, the comment section fell silent, devoid of any messages. Everyone was engulfed in an atmosphere of disbelief, grappling with the incredibility of the situation, fully aware that they were witnessing a prodigious talent. The notion of commenting was utterly absent as all were left in a state of stupor. Even the anesthesiologist beside Zheng Ren stood in shock, mouth agape, staring at Zheng Ren's blind operation in utter astonishment. Only the big-hearted Ran was indifferent to Zheng Ren's actions, relying solely on intuition. She estimated what Zheng Ren would do next and handed him the corresponding instruments. Ran possessed an inexplicable confidence in Zheng Ren. There were no dazzling, magical maneuvers. Every step taken by Zheng Ren was familiar to all the doctors present, and they were acutely aware of what was to come next. Yet disbelief lingered that all of this was indeed real. After all, He was operating blindly. Surely, it was time to sever the appendicular artery. Then, she saw Zheng Ren use an elongated forceps to grasp the smallest blade and insert it. Then it should. If all went well, the surgery should be concluding. As this thought crossed her mind, Zheng Ren began to extract the forceps from the incision. Without visual access to the surgical field, had the appendix truly been severed? Was the appendicular artery securely ligated? Would there be any bleeding? Today, the status of the manuscript was successfully modified, and the potential for signing a new book could now be calculated. It appeared there was a possibility of making an impact on the urban category rankings for new signed books. It wasn't merely the quality of the book. It was the support from the readers, and all one could do was express gratitude, seeking votes and support, many thanks, and a bow. A vibrant, slightly swollen appendix was extracted with the forceps. Success. Wow, what a divine maneuver. Blindly operating on an appendix. My imagination is limited by intelligence and experience. How did he achieve this? In an instant, the surgical live stream exploded with excitement. The previously suppressed emotions erupted like a volcano, the online viewer count reaching a record-breaking 500. It was now 12:25 in the morning. How many doctors were awakened from their warm beds by friends, colleagues, and classmates? The barrage of comments flooded the screen, and as for the subsequent maneuvers, who cared? After all, one could not see what the surgeon was doing, and with the appendix already removed, what other miraculous feats could possibly remain? Unbelievable was the unanimous thought among the doctors watching the surgery at this late hour. This seemed like an unlearnable operation. No one knew what the surgeon had done in that confined space. How could he possess such exquisite tactile sensitivity? Locating the appendix with just a finger and completing the surgery in conjunction with the forceps? In the teaching room, Director Liu and Qin Feng were left utterly speechless. Not just them, even the seasoned Director Pan, who had performed countless surgeries, including those on the battlefield and in living rooms, was rendered dumbfounded. This was blind operation. Everyone could see that. Such a procedure was not only absent from textbooks, but also unexplored in any journal or research. Surgical operations demand steadiness, precision, and decisiveness. The first requirement is stability, which includes visual access to the surgical field. How could one perform surgery without seeing the area being operated on? Yet, Zheng Ren had demonstrated a spectacular blind operation right before their eyes, an operation that was nothing short of extraordinary. Qin Feng wanted to articulate something, but the words caught in his throat. A phrase echoed in his mind. You may remain silent. Anything you say will be used as evidence against you. With Director Pan present, speaking carelessly would lead to repercussions. Only through a professional lens could one critique or belittle the procedure. However, the thought of Zheng Ren's audacious blind appendectomy left Qin Feng feeling desolate. Just how proficient must one be with anatomical structures? If all the anatomy instructors from the affiliated medical university were gathered, even they would hesitate to perform a blind appendectomy. But if he did not do something? Qin Feng suddenly shivered, realizing Director Liu's piercing gaze was upon him. He gritted his teeth, his mind racing as he desperately sought a way to undermine Zheng Ren's surgery. However, not even having seen how the procedure was performed made it futile to criticize. Though he knew he must say something with Director Liu watching. Qin Feng's thoughts short-circuited, and he muttered, with this method, the appendix lacks a soul. Director Liu nearly spat blood. A soul? Does a severed appendix possess a soul? The usually sharp-witted Qin Feng seemed utterly lost. In the live stream, a single comment quickly overshadowed all others. Stop chatting. Watch the surgeon's next move. Initially, the viewers found this comment dismissive. It was merely an appendectomy, not a complex procedure like the tetralogy of Fallet. With the appendix already removed, what further extraordinary actions could transpire? As that comment flooded the chat, discussions diminished, and attention returned to Zheng Ren's actions. The appendix was excised, the abdominal cavity flushed, and the peritoneum sutured. At that moment, Zheng Ren was addressing the 12 centimeters thick adipose tissue. Under normal circumstances, as long as one refrained from using an electrocautery on the small blood vessels within the fatty layer, avoided contamination from pus, operated carefully, and did not leave excessive sutures, the likelihood of liquefaction in the fatty layer would be minimal. Yes, it was about not leaving too many sutures, not about avoiding sutures altogether. However, Zheng Ren had no intention of suturing the fatty layer. He took the bottle of biological gel protein Xie Iran handed him, applied it evenly to the fatty layer, and then commenced suturing the subcutaneous tissue. What kind of operation was this? The previous blind maneuvers were impressive, but now, Applying biological gel protein to the fatty layer left everyone utterly perplexed. Typically used for hemostasis, the efficacy of biological gel protein was only moderate, and its application was relatively narrow. Smaller hospitals often lacked such auxiliary materials. What was he doing? After applying the biological gel protein, the surgeon directly began suturing the subcutaneous tissue. Was this some form of black technology? Behind the screens, hundreds of viewers were astonished. A surgeon of such caliber should not engage in reckless behavior. Did this imply that biological gel protein, a seemingly trivial product, could effectively prevent fat liquefaction? This was a monumental discovery. It is well known that sildenafil citrate was originally developed to treat heart disease, but ultimately became a boon for middle-aged men worldwide, becoming Pfizer's flagship product. Could it be that biological gel protein had other effects? At this revelation, the hundreds of doctors went wild. If biological gel protein could indeed address the issue of fat liquefaction, hands clutching phones trembled uncontrollably. This discovery held epoch-making significance. Tomorrow. No, today. It must be tested. This thought simultaneously emerged in the minds of all the doctors watching the live stream. Finally, the procedure was complete, and Zheng Ren exhaled deeply. There was no need to wait several days. Upon finishing the last stitch, as the surgical completion percentage in the upper right corner reached 100, Zheng Ren knew this patient would certainly not experience fat liquefaction. The more surgeries he performed, the more he appreciated the benefits of systematic training. Anatomy instructors? Completely unnecessary. The system could provide countless realistic experimental subjects. Those fresh, blood-scented experimental subjects were far more endearing than those preserved in formaldehyde. Whether it was blind operations or the notion that biological gel protein could prevent fat liquefaction, such imaginative ideas required experimental subjects to support the procedures. Most crucially, every trial yielded immediate results, success or failure, without the need for waiting. However, conducting experiments in genuine treatments, Zheng Ren feared he would never have the opportunity to put various ideas and brainstorms into practice. Zheng, were you just operating blindly? Xiaoran asked while tidying up the surgical instruments. Yes. How cool. Xiaoran praised without hesitation. The anesthesiologist beside them only then came to his senses, realizing what he had just witnessed. Zheng, incredible. He thumbed up in admiration. Haha, Zheng Ren replied with a hollow laugh. Hastily cleaning up the surgical table and preparing to transport the patient, Zheng Ren intended to take a break. Such late-night surgeries were not uncommon. However, that was merely a thing of the past. The surgical completion rate had reached a level acceptable for a competent attending physician. Zheng Ren now held himself to a no, it was the system that imposed exceedingly high expectations upon him. Every operation must be executed to perfection. Thus, while Zheng Ren appeared to perform surgeries with effortless grace, he expended an immense amount of energy. He desperately needed to lie down and rest to alleviate his mental fatigue. Upon escorting the patient out of the operating room, Zheng Ren glanced up to see the patient's family, along with a striking figure. Huh, what is she doing here? Zheng Ren inquired. Standing at the entrance was one of the captivating sisters he had encountered while eating crayfish. He vaguely remembered their names as Chu Yanran and Chu Yanji. As a seasoned face-blind individual, Zheng Ren found it impossible to discern which of the sisters stood before him. With her long black hair simply tied back into a ponytail, it swayed gently with her every movement, exuding an adorable charm. Her expressive eyes were fixed on Zheng Ren, which made him feel somewhat uneasy. Mr. Zheng, right? The girl approached him with poise, accompanying him as he guided the patient back to the ward. I am Chu Yanji. Ah, hello. The results of my mother's examination are out, and as you predicted, it is an acute anterior wall myocardial infarction, Chu Yanji stated. That's good to hear, Zheng Ren replied, a flicker of happiness momentarily dispelling some of his fatigue. Analyzing the patient's condition at that time, had it not been for timely diagnosis, a myocardial infarction could have occurred at any moment. The most alarming scenario would have been a heart attack during the night while asleep. By the time the family noticed, it would likely have been too late. This atypical symptom posed significant challenges for diagnosis. With a clear diagnosis established, subsequent treatment would not be difficult. The family, gathering together to enjoy crayfish, was quite pleasant. Blood tests can only serve as a reference. It would be best to conduct a 256-slice coronary CT during the day shift to confirm, Zheng Ren advised. Oh, we just completed a 256-slice scan. The left anterior descending artery is 80 blocked, but the right coronary and circumflex arteries are fine, Chu Yanji responded. The left anterior descending, right coronary. and circumflex arteries are the three main blood vessels supplying the heart. If only the left anterior descending artery is blocked, avoiding strenuous activity along with medication would suffice. However, it was quite late for a 256-slice scan, and there likely wouldn't be anyone around. How had she managed to undergo the examination? This was not Zheng Ren's concern, so he did not dwell on it. He nodded and continued walking briskly, completely oblivious to whether Chu Yinji could keep pace with him. In Zheng Ren's eyes, Chu Yinji was merely a family member of a patient. Since he had resolved the medical issue, he felt no further connection to her. His years of being single were not without reason, not knowing how to flirt with a girl. Even when she initiated conversation to express gratitude, a splendid opportunity, Zheng Ren found himself at a loss. Chu Yinji trailed behind him, her long legs keeping up effortlessly. Her ponytail swaying energetically, radiating youthful vitality. The silence was finally broken by Chu Yinji, who said, "Thank you very much, Mr. Zheng." She smiled brightly, tucking a stray hair behind her ear, her beauty captivating. Unfortunately, Zheng Ren remained oblivious, lost in his own world. "You're welcome. It's merely the duty of a physician." Zheng Ren replied, continuing to walk ahead. "My sister and I have discussed it. Our mother needs care, and we plan to return to Haicheng for training," Chu Yinji continued. "I had originally considered completing my doctorate at West China before deciding whether to go abroad or stay, but now I need not deliberate. Starting work sooner seems quite favorable. Returning home to spend time with your parents is indeed the right thing to do," Zheng Ren remarked. Chatting with him felt rather awkward. Shouldn't he, someone of his caliber, engage more warmly in conversation with such a beauty? Chu Yinji felt a twinge of frustration, having been quite clear about her intentions. Yet this oblivious resident physician seemed utterly unaware. The silence stretched on, the awkwardness palpable. The only sound echoing in the quiet corridor was the rolling of the surgical trolley's wheels against the marble floor. Upon reaching the general surgery department, Zheng Ren handed over to the on-call physician, checked on a patient who had undergone surgery for appendicitis during pregnancy. Everything was stable, then declined the family's expressions of gratitude, preparing to return to the emergency department for a brief rest. Heaven knows if there would be any emergency appendicitis cases requiring surgery tonight. Conserving energy was paramount. Why was that girl still following him? What was her name again? Chu Yinji or Chu Yinren? After leaving the general surgery department, Zheng Ren took out his phone, intending to check on Xie and remind her to get some rest, only to find that Chu Yinji was still by his side. "Why haven't you gone back?" he asked. "Mr. Zheng, my sister and I have decided to train at Haicheng First Hospital, and we hope you might offer your guidance," Chu Yinji replied, feeling exasperated that this oblivious resident physician had seemingly forgotten her presence. Forgotten, as if she were invisible. Chu Yinji and her sister despised the sort of street-side pickup lines, but encountering someone like Zheng Ren, who treated her as though she were air, was even more infuriating. Suppressing her rising anger, Chu Yinji directly stated her purpose. By this point, she regretted the decision made with her sister earlier. This resident physician was utterly blind. Without a doubt. "Oh, that is fine. However, how the training office arranges it is beyond my control. The most pressing matter is that I currently work in the emergency department, and the EICU has yet to be established," Zheng Ren explained. Recalling that the sisters were studying critical care, he was quick to absorb medical information, feeling a touch of regret. Chu Yinji could not discern any hint of regret in Zheng Ren's words. "In critical care, one can also become an anesthesiologist," she said with a smile, though her grin felt somewhat forced. "The training aspect is not an issue. We can manage that." It was truly frustrating. When had the sisters ever endured such indignities? Being so blatantly ignored by others? Chu Yinji felt a sense of grievance, her nose tinged with the onset of tears, her tone somewhat sour. Yet, before a man as emotionally oblivious as Zheng Ren, all those elusive sentiments were rendered inconsequential. He simply could not perceive them. "Very well. The emergency department is indeed in need of personnel. Your arrival is most welcome," Zheng Ren said as he continued walking, sending a WeChat message to Xie. After learning she had already settled into the operating room, he put away his phone and strode purposefully toward the emergency department. Chu Yinji halted in her tracks, feeling helpless. She had rarely encountered someone of such professional caliber with such abysmally low emotional intelligence. In school, individuals like that were easily overlooked. But this time, who could blame her for pursuing him? A sense of grievance, helplessness, and disarray washed over her. Zheng Ren promptly forgot Chu Yinji's existence upon returning to the emergency department. Noting that the number of emergency patients was relatively low that night, he sought out an unoccupied bed in the on-call room and lay down fully clothed. Closing his eyes, Zheng Ren entered the system space. Previously, during the training on appendectomy, he had sensed an unstable trend in the space. However, upon returning, it seemed to have weathered the most perilous period and had become refreshing once more. The thatched hut remained unchanged, yet the fox statue in front appeared more lifelike than before. The pond seemed to have expanded slightly. Zheng Ren could not quite tell. He shouted a couple of times, but the system remained unresponsive. As long as the system refrained from appearing and declaring annihilation, Zheng Ren felt a sense of tranquility. Upon checking the skill tree, Zheng Ren was elated to discover that after completing 4 various appendectomies, his general surgery skill points had increased from 1,005 to 1,012. He found no need to delve into which surgery had awarded more points or less, as this was not a video game where one could pick and choose tasks. When emergency patients arrived, he could not possibly refuse treatment based on the points earned. If that were the case, his moral compass would shatter, and he would descend into darkness without the system's intervention. Not only did he gain these points, but other skill trees also saw substantial progress. The skill points in cardiothoracic surgery, neurosurgery, urology, orthopedic surgery, oral surgery, and ENT had all surpassed the 300-point mark, reaching an advanced level. It appears that the intensive training for appendicitis has led to a comprehensive enhancement of basic skills, much to Zheng Ren's satisfaction. While he was joyfully examining his skill tree, an indifferent mechanical voice suddenly interrupted, announcing an alarming alert. Warning, warning, this is not a drill, this is not a drill. What now? Zheng Ren pondered, sensing the impending trouble. Hostile intent towards the subject detected. Please accept the new mission. A few points of white light materialized before him, swiftly transforming into twinkling stars that coalesced into Chinese characters. Emergency mission, hostility from a peer. Mission objective, complete all surgeries. Mission reward, unknown. Mission duration, 1 day. After a day of surgeries, one is likely quite fatigued. However, muster your spirit. Energy potions may be utilized if necessary. Prepare to face the challenge posed by your rival. This is merely a trivial conspiracy. In the teaching room, Director Pan could no longer endure the exhaustion and retired for rest after the last appendectomy concluded. At that moment, only Director Liu and Qin Meng remained, the atmosphere thick and stifling, inducing a sense of suffocating despair. Following Liu's vehement critique of Qin Meng for half an hour regarding the soulless nature of the appendices, he remained agitated, ensconced in the sofa, showing no signs of fatigue. Qin Meng, still dazed from the scolding, felt his thoughts spilling over, staring blankly into the dark night. The silence was palpable and unnerving. Director, I have an idea. Qin Meng eventually spoke up. Speak quickly. Liu's patience was wearing thin. Ever since Professor Sinuichiro was invited for surgeries, a series of unforeseen events had pushed him to the brink of collapse. I acknowledge that Zheng Ren possesses remarkable skills. He executes surgeries for mid-pregnancy appendicitis and appendicitis in obese patients with great proficiency, Qin Meng stated. But a person's stamina is finite. I propose we employ a fatigue strategy to resolve this issue. Fatigue strategy? Yes. Qin Meng's initially vague idea became increasingly lucid as he elaborated. Zheng Ren mentioned performing 10 appendectomies in 3 days. I estimate his stamina can only accommodate that much. Tonight's surgery appeared simple, yet he is utterly drained. And then, I will make a call to confirm. Qin Meng felt he had identified his opponent's weakness. He dialed the general surgery department to inquire about the postoperative conditions of patients. Learning that all 4 were stable without complications, he then asked about Zheng Ren's whereabouts. The nurse on the other end was unaware of Zheng Ren's location. After hanging up, Qin Meng contacted the emergency department and discovered that Zheng Ren had returned to the duty room to rest. A satisfied expression crossed his face as he hung up. Director, Zheng Ren is utterly exhausted, Qin Meng remarked with a hint of pride. State your proposal. Liu, now fatigued and irritable, had lost all patience. We can arrange for other affiliated hospitals to send patients with acute appendicitis, rather than specifically seeking out complex cases. If we cannot overwhelm him with quality, we shall do so with quantity. Liu pondered this. Was there a more challenging case of acute appendicitis? After much contemplation, he could not recall a surgery more complex than mid-pregnancy or ectopic appendicitis. It was merely appendicitis after all. How complex could it really be? Based on the surgeries already performed, Zheng Ren had achieved an exceptional level of proficiency in appendectomies. Thus, Intermittently presenting him with high-difficulty cases seemed futile. Sun Meng made a valid point. Nodding in acknowledgement, Lu began to make calls. With decades of accumulated experience, he reached out to the heads of general surgery at various hospitals across High City, requesting acute appendicitis patients to be sent within 24 hours. Furthermore, he contacted hospitals in the surrounding counties, reaching out to any connections he had. Doctors do not remain at the surgical table indefinitely, as a portion of the operating time is consumed by the anesthesiologists. Therefore, Lu also called the anesthesia department to arrange for 2 on-call anesthesiologists. 3 surgeries would be conducted in succession, ensuring no gaps in anesthesia. Lu believed he had orchestrated everything perfectly, intending to keep Zheng Ren tirelessly performing appendectomies until exhaustion set in. At exactly 2:11 a.m., Zheng Ren's phone rang, awakening him. It was the general surgery department, notifying him of a patient ready for surgery. Although he was aware of the conspiracy from the system notification, he remained unfazed. It was merely a sleepless night. He was confident in his abilities. Additionally, he had received an energy potion during the novice mission, now stored in the system space. With unwavering confidence, Zheng Ren rose from his bed. The night shift doctor in the adjacent bed expressed displeasure at being roused by the ringing phone, turning over to sleep again. Donning his white coat, Zheng Ren proceeded to the general surgery department. The patient was prepared for surgery, and upon inspection, Zheng noted that the system indicated a case of simple appendicitis. That should suffice. He estimated it would take around 10 minutes. This time included preparing sterile drapes and transporting the patient post-surgery. Most of the time would be consumed by the anesthesiologist's continuous epidural anesthesia, a factor beyond Zheng Ren's control. As he reflected on this, Zheng Ren recalled the Chu sisters and wondered about their anesthesia skills. He had long forgotten what they looked like but remembered that Chu Yin had mentioned they were graduate students in critical care medicine with anesthesia training. In China, most ICUs are established by the anesthesia department of the operating room, indicating that critical care and anesthesia are 2 interrelated branches. It was no surprise that the Chu sisters possessed anesthesia licenses, yet they were not an option now. He would have to manage on his own. With those thoughts receding, Zheng Ren focused on the system task. After confirming the patient's details, he conducted preoperative explanations and wheeled the patient into the operating room. Awakening Xie, Zheng Ren began scrubbing in and setting up the sterile drapes. The surgery commenced once more. The anonymous account on Xinglin Garden promptly began to live stream the operation. Doctors who had followed the account were awakened from their slumber by the cacophony of notifications. Why is there an alarm? There was no scheduled notification. Confused and groggy, the doctors felt a surge of irritation upon seeing that Xinglin Garden had new updates. They were puzzled. When had such a reminder feature been added? As they realized it was another live stream from that account, some became alert, retrieving their phones to comfortably watch the operation from their beds. Is this deity planning to perform appendectomies all night? It's just appendicitis. Is this really necessary? I'm looking forward to it. I wonder what novel techniques will be demonstrated. Lying in comfort while others stood, sleeping while others operated. It was undoubtedly a form of bliss. The beleaguered doctors had to perform emergency appendectomies in the middle of the night, while they themselves could luxuriate in bed, warmly watching the live stream. However, this fleeting happiness was short-lived. After preparing the sterile drapes, the glint of the scalpel sliced through skin, and moments later, a fresh appendix was extracted, nothing innovative. The only highlight was the small incision and the surgeon's skilled, steady hands. An acute appendectomy procedure lasted a mere 4 minutes and 12 seconds. Some doctors barely finished reviewing the patient's initial medical records before the comments in the Cine Garden live broadcast room were few. Having watched several previous live surgeries of exceptionally challenging appendectomies, the doctors' appetites had been whetted to a fine edge, rendering this simple appendectomy insufficient to satiate their curiosity. As the patient was lifted from the operating table, many viewers prepared to turn off the live stream, seeking a way to silence the new video notifications in order to steal a quiet moment of rest. Just then, the next patient's case appeared on the live stream prompt. Another appendicitis? Where did he find so many cases? Is this the legendary night of appendicitis? I was ready to sleep, and suddenly, all fatigue vanished. Oh dear, have mercy on me, for I still have 5 surgeries tomorrow. The preparation time for the surgery was brief, and another patient was soon placed on the operating table. Zheng Ren had no time to examine the patient. He only caught a glimpse when the surgical patient was brought in, allowing him to ascertain the general condition. The opponent's counterattack was swift, but Zheng Ren merely smiled, unfazed. For a man who had undergone thousands of appendectomies during the system's rigorous training, this was merely trivial. This patient was diagnosed with a periappendiceal abscess, slightly more complex than the previous case, yet still manageable. The procedure involved opening the abdomen, separating the subcutaneous tissue, the fatty layer, the muscles, and the peritoneum, locating the appendix, isolating the appendicular artery and ligaments, excising the appendix, draining the abscess, flushing the abdominal cavity, and suturing. The operation concluded in 8 minutes and 12 seconds, executed with flawless precision. Those watching the surgery in a semi-somnolent state lay in bed, silently observing the procedure. The periappendiceal abscess was a more intricate case of appendicitis, yet under the surgeon's deft hands, each step was executed with clarity. This demonstrated a level of mastery akin to lifting a feather, honed through decades of practice. Nevertheless, nearly all the doctors watching the live broadcast felt fatigued. There were no enthusiastic exclamations, and communication dwindled. They simply watched in silence. The captivating yet uneventful surgery lulled them into a state of slumber. 1 surgery, 2 surgeries, 3, 5. Patients suffering from acute appendicitis from the entire Haicheng city and surrounding towns converged upon the First People's Hospital of Haicheng, and the Department of General Surgery was already bustling. One doctor after another, along with nurses, were summoned from their homes to fulfill preoperative preparations and postoperative care. Merely being able to perform surgery was insufficient. The journey from patient admission to discharge entailed numerous intricate tasks. Director Liu and Meng's scheming inadvertently aided Zheng Ren in completing his task smoothly, a fact they were unaware of. Ding! At the moment one surgery concluded, a melodious voice echoed in Zheng Ren's ear. The S-rank life and death challenge has been completed. A cold, mechanical female voice followed, announcing that the blade hanging over Zheng Ren's neck had been lifted. System rewards have been granted in advance. Please continue your efforts. There were no additional rewards, but Zheng Ren felt no disappointment. After all, he had already reaped significant benefits during the system's training, and the desire for more was merely a fanciful thought. Moreover, there was a task awaiting him labeled hostility from peers, the reward for which remained unknown. Yet Zheng Ren sensed that his system was generous, and the rewards would undoubtedly be worthwhile. His system seemed to eschew the constraints of progressive upgrades, exhibiting a rather unrestrained nature. This task was certainly something to anticipate. Continue performing surgeries. As many appendicitis cases as there are, let them be done. 10 surgeries. 15 surgeries. Before he knew it, dawn broke, casting a pale light across the horizon. Xie Yiren had grown numb, devoid of any fatigue, yet equally lacking in enthusiasm. She apathetically observed Zheng Ren's surgical movements, mechanically passing him the instruments he required. The Department of General Surgery was utterly overwhelmed. Having completed 15 appendectomies, along with the 4 surgeries performed earlier in the day, that amounted to 19 patients. 19 patients. 19 occupied beds. The hospital's bed capacity was perpetually at full load, and the sudden influx of patients left the medical staff reeling. The head nurse of the General Surgery Department, along with the on-duty head nurse, rushed to assist, while 5 general nurses were temporarily assigned to manage the crisis. They had alleviated the immediate pressure, yet it remained insufficient. Not only were the medical personnel stretched thin, but the beds in the General Surgery Department were nearing a breaking point. With 55 standard beds, the department had long reached full capacity. Overflow beds lined the corridors, extending all the way to the entrance. Each patient required at least 2 attendants, some more. Dozens crowded the hallways, resembling a bustling marketplace. Post-surgery patients were receiving 4 drips on the overflow beds, while their families began to voice their dissatisfaction. New patients continued to arrive at the General Surgery Department of the First People's Hospital of Haicheng, overwhelming the staff and leaving them without hope. The hospital's chief on duty was roused from sleep to address the situation, coordinating bed assignments and tackling the imbalance between patient numbers and the available physicians and nurses. Zheng Ren's frenetic night of appendicitis surgeries set off a domino effect throughout the hospital. Under the coordination of the chief on duty, the Second Department of General Surgery began to accept patients. The head nurse was summoned, along with more doctors and nurses called in to assist. The entire General Surgery Department of the First People's Hospital operated like a finely tuned machine, with Zheng Ren as the driving force, propelling it into rapid motion. One after another, appendectomy patients were brought in, and all the idle monitors in the hospital were concentrated in the 2 general surgery departments. their collective beeping harmonizing into a symphony of busyness. Ultimately, the chief on duty summoned the director of the medical department, making an executive decision that patients with milder conditions could forego monitoring their vital signs. At dawn, at 5:34, the overflow beds in the corridor of the second department of general surgery were also filled to capacity. Meanwhile, more patients continued to stream into the First People's Hospital of Haiqing. One arrives, one is operated on. One is operated on, another arrives. Zheng Ren had lost count of how many surgeries he had performed. A singular thought occupied his mind. He must find an assistant. Not for any other reason, but to help transport patients onto and off the operating table. It was exhausting. Zheng Ren felt as though his back might fracture under the strain. In the teaching room, Director Pan leaned on his hand, oblivious to how many times he had drifted in and out of sleep. Meanwhile, Director Lu's face was ashen, staring blankly at the screen. Was Zheng Ren a machine? Over 20 appendectomies executed flawlessly. At precisely 7:48 a.m., the on-call anesthetist relieved the weary night shift doctor, casting a bewildered gaze upon the towering stack of anesthesia records. What in the world transpired here last night? She mused. And where have all the sterile surgical packs vanished to? Her exclamation was met by the stentorian roar of the head scrub nurse. Sterile surgical packs were finite in number. Municipal Hospital Number 1 typically allocated around 30 for emergency procedures during the night shift. However, Zheng Ren's surgical spree had not only exhausted the emergency supply, but had also encroached upon the packs reserved for elective surgeries scheduled for the day. Head nurse. Dr. Zheng has already performed 37 surgeries since last night, a voice interjected. 38, actually. Another one just went up, another added. The head nurse paused, taken aback. Zheng Ren? Are we speaking of that Zheng Ren? Indeed, the very same. Their cryptic exchange was deliberate. An unspoken decree had been issued within the hospital. Those privy to the knowledge of Zheng Ren's feat in substituting for Professor Mori Wichiro were bound by a code of silence, refraining from any mention of the event. 38 surgeries in a single night? The head nurse questioned, still incredulous. Rumor has it that the general surgery ward still has a dozen patients awaiting their turn. Impossible, she retorted, dismissing the notion as preposterous. I shall investigate. Within the operating theater, the head nurse reigned supreme, her authority surpassing even that of departmental directors. Donning her surgical attire, she entered the room with a disarming smile, addressing Xie, "You must be exhausted, my dear." Xie, her eyes glazed with fatigue from the sleepless night, looked up in a daze. The head nurse, feigning concern, chided Zheng Ren, "Young Zheng, why don't you show some consideration for others?" Zheng Ren, oblivious, nonchalantly tossed the excised appendix into a basin with a clatter. "Once this surgery is complete, Erin, take a break. I'll find someone to assist you," the head nurse declared, her decision brooking no argument. "Very well," Zheng Ren acquiesced. "I'm not sure that's wise." Xie Erin demurred. "Nonsense. Surgeries cannot be completed in a single day. Are we to exhaust our doctors and nurses, leaving no one to care for the sick?" As the head nurse attempted to steer the conversation toward Zheng Ren, she observed him extend his hand, and Xie Erin deftly placed the continuous subcutaneous suture into his grasp. "Already finished?" the head nurse exclaimed, bewildered. "Has it even been 3 minutes since I arrived? How can the surgery be complete?" "Next," Zheng Ren announced, summoning a doctor from the general surgery department to transport the patient. "You should rest," he told Xie Erin. "But the surgeries?" "Rest assured, I'm here." The head nurse assigned a highly skilled scrub nurse, well-versed in assisting the general surgery department, to work with Zheng Ren. She then whisked Xie Erin away to her office. "What would you like to drink?" the head nurse inquired. "Sister, I simply wish to sleep," Xie Erin replied, her energy sapped. "You foolish child. Why do you push yourself so hard?" the head nurse scolded. "Zheng Ren is a brute, devoid of humanity. You are our precious gem. What if you become ill from exhaustion? I had intended for you to avoid the storm in the emergency department, to enjoy a paid vacation of sorts. But that Zheng Ren has seized you and is exploiting you mercilessly. It's all right, Dr. Zheng's surgical skills are exceptional. I have learned much," Xie Erin yawned. "Oh, what types of surgeries have you been performing?" the head nurse inquired, feigning innocence. She doubted the veracity of the claim that Zheng Ren had performed nearly 40 surgeries in one night. "We performed 1 midterm pregnancy acute appendicitis for obese patient appendicitis, 8 perforated appendicitis, 11 acute suppurative appendicitis, and 15 simple acute appendicitis," Xie Erin recounted, her voice barely above a whisper. "Indeed," the head nurse exclaimed. astonished. Could it be that what they say is true? How can this be possible? Is something amiss? Xie Yiren murmured, already drifting into slumber. Arise and rest upon the bed, the head nurse instructed, gently placing Xie Yiren on her cot. She then hastened to take command of the situation, realizing that numerous pressing matters required her immediate attention. The exorbitant consumption of sterile surgical packs posed a significant challenge for the day's elective surgeries. However, the head nurse was determined to resolve another matter. She strode to the nurse's station, picked up the telephone, and dialed a number. Without waiting for a response, she barked into the receiver, "Summon Lu Tianxing to me." "Who is calling?" A voice inquired. "That is none of your concern. Inform Lu Tianxing that if he does not appear before me within 3 minutes, the general surgery department will be relegated to the late-night operating slots for the next week." Such was the indomitable aura of the head nurse. Enraged, she berated a seasoned director of general surgery as if he were a wayward child. Soon, Lu Tianxing, his eyes bloodshot, arrived with Sinming in tow. It was the peak of activity, and waiting for the elevator would have taken at least 10 minutes. Lu Tianxing dared not delay, and he sprinted up the stairs to the operating theater, panting heavily. "Lu Tianxing, you have grown quite bold," the head nurse began, her hands on her hips. "What are you implying, little Li?" Lu Tianxing responded with a forced smile. "Tell me, where did all of these emergency appendicitis cases originate last night?" The head nurse demanded. Having worked in the operating theater for 30 years, she possessed intimate knowledge of the hospital's workings. "It has nothing to do with me," Lu Tianxing attempted to deny. "Lu Tianxing, I care not whether it concerns you or not," the head nurse retorted. "Emergency appendicitis cases, how many patients remain?" Lu Tianxing hesitated, glancing at Sinming. 11. Sinming whispered. "Very well, 11 it is. Should there be any more today, I shall personally disfigure your face," the head nurse warned. Lu Tianxing's facial muscles twitched. Just as he was about to respond, the head nurse, with a sardonic grin, picked up the telephone and dialed a number. "Zhou, it is I," she began. "I require a favor. We experienced an unusually high number of emergency cases yesterday. I was curious if anything was amiss." "Ah, I understand. We should be fine today. Thank you for your support. I shall join you for shopping soon. There is a new duty-free shop in the development zone with the latest Milan Fashion Week attire." "Very well, it is settled. Farewell." Slamming down the telephone, the head nurse seized a patient's medical record from the table and hurled it at Lu Tianxing. "Dare to defy me? I shall teach you a lesson." Director Lu was acutely aware that Nurse Li had caught him red-handed. It was futile to conceal such matters from the observant, and he had no intention of doing so. However, Zheng Ren's flawless surgical execution rendered all his efforts inconsequential. "What nonsense! Get lost!" Nurse Li exclaimed with disdain before turning to leave. A doctor or nurse, perhaps drawn by the spectacle, couldn't help but chuckle at Director Lu's discomposure. As Zheng Ren was performing surgery, a cheerful chime echoed in his mind. Was this a sign that he had completed his task? A cold, emotionless mechanical voice of the system announced, from the hostility of peers, task completed. Remaining time, 16 hours, 23 minutes, 43 seconds. Exceeding task requirements, the host earns 332 experience points. Task rewards, system calculating. Indeed, Zheng Ren felt a surge of joy. Yet, what was this experience point? Wasn't it supposed to be skill points for ascending the technological tree? Why was experience now in the mix? Suppressing his inner elation, he diligently continued with the appendectomy he was performing. This was merely a case of uncomplicated appendicitis, and it wouldn't take long. After 2 minutes and 15 seconds, Zheng Ren completed the subcutaneous suturing, applied the dressing, and, alongside the anesthetist and a general surgery physician, transferred the patient to the operating table. "I'll take a break. You can anesthetize the next patient," Zheng Ren said. The freshly rotated anesthetist, still brimming with energy, nodded in agreement, knowing Zheng Ren must be exhausted after nearly 40 appendectomies. Zheng Ren retreated to a corner of the operating room, removed his deep green sterile surgical gown, and unceremoniously tossed it onto the floor instead of the red contamination bin. Lying down without concern for appearances, such occurrences were commonplace among the surgical staff during night shifts. No one deemed it tragic, as long as there was food to eat. Who could afford to be picky? Closing his eyes, Zheng Ren accessed the system space. After performing nearly 40 surgeries, the system space had reverted to its original form, with the fox statue in front of the thatched cottage appearing even more lifelike. The pond seemed to have expanded, and the air remained refreshingly pristine. Having grown accustomed to the haze-laden atmosphere, Zheng Ren instinctively coughed a couple of times. Task reward calculation complete. The system mall will be accessible to the host. Please spend wisely, the mechanical voice stated. This task reward, 150 skill points, one opportunity to enter the system's surgical training room for 20 days, 16 hours, and 23 minutes. Following this, the mechanical voice vanished, leaving only echoes by the pond. This reward was indeed substantial. Having experienced the system's surgical training once, Zheng Ren understood the magnitude of this opportunity. Each system experimental subject was far more valuable for practicing surgery than any esteemed instructor from a medical school. The training time awarded was also longer than the time spent on the appendectomy, demonstrating the system's generosity, truly worthy of Zheng Ren's trust. Furthermore, Zheng Ren noted that the time awarded for surgical training included both whole days and additional hours, suggesting that the standard reward was 20 days, with the extra time being the remainder after completing the task. However, whether this was a fixed rule or mere coincidence remained to be seen. With the voice gone, Zheng Ren chose not to seek its source and instead examined the skill tree. After a night of performing nearly 40 emergency surgeries, his skills had flourished. His general surgery skill had increased from 1,005 points to 1,067 points, a commendable rise. Yet, the pinnacle of expert-level proficiency at 5,000 points still seemed distant, and the 150 skill points from the task were insufficient for significant advancement. Other skill trees had also seen some growth, albeit less pronounced than general surgery. What was this mall? After assessing his abilities through the skill tree, Zheng Ren began searching for the so-called system mall. With a thought, a light screen unfurled, revealing the mall before him. It was surprisingly straightforward. Aside from surgical tools, the system had no intention of indulging in pretentious formalities. It was a practical and utilitarian system. As he browsed the items in the mall, the first thing that caught his eye was a set of general surgical instruments, priced at 15,000 experience points. So, experience points were the currency for purchasing items in the system mall. Zheng Ren felt a wave of realization wash over him. Why not just use gold ingots? He had nearly misunderstood the entire system. Continuing to explore, he noticed descriptions accompanying the prices. The general surgical instruments boasted various functionalities, such as automatic sterilization and slight reparative capabilities when detaching connective tissue. The array of instruments included many Zheng Ren had never encountered before. While these were undoubtedly valuable, their steep prices rendered them inaccessible to him at the moment. Scrolling down, he discovered that surgical instruments from other specialties were also available. Although they were similar, they encompassed various surgical branches, hinting at deeper needs for advanced techniques once his skills reached a higher level. For instance, Zheng Ren had developed a profound understanding of extended curved forceps, having found the ones in the municipal hospital's operating room to be quite cumbersome, nearly jeopardizing the success of his surgeries on 2 occasions. Nonetheless, he decided to wait until he had the means to purchase them. After all, owning the instruments wouldn't suffice if he couldn't adhere to operating room regulations. The last reward was the one Zheng Ren yearned for the most, the opportunity for 20 days of further training in the system's surgical room. He searched diligently, yet found no proper way to access this reward. It seemed so elusive, lacking any tangible form. System deity, how do I claim my training reward? Zheng Ren scoured the small system space but found no sign of the surgical room, ultimately having to appeal to the system. Unfortunately, the system remained as aloof as ever, indifferent to his inquiries. It appeared he had no choice but to proceed as he was. Zheng Ren pondered whether to allocate the 150 skill points to the general surgery skill tree, fearing that if the system were to issue him another impossible task, he would be at a disadvantage. Retaining some skill points for potential future use might prove advantageous. The system space was quiet. After glancing through the mall's offerings once more, Zheng Ren exited the system space, feeling invigorated. Hey, stop playing dead. Get up and perform surgery. The anesthetist lightly kicked Zheng Ren's leg to rouse him. After a 10-minute break, Zheng Ren realized that the flow of time in the system space matched that of reality. During his previous training, the system had likely needed to expend considerable energy to maintain a state of suspended time. Rising from the floor, Zheng Ren felt a surge of vitality coursing through him. Perhaps resting in the system space facilitated a rapid recovery of his mental acuity. He would have to explore that further. Let's get to work, Zheng Ren declared. Are you sure you can manage? The anesthetist inquired, astonished that Zheng Ren could withstand such a grueling session of nearly 40 surgeries. From an experiential standpoint, he should have been utterly exhausted. If I can't, then who can? A man must never admit weakness, Zheng Ren replied with a grin, sprinkling his words with a hint of playful innuendo, a peculiar yet accepted culture within the surgical room. After scrubbing in, sterilizing, draping the sterile sheet, and donning his surgical gown, another fresh appendectomy commenced. As always, Zheng Ren's scalpel moved with remarkable agility, and within minutes, the appendix was neatly excised and discarded into the specimen basin. On the Xiaoyuan website, a new day dawned, and more viewers flocked to the live stream. After a sleepless night broadcasting 40 appendectomies, this remarkable feat had never been witnessed before on the Xiaoyuan platform. While many surgeons could perform 8 to 10 appendectomies within 24 hours, none had experienced such an extraordinary event as Zheng Ren's. Once, during a break, I found myself seated at a roadside barbecue stall, savoring beer and skewered delicacies, when a brash individual began to boast, proclaiming that on a certain date, he had performed 10 appendectomies in one evening. The mere mention of 10 appendectomies conjured an image of tumultuous battles and spilt blood. Yet, within the confines of the surgical live streaming room, all of this seemed trivial. The count of surgical recordings had surged to 41, and the surgeon continued to escalate this number, creating an atmosphere of dread, feeling a mix of apprehension and excitement. I embarked on my first chapter, engaging with fellow readers. That afternoon, I received a message indicating that beginning on the afternoon of 11/11, my work had garnered a recommendation reminiscent of the once popular Mosquito Leg series. This marked the first recommendation for the surgical live streaming room, albeit a marginal one. Yet it held significant meaning for me. Initially, I had no intention of writing a book, as my professional obligations consumed my time. However, after reading the great Dr. Ling Ran, I found immense joy and enlightenment, realizing that medical literature could be approached in such a manner. Thus, The King of the Operating Room was born, though it ultimately went unsigned, leading me to question my abilities. Was my writing so lacking that I could not even secure a contract? That notion felt unacceptable. In the final chapter of The King of the Operating Room, I vowed to write diligently, promising that even without a contract, I would complete the book with over 100,000 words. Fortunately, an editor reached out, and I successfully signed a contract. The journey since the book's launch has been modest, but for a novice author, it has been a notable achievement. Since the book's release, I have not engaged in standalone projects. Instead, I have witnessed a steady increase in daily collections, even achieving 300 collections before reaching 10,000 views, a considerable feat for a newcomer. I extend my gratitude to all who have supported the surgical live streaming room. This initial attempt at promotion could lead to more significant recommendations next week if successful. Otherwise, it may lead to a swift decline. Therefore, I earnestly seek your continued support. As we navigate this journey, it is imperative to maintain a sense of self-awareness. To garner your backing, I must first show my utmost respect. From November 11th to November 18th, I will update 3 times daily at 6 a.m., 2 p.m., and 10 p.m. For those who prefer not to chase after updates, I kindly ask you to cast a daily recommendation vote. This costs nothing but holds great significance for me. I am uncertain about the metrics the editor values, be it clicks, collections, recommendations, or daily reads. However, I am committed to diligent updates and hope for your unwavering support. The standalone chapters disrupt the reading continuity. Therefore, after this release, I will refrain from posting standalone chapters until the book is officially launched, despite my desire to seek votes. I hereby establish a commitment. For major recommendations, like category promotions and significant endorsements, there will be 4 updates daily. For minor recommendations, 3 updates, and additional updates for supporters of various tiers. Finally, after completing the last emergency appendectomy, I hesitated to call Xiaoyuan, knowing she would likely be asleep. Instead, I contacted Director Pan, noting that I was on my way. Following a brief exchange, I changed and left the operating room, headed for the teaching room in general surgery. Upon arriving, the elevator doors opened to a familiar yet overwhelming scent, a blend of foot odor, disinfectant, stale food, and the unmistakable aroma of a bustling hospital. It struck me that, due to regulations, I had not experienced this olfactory chaos in over 2 years. As I approached the teaching room, I knocked, but the scolding voices within paid me no heed. I opened the door to find the head of the medical department addressing Director Liu and others. Amidst the tension, I recognized the familiar rhythm of my early days in the hospital, unperturbed by the chaotic atmosphere surrounding me. The director of the medical affairs department continued. You are well aware of Nurse Li's temperament. The crux of the matter is that her assertions hold merit. As for your actions, following an urgent consultation among the hospital leadership, we shall put this matter to rest. Henceforth, appendicitis cases will be managed by the emergency department. Ultimately, the director of the medical affairs department rendered a final verdict. I wish to assist, but what about the staffing? Director Pan inquired, a casual demeanor masking the gravity of the situation. The two directors of general surgery had notably fallen from grace in Director Pan's eyes, having suffered a humiliating defeat. Should anyone dare to provoke him, there were 49 video recordings available to counter their claims. With such overwhelming evidence, who could withstand the barrage? Director Pan, there's no need to rush, the director of the medical affairs department expressed, burdened by the increasing medical disputes and the emergence of a new kind of professional malpractice. Hospitals nationwide are facing a shortage of personnel, particularly in the emergency and pediatric departments. Yet, the staffing inadequacies extend beyond these two specialties. Other departments also experience varying degrees of understaffing, with the acute shortages most pronounced in the aforementioned fields. Director Pan, seasoned and irritable, could easily resort to slamming his hand on the table in frustration, and the director of the medical affairs department was reluctant to provoke such a reaction. Respect for the elder was paramount, and one must tread carefully. Just then, the instigator of the recent turmoil entered, and the director of the medical affairs department pretended not to notice. If it had been someone else, regardless of right or wrong, they would have been chastised without mercy. As if the hospital could function normally without any individual. Director, I have concerns, Director Liu stated, rising to make his point. He gestured for Qin Feng to approach the computer and began searching for something. Retain your objections. This is the leadership stance. The director of the medical affairs department asserted firmly, leaving no room for negotiation. Director Liu had anticipated such a response and disregarded the director's words. Turning to Director Pan and recalling, I remember Zheng Ren saying that if it were a simple appendicitis case, he could perform the procedure without any incisions. At that moment, Qin Feng managed to locate the video of Zheng Ren conversing with Xia Yiren during surgery and projected it for all to see. Indeed, if it's uncomplicated appendicitis, I can achieve a no-incision procedure. Zheng Ren's words resonated clearly among the assembly. If he can truly accomplish that, I might as well resign. Director Liu seized upon Zheng Ren's only vulnerability, clinging to it as fiercely as a dog to a bone, unwilling to relent. He even went so far as to declare his resignation, all to salvage a shred of dignity. You can't possibly take the operating room's jest seriously, Director Pan chuckled, expressing his skepticism. I genuinely wonder how you've managed your surgeries over the years. Director Liu, I too believe Zheng Ren is jesting. Could you kindly refrain from causing further disruption? How am I being unreasonable? Director Liu, now visibly agitated, retorted, I concede that his surgical skills are commendable, but they are not superior to mine. Not by much. Even in his final stand, Director Liu could not articulate that his appendectomy skills matched Zheng Ren's. In such a public setting, who among them was unaware of the truth? Those who were oblivious would soon find themselves the subject of ridicule. Yet, he held fast to his words. Mark my words, if he can perform a no-incision appendectomy, I will no longer concern myself with who handles appendicitis cases. I will simply resign. Such a petty mindset, Director Pan scoffed. Director Liu, your emotional response is ill-advised, the director of the medical affairs department implored, seeking to dissuade him from escalating the situation. With Director Pan firmly established in his reasoning, any insistence for immediate staffing resolution might lead to chaos within the hospital's ranks. Director Liu, I do not expect your resignation. I merely ask that you agree to let the general surgery department refrain from any further involvement in acute appendicitis cases. Note that I am referring to general surgery, not the first surgical department. Zheng Ren shot a sidelong glance at Director Liu, standing his ground. This is madness. Everyone has lost their minds, he thought. A no-incision appendicitis? Who has ever heard of such a thing? Is Zheng Ren confused about the nature of surgery? The director of the medical affairs department regarded Zheng Ren with a piercing gaze. Whether appendicitis procedures fell under the purview of general surgery or the emergency department was inconsequential to him, as both cases pertained to patients of the same hospital. What astonished him was Zheng Ren's audacity to claim he could perform an appendectomy without an incision. Without an incision? How on earth do you plan to extract the appendix? Will you perform magic tricks to retrieve it? Do you think you are a magician? Zheng Ren seemed oblivious to the astonished stares from those present and continued. First, second, I request that in the future, The emergency department be allowed to perform any surgeries without interference from the general surgery specialists. This was a blatant attempt to seize resources from general surgery. Would all surgeries related to acute intestinal obstruction, acute cholecystitis, and the like now belong to the emergency department? Who did he think he was? At that moment, both Director Liu of the first general surgery and Director Sun of the second general surgery, as well as the neutral director of the medical affairs department, felt a surge of anger. How audacious it was to declare oneself capable of performing a no-incision appendectomy while outlining a series of conditions. Young Zheng. Director Pan felt a twinge of embarrassment. He had always aspired to strengthen the emergency department, but who could have anticipated that this newly appointed resident would be so assertive, boldly commanding attention? Even if Zheng Ren proposed to perform a Whipple procedure or organ transplants, Director Pan would support him unconditionally. However, declaring the ability to perform an appendectomy without incisions was utterly nonsensical. Thus, Director Pan found himself in an awkward position, as the well-laid plans he had were now in disarray due to Zheng Ren's reckless assertions. Do not worry. I understand you have been in the operating room for a day and night, and you must be exhausted. Director Pan began to mediate. Why not take a break? I will handle this matter. Rest assured, I will not allow the interests of our emergency department to be compromised. I, Director Pan, will not allow our team to fight on the front lines while I sign treaties of betrayal from the rear. He thumped his chest with conviction. However, those present were seasoned professionals who had navigated the complexities of clinical practice for years. Director Liu, in particular, was shrewd and strategic. He would not relinquish such a prime opportunity for counterattack. Young Zheng is correct, Director Liu interjected, interrupting Director Pan's efforts. Let us proceed as you suggested. If you can indeed perform a no-incision appendectomy, then the general surgery department will cease to handle acute appendicitis cases. All surgeries related to general surgery will be yours to undertake. With that, he turned to Director Sun, casting a menacing glance. You share this sentiment, do you not, Director Sun? Reluctantly, Director Sun nodded, not wanting to take a stand yet recognizing the likelihood of victory in this gamble. It is agreeable. With Director Sun's support, Director Liu's spirits lifted. The weariness and frustration from the previous day dissipated. Young Zheng, I happen to have a patient here. Come take a look and let everyone witness. Director Pan internally lamented, realizing that Director Liu had orchestrated this scenario. He had dug a pit, preparing to ensnare Zheng Ren, who, unaware of the danger, leaped in without hesitation. The notion of treating an ailment without surgery to achieve surgical outcomes was something Director Pan had witnessed decades ago. Back in the early days of reform, practices such as Qigong, traditional Chinese medicine, and acupuncture were all the rage. Ultimately, however, they left behind a trail of disappointment. Director Pan felt a chill run through him. Zheng Ren was both the architect of his potential success and the harbinger of his impending failure. Why did Zheng Ren lack the awareness of the gravity of his claims? Before Zheng Ren could respond, Director Liu gestured for Qin Feng, who, like a well-trained hound, retrieved a USB drive from his white coat pocket, plugged it into the computer, and swiftly opened an app-format medical case file. The patient was a young female model participating in the New Ideas model competition in the city. Qin Feng's voice was subdued and consistent, manifestly having rehearsed the case presentation. Given the city's profound interest in the new Silk Road model competition, Secretary General Qin contacted Director Liu upon the patient's affliction, requesting her treatment at our municipal first hospital. After 3 days of conservative treatment yielding negligible results, Secretary General Chun decreed that, as a prospective frontrunner in this year's competition, all efforts should be exerted to minimize scarring and expedite her recovery, aiming for her participation in the finals in 3 days. Concurrently, the patient's laboratory reports and a concise medical history were projected. Uncomplicated acute appendicitis, Director Liu affirmed. This diagnosis should be irrefutable. All requisites align with Xiao Zheng's proposition. Uncomplicated appendicitis amenable to a scarless approach. Due to the city's injunction, I have been racking my brains for a solution. Director Liu's demeanor grew increasingly composed, shedding his previous despondency and focusing the crux of the matter on Zheng Ren's casual jest. Considering Xiao Zheng's technical prowess, I had initially intended for him to be the primary surgeon. Given the patient's condition, conservative treatment appears to be of limited efficacy, with indications of appendiceal perforation. A smile began to dawn on Director Liu's face. If Xiao Zheng possesses a method to avert scarring, it would be more in line with Secretary General Qin's directive. The demonstration room fell silent. The new Silk Road model competition serves as the city's signature event, receiving substantial support from the municipal government. As the female patient is a promising contender, required to perform in swimwear, prominent scarring would be exceedingly undesirable. Hence, Secretary General Qin issued the decree. Exemplary execution might only elicit perfunctory praise, whereas failure would undoubtedly incur Secretary General Qin's wrath. This transcends a mere contest of wills. Director Liu is placing Zheng Run in an untenable position, leaving him in a predicament. Director Liu, this is hardly appropriate, the director of the Medical Affairs Department interjected, his countenance hardening. I cannot endorse your proposition. This director had previously interacted with the patient, aware of Secretary General Qin's expectations and the girl's reputed familial connections. Such cases demand a cautious approach, prioritizing the avoidance of missteps over the pursuit of accolades. Yet, the troublesome Director Liu was exploiting such a critical patient for a petty dispute, a matter that would require addressing later, lest the old man become insufferably arrogant. He claims a scarless procedure is feasible. What do you say, Xiaozheng? Director Liu inquired, smiling ingratiatingly. He harbored no expectations that Zheng Run would be naive enough to accept this peculiar appendicitis case. Zheng Ren's declaration was merely a jest, seized upon, amplified, and countered to wrest victory from defeat. This tactic is known as muddying the waters. Should Zheng Ren retreat, the subsequent course of action would be simplified. Director Liu fixed his gaze upon Zheng Ren, attempting to exert further pressure. The patient's condition requires clarification. I can tentatively agree to a scarless appendectomy. However, a definitive decision necessitates a patient examination, Zheng Ren declared in a clear voice. The entire demonstration room was dumbfounded. Is he courting death? Does he lack self-awareness? Sudden mission. A scholar dies for his patron Xiaozheng. Director Pan nearly bellowed, attempting to dissuade Zheng Ren from this reckless course of action, which could have dire consequences. This is excessively audacious and imprudent. Even Director Liu was taken aback, scrutinizing Zheng Ren, uncertain of his intentions. Zheng Ren was not foolish, that much was certain. Over a day and night, he had performed 49 appendectomies with such flawless precision that even Director Liu, hailed as the city's premier surgeon, could find no fault. Could a simpleton achieve such a feat? Yet, Zheng Ren's confident demeanor momentarily undermined Director Liu's conviction. Upon further reflection, such a scenario seemed improbable. A scarless appendectomy was unheard of. In a daze, Zheng Ren approached the projection screen, addressing the assembled audience with eloquence. Endoscopic submucosal dissection, ESD. I presume you are all acquainted with? ESD is a recently emerging endoscopic technique, involving the endoscopic resection of lesions confined to the mucosa. The Municipal First Hospital's endoscopy suite is preparing to implement this technique, but it is still in the planning stages. The director of the Medical Affairs Department had heard of this novel technique, while veteran directors like Liu and Pan were less familiar with such innovations. In essence, ESD involves utilizing an endoscope, employing specialized techniques to dissect the diseased mucosa, thereby achieving therapeutic outcomes, Zheng Ren elucidated. In 2010, the endoscopy department of the second affiliated hospital of Harbin Medical University pioneered transanal endoscopic appendectomy. Although not yet widely adopted nationwide, sporadic case reports are not uncommon. Hence, this technique is not an isolated incident, with records of over 100 successful procedures. The director of the Medical Affairs Department was intrigued, listening attentively to Zheng Ren's explanation. In my estimation, this patient possesses unique requirements, and her medical summary suggests her suitability for transanal endoscopic appendectomy, Zheng Ren stated with unwavering conviction, causing Director Pan to shake his head in disapproval, unwilling to take such risks. May I examine the patient first? Without a patient examination, I cannot ascertain the feasibility of the procedure. The hospital can determine whether or not I will perform the surgery. The director of the Medical Affairs Department pondered, then nodded. The patient is in Special Needs Ward 32. Director Pan, please accompany Zheng Ren for an examination. I will seek Secretary General Qin's counsel. As Zheng Ren and Director Pan departed the demonstration room, Director Pan lamented, Xiaozheng, you are being overly impulsive. Could fatigue be affecting your judgment? Not at all, Zheng Ren replied, forcing an optimistic demeanor. However, after a night of surgery, his hair was disheveled from the surgical cap, giving him a wan appearance. It is my fault, Director Pan confessed, refraining from further reprimands and engaging in self-reproach. I underestimated Liu Tianxing's unscrupulousness. Rest assured, I, Lao Pan, will settle this score within a month. Let us concede this time, shall we? Director Pan, there is no need, Zheng Ren replied. My technical proficiency in transanal endoscopic appendectomy is considerable, and I am confident in my ability to perform the procedure, which is no more perilous than open surgery, Zheng Ren continued with unblushing bravado, showing no trace of shame when boasting of his expertise. You jest. Our municipal first hospital has not even implemented this procedure. Where did you acquire such skills? Director Pan questioned incredulously. Surgery relies on innate talent. Consider my performance of the pancreatoduodenectomy. Even though I had never performed it before, I managed to complete it successfully after Professor Sinyu left, Zheng Ren retorted. This example was irrefutable, prompting Director Pan to fall silent and cease his objections. However, he did not explicitly endorse Zheng Ren's proposal, remaining silent and lost in thought. The two proceeded in silence to the special needs ward in the rear courtyard. Arriving at room 2 on the 3rd floor, Zheng Ren knocked and entered, finding a young woman reclining on the bed. She was at least 6 feet tall, her feet extending beyond the edge of the standard 180 centimeters bed. Such height, Zheng Ren mused inwardly. Glancing at the patient information in the upper right corner of his field of vision, acute uncomplicated appendicitis, unresponsive to 3 days of conservative treatment, verging on perforation. The system also provided precise temporal data, perforation imminent in 3 hours. The assistant beside the patient rose to greet Zheng Ren and Director Pan. Despite her illness, the model was courteous, exchanging greetings with the two doctors. Her brow was furrowed, her expression reminiscent of Shizi holding her heart, conveying both beauty and refined upbringing. To avoid appearing conspicuous, Zheng Ren examined the patient before departing with Director Pan. What is your assessment? Director Pan inquired. Perforation will occur in 3 hours. If surgery is indicated, it must be performed immediately, Zheng Ren replied with certainty. Director Pan considered this manner of speaking to be somewhat alarmist. To be able to predict an impending perforation signifies mastery of the highest order. Yet, the fact that Zheng Ren could even estimate the timing seemed absurd. Nevertheless, Director Pan did not refute this. No matter how one might argue against it, Zheng Ren would undoubtedly counter with the example of Professor Sinyu, who had fled from the pancreaticoduodenectomy, asserting that he had not undertaken the procedure alone. This example was irrefutable. Are you confident? Director Pan inquired. Yes, Zheng Ren replied. How confident? 10 out of 10. At this, Director Pan halted, gazing intently at Zheng Ren, his eyes gleaming with the fervor reminiscent of soldiers drinking before heading into battle. Zheng Ren felt a sense of unease under the scrutiny of the elder, who had once fought in the Southern Front, where casualties were overwhelming, and had even taken up arms to eliminate the enemy. The innate ferocity emanating from him was something Zheng Ren could not withstand. I believe in you. Prepare for the surgery, Director Pan declared gravely, pulling out his phone to make calls. The weight of those 3 words, I believe in you, ignited a fire within Zheng Ren. Suddenly, a mechanical voice echoed in his ear, and a translucent screen appeared before his eyes, revealing a new task, emergency task, a soldier dies for his beloved. Task details. Do not betray Director Pan's expectations and complete the laparoscopic transrectal appendectomy. Task reward. 30 skill points, 300 experience points. Task duration. 5 hours. Zheng Ren was momentarily stunned. He had long seen through Director Lu's little tricks, but he realized that the likelihood of being entrusted with this surgery was now substantial. Director Pan's trust had triggered the system's task, leaving Zheng Ren no choice but to proceed. The task's title, A Soldier Dies for His Beloved, alone was compelling enough to drive him forward. To forego this surgery would mean betraying the passion that had just surged within him. Soon, Director Pan returned. Xiaozheng. I called the city and secured a commitment for the surgery. We are allowed to proceed, but we must succeed. Director Pan, rest assured, we will succeed, Zheng Ren affirmed, fists clenched. During his training in the system, Zheng Ren had practiced various innovative techniques, including laparoscopic appendectomy. While he had not performed one in the real world, he had completed at least 100 of them in the system space. In the national context, Zheng Ren could be considered the most experienced in laparoscopic appendectomy. After making several calls, Director Pan, with a serious expression, instructed Zheng Ren to find Director Shi in the laparoscopic room and ascertain any equipment shortages. If there is anything that can be borrowed, do so. If not, we will manage. If you can proceed with the surgery, call me immediately. I will be waiting at the entrance. The military's efficiency was evident in Director Pan's approach, emphasizing urgency and precision. Zheng Ren nodded in understanding. Knowing that any further dialogue would be superfluous, his sole focus was to execute the surgery successfully. Hastening toward the third inpatient department, Zheng Ren quickened his pace, ultimately breaking into a light jog as he reached the laparoscopic room. Director Shi was cooperative, suppressing his surprise as he inquired about the necessary instruments. The laparoscopic room had been preparing for an upcoming ESD procedure led by a professor from the capital, so most of the preliminary arrangements were in place. Essential equipment such as the hook knife, endoscopic injector, endoscopic dissector, and electrosurgical knife were available, but they lacked the crucial endoscopic closure device needed for appendectomy. Director Shi had only intended to perform a mucosal dissection, thus rendering the closure device unnecessary. Zheng Ren, gritting his teeth, feigned a need to use the restroom and discreetly entered the system space. Opening the system marketplace, he began searching for ESD-related equipment. Upon seeing the price tag of 16,000 experience points for the complete ESD set, his heart sank. It was far too expensive. In a moment of desperation, he attempted to purchase the closure device separately. To his surprise, the transaction was successful. Viewing the closure device's cost of 200 experience points, Zheng Ren felt conflicted. He was pleased to have completed the equipment set, ensuring the surgery could proceed, yet disheartened by the financial burden it imposed upon him. Parting with nearly all his savings for a single surgical instrument was a daunting prospect. However, in light of Director Pan's trust, he resolved to proceed with the purchase. Gritting his teeth against a pang of anxiety, Zheng Ren confirmed the transaction. Watching as his experience points dwindled from 332 to 132, leaving him nearly destitute. The closure device materialized in his hands, its titanium nickel composition giving off an air of opulence. How do I take this out? Zheng Ren wondered aloud, but the system remained unresponsive as ever. Resolving to exit, he grasped the closure device tightly, akin to a drowning man clutching a lifeline, before leaving the system space. The moment he opened his eyes, he felt the solid weight of the device still present. Returning to Director Shi, Zheng Ren was met with a moment of disbelief. Xiaozheng, do you have classmates working in medical supplies? Are they with Johnson or Phillips? Such specialized instruments, seldom used domestically due to profit constraints, were typically produced by major international firms like Johnson & Johnson. Given Zheng Ren's age, it was improbable that sales representatives would engage with him, a mere junior doctor. Even as a chief resident, he lacked the standing. The introduction of new technology and equipment was typically reserved for senior staff, at the very least, a deputy chief. Zheng Ren's rapid acquisition of the closure device led to logical assumptions about his connections in the industry. Yet they would never suspect the existence of a system that could swiftly alter his circumstances. No, I attended a conference recently and found it appealing. So I purchased one myself, Zheng Ren replied evasively. Director Shi was skeptical. Who would casually buy such an expensive surgical instrument? Moreover, a closure device alone would not suffice for surgery. Did he intend to keep it as a trophy? However, Zheng Ren's reluctance to divulge the truth left Director Shi with no recourse but to envy the sleek, metallic sheen of the closure device, which was undeniably enticing. Director Pan, the instruments are complete. When can we commence the surgery? Zheng Ren called to inform Director Pan. Great, I'm on my way, Director Pan replied, promptly ending the call. A few minutes later, Zheng Ren's phone rang again. Director Pan informed him that preparations were underway, and he was en route to fetch the patient. Director Shi, in the laparoscopic room, received a call from the head of the Medical Affairs Department, emphasizing the high importance of this patient, prompting immediate action in the laparoscopic room. The Medical Affairs Director informed Director Shi that Secretary Qin from the city was en route to the hospital, and the hospital director would personally accompany him to observe the surgery. The atmosphere in the laparoscopic room grew tense as everyone swung into action, preparing for the impending procedure. Director Pan arrived first, standing silently beside Zheng Ren, embodying a steadfast anchor. As the Medical Affairs Director entered alongside the head of the anesthesia department, the atmosphere grew increasingly solemn. The general surgery team arrived, wheeling in a patient whose legs extended far beyond the gurney. She was exceptionally tall. Director Lu's expression darkened as a premonition settled in. It was evident that Zheng Ren would indeed perform the surgery, and with remarkable skill. However, at this juncture, he had no authority to voice dissent. The patient lay upon the operating table, awaiting the necessary signatures from the director and Secretary Qin, rendering any urgency moot. Zheng Ren glanced at the countdown timer in the upper right corner of his vision. 4 hours and 15 minutes remaining. 10 minutes later, Dean Xiao and Secretary General Chun arrived at the operating room. In the office, Zheng Rin sat in the corner, almost invisible, despite being the surgeon. On the left side of the long table sat Dean Xiaokiming, the executive vice, Dean Fu Guangshi, Director Pan, and the heads of related departments such as general surgery, endoscopy, and anesthesiology. To the right were Secretary General Chun, the office director, and the patient's agent and assistant. Dean Xiao was the first to speak. This patient had garnered significant attention from the city, and General Liu from general surgery would present the case. His words were few but powerful. The patient was diagnosed with simple appendicitis, and after 3 days of anti-inflammatory treatment, the results were unsatisfactory. There was notable tenderness in the right lower abdomen, and rebound tenderness had appeared this morning. It was suspected that the inflammation of the appendix was worsening, with the possibility of perforation. Director Liu's eyes were red, and his dark circles were particularly pronounced, reflecting his exhaustion. Only a few were aware that this was the result of a night spent in competition with Zheng Rin. Others might assume he was simply dedicated to discussing the case. Liu paused, theatrically expressing regret, stating that the general surgery team had deliberated many times and concluded that conservative treatment was no longer an option. Surgery must be performed urgently. Director Liu, what surgical methods are available? Inquired a bespectacled, refined middle-aged man on the right. The options included traditional open appendectomy and laparoscopic appendectomy. Liu did not mention the method Zheng Rin had proposed. I recommend the open surgery, as the patient's condition is suitable. The subcutaneous fat layer is very thin, allowing the incision to be controlled at 3 to 4 centimeters, enabling the patient to be up and about the next day and fully recover within 5 to 6 days. This, in terms of timing, had already exceeded the requirements set by the New Ideas Competition Committee. However, it was a professional opinion that must be heeded. Most understood the gravity of the situation. Throwing a tantrum would not aid the patient's condition. Nevertheless, missing the finals was regrettable, a sentiment shared by both the patient's agent and Secretary General Chun from the city. We can perform a non-invasive appendectomy, which will not delay the finals in 3 days. Suddenly, Director Pan interrupted Liu's introduction, his voice booming and overwhelming. He commanded attention like a tiger descending a mountain. It was then noted that the Double 11 event had indeed updated its purchasing system. At 2 p.m. this afternoon, it would begin marginal pushing, meaning this book would finally enter the phase of being tested. I kindly ask fellow readers to cast their recommendations in the coming days. Perhaps some, like myself, only start reading after seeing recommendations. I am grateful to everyone for the over 400 collections, with 30 to 50 recommendations each day, a rather astonishing ratio. I bow in gratitude once more. The update time has changed to 3 times a day at 6, 14, and 22 o'clock. Please take note. I humbly ask for your support. Director Pan's presence dominated the room. The agent and Secretary General Chen's eyes lit up. They had heard on the way that this could be done. However, the general surgery director, who had just treated the patient, did not mention this technique. They had intended to inquire further, but were taken aback when this seemingly composed and trustworthy elder directly spoke up. Director Pan, with an air of integrity, a square face, and thick eyebrows, might lose to younger faces in terms of looks, but in terms of providing a sense of security, he surpassed everyone present, including the deans. His demeanor bore the unique gravitas of someone who had seen battle, lending him additional credibility. This elder was. The agent, taken aback, cautiously asked. Teacher Pan had an impressive background. He had seen combat and earned a second-class merit. After retiring, he served as the head of the senior ward at the Military District Hospital. Following retirement, he was rehired at the 1st Municipal Hospital's Emergency Department, currently working to establish it as the Emergency Center for Haicheng City. Secretary General Chun, familiar with Director Pan, interjected, adding that Teacher Pan was quite a remarkable figure. Performing an appendectomy via endoscope had never been done at the 1st Municipal Hospital. Director Liu abruptly stood up, ready to dispute this. He keenly sensed that Zheng Rin could successfully undertake this surgery. Liu had long regretted his obstinacy in clashing with a mere resident chief, resulting in his own embarrassment. He instinctively reacted, fearing that allowing Zheng Rin to perform the surgery would leave him in a more passive position. Just because you haven't done it doesn't mean others haven't. Director Pan could not retreat. Having decided to support Zheng Rin, he would do so wholeheartedly, leaving no room for withdrawal. Trust those you employ, doubt those you do not. This was a principle passed down from the military. I can assure you that Zheng Rin can successfully complete this procedure. Director Pan did not give Lu a chance to argue, standing up and asserting, as an experienced military doctor, I have my own judgment. If the surgery fails, I am prepared to operate myself. He shot a glance at Lu, a cold smile on his face. As for the appendectomy, my subordinate Zheng Ren performs the best at the first municipal hospital. Director Pan declared. He is also the best in the city and the province. Oh, Director Pan holds him in such high regard? The dean, secretary general, and agent all displayed curiosity, having never heard of Zheng Ren before. However, upon hearing Zheng Ren's name, Executive Vice Dean Fu Guangshi's expression changed. Just yesterday, Zheng Ren had completed 49 appendectomies in 16 hours, each with various complexities, executed flawlessly without a single flaw. Director Pan continued, thus, allowing Zheng Ren to perform the surgery is the best solution. Even if the laparoscopic procedure were to fail, there are remedial measures. Director Pan paused, surveying the room, his presence formidable, like a lion. I have spoken. Who agrees and who opposes? Silence enveloped the room. Moments later, Lu spoke. You have no standing. Director Pan interrupted Lu Tianxing directly. You cannot perform appendicitis better than Zheng Ren. Silence. Lu was instantly silenced, feeling the harsh reality of being overshadowed. He had performed over 1,000 appendectomies. How could he be so easily dismissed? Director Pan shot him a dismissive glance. What about the 49 surgical recordings? Don't you remember? The dean and others were unaware of what the 49 recordings referred to, but soon witnessed Lu, known as the best surgeon in Haiqing, shrink back. His face flushed as he sat down, nearly hiding under the table. So it is decided. Dr. Zheng Ren will lead the appendectomy. How does that sound? Dean Xiao waved his hand, finalizing the decision, and turned to the patient's agent for her opinion. Although the agent lacked medical knowledge, she was perceptive. Despite the lead surgeon being seated in the corner and his skill unknown, witnessing Director Pan confront the general surgery director gave her sufficient confidence. The most challenging step was resolved. However, the agent declined the live broadcast of the surgery and requested the arrangement of female assistants. As for Zheng Ren, there was no alternative. The dean, agent, and Director Pan remained in the conference room awaiting the surgery. The anesthesiology director arranged for a highly skilled anesthetist to stay, while Director Shi from the endoscopy department assisted Zheng Ren in preparing everything for the surgery before being ushered out in sterile attire. This was the most particular patient Zheng Ren had ever encountered, but not in an off-putting manner. Only 3 individuals remained in the operating room: a female anesthetist, a female assistant, and Zheng Ren. The assistant, donning a cap and mask, bowed apologetically. Dr. Zheng, I am sorry. Miss Zhou Jinxie aspired to become a star. Hence avoiding any gossip as much as possible. I hope you understand, the assistant explained. It was only then that Zheng Ren learned the model's name was Zhou Jinxie. However, her future celebrity status held no significance for him. Zheng Ren was uninterested in celebrity culture. His focus lay solely on the success or failure of the surgery. With a swift hand wash, disinfection, and preparation of sterile sheets, the surgery officially commenced, until Zheng Ren laid out the surgical sheet and inserted the endoscope. After which he could no longer see Zhou Jinxiu's youthful, vibrant thighs, radiating with collagen, as well as other indescribable areas. The live broadcast in Xinglin Garden simultaneously commenced. The system demonstrated remarkable intelligence, seemingly aware of potential complications and directly circumventing them. The power of the 404 mythical beast was terrifying in its essence. Is the master live streaming again? Does he not require rest? Wait, this position seems incorrect. Is he performing a laparoscopic appendectomy? It doesn't appear so. It looks like he's conducting a colonoscopy. I shall check the medical records. Using a colonoscope for an appendectomy, is the master aiming for the heavens? Within the Xinglin Garden live stream, mere seconds after the broadcast began, numerous onlookers erupted into discussion upon reviewing the case. The vast majority of physicians nationwide were unfamiliar with ESD technology, and even among the few who were, none had witnessed it firsthand. Even those who had seen it in practice had never performed an appendectomy using this technique. The number of individuals across the country who had utilized ESD for appendectomy could be counted on one hand. Doctors holding their phones began notifying friends and colleagues, urging them to log into Xinglin Garden to witness this extraordinary endoscopic retrograde appendectomy. Xinglin Garden itself was a niche platform with a strong professional focus and limited funding. Within a minute of the broadcast commencing, the surgical live stream room reached capacity. As the technical staff of Xinglin Garden had never anticipated that a single stream would attract 1 000 simultaneous viewers. Is the surgeon aiming for the heavens? How on earth is this procedure performed? Can anyone share a surgical record with me? Don't even think about finding a surgical record. I just searched and found nothing. I don't know many people familiar with ESD technology. Allow me to provide some context. In 1994, an RB scholar invented the IT knife, pioneering mucosal dissection techniques, initially targeting esophageal and gastrointestinal mucosa. In 1999, an RB expert utilized ESD for the resection of early gastrointestinal cancers. In 2010, the endoscopy department at Harbin Medical University's second affiliated hospital attempted appendectomy, but thus far, it has not gained significant traction nationwide. How is this perfo Zhou Xiaopei let out a brief snort through his nose? The patient regained consciousness, and he instructed to carry her out. The female anesthetist confirmed once more and then called out to Zheng Ren, "Dr. Zheng, I appreciate your assistance." Suddenly, Zhou Xiaopei's assistant obstructed Zheng Ren's path, bowing deeply and expressing his apologies. Apologies? Zheng Ren pondered whether he was overly fatigued, as he could not comprehend the sentiment of regret amidst the family's words of thanks. However, the assistant's deep bow caused his loose isolation gown to shift, revealing a spacious interior. It seemed a tad too small, Zheng Ren mused. "Please step aside. We have arranged for a nurse to escort Miss Zhou back to her room." The assistant said gently yet firmly. "Oh, I see." Zheng Ren smiled, understanding that the assistant wished to shield him from witnessing her lack of trousers. This was quite reasonable, given that she might become a prominent figure in the future. If such a day were to come, and someone were to disseminate today's events online, it would undoubtedly cause a stir. Zheng Ren nodded and turned to leave the operating room, oblivious to the chaos that had ensued on the Zinglinuan website due to the surgery. The live broadcast had reached its limit of 1,000 viewers. The moment Zheng Ren completed the appendectomy and closed the device, hundreds, even thousands of comments flooded the screen, surpassing the technical threshold, resulting in the broadcast being shut down, with all 1,000 viewers disconnecting simultaneously. This had stirred a hornet's nest. Upon reconnecting, the viewers discovered the surgery had concluded and the broadcast was terminated, leading to an uproar on the forum. Additionally, the CEO of Zinglinuan's phone was inundated with calls. Running a specialized website without substantial backing from influential figures is an arduous task. As the website expanded, the circle of influential acquaintances grew, which was advantageous. However, it was precisely this growth that led to the CEO facing a barrage of criticism today. The senior experts, being seasoned intellectuals, exhibited a range of temperaments from graceful to irascible. Although a barrage of criticism was merely a figurative expression, the mere expression of their dissatisfaction and disappointment was sufficient to send a chill down the CEO's spine. Zinglinuan promptly initiated reforms, dispatching a team of senior technicians for an upgrade. The CEO was perplexed, wondering who had incurred the simultaneous displeasure of so many professors and what circumstances had led to the broadcast's failure. He could not fathom. As the new week commenced, the call for votes and recommendations was earnest. Zheng Ren remained blissfully unaware that his surgery had caused the nation's largest medical professional website to crash. He exited the operating room with a buoyant spirit. Sin Meng, anxious and impatient, awaited in the corridor, knowing that with his rank, he was unqualified to enter the meeting room. He could only pace in the hallway, feeling restless. Upon seeing Zheng Ren emerge, Sin Meng was momentarily taken aback. He had imagined that such a high-level, unfamiliar procedure, which the first municipal hospital had never conducted, would be a strenuous task for Zheng Ren and would not conclude so swiftly. Sin Meng prided himself on understanding Zheng Ren's capabilities, yet in recent days, he found himself unable to discern Zheng Ren's intentions. Surely, something must have gone awry. The mere thought that Zheng Ren might have faltered sent a jolt of anxiety through Sin Meng. However, as he pondered this, his mood lightened, and he approached Zheng Ren with a gentle smile. "Dr. Zheng, do you require any surgical equipment or assistance? I suggested providing you with a doctor for the operating room, but the patient adamantly opposed it." Sin Meng exhibited his goodwill while subtly expressing his hope that Zheng Ren had indeed encountered difficulties. "I just finished," Zheng Ren replied with a smile. "Finished already?" Sin Meng's mind reeled at the revelation, though he had mentally prepared himself. The rapid conclusion of a procedure he had neither witnessed nor heard of shattered his expectations. As Zheng Ren passed by Sin Meng, noticing his dazed expression, he patted his shoulder and remarked, "What else would it be?" With that, Zheng Ren entered the meeting room. Zhou Jinxin's manager, still on the phone, looked at Zheng Ren's entrance with an expression of disbelief. Dr. Zhang, was it successful? She inquired cautiously, fearing unfavorable news. It went smoothly. The removed appendix is in the operating room. You may take a look before sending it for pathology, Zheng Ren replied as he seated himself beside Director Pan. Both the president and vice president were astonished but masked their surprise well. The head of the medical office began mobilizing staff to transport Zhou Jinxin, casting a deep glance at Zheng Ren as he departed. Seizing the moment while everyone attended to the patient, Director Pan whispered, "How did the surgery go?" "Smoothly." "Certainly no issues," Zheng Ren assured him, meeting Director Pan's gaze with clarity. A sly grin spread across Director Pan's face, reminiscent of a cunning fox. As he said, "You should rest. Once this is wrapped up, I'll ensure you receive everything you need." Zheng Ren nodded, expressing his gratitude. "You've worked hard," Director Pan remarked before standing up to leave. "Hard work? What hardship is there in a 9-minute surgery?" At that moment, a notification chimed in Zheng Ren's ear. The system's mechanical voice announced, "Emergency task. A soldier dies for a confidant. Reward, 30 skill points, 300 experience points." The system seemed rather stingy. Having spent 3,200 experience points on equipment, the reward was merely 300 points. Total time, 112:36. You have gained 13,644 experience points. Still grumbling about the system's frugality, Zheng Ren was startled by the new reward. He quickly deduced that this was the remaining seconds calculated from the task requirement minus the time consumed, yielding 1 experience point per second. What an ingenious mechanism. His spirits soared, and he felt a bright future ahead. Suddenly, he recalled that the anastomosis device he had purchased in the system marketplace was still in the operating room. A chill ran down his spine. That device was worth 3,200 experience points. Without hesitation, Zheng Ren dashed out like a rabbit. Although he had accumulated over 10,000 experience points, he knew he could not squander his own belongings. The gurney carrying the patient had already exited the operating room, and Zhou Jinxin had awakened from general anesthesia, everything stable. Her manager was observing the metal basin held by Director Pan, which contained the excised appendix. While unaware of the procedure's details, it did not hinder Director Pan's elaborate explanation of the appendix's edema, the signs of rupture, and the potential repercussions of delaying surgery. Meanwhile, Directors Liu and Sun from the general surgery departments stood to the side with grim expressions, particularly Liu, whose face resembled that of a corpse, pale and devoid of color. The manager, visibly shaken, listened to Director Pan's exposition while muttering her relief that the surgery had been performed. By the time Director Pan concluded, the gurney had long since departed, leaving the endoscopy corridor eerily empty, save for a few individuals. The manager approached Zheng Ren with a beaming smile, slightly bowing, and warmly shook his hand, asking, "Dr. Zheng, when do you anticipate Miss Zhou will fully recover? She'll be able to stand tonight and can take gentle steps in 2 days. The fashion show in 3 days should not be affected, but she must adhere to a liquid diet for the next few days and avoid any vigorous activities." The manager's heart soared at the prospect of the final round not being jeopardized. She presented Zheng Ren with a business card, saying, "Dr. Zheng, you truly possess miraculous skills. Here is my card. Please don't hesitate to call me when you're in Magic City." "You're too kind," Zheng Ren replied, accepting the card but noting the overly bright nail polish and lipstick, which he found unappealing. With the manager's departure, the corridor was left with only Zheng Ren, Director Pan, and the 2 directors from general surgery. Director Pan wore a triumphant smile, exuding the demeanor of a victor, yet lacking the grace typically associated with such a role. Before Director Liu, Director Pan extended a finger, waving it before him. "From now on, in our emergency department, all general surgery-related emergency procedures will be handled solely by my team. You are to refrain from participating." It was an imperious decree, devoid of any room for negotiation. The 2 directors lowered their heads, unwilling to witness the unscrupulous demeanor of Director Pan, reveling in his newfound authority. However, the confrontation was far from over. Director Pan raised a second finger and calmly stated, "Given that the general surgery department does not undertake emergency surgeries, and considering the surplus of medical personnel, I will petition the hospital to reassign some of your staff to bolster the emergency department." This was a direct assault on the very core of the general surgery department's interests. The 2 directors suddenly lifted their heads, with Director Sun pleading, "Director Pan, I bear you no ill will. This matter requires further discussion." Director Liu trembled slightly, locking eyes with Director Pan, acutely aware that retreat would lead to a precipice. "I disagree," he declared resolutely. "You disagree?" Director Pan raised an eyebrow, his hostility palpable. "Do you still have any sense of shame? You still care about your dignity?" The words were blunt, harsh, and unyielding. "You cannot perform surgery, yet you wish to hoard resources. I ask you, do you have any self-respect?" The two directors were left reeling from the verbal onslaught, stunned by the audacity of the reprimand. After years of being unchallenged, they had long since ceased to be threatened by others, even as they gathered patients from neighboring towns. Their proficiency in appendectomies was well established, and they were unafraid of petty tactics. Yet, they were being accused of occupying a position without contributing, tarnishing the reputation of the first municipal hospital. Director Pan's scornful huff echoed through the corridor. Zhang Ren, having emerged from the laparoscopic room with his equipment, was bewildered by the unfolding drama. "Do you think you're a veterinarian?" Director Pan snapped, chastising Director Liu as if he were a wayward child, deriding him for claiming to be the best surgeon in Haiqing, while his character and diagnostic skills fell short. "What gives you the right to call yourself the best? How brazen!" Director Liu felt a surge of blood rush to his head as the figures of Director Pan and Zheng Ren receded, the world around him fading from color to black and white. A sense of disorientation enveloped him, reminiscent of his early days as a junior doctor under the stern gaze of his superiors. The pressure in his chest intensified, and he felt a stabbing pain, as if a knife were twisting within him. As consciousness began to slip away, the last echoes of Director Pan's scorn reverberated in his mind. Brazen. Liu Tianqing's body succumbed, collapsing with a thud. Director's son, jolted back to reality, turned Liu Tianqing over and immediately recognized the signs of an acute myocardial infarction. "We need to save him," he cried out in desperation while initiating resuscitation efforts. Meanwhile, in the hepatobiliary and pancreatic surgery department, upon hearing the cries for help, the two men rushed back to assist Liu. Chaos ensued until Liu was stabilized and transferred to the CCU. Only then did Director Pan depart with Zheng Ren. Liu Tianqing had suffered no lasting harm, merely a reaction to the stress. Zheng Ren observed Director Pan's confrontational prowess with a sense of admiration. Feeling detached from the unfolding turmoil, Director Pan granted Zheng Ren a brief reprieve, encouraging him to rest at home. Zheng Ren, sensing the need to collect his thoughts, gathered his belongings and returned home. Though only a few days had passed, it felt like an eternity. He had navigated the turbulence surrounding Professor Senyu's surgical ordeal, contended with the system's interference, and faced threats to his existence, all while working nearly 30 hours straight in the hospital. Had there been more surgeries, Zheng Ren would have consumed a vial of stamina-enhancing potion, but his body still seemed capable of enduring more. Once home, however, the accumulated fatigue from 30 hours of intense surgical work crashed over him like a tidal wave. His roommate, Xiao Xiao, was engaged in a live-streaming session, showcasing a feast of seafood he had prepared. Zheng Ren carefully evaded the camera's view, gesturing a silent greeting before retreating to his room. He disrobed, lay on the bed, and entered the system space. The usual cold, monotonous voice of the mechanical assistant did not greet him. Instead, he inhaled the refreshing air of the system space, reminiscent of the picturesque descriptions from elementary school texts, invigorating and revitalizing. Having visited the system space several times, Zheng Ren speculated that it might accelerate his recovery, though this remained unverified by any system data. Seated before the skill tree, he began to contemplate his gains, meticulously calculating skill points and experience. His general surgery skill stood at 1067 points, with a total of 150,30180 points stored. He was still far from surpassing the 5,000-point threshold required for expert status. For the time being, he decided against investing skill points, as his current level was sufficient. His experience points totaled 132,136,44300,14076, enough to purchase a complete set of surgical instruments. Yet he opted to reserve them for emergencies. Like a frugal child hoarding provisions for the harsh winter, he prepared for potential challenges ahead. After assessing his inventory, he turned his attention to the task system, which offered a remarkable reward of 83 days of surgical training in the operating room. This was a considerable boon. During his previous stint of just over 15 days, his general surgery skills had elevated from advanced to expert, with his appendectomy techniques attaining perfection. What would this new opportunity yield? Such task rewards were far more tangible than skill points. How does one claim the training reward, O illustrious system? He inquired. gazing at the small fox sculpture nestled before the thatched roof hut. Please select the branch of the skill tree you wish to train, the system responded, illuminating a display of various surgical specialties before him. Having already mastered appendectomy, Zhang Ren was confident in his abilities, believing he ranked among the nation's elite in this procedure. The next logical step was to delve further into the realm of general surgery, yet he also considered the demands of emergency surgical procedures. Director Pan's faith in him, coupled with the system's task to support his endeavors, suggested he would need to elevate the emergency department at the first municipal hospital in the coming years. After narrowing down his options, he eliminated those with minimal emergency applications. Breast surgery, thyroid surgery, and colorectal surgery were all deemed unsuitable. However, hepatobiliary and pancreatic surgery appeared promising, as did gastrointestinal surgery. Zheng Ren found himself torn between the two. Conditions such as acute cholecystitis and liver rupture frequently presented in emergency situations, while acute intestinal obstruction and gastric perforation were also common. Which branch should he pursue? He gazed at the illuminated display, momentarily lost in thought. After a while, an idea struck him. Could he consult the system space for guidance? Yet, the system had proven unpredictable, often ignoring his inquiries or even threatening annihilation. But bound to it. What other choice did he have? Oh, illustrious system. Should I choose hepatobiliary and pancreatic surgery or gastrointestinal surgery? He posed the question with a tentative hope. As his words faded, the screen flickered, and gradually, all other surgical options dimmed, leaving only hepatobiliary and pancreatic surgery glowing enticingly before him. Though the system did not communicate directly, this undeniable cue was sufficient for Zheng Ren to make his choice. Zheng Ren clicked on the option for hepatobiliary and pancreatic surgery, and in an instant, the operating room rose from the ground beside him. The surgical table, the experimental subjects, everything felt so familiar. Yet this time the ailment had shifted from appendicitis to various acute and chronic cholecystitis. Zheng Ren pondered. He had intended to assess his inventory and take a well-deserved rest to recuperate before diving into training. How had he ended up thrust into an intensive training session so unexpectedly? Regret was futile, and after fruitless attempts to negotiate with the system, Zheng Ren found himself compelled to perform a cholecystectomy for acute cholecystitis. Without the looming threat of the system's erasure, he felt more at ease and began to absorb much more. He realized that while performing surgery here, he did not experience fatigue. Rather, he felt increasingly invigorated. The extensive literature he had read over the years regarding hepatobiliary and pancreatic surgery flooded his mind with clarity. In terms of surgical classification, a simple open cholecystectomy is on par with an appendectomy, both categorized as primary surgeries. However, in practice, interns often have the opportunity to perform an appendectomy under close supervision by their instructors as they near the end of their training, whereas no one dares allow interns to undertake a cholecystectomy. Anatomically speaking, cholecystectomy is considerably more complex than appendectomy. Zheng Ren commenced with the open approach, gradually honing his skills and familiarizing himself with the anatomical structures, preparing for the intricacies of laparoscopic cholecystectomy. He lost track of time, only glancing at the countdown after completing each procedure. Within the confines of the system space, Zheng Ren truly felt that time is indeed precious. After 83 days, Zheng Ren felt somewhat disoriented. The complexity of hepatobiliary and pancreatic surgery far surpassed that of appendectomy. This was evident. Appendectomy is merely a primary or secondary surgical procedure within gastrointestinal surgery and cannot be compared to hepatobiliary and pancreatic surgery. As the countdown reached its final second and the operating room vanished before his eyes, he instinctively raised his hand, yearning to grasp the fleeting surgical environment. But alas, he only caught air. In that moment of distraction, a multitude of crystalline white lights surged into the system space, transforming into gentle streams, enlivening the entire environment. Host, please note that the system shop has unlocked the option to purchase surgical learning time. What? This can be purchased too? Zheng Ren hurriedly opened the system shop and began his search. Meanwhile, the surgical live streaming room on the Zinglinuan website was restored. Hundreds of doctors, who had been waiting, surged in, fearing they would be unable to enter once capacity was reached, reminiscent of a newly launched game. Peng Jia, the CEO of Zinglinuan, sat in his spacious, bright office on the 38th floor of a landmark building in Shanghai, staring blankly at the flowing Huangpu River below. Today was peculiar. The Zinglinuan website had adopted a professional route, imposing a high threshold for registration, requiring a practicing physician's license number and refusing tourist browsing. To achieve professionalism, it had to reach its limits, a reflection of Peng Jia's character. With ambition and execution, after 5 arduous years, Zinglinuan had ascended to the top position nationwide, leaving competitors far behind. For at least 5 years, no one could shake Zinglinuan's status. Just as everything seemed to be going smoothly, Peng Jia received a report from the forum department manager early that morning, informing him that a post had caused the server to crash due to overwhelming traffic. Was this really an issue? Peng Jia acknowledged the report without the same level of curiosity he had exhibited years ago when pondering what kind of post could crash the server. His focus was solely on the capital market, with the paramount concern being how to list Zinglinuan. It was merely a server restart, no big deal. However, immediately after the manager concluded the report, Peng Jia received a call from an esteemed professor at Xia Hospital, relayed through his personal secretary, inquiring why the surgical live streaming room had suddenly crashed. There were very few doctors in the country who could afford a personal secretary. This influential figure was one of Peng Jia's benefactors. Thus, he could not afford to be careless. After a series of polite acknowledgments and apologies, he braced himself to investigate what kind of live stream had piqued the interest of such a venerable elder. However, before he could finish the call, another call interrupted him. Glancing at the caller ID, Peng Jia quickly apologized to the elder and assured him that repairs would be expedited with ample manpower and resources. After hanging up with one elder, he answered another call from yet another prominent figure, still inquiring about the surgical live streaming room's predicament. Stunned, Peng Jia found himself curious about what kind of surgical broadcast could attract such attention from these distinguished individuals. Thankfully, there was no third call. Otherwise, he would have suspected something supernatural was afoot. These elders held significant status in the medical community, and it was exceedingly rare to meet them. Generally, one must seek permission from their personal secretaries before making a call. As the CEO of a top domestic website, he had to adopt a humble demeanor, but today, the elders had all decided to call him simultaneously, inquiring about the situation. Their questions were not merely routine. There was an underlying displeasure in their tone, which alarmed Peng Jia. After placing down the phone, he hurriedly sought to understand what had transpired, racing to the technical department to personally participate in the troubleshooting efforts. Along the way, numerous speculations filled his mind, and his phone incessantly chimed with inquiries from doctors of varying ranks who had his contact information. Yet, upon arriving at the technical department and witnessing the surgical live stream's recordings, he realized the extraordinary nature of the situation. A prestigious figure was live streaming surgery on his website. What a tremendous opportunity. Peng Jia immediately set about contacting vendors to purchase new servers, aiming to increase the surgical live streaming room's maximum capacity to 3,000 participants. He had previously regarded the servers as costly, but now he did not even negotiate the price. He simply demanded installation within an hour. With adequate compensation, he believed anything was possible. The supplier, without hesitation, overcame all obstacles, completing the server installation in just 56 minutes. After testing and ensuring operational readiness, Peng Jia issued a strict order, even if faced with insurmountable challenges. All other postings on the website should be disabled to guarantee the surgical live stream's functionality. After 3 hours and 15 minutes of downtime, the surgical live streaming room was restored. Peng Jia felt a sense of pride in his decisive actions, proving once again to be a pioneer in the medical website domain. He elegantly picked up his phone to respond to the two elders, recognizing that it was not about what he had accomplished, but rather about fulfilling the elders' expectations. As the server rebooted and the surgical live streaming room reopened, hundreds of participants rushed in. Peng Jia felt relieved, grateful he had opted for a comprehensive solution rather than a simple fix. After procuring the new servers, he was confident that another crash was impossible. However, just as he began to smile while reporting to the elders, a technician approached him with a grave expression. "Mr. Peng, we need to talk." Peng Jia, irritated, covered the phone and replied, "Not now." The engineer quickly clarified, "The server is experiencing congestion again." Profanity surged within Peng Jia at that moment. He swiftly bid farewell to the elder on the line, then rushed to the main server. "Is it about the live stream again?" he inquired, his voice hoarse. The engineer replied, "The live stream can still hold, but the influx of new registrations is consuming massive system resources." Under normal circumstances, a surge in registrations would have delighted Peng Jia. But given the prior server crash, the prospect of another imminent failure filled him with dread. He could already envision a bleak future. "What are you waiting for?" Activate the backup server immediately, Ping Jia shouted. It's already online, the engineer responded, beads of sweat forming on his brow. In the first 10 seconds after reopening the live stream, 366 new users rushed in. In 20 seconds, 983. Within a minute, 360 had entered. I don't need just numbers. I want, Peng Jia bellowed. Mr. Peng, all the newly registered users are flooding into the live stream. Should we do something? The engineer, his voice hoarse, pointed at the back-end traffic monitor. The operating theater had been renovated to accommodate a maximum influx of 3,000 viewers. After all, Xinglin Garden was not a professional streaming platform, and there were few who would broadcast surgical videos. The majority of content consisted of technical posts. Hence, Peng Jia had not invested in the most advanced servers, deeming it an extravagant waste. However, today presented a challenge. It seemed as if a popular female streamer had brought her followers to Xinglin Garden, causing a surge in traffic on this sunny morning. The server had already been overwhelmed once, and it appeared the second would soon follow. The backup server was activated, barely managing to support 4,000 viewers. An announcement was made to temporarily halt registrations. Peng Jia made a swift decision to refuse new members and consolidate other servers, allowing the operating theater's capacity to reach 4,600, thus preventing further escalation. Yet, even the slow increase was unbearable for him. He hastily picked up the phone to order a high-spec commercial server, refusing to haggle. Only concerned about installation time. He could not bring himself to check the back-end host. Each time he saw the viewer count rise again in the operating theater, his heart nearly stopped. Back in the office, he gazed grimly at the Huangpu River. This was a bittersweet happiness, but if he could not overcome this hurdle, all would be in vain. What a strange turn of events. Where had this influx of viewers come from? Zheng Ren remained oblivious to the fact that someone outside was fretting over him, as he eagerly opened the system's mall page to explore options for purchasing surgical training time. When he reached the purchasing interface, he was momentarily stunned. What on earth was this? The option to buy surgical training appeared on the menu, but the price was exorbitant, 3,600 experience points per hour. For hours of surgical training time could be exchanged for a complete set of surgical instruments. After calculating the cost of one set of instruments, Zheng Ren felt his heart shatter. Upon further examination, he realized that the system calculated a point of experience for every second spent. Truly meticulous accounting. Once the sting of disappointment subsided, he quickly noticed changes in the system mall. Not only were hepatobiliary surgeries listed, but interventional surgeries had also entered his view. Interventional surgery was an unfamiliar domain for Zheng Ren. He possessed only a superficial understanding of it. For instance, coronary heart disease could be treated by placing a stent through interventional methods, and obstructed bile ducts could be alleviated with internal stents to improve jaundice symptoms. Beyond that, he was at a loss. The first municipal hospital had once had an interventional specialty, but it lacked a dedicated department, relying instead on a few radiologists to perform procedures. They had initially conducted operations for ruptured liver cancer and pelvic fractures, but eventually ventured into interventional treatments for uterine fibroids. However, when a 45-year-old doctor developed a malignant blood disorder, the others abandoned this radiation-exposed surgical approach. After all, at just 45 years of age, arguably the prime of a surgeon's career, falling victim to malignancy due to excessive radiation was a sobering prospect. What use was it to learn such surgeries? Zheng Ren only wished to I simply wish to inquire whether the hospital is rife with gossip. If it remains closed for 2 days, I would have no choice but to endure the bitter winds of hardship. Xiao Xiao is genuinely beginning to feel distressed. Those at the bottom of the social ladder share similar experiences, and tales of heartache could fill an entire day. Brother, you are aware that I have a girlfriend. I lack even the funds to visit her. Life is indeed arduous. As for you, my brother, you have no girlfriend and reside with me in a rental room. Would you not say you are in a better position than I? Zheng Ren hastily interrupted Xiao Zhao to prevent the wound inflicted by Xie Yiren from reopening. Such occurrences are indeed frequent in hospitals, particularly in the emergency department, where a diverse array of individuals can be found. If you wish to engage in live streaming, I can impart a useful tip. Zheng Ren chuckled, stating, you must first cultivate a good rapport with the security personnel. Typically, trivial matters like live streaming do not concern doctors or nurses. What a joke, when the emergency department is bustling, attending to 100 or 200 patients in a single night. Who has the time to manage such trivialities? Besides, it bears no relation to medical safety. Xiao Zhao became animated. exclaiming, "Of course, I am well aware of the rules of the game." Zheng Ren inquired if Xiao Zhao would accompany him to visit post-operative patients. Xiao Zhao, who owned an electric motorcycle, considered that traveling together might save on transportation costs. Along the way, Zheng Ren reminded Xiao Zhao of several trivial matters. For instance, should someone pass away, he cautioned him against streaming live from the scene, lest he provoke the ire of those grieving, potentially leading to a most unfortunate fate. Upon arriving at the city hospital, Zheng Ren separated from Xiao Zhao, proceeding to the emergency department to locate Director Pan. As anticipated, the emergency department was chaotic, with patients who had been in fights, those who had fallen, and individuals requiring gastric lavage due to excessive drinking. Zheng Ren could not fathom the reasoning behind consuming alcohol during the midday hours. Navigating through the throngs of onlookers, he made his way directly to Director Pan's office. Passing the emergency resuscitation room, Zheng Ren heard the alarming sounds of an acute asthma attack emanating from within. The doctors and nurses inside were diligently engaged in life-saving efforts. Administer 2 milliliters of dihydroxypropyl theophylline intravenously. Add a dose of epinephrine. Prepare the tracheostomy equipment and notify the surgical team for a potential tracheotomy, he heard. Zheng Ren reconsidered and quickly changed his clothes before heading straight to the resuscitation room. No one acknowledged his presence. They were all preoccupied with their critical tasks. The patient was a young man in his 20s, lying on the emergency bed, while a girl beside him, presumably his girlfriend, wept uncontrollably. Zheng Ren assessed the patient, noting the symptoms and diagnosis displayed in the top right corner of his field of vision. Upon seeing the diagnosis, he raised his hands in resignation. "Family member, please step outside for a moment," Zheng Ren said in a low voice. The girl in the red dress turned, her eyes glistening with tears. To her, his words were synonymous with deteriorating health and the urgent need for resuscitation. "Doctor," she gasped, unable to form a coherent sentence through her sobs. "Do not worry. Step outside for now. I will come to explain everything shortly," Zheng Ren assured her. Reluctantly, the girl clung to the boy's hand, expressing her unwillingness to let go. "Oh, such beautiful love. Why is it that no one holds such affection for me?" However, with the recent acquisition of a system, Zheng Ren felt acutely aware of his situation. Lacking wealth and charm, he often went days without changing clothes, leaving him in a state of discomfort. Who would ever love someone like him? "Please, go outside now. You are delaying critical care," Zheng Ren insisted, his tone firm, as he saw the boy's condition worsening. The text in the top right corner gradually turning red, a sign of imminent danger. With no sympathy for the girl's plight, he remained resolute. She was ushered out, crying even more fiercely. Patients in the emergency department often attracted onlookers, eager to gossip. Xiao Zhao appeared amidst the crowd, phone in hand, already live-streaming. "Wait here. I will come out shortly to update you on the patient's condition," Zheng Ren declared with unyielding authority before entering the emergency resuscitation room and closing the door behind him. Although his approach was brusque, rational discourse was futile in such moments. "Control the medication dosage, and the patient will soon improve," Zheng Ren instructed. "Director Zheng, there are signs of laryngeal edema," a nurse reported, shining a flashlight into the patient's mouth. "It's fine. Administer 10 milligrams of dexamethasone intravenously, followed by 250 milliliters of saline, and 3 doses of theophylline at a drip rate of 60 drops per minute," Zheng Ren directed. "Set up cardiac monitoring and keep an eye on the oxygen saturation levels." Following Zheng Ren's orders, the 4 was quickly established, revealing a heart rate of 132 beats per minute and an oxygen saturation of 80, indicative of acute respiratory distress. The attending doctors and nurses awaited Zheng Ren's next command, yet he stood silently by the patient's side, arms crossed, saying nothing. "Is that all? Just administering 3 doses of theophylline?" They murmured among themselves. "Do not speak. This is the new director, and I hear Director Pan has a fondness for him," someone remarked. "But what does that matter? We need to provide care. We can't simply watch and wait for the patient to die." Zheng Ren, having spent extended time in the system space, felt his hearing sharpened, allowing him to catch snippets of their conversation. "No worries," he replied with a smile. "The patient's condition is unique. I anticipate that in 3 minutes, their symptoms will begin to alleviate. If we administer too much medication, it will slow metabolism and lead to further complications." Zheng Ren's demeanor exuded confidence, and the attending staff ceased their chatter, recognizing the weight of responsibility borne by the senior physician in the event of complications. Despite their silence, a lingering skepticism remained as they observed the patient's condition. Could a patient with laryngeal edema truly improve with just theophylline? Yet, to their astonishment, mere minutes later, the patient's breathing became steady, and the heart rate gradually decreased to 110 beats per minute. The cyanosis around the lips began to resolve, and the situation visibly improved. Is this truly happening? The doctors and nurses wondered, astonished that nothing had been done yet the patient was stabilizing. "Young man, are you awake?" Zheng Ren gently tapped the patient on the shoulder. The young man moved his hand slightly, signaling that he was aware. "Reduce the oxygen flow to 3 min. I will inform the family about the patient's condition," Zheng Ren said, offering a reassuring pat on the shoulder before turning to leave. "You, stand up and speak," Zheng Ren instructed as he emerged to find the girl crouched on the floor, weeping. "Doctor, how is he?" She stammered. "There is nothing to worry about." "Why are you crying?" Zheng Ren replied. "The patient is stable, and I am here to inform you of his condition. Your cooperation is needed." The girl quickly wiped her tears, sniffing hard before standing up. Appearing to be around 21 or 22, she had short hair, and her skin was somewhat rough, suggesting modest means. The smeared eye makeup gave her a panda-like appearance, and she wore a bright red sweatshirt, still carrying the pungent scent of cheap fabric. In the eyes of doctors, wealth or poverty made no difference. However, the perspective varied among hospital administrators. The patient's condition is stable. He will likely remain for observation overnight and can return home tomorrow, Zheng Ren reassured the girl. "Really?" She gasped, disbelief evident in her expression. Xiao Zhao had pushed to the front of the crowd, securing a prime position for the live stream. The surrounding spectators were equally astonished. "Did you see when they brought him in? His face was purple. Is he really going to be okay?" They whispered among themselves, incredulous at the doctor's apparent confidence. "What a joke. Just a few minutes have passed, and you think you can revive the dead with a magic elixir?" The stifled whispers of the crowd grew louder, while Xiao Zhao focused intently on the live stream. Uncertain of the veracity of Zheng Ren's claims, he refrained from commenting, merely panning the camera to capture the emotions of those present. "If you remove that garment, the patient will be fine," Zheng Ren declared. A collective gasp erupted from the onlookers. Was this man a rogue doctor, asking the patient's family to undress him? How shameless. What kind of nonsense is this doctor talking about? One onlooker exclaimed. "If he dares to speak to me like that, I'd surely put him in his place." Is this the level of care at City Hospital? The murmurs of the crowd escalated, their anger teetering on the brink of chaos. Xiao Zhao cast furtive glances at Zheng Ren, signaling the danger, but Zheng Ren remained oblivious. Shouting won't help. Are you even doctors? If you have the ability, go treat the patient yourselves. Xiao Zhao finally stepped forward, gallantly defending Zheng Ren. "Is this garment something you bought today, or perhaps just changed into?" Zheng Ren inquired, undeterred by the crowd's ire. The young woman appeared bewildered. What did her clothing have to do with treating her boyfriend? Yet, she nodded obediently, explaining. "Today marks our 1-year anniversary. I bought the outfit a few days ago, but I did indeed change into it today. We had planned to have lunch together, but..." Her voice trailed off as tears began to flow. "Don't cry," Zheng Ren said, raising his voice slightly. "Your boyfriend suffers from a rare color allergy, and it is this garment that triggered his reaction." Not only the girl, but even the surrounding crowd was taken aback. A color allergy? What on earth was that? To put it simply, Zheng Ren continued, if your boyfriend merely glances at this uncommon shade of red, he is fine. However, if he stares at it for an extended period, his body will react, leading to an allergic response. His assured tone instilled a sense of calm. With a clear diagnosis, the treatment became straightforward. Remove the hoodie and be cautious in the future. The patient will soon be moved to the observation room. Ensure he refrains from eating or drinking for the next 12 hours to avoid any irritants that could provoke an allergic reaction, Zheng Ren instructed. The young girl nodded repeatedly, unhesitatingly shedding her hoodie. She attempted to fold it neatly, but with only a small handbag in hand, she had nowhere to place it. After a moment's hesitation, she tossed the new garment into the trash. "No," Zheng Ren interjected, understanding the mentality of those from humble means. "I'll take care of it. Remove your valuable belongings, and you can retrieve them from me when you discharge." It was a pity to discard a new piece of clothing. Xiao Zhao and the bystanders were left speechless. Was this what a diagnosis looked like? A near-death patient was miraculously restored to health? "Mr. Zheng, the patient's heart rate has returned to normal, and his blood oxygen saturation is at 100. Can he be moved to the observation room?" A nurse inquired. "Yes, he can go. He is fine now," Zheng Ren confirmed. As the patient was wheeled away to the observation room, the crowd erupted into a flurry of chatter. Is he really okay? Was the patient's condition that severe? It was serious. When the ambulance arrived, I saw his face was purple, his hands too, and there was white foam at his mouth. It was terrifying. Don't speak nonsense. If it weren't serious, would his girlfriend be crying like that? Xiao Zhao soon regained his composure. Holding his phone, he noticed dozens of comments flooding the live stream chat, indicating high engagement. Friends, let us give a round of applause for the divine doctor who saved a life. Amidst the chaos, he didn't forget to encourage donations. The unexpected events had ignited enthusiasm in the live stream, with various gifts pouring in, from virtual fishballs to rockets. Host, what just happened? Please explain again. I didn't catch it. Please share your location. I'll come see you next time I'm ill. You're truly a miracle worker. I've sent a rocket. Please give positive energy to this divine doctor. Xiao Zhao beamed at the lively comments. How long had it been since there was such excitement? The donations were pouring in, and it seemed the emergency department was bustling. No, it was Zheng's exceptional skills that drew such attention. If the patient had perished, few would have bothered to support a dead man's live stream. Zheng Ren navigated through the crowd, guiding the patient on a gurney to the observation room. He crossed paths with Director Pan, who seemed surprised to see Zheng back so soon. What are you doing back so quickly? Go rest. You're still young. You can handle it, Director Pan said, striding past, unaware of what the elderly gentleman was busy with. 2 hours of cardiac monitoring. Once stabilized, we can proceed, Zheng Ren instructed, reminding her to be cautious. Yes. The girl nodded earnestly. Doctor, thank you. The young man, now able to muster a few words, reached out to express his gratitude. But Zheng Ren was already at the door, leaving him to manage a weak thank you. It's nothing, Zheng Ren replied lightly, stepping out of the observation room, where he spotted Xiao Zhao chatting with someone who had just been observing the scene. He smiled and approached Director Pan's office, knocking before entering. Director Pan was taken aback upon seeing Zheng. How did you return so quickly? Get back to rest, he urged. Zheng Ren chuckled, confessing that he felt uneasy not checking on his post-operative patients. Director Pan understood Zheng's mindset. Every surgeon experienced such anxiety. If he didn't check on his patients post-surgery, restful sleep would elude him. If a critical case arose, sleeplessness was inevitable. Let us go round on the patients, Director Pan suggested, and Zheng Ren eagerly accepted. As the attending physician of the emergency department, he would have been reprimanded had he ventured into the surgical ward alone. However, under Director Pan's auspices, he felt secure. Anyone daring to critique would surely face Pan's wrath. Both men were straightforward, heading directly to the surgical ward. Along the way, Director Pan briefed Zheng on the progress of the nurses and doctors. Thanks to Zheng's outstanding surgery, hospital support had increased. However, nurse staffing would still take about a week to stabilize, while the hospital preferred to focus on training residents due to the known shortage of doctors. Soon, they arrived at the surgical ward, where the patient count overflowed into the hallway, seemingly without end. Even Zheng Ren felt a pang of awe. These were all his post-operative patients? Director Pan confidently summoned the ward's doctors to begin rounds. Director Liu was hospitalized for a myocardial infarction, leaving the surgical ward without leadership. They dared not oppose the presence of the doctor responsible for sending Director Liu to the CCU. At each patient's bedside, the corresponding doctor provided updates. Normally, Zheng might struggle to recall the details of each case, but today, perhaps due to a newfound clarity, every surgical procedure came vividly to mind without needing any introduction. Condition stable, good recovery, echoed the reports, bringing joy to both patients and their families. The air, once heavy with a medley of scents, felt less oppressive, and smiles began to emerge. Upon reaching room 5, a frail figure appeared before Zheng. With a sudden thud, the figure collapsed at their feet. Ah, elderly lady, what are you doing? Please, get up, get up. Director Pan, seasoned and wise, quickly extended both hands to assist the elderly woman. You are my benefactor. The old woman grasped Director Pan's hands, tears streaming down her cheeks uncontrollably. Zheng Ren hurriedly stepped aside, feeling unworthy of such heartfelt gratitude. He feared that this elderly woman's overwhelming appreciation might deplete his own fortune. If fortune were indeed a tangible concept, he would have squandered a great deal by now. And perhaps the next task assigned by the system would be one that could lead to his own obliteration. A living bodhisattva. You saved my granddaughter. The old woman sobbed as she was helped to her feet by Director Pan. Zheng Ren found himself pondering the situation, taking a moment to truly observe this elderly lady. In the preoperative encounters with the family, including the parents of the pregnant woman, none had considered the young female patient significant. In their eyes, only the unborn boy held any importance. Yet, here was this elderly woman expressing her profound gratitude for saving her granddaughter's life. At that moment, Zheng Ren felt a sense of fulfillment and reassurance in the work he had undertaken. Director Pan, though somewhat exasperated, was accustomed to such displays and managed to coax the elderly woman inside. Zheng Ren cautiously followed, eager to assess the recovery of the patient. Upon inquiring about her condition, he learned that on the first day post-surgery, the patient had already begun passing gas and was sipping porridge. Her complexion was markedly improved, and she sat partially upright in bed. Upon seeing Director Pan enter, she made a valiant effort to rise, wishing to convey her sincere gratitude. Director Pan promptly pushed Zheng Ren forward, reminding her that he was the one who performed the surgery and deserved her thanks. The young woman, still somewhat embarrassed, realized her error in misidentifying her savior. Her husband, parents, and in-laws were all crammed into the small hospital room, and as she attempted to stand, they awkwardly rushed to assist her, avoiding Zheng Ren's gaze, their movements stiff and unnatural. However, they were unceremoniously shooed away by the elderly woman, who likely believed that her granddaughter could only be cared for by herself, viewing the others as ungrateful. Though advanced in years, the elderly lady was not oblivious. Zheng Ren quickly urged her to lie back down, as it was only the first day post-surgery, and being able to pass gas and eat was already a significant achievement. He dared not let her attempt to stand. Information in the upper right corner of his field of vision informed him that the pregnant woman exhibited no signs of secondary infection or other complications, and the threat of miscarriage had dissipated. She was on the path to a swift recovery. Thank goodness. Zheng Ren reassured the patient before leading Director Pan out of the room. Not accustomed to this, Director Pan remarked, noting the emotional expressions typical in rural areas. It's the relatives I dislike. Except for that elderly lady, Zheng Ren confessed, feeling compelled to voice his frustrations about the previous encounter. Without needing further explanation, Director Pan understood the challenges Zheng Ren had faced that day. Such experiences were common for anyone who had spent over 5 years in clinical practice. Director Pan had long since tempered his resolve through experience. You'll get used to it. If not, you'll end up resigning, he said with a faint smile, seemingly unperturbed. After completing their rounds in the general surgery department, Director Pan guided Zheng Ren to visit the patients in the second general surgery ward. Upon arrival, they were greeted by Director Sun, who, upon learning of the emergency department's presence, displayed no sign of embarrassment and warmly welcomed them, treating them with the utmost respect as if they were conducting a grand ward round. That fellow understands the situation, Director Pan remarked after departing the second surgical ward. Upon reaching the second floor of the special care unit, they heard a voice exclaim, "Miss, why are you out of bed?" Both Director Pan and Zheng Ren paused, then hurried into the room. A tall, slender girl was propping herself against the bed, standing at an impressive height of 1.80 meters. Despite appearing somewhat haggard, she exuded an air of grace. "Zhou Jinxia?" Zheng Ren inquired, his voice tinged with uncertainty. He had never performed a transrectal appendectomy in reality, and thus was unaware of what the patient would be like post-surgery. According to literature, a patient could typically stand and consume a liquid diet the day after surgery, walk within 2 days, and be discharged by the 3rd day. However, how could Zhou Jinxia be standing less than 6 hours post-operation? Both Director Pan and Zheng Ren were taken aback. "Yes, who are you?" Zhou Jinxia asked cautiously, her large eyes blinking in surprise. "I am the director of the emergency department. My surname is Pan. This is my subordinate and the doctor who performed your surgery," Zheng Ren, Director Pan introduced, his tone brimming with pride as he referred to Zheng Ren as his subordinate. Upon hearing that Zheng Ren was her surgeon, Zhou Jinxia became flustered, resembling a startled rabbit. She hastily sat back on the bed, pulling the covers over her face, her cheeks flushed with embarrassment. "Is she shy?" Zheng Ren mused, reflecting on the contrast between his own stoic demeanor and the patient's modesty. "Miss Zhou, we have come to assess your recovery," Director Pan said gently, his voice softening as he sought to soothe Zhou Jinxia's bashful heart. After several minutes of encouragement from the assistant, Zhou Jinxia finally emerged from her cocoon, her face still rosy, and responded to Zheng Ren's inquiries regarding her condition. "Recovery is going well," Zheng Ren noted with relief, pleased to see that the patients who had undergone the most challenging surgeries were young and recuperating swiftly. Zhou Jinxiao reported no pain in her lower right abdomen, and physical examination showed no tenderness, rebound tenderness, or muscle rigidity. Observing her lively demeanor, Zheng Ren had no doubt that she would be wandering out of the hospital the following day. Thinking of this, Zheng Ren's tone turned serious as he cautioned the assistant to ensure that Zhou Jinxiao remained in bed for a full day before attempting to stand. Just then, Director Pan's phone rang, interrupting their conversation. "Hello, this is Pan," he answered while stepping out of the room. "All right, I'll head back to the emergency department immediately." A sense of urgency enveloped Director Pan as he hung up, his expression turning grave. "There has been a mass poisoning incident. All ambulances in the city are being deployed to transport patients. We must return." "How many patients are affected?" Zheng Ren asked, his heart racing. "There are dozens in critical condition, but I do not have an exact number." "Dozens? That truly is a mass poisoning." The two fell silent, rushing back to the emergency department. Upon arrival, Director Pan ordered the discharge of stable patients to other hospitals. He announced the mass poisoning incident, urging the hospital to concentrate efforts on treating critically ill cases. Most patients complied, leaving for other hospitals, while some, whose injuries originally, Zheng Ren did not intend to go. But he thought that an earlier diagnosis might save a precious life. The ambulance screeched to a halt, the tires screeching against the pavement in a cacophony of sound. A plume of white smoke billowed forth, leaving behind black skid marks on the ground. As the stretcher was pushed down, Zheng Ren momentarily froze. The patient's exposed skin exhibited a bluish-gray hue, resembling a living avatar. A grim thought surged through Zheng Ren's mind. This was indeed nitrite poisoning. Since his intensive training, his memory had vastly improved, and such a rare condition, which he had only seen briefly mentioned in textbooks during his school days, now surfaced with startling clarity. Having left school and joined the workforce, he had never encountered a single case of nitrite poisoning. Yet, that fragment of memory appeared unambiguously in his mind. Through the diagnostic interface in the upper right corner of his vision, Zheng Ren confirmed the diagnosis: nitrite poisoning. The patient was in a state of toxic shock and could die at any moment. He pushed the stretcher forward, sprinting down the corridor. Each passing second was incredibly precious, capable of determining life or death. "Prepare methylene blue. Prepare potassium permanganate for gastric lavage," Zheng Ren shouted as he ran. His voice echoed throughout the corridor. Xiao Zhao, hiding in an inconspicuous corner of the emergency department, was live-streaming. Upon hearing Zheng Ren's commanding voice and witnessing his frantic dash, a sense of admiration welled up within him. The usually unremarkable, financially struggling youth, devoid of a romantic partner, suddenly appeared monumental in that moment. "Prepare methylene blue in large quantities," Zheng Ren called out loudly as he passed by Dean Xiao, issuing commands with an authority that made it seem as though he were the dean himself. Dean Xiao was momentarily taken aback. The disruptive elderly woman, bolstered by the presence of police officers, continued her ruckus. Zheng Ren released the stretcher and said, "Establish an intravenous line, 250 milliliters of 10-dextrose with 140 milligrams of methylene blue, administered at full speed, while simultaneously performing gastric lavage with potassium permanganate." The stretcher, carrying the patient, was expertly received by the nurses awaiting at the emergency resuscitation room door. The emergency department had a routine stock of methylene blue, but it was insufficient. Zheng Ren approached Dean Xiao, speaking gravely and solemnly. "You are bullying an elderly lady. I will not let this go. I refuse to believe that there is no justice left." The elderly woman seemed to have lost her mind, grasping Dean Xiao's white coat collar and causing a scene. Ignoring the police officers nearby, without hesitation, Zheng Ren seized her arm and forcefully tossed her aside, sending the troublesome old woman crashing into a group against the wall. She paused for a moment before sitting on the ground, wailing and pounding the floor, screaming that the doctors and police were killing her. "You all need to handle this. More people will come." Zheng Ren entered into a state of command, instructing the police to take action, then turned to Dean Xiao, stating, "Our hospital's inventory is likely insufficient. We need to request assistance from the city. If the city cannot provide enough, we will seek aid from neighboring cities and counties." With that, he pivoted and left without further explana. The patient was swiftly transported to the resuscitation bed, where Zheng Ren commenced his procedure. The patient was positioned supine with the head lowered and the feet elevated at an angle of approximately 15 to 25 degrees, thereby enhancing venous pressure to facilitate venous filling. This maneuver ensured that the pressure within the veins exceeded atmospheric pressure, thereby mitigating the risk of air embolism during deep venous puncture. Zheng Ren tore open the patient's shirt with such force that it evoked a sense of wildness. He placed a 500 milliliters water bottle between the patient's scapulae. Given the patient's slender physique, he opted for a soft bottle of saline. The intention was to expand the thoracic cavity, allowing the shoulders to droop and elevating the mid-clavicle, thereby bringing the subclavian vein closer to the clavicle and separating it from the apex of the lung. Zheng Ren then rotated the patient's face towards himself, diminishing the angle between the subclavian vein and the internal jugular vein, thus facilitating the catheter S approach towards the superior vena cava. Prepare the next patient. Zheng Ren wished to shout, but his voice had become hoarse, audible only to a few nearby nurses. Understood, they replied. This positioning was straightforward, with a clear purpose, making it an uncomplicated task. Donning gloves, Zheng Ren held the needle in hand, selecting the puncture point with intention. Contrary to the textbook method of puncturing 12 centimeters below the midpoint of the clavicle with the needle directed towards the same side as sternoclavicular joint at a horizontal angle, he opted for a puncture site in the subclavian triangle, lateral to the midclavicular line, selecting a point distant from the clavicle. The nurses had witnessed subclavian venous punctures before, but never under such critical circumstances or with such low blood pressure. Is Dr. Zheng confused? Is the puncture point incorrect? They pondered, but amidst the urgency, Zheng Ren's hands moved with remarkable steadiness and speed, leaving no time for admonishment. They could only watch as Zheng Ren pressed down with his left thumb on the skin until it was at the same level as the intercostal space, marking the point just below the edge of his thumb, then released it, performing the puncture at that marked location. This technique was derived from his extensive training, where he had assimilated knowledge from thousands of articles on subclavian venous puncture alongside his own practical experiences. During his intensive surgical training, all experimental subjects were positioned before him, initially taking about 3 minutes for each procedure, which progressively quickened to mere seconds by the end, culminating in 452 deep venous punctures within 234. 6 minutes. Although this number may be slightly lower than that of emergency or ICU physicians in some large hospitals, Zheng Ren accomplished it all in one continuous session, all being high-difficulty cases of low blood pressure and hypovolemia. The challenges were significant, yet the rewards were substantial, qualifying Zheng Ren to rank among the nation's elite in puncture techniques. One puncture, blood flows. The unconventional approach yielded remarkably evident results, momentarily stunning the seasoned nurses nearby. Such a challenging puncture typically required 5 minutes at minimum, marked by repeated attempts and meticulous probing, often akin to a stroke of luck. Yet, how long did Zheng Ren take? Excluding the time for positioning, perhaps just 2 minutes? No, it was certainly not 2 minutes. It was closer to 1. Perhaps even less than 1 minute. In the blink of an eye, he observed the venous blood return. Prepare the 4, administer myelin, Zheng Ren instructed, raising his voice slightly in frustration. The adrenaline and dopamine surging through him due to the previous urgency left his voice almost muted. Oh, an experienced nurse beside Zheng Ren snapped back to focus, promptly connecting the deep venous puncture tube to the 4 line. Set the flow to maximum, and after the infusion, continue with the dextrose and gastric lavage, Zheng Ren directed. Yes, responded several senior nurses, temporarily reassigned from different departments. In the hospital, if you could deliver, countless others would heed your command. If you could not, no amount of chatter would suffice. The nurses busied themselves with medication preparation and patient positioning. Zheng Ren picked up the suture from the puncture kit, securing the deep venous puncture needle with the precision of a general issuing commands in a military camp, devoid of any delay. After finishing one patient and observing the steady drip of the glucose and myelin solution, he felt a sense of relief. The next patient was already positioned, and Zheng Ren removed his sterile gloves, sanitized his hands with alcohol gel, unwrapped the next puncture pack, donned sterile gloves anew, and continued his surgical endeavors. Meanwhile, Director Pan, undistracted, wielded hemostatic forceps, searching for the now flattened femoral vein. In his days on the battlefield, he had witnessed too many comrades succumb to hemorrhagic shock. This procedure had become as routine as eating and drinking. His vision faltered as the patient's local tissue structure eluded clarity. Age had taken its toll, and he mused, if not me, then who? The younger generation had scarcely mastered such incision techniques, honed only through the crucible of life and death. In times of peace, where could one find patients in such dire need? After 5 minutes, Director Pan finally located the femoral vein, successfully punctured it, and administered a bottle of glucose mixed with myelin. As he watched the liquid flow steadily, he exhaled deeply, although he was slightly slower than in his youth. Finding the femoral vein within 5 minutes was not perfection, yet it was satisfactory. He felt content, still capable despite the passage of time. Straightening his back, he faintly heard his lumbar spine creak. One must yield to age, he chuckled to himself, suddenly wondering where Zheng Ren had gone. The intern who had been so impressive before had excelled in diagnosing this patient's condition. After all, not many would encounter nitrite poisoning in their lifetime. Director Pan recalled a patient from his younger days, having to sift through texts for treatment methods. Unfortunately, that patient had not survived long enough for him to find myelin. The previous surgeries and the current emergency diagnosis suggested that Zheng Ren was undoubtedly capable. Yet, where was he? As Director Pan turned to survey the room, he was taken aback. 12 beds lined up behind him, with 7 or 8 patients positioned in unique postures. Some had already undergone deep venous puncture, while medical staff lifted them onto stretchers for transfer to the observation room. Zheng Ren, however, was bent over, intently performing another deep venous puncture. The youth indeed possessed quick reflexes, Director Pan mused, but he soon realized that Zheng Ren was not just quick, he was as swift as lightning. Xie Yiren had quietly joined the resuscitation efforts, standing beside Zheng Ren to assist. From the moment the puncture pack was opened, through disinfection, puncture, suturing, and securing, the entire process took 30 seconds. Director Pan felt he may have overstated the time, while Zheng Ren secured the sutures. Xie Yiren had already moved on to prepare for the next patient. This is astonishing. Zheng Ren's side was a hive of activity, consuming over 20 medical staff. Some transported patients from the ambulance, others meticulously prepared myelin and glucose solutions, while yet others connected glucose bottles to the deep venous puncture tubes, raising them high and maximizing the flow rate. Some followed Zheng Ren closely, ready to assist with suturing and bandaging after he completed each puncture, while others escorted the patients he had treated to the adjacent observation room. It was an orderly operation, akin to an assembly line. By the time Director Pan completed one venous incision, Zheng Ren had already performed over 10 deep venous punctures. A wave of melancholy washed over him, tinged with a sense of pride. The future belonged to the young. He would focus on what tasks he could still manage. How much myelin remains? What about the venous puncture kits? Director Pan inquired. We are nearly out, the head nurse responded anxiously, the sound of the emergency ambulance echoing around them. This is not all. Some patients, either feeling too anxious or in a less critical condition, do not wait for an ambulance, but instead take taxis or private cars to the hospital. Outside the emergency room, chaos reigns. An increasing number of patients flood into the first municipal hospital, the strongest medical institution in the city. When faced with a family emergency, the first thought for relatives is to rush to the first municipal hospital for treatment. Despite the city's swift response and appropriate patient diversion, only ambulance patients can be effectively managed. Those who arrive on their own inevitably crowd the facility. Director Pan furrows his brow, pondering the bizarre situation. Why are there so many cases of nitrite poisoning? But such thoughts quickly fade. As a medical professional, his primary concern is to treat and save lives. He approaches Dean Xiao without uttering a word. His eyes, slightly clouded by time, shine with intensity, fixed on the Dean without reservation. Though he remains silent, Dean Xiao understands his intent. The deep vein puncture kits have run out, yet there is sufficient stock throughout the hospital. This is not a pressing concern. However, the supply of myelin is depleted, and with no more available, incoming patients will go untreated. Being untreated here translates to waiting to die. Dean Xiao, already anxious as if he were an ant on a hot stove, feels a surge of irritation from Director Pan's piercing gaze, which has stripped him of his usual composure, forcing him into a state of anger. What do you want from me? The hospital is out of stock. We are currently reallocating resources from the entire city. He shouts, venting his frustrations, including his dissatisfaction with himself. The office director has never seen Dean Xiao in such a state and hesitates to intervene, unsure of how to approach the situation. You are the dean. Who else am I supposed to turn to? Director Pan retorts, if even one person dies, you might as well prepare for the consequences. I assure you, many are waiting for you to make a mistake. Unfazed by anger, Director Pan calmly states a harsh truth, his voice steady even when using coarse language, which sends a chill down the spine. His words imply that, at a critical moment, he wouldn't hesitate to push for accountability. His stature in the field is unquestionable. No one could threaten the position of the dean. However, Dean Xiao seeks to avoid further complications. More importantly, as a clinical professional. The urgency of the rescue reignites a long-dormant passion within him. Dean Xiao's expression shifts, and seizing the phone from the office director, he dials with urgency. Upon connecting, he barks, "Milan, send all your stock to the first municipal hospital immediately. I don't care what difficulties you face if you don't comply. I'll convene a meeting tomorrow to clear your entire product line from our hospital." His domineering attitude, devoid of reason, paradoxically instills a sense of reassurance amidst the tumult outside, where patients and families, once loud, now seem subdued, as if the emergency room harbored some lurking danger. Dean Xiao continues to make call after call. Time is of the essence, and the city's coordinated response will surely take too long. The usual procedures would require at least another half to full hour, far less effective than a direct threat. He recognizes Director Pan's point. A single death could spell disaster for him. Rather than risk that, he decides to cut off the supply chain entirely, ensuring that no one would benefit. Zheng Run, like the eye of a storm, works steadily on deep vein punctures, one every 25 seconds, with remarkable consistency, regardless of whether the patient is elderly or a child, a man or a woman. After each procedure, a bottle of glucose is hung, with myelin flowing like a gentle cascade into the patient's veins, entering peripheral circulation, reaching the liver, and commencing the biological metabolism to neutralize the nitrites within their bodies. The hospital's supply of myelin quickly depletes, and when the last bottle is opened by a nurse and added to a tin glucose solution, a Wuling van arrives at the emergency department, moving with an urgency surpassing that of an ambulance, sparks flying from its brakes. A middle-aged man, clad in a suit and sporting a beer belly, rushes in, carrying a box of myelin. "Dean Xiao, 8 minutes," he exclaims, placing the box on the floor, his face pale, breathing heavily as if his lungs were bellows. Dean Xiao's expression softens upon seeing the myelin delivered. He simply instructs, "Report to the Health Bureau and inquire about the city's allocation. Be proactive about this." He then joins Director Pan in assessing the patients, reallocating those who have improved to any available ward within the hospital. The emergency rescue operation, spanning 3 hours and involving 246 deep vein punctures, has made all medical staff lose track of time, replaced solely by respect for life and the urgency to save it. Everyone has exerted their utmost effort. Zheng Rin completes the final patient as procedure, glancing around to find the emergency beds empty, devoid of any more poisoned patients. Is it over? Has it truly ended? For a moment, he feels disoriented. After performing a procedure for an extended period, one can become numb. Particularly as Zheng Rin had previously traded all his experience points for surgical practice in the operating room, honing his skills on hundreds of deep vein punctures. Following that, he had performed over 200 procedures in the emergency room. Although puncturing isn't strictly classified as surgery, the sheer volume is overwhelming. Zheng Rin suddenly feels fatigued. "Are there any remaining patients?" he inquires. "I'll check," replies Xie Yiren, who also notices the absence of patients and steps outside, her steps light and buoyant. Observing her retreating figure, Zheng Rin notes that her white coat seems tailored, accentuating her slender waist and perfectly complementing her figure. Each movement appears to embody a graceful curve. Before long, Xie Yiren returns, her mask removed, her face flushed with excitement. "Zheng, there are no new patients. Director Pan has gone to the inpatient department to coordinate the wards, asking you to keep an eye on things." "Oh," Zheng Rin responds absent-mindedly. Upon hearing that it has concluded, exhaustion floods over him like a tide. During the rescue, he had been singularly focused on saving one patient after another, oblivious to his own fatigue and hunger, masked by the surges of adrenaline and dopamine coursing through his body. He scarcely remembers the tasks assigned by the system. Tasks? Zheng Rin hadn't considered them at all. Confronted with patient after patient, resembling avatars, he had no time to ponder how many experience points he might gain. In his mind, only the deep vein punctures and administering myelin to counteract nitrite poisoning occupied his thoughts. In his ears, the harsh sounds of ambulances and the desperate cries of patients' families echoed. At last, it is ended. Zheng Rin approaches the doorway when suddenly the world spins. And in a daze, he collides into Xie Yiren's embrace. In his stupor, he registers a softness against him. Quite ample. Instinctively, Xie Yiren pushes Zheng Rin away, and with a thud, his head strikes the door, leaving him weak and crumpled on the ground. Startled, Xie Yiren stands frozen, shouting, "Someone help!" Several medical personnel hurried to Zheng Rin's side, assisting him to his feet. Zheng Ren was drenched, and those who helped him were equally soaked with sweat. Lift him onto the bed, one doctor instructed. Zheng Ren had merely lost consciousness momentarily. His mind remained in a semi-conscious state. He sensed the changes in his body and summoned all his strength to utter, "Help me sit up, do not move me. Administer 20 milliliters of high sugar intravenously, and provide me with another bottle of 10 sugar." He felt utterly exhausted, dizzy, with a ringing in his ears and profuse sweating. These were the symptoms of hypoglycemia. It was only at this moment that Zheng Ren realized he had not eaten for almost a day. The last meal being a late-night snack of crayfish shared with Xie Yiren, which felt like an eternity ago. Hearing Zheng Ren issue his own medical orders, the others concluded it was merely low blood sugar and their anxiety subsided. Soon, a large syringe filled with thick 50 glucose was pushed into Zheng Ren's vein. He leaned against the wall, sitting on the floor, sipping from a bottle of 10 glucose, droplets of sweat cascading down his hair. The family members of the patients, witnessing his pale complexion, felt a pang of sympathy and contemplated offering food, yet hesitated, not wanting to disturb him. Humanity is inherently compassionate. While people may vent frustrations about a lack of medical ethics online, in this moment, they could only feel empathy for the weary doctors who had just saved lives. The term great physician arose in their minds. A few minutes later, as the symptoms of hypoglycemia alleviated, Zheng Ren felt as though he had been reborn. Although he lacked an appetite, he adhered to a routine of eating, indifferent to what he consumed. After an exhausting night of appendectomies, he returned home only to lie down briefly before heading back to the hospital for rounds, completely forgetting about food. "I must pay more attention in the future." Observing the bustling emergency department filled with beds, he noted the patient's bluish-gray hues gradually fading, filling him with joy, a moment of boundless happiness for doctors and nurses alike. Oh, it seemed the system had assigned him a task. Zheng Ren vaguely recalled that the task was quite rewarding. Holding the glucose bottle, he took a generous swig. The viscous glucose traveled from his mouth down his esophagus to his stomach. He could almost feel his gastric mucosae swiftly absorbing the sugar, replenishing his energy. He pretended to rest, bowing his head as his consciousness slipped into the system space. As he lowered his head, more sweat fell like rain, as if a cloud above him were pouring down. Emergency task. The Buddha of thousands of families has concluded. The cold, mechanical voice of the system echoed the moment Zheng Ren entered the system space. A total of 246 deep vein punctures completed, with no failures. Earned 750 skill points, 3 silver chests, and 75,000 experience points. Zheng Ren's first thought was that he had struck it rich. During the rescue, there had been no time to ponder this matter. Now that the emergency was over, it was time to celebrate. His general surgery skills had originally been at 1360, but after the system training in cholecystectomy and deep vein punctures, along with over 200 deep vein punctures, his skills had risen to 1690 points. Deep vein puncture was a routine procedure with low technical difficulty, so the skill enhancement it provided was modest. It was likely that most of the skill points he gained were due to the cholecystectomy training. He had previously accumulated 180 skill points. With the rewards from this emergency task, he now had a total of 930 skill points to utilize. Given his current foundational level in other disciplines, he could elevate any skill tree to an advanced level in an instant. Attaining the position of a professional deputy chief physician was well within reach, and that feeling was undeniably gratifying. However, Zheng Ren intended to deliberate on which specialty to enhance, as he was frugal, wanting to maximize every point. The recent emergency was merely an anomaly. Everyone has moments of impulse in life. These skill points and experience rewards were before him, alongside 3 shimmering silver chests floating in the air. Zheng Ren had never been one to spend money on games, so he was surprised that the system had granted him such fortune. As a non-RMB player, he had never experienced the concept of luck. No European lord or non-European lord existed in his reality. With a mere thought, he opened all 3 silver chests. A brilliant light erupted. 0047 points of water grace, spring water repayment. After the dazzling light faded, Zheng Ren found 3 identical books before him. The system seemed to have taken the easy route, as the contents of the silver chest were all the same, lacking any surprise. Zheng Ren did not consider his unfortunate luck. Had he been slightly luckier, perhaps he could have uncovered something extraordinary. The 3 books served to enhance skill levels. Essentially skill books that could elevate any skill tree to its peak. In terms of tiered calculations, each book was worth up to 1,000 skill points. Zheng Ren felt a twinge of regret. If only he had 3,000 skill points, Combined with the 930 points he had saved, he could elevate his general surgery skills to a master level. After some contemplation, he decided to keep the 3 skill books for later use rather than applying them immediately. The immense psychological shadow left by the system's prior threat loomed over him, weighing heavily, around 3 kilograms, to be precise, not a typo. He needed to retain some backup options. Just like the deep vein puncture technique, had Zheng Ren not saved several thousand experience points to exchange for surgical training time, he might not have been able to save as many lives. Zheng Ren was no fool. He had grown up in an orphanage, witnessing the generosity of donors and working part-time jobs to support himself while still gaining admission to the nation's top medical university. As for entering graduate school without an exam, as long as his mentor was not blind, he would certainly be accepted. He gradually discerned the behavioral patterns of the system. Each inducement seemed linked to specific patients he needed to save. In other words, the system appeared to possess a certain foresight regarding patients in need. Should he consider learning interventional surgery? Zheng Ren began to entertain the notion of donning a lead apron to perform such procedures, though it remained just an idea for now, as he had no immediate plans to act on it. The system's experience points were not to be squandered, with 75,000 experience points. He could only accumulate less than 21 hours of surgical training time, which was insufficient for an entirely unfamiliar surgical branch. This contrasted sharply with the 20 days of training time the system had initially granted him, during which the system space's light had seemed to blur, as if it might shatter at any moment. Zheng Ren sensed that the system had been in a precarious state back then, bestowing 20 days of training time as a last-ditch effort. Now, it was better to gradually accumulate surgical training time. Moreover, the pressing issue was not to learn surgery but to rest properly, as he had already experienced low blood sugar. Zheng Ren did not wish to find himself in a funeral home the next day, listening to the insincere eulogy of a detestable hospital administrator. With the restoration provided by the system space, his mental faculties were not lacking. It was merely his body that needed recuperation. As Zheng Ren observed the system space for changes, he suddenly sensed an approaching crisis. With a fleeting thought, he returned to the present moment. That's him. The son of a dog. How dare he strike my mother? A furious voice erupted from nearby. He's the one who kicked me. The same elderly woman who had previously caused a scene in the hospital, grabbing Director Xiao by the collar, now stood animatedly, pointing at Zheng Ren and spitting venomous accusations. Whether Zheng Ren had actually kicked her was of no concern to her. With his blood sugar now stabilized, the sweat on Zheng Ren's back gradually dried. Clinging to him uncomfortably, he looked up to see a tall, muscular man adorned with contorted dragon tattoos on his exposed neck, arms, and hands, wearing a thick gold chain, accompanied by several others who barged in. The corridor was teeming with urgent care patients and their families, all of whom stood frozen, cautiously making way for the imposing figure of a burly man. Such menacing individuals are typically not ones to provoke, as the local police, who had been maintaining order, had already departed after the emergency response concluded. The commotion outside escalated, prompting 2 security guards stationed at the hospital to swing open the heavy iron door of the security room and peek out. "Curse you!" the hulking man exclaimed, his glare fierce and imposing. The guards, without a moment's hesitation, plastered on forced smiles and promptly shut the door, the resounding clang providing a backdrop to the frenetic energy and inner turmoil surrounding them. Zheng Ren felt resigned. Encounters like this were all too common in the hospital. The security guards were merely contract workers clad in auxiliary police uniforms. Should a conflict arise, they would not dare intervene. If someone were injured, the guards would be dismissed without inquiry into right or wrong, and only then would compensation and apologies follow. They were all just struggling individuals, and Zheng Ren bore no ill will toward their retreat. What could one do in such a situation? Simply endure the blows, for what other choice was there? Every day across the nation, incidents of healthcare workers being assaulted occurred, and Xiangya Second Hospital was reputed to be one of the most principled institutions. Yet, what was the ultimate outcome? It was disheartening. Facing the towering figure, a fleeting thought crossed Zheng Ren's mind. If he were to be injured, could he perform surgery on himself under local anesthesia? Though apprehensive, he did not falter. After all, showing fear would be of no avail. Regardless, one must brace for the impending blows. Who would he show cowardice to? He remained silent, rising to stretch his shoulders and neck. Several doctors and nurses, trembling, attempted to intervene but were cowed by the man's imposing presence. They were educated individuals, accustomed to verbal disputes but unaccustomed to physical confrontations. "Oh, so you wish to try your hand?" The giant sneered, his fists clenched like heavy sandbags. Even from 10 paces away, Zheng Ren could hear the ominous cracking of knuckles. He had no intention of resisting. His close combat skills were non-existent. What could he possibly use to defend himself? He merely intended to loosen his muscles, hoping to recover swiftly after the inevitable beating. The once boisterous corridor fell silent, with over 100 pairs of eyes exchanging glances, rendered mute by the tension. What do you intend to do? Xie Yiren dashed in front of Zheng Ren, arms outstretched in a futile attempt to shield him. Zheng Ren smiled wryly. Given her petite stature, any blow would surely fracture her. He quickly covered her mouth, pulling her behind him. He had accepted his fate, fervently wishing his dear cousin would not share in his suffering. The hulking man, clearly pleased with his intimidation tactics, regarded Zheng Ren with a predatory grin, his voice booming. Pretty brave, are we? Dare to strike my mother? Zheng Ren chuckled bitterly. Reasoning with him was absurd. This was the stark distinction between being labeled a troublemaker and being perceived as innocent. He strained to recall the adept self-defense maneuvers he had witnessed from a senior colleague in the emergency room during similar situations. Zheng Ren felt he could never master such skills. That colleague had likely endured countless assaults to hone his craft. Director Pan was absent, off searching for an empty bed in the internal medicine ward. Thank goodness for that. With Director Pan's notorious temper, he would surely join Zheng Ren in facing the wrath. Being young, a beating was hardly a concern for Zheng Ren, but for the older gentleman, injury could spell disaster. He crouched down, shielding Xie Yiren in the corner, hands clasped over his head in an awkward position. Youth, doctors are the saviors of life. An elderly man lay on an emergency gurney, whispering. His voice, though faint, resonated in the unusually quiet corridor, capturing the attention of many present. His symptoms of nitrite poisoning were not severe, likely due to the elderly man's limited food intake. After administering a dose of myelin, the bluish-gray hue that had characterized his pallor began to fade, signaling an improvement. Father, please stop. A middle-aged man in his 40s leaned close, softly urging his father while turning his face towards the hulking man, offering a conciliatory smile. Beast. The elderly man, agitated, struck his son across the face. How could you behave this way? His voice rose, veins bulging on his forehead, giving him an intimidating appearance. Although not particularly strong, his words carried a weight that stunned the atmosphere in the corridor. Father, control your emotions. Mind your blood pressure. The middle-aged man, now alarmed, feared that an outburst could lead to a cerebral hemorrhage, which would only complicate matters further. A drop of kindness deserves a fountain of gratitude. The elderly man struggled to rise, exclaiming, Look at how tirelessly the doctors are working to save lives, and you just stand there watching them suffer? Get away. I don't need a son like you. A middle-aged man, slightly overweight yet refined in appearance, bore the brunt of his father's wrath, his face flushed. The patients had likely arrived unaware of the unfolding chaos, but the 100 or so family members present were acutely aware of the entire resuscitation process, having witnessed everything through the open door of the emergency room. Most could not fathom why Zheng Ren had incurred the wrath of that unreasonable woman, yet none were fools. They could piece together the events. The slap that landed on the elderly man's son felt as though it had struck everyone present, leaving a palpable tension in the air. You still have the audacity to show your face. A woman in her 30s rose, angrily pointing at the arrogant old woman beside the hulking man. Aren't you the one who was ill? Weren't you on the brink of death? Yet here you are, full of life. Perhaps you should hurry and buy a coffin. Given your character, it ought to be a sturdy one, lest it be unable to contain you. You, the old woman, momentarily taken aback, opened her mouth to retort, but the woman stepped forward, standing defiantly in the corridor, hands on her hips, exuding an unyielding spirit. My family member was the first to arrive. They were on the verge of death. And you, with your nonsense, have done nothing but cause trouble. Indeed. I witnessed her assault a police officer. She claimed she was dying while clutching the director's collar. Had it not been for Dr. Zheng pushing her aside, the medication for resuscitation would not have reached us in time, and who knows how many lives would have been lost. As the chorus of support grew louder, it became evident that the collective frustration against the unruly old woman surged, resonating within the hearts of those present. The elderly man's sentiments rang true. Doctors are indeed the saviors of life, while the troublemaking old woman was merely a nuisance. Shouts of indignation crescendoed, and at some point, someone hurled a bottle of purified water at the henchman behind the hulking man. In an instant, a barrage of bottles rained down upon the troublemakers. Realizing he had incurred the ire of the crowd, The hulking man's face turned a deep shade of purple. He pointed at the onlookers, attempting to utter some conciliatory words, but fear took hold, and he, along with his companions, fled the hospital amidst the storm of bottles. The doctors and nurses in the emergency department formed a protective barrier around Zheng Ren, and once the tumult subsided, they began to urge the crowd to calm down, emphasizing the importance of focusing on recovery. "Thank you, Dr. Zheng," a family member approached, bowing deeply in gratitude. "Too kind. It was the least I could do." Zheng Ren replied with a humble smile. Xie Yiren peeked around him, curiously observing the scene. One by one, family members expressed their heartfelt thanks, demonstrating that while simple folk may cower in the face of darkness, they undeniably comprehend the essence of righteousness. Perhaps they are the silent majority, yet when the occasion arises, none shall flinch. After much commotion, Zheng Ren finally, utterly exhausted, accepted the gratitude of nearly all the patients' families. The scene, Zheng Ren felt it resembled a farewell for the deceased. Of course, he was the one being mourned. But where was Xie Yiren? Zheng Ren glanced behind him, noticing her absence, and inquired. "She went to buy you something to eat," replied a physician from the internal medicine department, hastily returning to write patient records. Emergency treatment is one matter. Once the patients are stabilized, a mountain of tedious documentation awaits, which can be utterly disheartening. Xie Yiren was indeed more considerate. Earlier, he had bumped into her and wondered if he should apologize. Such a thought flitted through Zheng Ren's mind. However, as a man of steel-like straightforwardness, pondering such matters was quite perplexing. After the wards and corridors fell silent, he decided to dismiss the thought and proceed with his rounds. Zheng Ren circled the ward, noting that around 100 patients remained in the emergency department. The observation room was at full capacity, with additional beds lining the corridors. At that moment, no one rushed over to protest against the overcrowding. The patients' conditions were stable. The blue-gray avatars gradually revealed their yellowed skin, offering a surreal visual impact. Stability was reassuring, and Zheng Ren felt a sense of relief as he greeted the on-call doctors from internal and external medicine, instructing them to inform him immediately should any patient's condition change. The sticky discomfort he felt was a result of hypoglycemia leading to excessive perspiration. After a moment's thought, he called the anesthesiology department, and upon confirming they were not busy, expressed his desire to take a shower. To his surprise, the anesthesiologist responded with unexpected warmth. Zheng Ren hung up the phone and made his way to the operating room. The anesthesiologist's demeanor toward Zheng Ren was markedly different from before, likely due to the immense admiration accumulated from the numerous surgeries performed the previous night. Typically, clinical departments lack shower facilities, a luxury found only in operating rooms. Therefore, anesthesiologists tend to be impatient with physicians seeking to use their facilities without cause. Zheng Ren had initially intended to approach the matter politely, but he was taken aback by the anesthesiologist's courtesy. Though the hospital was not devoid of the social machinations and deceit prevalent in society, those with exceptional skills undoubtedly received greater privileges. This was indisputable. After his refreshing shower, he felt utterly rejuvenated. The anesthesiologist offered him a cigarette, and the two settled into a small smoking room. Smoking was prohibited in the hospital, yet the presence of numerous habitual smokers could not be ignored. The anesthesiology department had transformed a small storage room with a window into a smoking area, effectively addressing the smoking issue while preventing secondhand smoke from permeating the corridors. "Zheng, when did you hone your craft?" the anesthesiologist inquired, admiration evident in his voice. "The three of us who worked overtime last night were thoroughly impressed, even though we were exhausted." Zheng Ren chuckled modestly. "Quite remarkable, performing dozens of appendectomies in one night." The anesthesiologist continued. "I must warn you to be cautious of Director Liu. He is not a man to be trifled with." "Yes, I'm aware," Zheng Ren replied. "Having worked for nearly 30 years, I've seen my fair share of incidents." The anesthesiologist imparted his wisdom. 10 years ago, a graduate student from Concordia came to our hospital. 3 years later, Director Liu ensnared him in a medical dispute that was not his fault, inciting the family to escalate the matter. That doctor was subsequently relegated to the suburbs to raise rabbits. The city's first hospital has a storied history. During a time of great scarcity, it acquired land in the suburbs to establish a farm for self-sufficiency. As conditions improved with the advent of reform, the produce from that farm became a benefit for the hospital staff. However, the farm has long since been sold to real estate developers, replaced by towering buildings. Zheng Ren had heard of this history. In our profession, who has not made mistakes? What is to be feared is the watchful eye of others. The anesthesiologist continued to impart his experiences. Small matters can be blown out of proportion. Zhang Ren nodded in agreement, understanding the sentiment deeply. Stay close to Director Pan. He is a respected figure, the anesthesiologist concluded, imparting this vital advice with a tone that suggested the importance of discretion in such matters. Just then, the phone rang, and upon seeing it was Director Pan. Zhang Ren quickly answered, gesturing to the anesthesiologist that he must take his leave. The anesthesiologist expressed regret, having not yet had the chance to inquire about nitrite poisoning. However, given Zhang Ren had just finished an emergency rescue, he was undoubtedly fatigued. After exchanging farewells, Zhang Ren exited the operating room to take the call. Xiao Zhang, someone is looking for you, Director Pan informed him. Upon returning to the emergency department, Zhang Ren found Director Pan engaged in conversation with another individual, both seemingly in high spirits, sharing hearty laughter. The person appeared somewhat familiar. Who could it be? For someone afflicted with severe face blindness like Zhang Ren, recognizing anyone not encountered daily proved challenging, regardless of his high IQ of 150 or his photographic memory. It was a formidable task for a face-blind individual to identify a stranger based solely on their silhouette. Director Pan, I'm back, Zhang Ren announced as he approached the two. Old Sen is looking for you. He wishes to express his gratitude. You should hurry off for dinner and get some rest, Director Pan advised. Only then did Zhang Ren clearly see the visitor's identity, coupled with Director Pan's words. He recalled that this was the butler of the wealthiest man in Haiqing. He was uncertain of the relationship between Director Pan and Old San, or why Director Pan referred to him in such a familiar manner. Old San, good to see you again, Zhang Ren greeted with a warm smile, his demeanor gentle and refined. Dr. Zhang, a remarkable young man, truly impressive, Old San remarked. Let us not stand here exchanging pleasantries. Director Pan interjected with a wave of his hand, somewhat commanding in tone. The corridor is nearly full. I want to have you both sitting in my office. I heard Zhang Ren experienced hypoglycemic fainting earlier. Old San, ensure he gets something to eat quickly. And let me be clear, if anyone dares to ply him with alcohol, I will hold you accountable tomorrow. Old San chuckled, dismissing the idea with a wave of his hand, indicating such a scenario would not arise. Director Pan, what about the patients? Zhang Ren still harbored concerns for the hundreds of individuals suffering from nitrite poisoning, fearing unforeseen complications. The medical profession is fraught with uncertainties. Even the most skilled hands cannot prevent accidents. Though the patients had been stabilized, who could guarantee against liver or kidney failure? Who could assure that transient toxic shock would not precipitate further ailments? Do you think the hospital cannot function without you? Director Pan chided gently, his eyes filled with affection, akin to that of a parent regarding their most cherished child. Tonight, I grant you permission to turn off your phone and rest. The sky could fall, and I want to seek you out. Zhang Ren nodded. Whether they were junior physicians, seasoned attending doctors, or those residing in the hospital without a home to return to, all shared a common habit of keeping their phones on 24/7. When the phone rang at night, and it was the hospital calling, the adrenaline would surge even before the call was answered. The notion of cozying up in bed or waking up grumpy simply did not exist. Just as during the recent emergency rescue, the hospital mobilized its entire resources for the hundreds of patients, requiring a vast number of medical personnel to collaborate seamlessly. If it had solely depended on Zhang Ren, it was likely that the vast majority of patients would have already succumbed. Zhang Ren smiled and nodded in agreement. Dr. Zhang, this way please, Old San invited warmly, his demeanor and mannerisms instilling a sense of joy. After bidding farewell to Director Pan, Zhang Ren and Old San stepped out of the emergency building. A sleek, black, elongated vehicle awaited them at the entrance. Zhang Ren had never investigated luxury cars, thus remained ignorant of the brand or extravagance. A portly driver, clad in a suit and bow tie, opened the door and bowed slightly, inviting them inside. Zhang Ren observed that the vehicle's doors opened oppositely, unlike the typical household sedan or SUV. Once inside, after exchanging a few casual remarks with Old San, Zhang Ren was swiftly overtaken by fatigue. Human beings are not made of iron. During the emergency, his body had automatically released adrenaline, allowing him to forget his exhaustion and hunger. Now, however, the cumulative toll had come rushing back, and Zhang Ren longed to lie down and enjoy a deep, restorative sleep. As the evening twilight descends, even the most luxurious car cannot hasten its pace. After nearly half an hour, the sleek black vehicle finally arrived at a modest, unassuming courtyard. Above the entrance hung a sign, elegantly inscribed with the four archaic characters, Red Clay Pavilion. Two attendants stood at the doorway, silently and professionally assisting Mr. San, Zheng Run, as he stepped out of the car. The courtyard, though small, featured an artificial hill and a gentle stream, meticulously crafted to evoke a sense of tranquility amidst the bustling city. However, Zheng Run, devoid of any refined sensibilities, showed no interest in such artistic designs. After all, those who could indulge in such luxuries were undoubtedly wealthy, while he had endured countless hardships merely to sustain himself. He possessed neither the leisure nor the inclination to ponder over such trifles. Upon entering the courtyard, a woman clad in a red trench coat and with flowing black hair approached him. "Dr. Zheng, at long last, we meet," she said, her tone polite and warm. This woman, or perhaps a girl, was extraordinarily beautiful, her skin pale and radiant, as if she were a divine being sculpted from a single piece of jade. Her features were striking, and her eyes sparkled like stars, seemingly capable of piercing through Zheng Ren's very soul. Yet, her age was indiscernible. Her demeanor suggested a woman in her 30s or 40s, exuding the poise of a seasoned businesswoman, while her youthful eyes hinted at someone merely in her 20s. Zheng Ren paused momentarily before offering a gentle smile and extending his hand. Her icy fingers brushed against his, light as a dragonfly skimming the water's surface, leaving no trace of warmth. "I am Bu Li, the daughter of Bu Yun Pavilion. Please, do come in, Dr. Zheng." She gestured graciously for him to enter. Zheng Ren recognized the wealth of Haiqing's richest man, indeed bearing the surname Bu. Furthermore, he recalled that Bu Yun Pavilion had conducted at least 10 pre-operative consultations, and he distinctly remembered the name Bu Li. Yet, the name seemed rather antiquated. Upon entering, they took their seats, and a chef wearing a tall white hat began preparing a variety of delectable dishes at the dining table. Zheng Ren had never encountered such a scene and felt no enthusiasm for it. He would not be swayed into expressing any awe. To him, it was merely a plate of vegetables and undercooked meat. Noticing Zheng Ren's indifference, Mr. San appeared intrigued, effortlessly engaging in lively conversation, sharing tales from far and wide, all of which resonated with Zheng Ren's palate. Bu Li occasionally chimed in, offering her insights on the dishes, enhancing Mr. San's jovial discourse with her sparse, yet impactful words. The meal was rather bland, and the beef undercooked. Zheng Ren found himself unsatisfied, reminiscing about the skewers from the small shop near his home. How delightful it would be to enjoy a few skewers paired with an ice-cold cola. That, he mused, is the essence of life. As Zheng Ren's weariness became more apparent, both Mr. San and Bu Li, perceptive as they were, exchanged glances. Bu Li then remarked, "I must extend my gratitude to Dr. Zheng for his generous assistance in my father's surgery. You are too kind. It is merely the duty of a physician." Zheng Ren replied with a smile, "Yet, there is no should in such matters. From my perspective, regardless of your expertise, one must ultimately bear the consequences." Bu Li understood. Life, he mused, is fundamentally similar across the board. Zheng Ren smiled quietly, saying nothing further. "A blessing in disguise, perhaps. Dr. Zheng, this opportunity in the emergency department may lead to boundless prospects," Mr. San commented. "Ah, I have grown accustomed to it," Zheng Ren replied nonchalantly. In the hospital, one witnesses the myriad facets of humanity. Thus, many matters gradually lose their significance. For instance, most caregivers of comatose patients are mothers. Spouses often prefer to forego treatment. Children who care for their aging parents are typically not the favored ones at home. And if a woman presents with an ectopic pregnancy, one must promptly secure the man who brought her, lest he absconds, leaving no one to cover the medical expenses. His voice was calm, reminiscent of an elder who has seen through the vicissitudes of life, seated before a warm fire, reminiscing about the past. Outside, the cold wind howled, while inside, an air of desolation lingered. Wrapped in a blanket, he reflected on his bygone days, a wave of melancholy washing over him. Mr. Sen nodded, having long since discerned these harsh realities. Bu Li's gaze dimmed slightly as she remarked, "Dr. Zheng perceives the truth. Each family's circumstances differ. Yet the affairs of this world bear a striking resemblance. It truly is disheartening." After a moment of reflection, Bu Li's expression brightened as she smiled, filling the room with warmth. "However, I must trouble you with a matter, Dr. Zheng." "Please, go on," Zheng Ren urged. "Suspected nasal and T-cell lymphoma," she stated. Zheng Ren noted that it was customary for the families of patients to host a meal to foster goodwill with the physician, ensuring future medical dealings would proceed more smoothly. Yet, such a matter hardly seemed fitting for the scion of Haiqing's wealthiest family to consider. Zheng Ren sensed it might be yet another troublesome affair. Then I must rely on your expertise, Dr. Zheng, Bu said, clapping her hands. A female assistant entered, carrying a stack of medical images. These are my brother's scans, Bu explained. Zheng Ren observed a flicker of unspoken annoyance in her expression as she mentioned the word brother. My apologies for the inconvenience. He is my half-brother, Bu quickly clarified, sensing Zheng Ren's fleeting thoughts. He has been suffering from nasal ulcers for the past 6 months, and none of the treatments have yielded improvement. This should be evaluated by an otolaryngologist. I am merely a general surgeon, Zheng Ren thought to himself, feigning attentiveness. Leading specialists in the country suspected nasal NK T-cell lymphoma. Yet 3 biopsies had consistently revealed only inflammation. My father was overly worried and distressed, only to later discover he had pancreatic cancer, Bu continued. Zheng Ren harbored little interest in the entanglements of affluent families, even though he had begun to piece together the myriad grievances within the Bu family from her words. Such scandals could be perilous. Zheng Ren preferred to steer clear of them. He picked up the thick stack of images, preparing to examine them under the light, when Buli's assistant wheeled in a brand-new viewer. How remarkably professional, Zheng Ren thought, impressed, for Buyun Pavilion certainly lived up to its reputation. I wish to see the patient, he said, somewhat impatiently. I doubt he will allow a physical examination, Bu remarked. A glance will suffice. I have a general idea already, Zheng Ren replied. Without examining the patient, how can I ascertain whether this is indeed nasal NK T-cell lymphoma? It would be reckless to rely on a general surgeon for a diagnosis that even specialists struggle with, he admonished inwardly. Yet, fortune seemed to favor him, as he had the necessary systems at his disposal. Zheng Ren's words left both Bu and Mr. San momentarily taken aback. They exchanged glances before Mr. San quietly exited. The room fell into silence, the chefs having retreated the moment the assistant entered. Zheng Ren pretended to be engrossed, though his mind wandered as he examined the images, comparing them one by one. Having dedicated over a decade to medicine, he had acquired the ability to feign professionalism, even if he struggled to comprehend the details. After about 20 minutes, a defiant voice echoed from the corridor. The words were somewhat muffled, and Zheng Ren could not discern what was being said. Soon, the door swung open, and Mr. San entered, effortlessly lifting a 14 or 15-year-old boy who was squirming in resistance. Forgive the inconvenience, Dr. Zheng, Mr. San said. The child has visited the hospital so often that he has developed an aversion to doctors. Zheng Ren stared in astonishment at Mr. San, who casually held the struggling boy with a single hand, marveling at the strength that commanded such respect. Upon seeing the child, Zheng Ren's gaze caught the medical history and final diagnosis in the upper right corner. At that moment, he could not help but feel a mix of amusement and disbelief. Such was the chaos of affluent families. Mr. San, you are too kind. Let the child go. This commotion is unnecessary, Zheng Ren suggested. Standing behind Mr. San, a man's expression darkened. Miss, are you insulting the young master? Excuse me? Bu elongated her tone, casting a sharp glance at the man, her eyes glinting with an underlying fierceness. You said to bring the young master, and so we have. Upon a mere glance, the man was dismissed, prompting him to retort. Do you presume to treat me like a fool? He stood his ground, adding, the master is unwell, and the young master's disposition is equally poor, even suffering a nosebleed at midday. Should your actions exacerbate his condition, I shall report this directly to the master. As you wish, Bu waved dismissively, unconcerned. The man, teeth gritted yet powerless against Bu, turned his attention to Zheng Ren, demanding, from which hospital do you hail, Professor? The title was laced with mockery, as Zheng Ren's youthful appearance belied such a rank. I am undeserving of the title, Zheng Ren replied, unfazed. He was accustomed to the varied encounters within a hospital setting, and such derision was but a passing breeze. Having disrupted the young master's peace, have you discerned the nature of his ailment? The man sneered. Insolence, Bu rebuked. He is the physician who operated on the master. Professor Senjuro performed the surgery. If the young lady cannot provide a satisfactory explanation, I shall escort the young master to the master himself for answers. Your word does not yet hold sway within the Bu family. Zheng Ren found himself embroiled in a tiresome familial dispute. Are you certain you wish to know? He inquired, a smile playing on his lips. What is it? Speak plainly. Do not equivocate. The man snapped. Then enter and close the door. The malady is peculiar. I trust there are no unintended ears present? Zheng Ren questioned. If you have something to say, then say it. The man replied impatiently. Very well. Zheng Ren pointed to the most recent MRI image on the viewer. The patient's imaging diagnosis suggests nasal NK T-cell lymphoma. However, considering the comprehensive medical history, this diagnosis is untenable. Nonsense. The man retorted, growing increasingly agitated. I posit that the patient is engaging in the consumption of illicit substances, Zheng Ren declared. His words rippled through the room like a stone cast into a pond. Third Master's countenance shifted, a thoughtful expression settling upon him. Bu Li, however, was perplexed, scrutinizing Zheng Ren. How could he arrive at such a diagnosis after only a brief examination and 20 minutes spent reviewing the MRI scans? Even the seasoned professors from the capital and Shanghai had not spoken with such certainty. What was the source of his conviction? Preposterous, the man exclaimed. Then turning to Bu Li, he threatened, I shall report all that has transpired here to the master. As you wish, Bu Li responded. Dr. Zheng, Bu Li inquired. There are no visible needle marks on his body. He is likely mixing the substance with shards of glass, which, when inhaled, cause the capillaries in the nasal passage to rupture, allowing direct entry into the bloodstream and heightening the sensation, Zheng Ren explained. The child, previously struggling in Third Master's grasp, suddenly stilled, a look of terror in his eyes as if he had seen a specter. He had believed his actions to be clandestine, never imagining they would be so easily uncovered. Conduct a blood test at the hospital. If he experienced a nosebleed this morning, traces of the chemical substance should still be detectable in his bloodstream, Zheng Ren concluded. The boy's palpable fear, coupled with Zheng Ren's certainty, instantly convinced the others of the truth. How could anyone have suspected such a thing? Third Master released the child, cupping his hands in a gesture of respect. I was mistaken. Dr. Zheng, your acuity is truly remarkable. Zheng Ren chose not to dwell on the deeper implications of Third Master's words. He cared not whether Third Master served Bu Li or the child. Such internecine struggles for wealth inevitably led to ruin. The other man, bewildered, watched as the boy was released, attempting to steady him. However, the sudden revelation caused his legs to weaken, and he stumbled precariously. Dr. Zheng, you must be weary. I shall have someone escort you home, Third Master said calmly. Zheng Ren, eager to depart, accepted the offer. A line of men in black suits stood outside the door, led by the burly man from the emergency room, whom Third Master had called Little Lu. Escort Dr. Zheng home, Third Master instructed. Furthermore, address the events of this afternoon and provide Dr. Zheng with an explanation. With that, Third Master bowed in farewell. Dr. Zheng, this way, please, Little Lu said respectfully. May I inquire as to your esteemed surname? Zheng Ren asked. You are too kind. Just call me Little Lu. You are a benefactor to the Bu family, and therefore a benefactor to me as well. No need for such formalities, Little Lu responded, his tone subservient, a stark contrast to his menacing demeanor in the emergency room. As they exited the mansion, a man stood outside, disconsolate. Zheng Ren frowned. A gaudy gold chain, thick as a finger, gleamed ostentatiously in the night. Dr. Zheng, I was mistaken, the hulking man stammered, his former ferocity replaced by a pitiable demeanor. Zheng Ren ignored him, turning to Little Lu. Is this your car? Sixth brother? An Audi Q7 was parked nearby, a model Zheng Ren recognized, unlike the opulent vehicle that had transported Bu Li, which was beyond his comprehension. You are too kind. Just call me Little Lu. Little Lu grinned, gesturing towards the hulking man. Dr. Zheng, how do you wish to deal with him? Deal with him? Zheng Ren asked, puzzled. He had no experience with such matters and had no desire to become involved. Third Master instructed me to protect you. During the afternoon's rescue, the police arrived, and my brothers and I relaxed our vigilance. I never imagined he would seize the opportunity, Little Lu said, his voice growing increasingly indignant, the scar on his face seeming to writhe with malevolence. The once imposing man now cowered before Little Lu, unable to offer a single word in his defense. Oh, Zheng Ren said. Have you eaten? Not yet, Little Lu replied, taken aback. Seeing Zheng Ren avert his gaze and sensing his disinterest in the man, he hastened to open the passenger door. You are too kind. You are too kind, Zheng Ren smiled. As Zheng Ren entered the vehicle, Little Lu approached the hulking man and kicked him without a word. The man crumpled to the ground as if broken in two. Consider yourself fortunate that Dr. Zheng does not hold you accountable, Little Lu said, planting his foot on the man's head and twisting, the sound of skin scraping against the pavement reminding Zheng Ren of a crushing injury. Transfer the demolition contract from your company tomorrow and never return to Haiqing. With that, he turned and left, decisive and resolute. Little Lu entered the car, started the engine, and drove away into the night. Dr. Zheng, I am a rough individual. I hope you are not too offended by my actions, Little Lu said, grinning. Those fellows were unable to discern the gravity of the situation. Even in these times, they persist in their petty squabbles. I doubt they will last much longer. At the mouth of the alley, a red banner proclaimed, "Eradicate gangsterism completely." Zheng Ren smiled and nodded. Dr. Zheng, where do you reside? Little Lu asked. Zheng Ren provided an address, then hesitated. There is a skewer shop at the intersection. If you have not eaten, perhaps we could grab a bite together? Little Lu was surprised. Have you not just finished eating? Vegetable snails, foie gras caviar. And the meat was barely cooked. I am still hungry, Zheng Ren replied honestly. Haha. Little Lu laughed heartily. Dr. Zheng, you are forthright. I, too, find Western cuisine unpalatable. I prefer a roadside stall to a French meal. With those words, the distance between them lessened. Zheng Ren and Little Lu consumed dozens of skewers at the roadside stall, finally satiating their hunger. They exchanged phone numbers and WeChat contacts before heading home to rest. Upon arriving home, Zheng Ren found Little Zhao absent. He showered, brushed his teeth, and fell into a deep slumber. Knowing that all was well, he slept soundly, undisturbed by dreams. He awoke refreshed at 6 in the morning. After a cold shower, Zheng Ren felt invigorated. He ate breakfast at a nearby shop and took the bus to the hospital. As he entered the emergency building, he was met with a cacophony of noise. Yesterday, the emergency department was inundated with patients, their families, and hundreds of individuals crowded into an area of less than 1,000 square meters. The cacophony was almost overwhelming. Yet Zheng Ren found a peculiar sense of tranquility amidst the noise. To be alive is to have the privilege to complain about poor conditions. As he traversed the corridor of the emergency department, patients and their families greeted him warmly. He felt a profound sense of relief upon seeing a patient who had resembled an avatar the day before, now devoid of the blue discoloration. With a smile, he exchanged pleasantries with patients before changing into his scrubs in the duty room. The emergency department operated with remarkable efficiency. Early in the morning, he accompanied Director Pan on rounds, after which the director went to coordinate personnel and equipment for the emergency center. As patients received treatment and their conditions stabilized, more individuals approached Zheng Ren, requesting discharge. Each time, he patiently explained that those suffering from acute poisoning had sustained significant liver damage. During the treatment with myelin, the liver might exhibit exudation, potentially irritating the gastrointestinal tract, bile ducts, and pancreas. The conclusion was that they needed to remain hospitalized or under observation in the emergency department for a week until their condition stabilized and complications were ruled out. At this juncture, patients no longer faced life-threatening situations. Their psychological needs shifted from seeking treatment to desiring better conditions during their recovery. These unspoken desires became a source of considerable trouble for Zheng Ren. Phone calls flooded in from Director Pan, department heads, and even the hospital director, inquiring about patient conditions and requesting room changes. Given the scale of the food poisoning incident, securing a private room was exceedingly challenging. Consequently, those who could no longer tolerate the clamor of the emergency department corridor, after reassuring themselves of their well-being, began to adopt more assertive measures to discharge themselves. Despite Zheng Ren's attempts to dissuade them, patients and their families had a myriad of reasons to leave. Zheng Ren felt helpless. The hospital's resources were limited. Most elderly patients struggled to rest adequately, with some even exhibiting arrhythmias due to underlying heart conditions. He prepared a communication form for patient discharge, stating that while they could leave, they must sign a document indicating that it was a voluntary discharge at the strong request of the family. The form outlined the possible complications and stipulated that they would bear responsibility for any consequences. This communication document deterred some patients and families from leaving the hospital. After all, it was merely a week. How could they not endure it? Yet a greater number still chose to sign the discharge forms. As patients departed, the corridor gradually emptied. With no critically ill patients to attend to that day, Zheng Ren sutured 2 minor wounds without even calling upon Xia Yiren. The quietude seemed pleasant. He sat in his office, staring blankly at the gradually yellowing leaves outside. The frenetic pace of the previous days felt like a distant memory, yet it had taken a toll. Fortunately, all patients suffering from nitrite poisoning had been treated promptly and escaped life-threatening situations, a small blessing amidst the misfortune. Zheng Ren overheard nurses gossiping about a chef from the city's largest chain of braised meat restaurants who had mistakenly used nitrite instead of table salt, leading to the calamity. As for the presence of nitrite in the restaurant, Zheng Ren surmised it was a preservative to enhance the color of less-than-fresh meats. He paid little attention to the consequences faced by the restaurant owner. Considering his plans to perform emergency surgeries in hepatobiliary and pancreatic surgery, he had only practiced the traditional cholecystectomy due to insufficient surgical training time. Although he was proficient in open surgery, he had yet to practice laparoscopic techniques. Zheng Ren understood the necessity of mastering the local anatomical structures before conducting surgeries to avoid unforeseen complications. His education had not sufficiently covered this aspect. Now well-versed in the anatomy of the gallbladder region, he awaited an opportunity to acquire additional surgical training time to learn laparoscopic procedures. With only 20 days of surgical training time, he realized it was far from adequate. Nowadays, hepatobiliary and pancreatic surgery predominantly employed laparoscopic techniques. Even for simpler cases of pancreatic and gallbladder cancer, Zheng Ren was skeptical, believing that removing tumor tissue posed significant challenges. If the tumor contaminated surrounding tissues, patients would face the risk of metastatic spread. Nevertheless, he recognized that emergency cases of tumor patients were rare, and his focus remained on executing cholecystectomies effectively. Gazing at his accumulated 930 skill points and 75,000 experience points, Zheng Ren felt an overwhelming urge to invest them all into the hepatobiliary skill tree. Had it not been for the lurking threat of erasure from the system, he might have already allocated all his skill points. The looming danger felt akin to the sword of Damocles, compelling him to remain perpetually prepared for unpredictable risks. During his moments of respite, Zheng Ren repeatedly reviewed his hepatobiliary surgical texts, striving to comprehend the anatomical structures and surgical protocols. He wished to express his gratitude for the support received, noting the impressive metrics in terms of recommendations, subscriptions, and collections during the ongoing promotions. Entering the next tier brought both excitement and trepidation. He fervently hoped not to falter. He resolved to maintain a rigorous update schedule, releasing new content 4 times daily starting Sunday. He earnestly requested continued support, expressing his sincerity and appreciation. As he began establishing the emergency surgical unit, he realized that reading could also yield skill points, albeit in minimal increments. Over the course of a day, his general surgery skill tree only increased from 1690 to 1690. 12. Prior to this, he had been unaware that the system could measure skill points to such precision. He yearned for the system to issue tasks, providing him with direction to effectively utilize his accumulated surgical training hours. The day unfolded in a rather uneventful manner. Typically, a resident must be on standby at the hospital for 24 hours, a commitment lasting at least 6 months. However, Zheng Ren found himself exempt from this obligation, as the emergency department lacked the capacity for larger surgical procedures and the requisite medical staff. Should any issues arise, the on-call physicians would contact him. After work, he returned home, engaging in reading, personal care, and rest. Life was rather mundane, with the system remaining quiet and devoid of new tasks. Zheng Ren felt a mix of curiosity and anxious anticipation. Director Pan visited the administrative offices daily, though the results of his efforts were not significant. After 5 days of exertion, they had managed to recruit a handful of nurses. Unfortunately, every department was understaffed, leaving Zheng Ren disheartened. Eventually, the hospital conceded to Director Pan's persistent attendance, agreeing that whenever a doctor expressed willingness, they could transfer to the emergency department. Director Pan harbored a myriad of unspoken frustrations. If the emergency department were so desirable, he would not have to exert himself so diligently, wearing out his welcome. After conferring with Zheng Ren, they decided to tackle cases of appendicitis and acute cholecystitis first. With the most basic nursing staff in place, Zheng Ren assured he could independently perform surgeries. And he also secured the assistance of 2 anesthetists, thus establishing the initial framework for the emergency surgical unit. It was only due to Director Pan's efforts that this was made possible. 5 days later, Director Pan announced the official establishment of the emergency surgical unit and ward. Zheng Ren finally received a task from the system. General task: establishment of the emergency surgical unit. Task requirements: complete 5 cholecystectomies in the emergency department. Task rewards: 50 skill points, 1,000 experience points. The higher the completion rate of the surgeries, the greater the rewards. Task duration: 1 week. The system's voice resonated in Zheng Ren's ears, bringing an overwhelming sense of joy akin to a long-awaited rainfall. After all, relying solely on reading to gain skill points was exceedingly slow. In 1 week, through reading and performing various suturing techniques, Zheng Ren's general surgery skill increased from 1690 to 1692 points. If this rate of growth continues, it would take 33 years to reach a master level. Normally, the advancement of a physician proceeds at such a slow pace. However, Zheng Ren is different. He possesses a system, and he is proud of it. Newly established departments inevitably indulge in gatherings, fostering a sense of belonging among all members, especially now that there are no patients, allowing everyone to participate. Once operations officially commence, it would be nearly impossible for the entire department to dine together again. Amidst the celebratory atmosphere, Director Pan feels a sense of accomplishment, as the emergency department has taken a crucial step toward becoming an emergency center under his guidance. As for staffing, medical personnel are like water in a sponge. A little pressure will yield a flow. Recently, patients who have been under observation in the emergency department have learned of its upgrade to an emergency center. They prepared banners in advance, expressing their heartfelt gratitude while also joining in the festivities. The banners presented at this time will undoubtedly be preserved intact by the emergency center of the first municipal hospital. In the future, should they return, they can share with unfamiliar doctors and nurses. Look at that banner. It was from the time when Although there was no ceremony involving red cloth or flowers, the genuine appreciation of the patients left Director Pan feeling quite satisfied. Qin Feng, a graduate from a prestigious university, ventured into entrepreneurship in the capital after graduation, establishing an internet company with a commendable annual income of several million. Just as the company was entering a growth phase, a troubling matter arose. His mother recently began experiencing persistent tinnitus and dizziness to the extent that she feared movement as it exacerbated her symptoms. With no choice, he set aside his work and returned to Haicheng to seek medical attention for her. Endless phone calls from the company added to his distress. And despite consulting numerous hospitals across Haicheng, the capital, and Shanghai, a diagnosis remained elusive, leaving Qin Feng in turmoil. In Haicheng, he encountered a bewildering diagnosis when a doctor from the emergency department suggested his mother undergo a tooth extraction. Could tooth extraction truly treat tinnitus and dizziness? With his advanced education, Qin Feng logically dismissed this notion. However, this experience made him acutely aware of the inadequacies within Haicheng's medical system. By sheer coincidence, he decided to heed the doctor's advice and took his mother to the third hospital of Peking University for consultation. After exhausting the regular appointments without any conclusions, the only option left was to secure an appointment with a specialist. Through online searches, he identified several renowned professors at the hospital. The prior procedures had been straightforward, devoid of complexity. However, obtaining a specialist appointment soon proved to be a significant challenge for Qin Feng. Arriving at the hospital in the early morning, he found himself amidst a sea of individuals also seeking specialist consultations. Observing the hundreds of people around him, many lamenting their inability to secure an appointment even after a month, exacerbated his impatience. In a moment of desperation, he purchased a scalper's ticket. The normal fee for a specialist appointment was 100 yuan, but through the scalper, it escalated to 5,000 yuan. Although it pained him to spend such a sum, Qin Feng endured it, as his mother's swift recovery was paramount, allowing him to devote all his energy to his career, something that cannot be bought with 5,000 yuan. The specialist appointment was scheduled for 3 o'clock in the afternoon. By 1:30, Qin Feng had brought his mother to the third hospital of Peking University. The hard plastic chairs were uncomfortable, so he thoughtfully laid a small blanket for his mother, allowing her to lean against him, remaining perfectly still. Movement intensified her dizziness and tinnitus, a torment that had plagued him for quite some time. Finally, when their turn arrived, Qin Feng felt invigorated as he wheeled his mother into the consultation room. The attending physician was a venerable old professor, exuding an aura of security. Qin Feng could not help but compare him to the young doctor from Haicheng, whom he silently scorned. The old professor meticulously inquired about the medical history and examined the scans that Qin Feng had brought, ordering further tests for his mother. The endless cycle of examinations nearly drove Qin Feng to madness. Nevertheless, he persevered, spending 2 hours completing the tests, only to find the old professor preparing to leave as he returned with the results. The professor placed the CT scans on the viewer and, donning his reading glasses, studied them intently for 10 minutes. "Have you had dental implants in the past 2 years?" he inquired slowly. Yes, Chui Hemming replied. How peculiar, the professor remarked, adjusting his glasses and pointing to an image of a dental prosthetic. It's made of amalgam, whereas modern implants typically use resin. This is quite rare. Chui Hemming felt a sudden disorientation as an unwelcome figure crossed his mind. Call the dentist who treated your mother and inquire about the material of the prosthetic. The professor instructed, beginning to pack his belongings, indicating it was time to leave. Chui Hemming promptly dialed the number of a familiar oral surgeon who had been treating his mother for over a decade. The dentist confirmed that the prosthetic was indeed made of amalgam. Putting down the phone, Chui Hemming felt a deep admiration for the old professor. To discern the material of a dental prosthetic from an image was a remarkable skill. Nonsense, the professor retorted, pointing to two areas on the scan. These are two prosthetics, one from over a decade ago, a gold crown, which was quite popular at the time, and the other, a recent amalgam prosthetic. Different metal materials in the mouth can create a galvanic effect, amplifying biological electricity. Can it be surprising that you experience dizziness and tinnitus? Chui Hemming was somewhat bewildered by the professor's explanation, yet the term galvanic effect resonated with him. 5,000 yuan for a scalper's ticket. All for naught, he muttered, his speech faltering. Indeed, the professor affirmed with authority, removing the scans from the viewer and switching off the machine. You simply need to have a tooth extracted. Chui Hemming felt 1,000 alpacas stampeding through his mind. This diagnosis was identical to that of the young doctor from Haiqing's emergency department. Are you certain? He asked, somewhat dazed. Of course, the old professor replied, unperturbed by the family's skepticism. This condition is documented in textbooks. Amalgam crowns were known for their durability, often lasting a lifetime, and they were inexpensive, having been widely used over a decade ago. However, the drawbacks were apparent. They required a square dental post, which only skilled practitioners could create. As the professor began to change out of his coat, he added, the dentist who treated your mother had good intentions, but overlooked the fact that she had a gold crown. He noted, such cases have become increasingly rare over the past decade, as resin materials have largely taken precedence. Chui Hemming felt a sense of absurdity wash over him. After all the toil and trouble, had it all been in vain? The conclusion drawn from the 5,000 yuan scalper's ticket mirrored that of the emergency department in Haiqing. Was this not absurd? What? The professor, noticing Chui Hemming's detached demeanor, assumed he was in disbelief. No. Chui Hemming thought to himself, feeling anger bubbling within him, wishing he could voice his frustrations as he had in Haiqing. However, he dared not express such sentiments here in the capital. A doctor from the emergency department in Haiqing suggested my mother have a tooth extraction, Chui Hemming admitted, somewhat absent-mindedly. Oh, the emergency department? Your emergency care in Haiqing must be quite impressive, the old professor chuckled. Come now, it's time to finish for today. Tomorrow just come by. I want to be in practice, but I'll extract your mother's tooth. Chui Hemming refrained from asking why the extraction could not be performed today, concocting excuses in his mind about staff availability. However, with a clear diagnosis, matters became much simpler. The following day, after the extraction, his mother's symptoms completely vanished. By the third day, she appeared rejuvenated, even beginning to apply light makeup. Coming from a prominent family, her refined demeanor returned, exuding grace and elegance. With her health restored, Chui Hemming felt a surge of joy and promptly booked a flight back to Haiqing. On his journey, he harbored an inexplicable sentiment towards the young doctor at Haiqing City Hospital. After much hesitation, it was his mother's unwavering insistence that led him to prepare a banner, intending to present it to the unknown physician. After a week of back and forth, Chui Hemming, eager to return to the capital, hastily arranged for the banner and, accompanied by his mother, made his way to the hospital. Upon their arrival at the emergency building of the hospital, they were greeted by a bustling scene. Many individuals were holding banners outside, merely spectating without entering, which left him feeling somewhat awkward. Should he simply leave the banner in the doctor's office without even greeting the young doctor, thus missing the chance for a benevolent connection? Curiosity piqued. Chui Hemming lit a cigarette and inquired about the situation from a bystander. It turned out that the emergency department had been upgraded to an emergency center, signifying its official opening. The individual accepted the cigarette with a smile, savoring its quality, and remarked on the unusual number of banners being presented. When Chui Hemming expressed ignorance regarding the situation, the bystander, astonished, began to narrate the events surrounding a case of nitrite poisoning and the subsequent emergency responses, detailing the fate of the owner of a braised meat shop, which was a well-established establishment with numerous chain outlets. Cui Heming listened in astonishment as the bystander recounted how ambulances across the city were overwhelmed, with private ambulances being requisitioned in a desperate attempt to manage the crisis. He found it hard to believe that no one had died, given the scale of the emergency, as such situations often stretched medical resources to their limits, and certain outcomes were beyond reach. The bystander, enjoying his tale, described the patients arriving, appearing almost like avatars with their blue-tinged skin, reminiscent of a scene from a martial arts novel. Cui Heming followed the bystander's gaze to see the young doctor, Zheng, standing alongside the senior director, the very same doctor who had assured him that his mother would recover after a tooth extraction. As he was about to ask why he had come with the banner, he learned it was indeed for Dr. Zheng. Cui Heming felt a twinge of embarrassment for his earlier skepticism regarding the doctor's diagnosis and treatment, especially since the final assessment aligned perfectly with Dr. Zheng's, just as he had prepared himself mentally to express gratitude and apologize for his previous remarks. A vehicle hurriedly pulled up in front of the emergency building. A middle-aged man, clearly distressed, rushed out, exclaiming that his father was suffering from abdominal pain. In an instant, all his mental preparations seemed futile. He stood frozen, witnessing the medical staff swiftly disperse to attend to the new patient, while the elderly man was promptly taken inside on a stretcher. To his dismay, Dr. Zheng had already vanished from sight. As patients were brought in, Zheng's attention was drawn to a notification indicating chronic delayed cholecystitis. A weight settled in his heart, for he recognized this might be a complication arising from acute food poisoning. If antibiotics could be administered judiciously over the course of a week, the chances of complications could be minimized. However, a prevailing trend criticized physicians for the overuse of antibiotics, leading to stringent regulations that often overlook the realities of clinical practice. Zheng swiftly diagnosed the patient with cholecystitis, explaining to the anxious son that the condition arose as a result of transient liver dysfunction due to acute toxicity, which had led to secondary cholecystitis. Though the likelihood of such an occurrence was not high, it was evident that this particular patient was not favored by fortune. Nevertheless, he maintained a smooth and empathetic communication with the patient's family, carefully analyzing the ultrasound results and elucidating the complex interplay of factors that had culminated in this diagnosis. If conservative treatment with antibiotics is employed, the results are unlikely to be satisfactory. After analyzing these matters with the family, they expressed their willingness to follow Zhengren's arrangements. This reflects a certain level of trust in the physician developed through specific interactions. Without the successful emergency response to nitrite poisoning, the patient's family would not have uttered such words as "we will fully adhere to Zhengren's arrangements." Thus, the decision was made to proceed with the cholecystectomy. Zhengren ultimately decided to conduct the surgery, as the elderly gentleman had been feeling unwell since the morning, having abstained from food and water, allowing for a sufficient fasting period. Given the intense pain, preparations for surgery were initiated directly. Half an hour later, the results of the emergency tests were reported. The patient had no contraindications for surgery. After completing the communication with the family and obtaining the surgical consent, Zhengren accompanied the patient to the operating room on the third floor of the emergency building. During the planning of the emergency building, the first floor was designated for emergency care, observation rooms, ultrasound, CT, and laboratory services. The second floor housed the wards, with a planned capacity of 52 beds. The third floor was dedicated to surgical operating rooms, featuring several thousand square meters of space, designed with full laminar flow, making it one of the finest in the country. Director Pan was particularly eager to initiate surgeries in the emergency department, as the operating rooms had attracted the envy of various surgical departments in the inpatient area. Such exceptional operating rooms should not remain idle. If the emergency department had no use for them, many others would certainly take advantage. At the innermost part of the third-floor operating room, there was even an interventional catheter room specifically designed for interventional procedures. The design of the interventional catheter room employed the latest plans. It was a hybrid operating room, capable of accommodating both interventional and surgical operations. This was indeed advanced, as ordinary tertiary hospitals lacked such hybrid operating rooms. The hybrid operating room at the First Hospital of Haicheng was surprisingly underutilized. Failing to make use of it would be a waste. The temperature in the laminar flow operating room remained constant, equipped with a complete set of sterilization facilities. Breathing in the air here gave a sense of total purification. While other doctors moved the patient, Zhengren changed in his surgical attire. It was time to utilize all his skills and experience. Zheng Rin confirmed that the system was not concocting any schemes, but rather had foreseen his undertaking of the cholecystectomy. If he did not train in the system's operating room for laparoscopic cholecystectomy now, when would he? In the smoking area of the changing room. Zheng Rin lit a cheap cigarette, inhaling deeply, feeling a sense of relaxation wash over him, before entering the system space. Once inside, Zheng Rin refrained from adding skill points, as no matter how many he added, it was impossible to reach a master level, which would not result in a qualitative transformation. He accessed the system's marketplace, selected cholecystectomy, and exchanged the task reward of 75,000 experience points for 83 hours of surgical time, then entered the system's operating room to begin training. In this environment, patients were already anesthetized, thus saving considerable time. Outside, performing a cholecystectomy typically required at least 2 hours, including preparation and recovery. However, in the system's operating room, Zheng Rin did not need to consider the patient's condition, postoperative recovery, or wait for anesthesia. He could begin immediately. For his first laparoscopic cholecystectomy, Zheng Rin took nearly an hour to complete. During his time in the general surgery department, he had never held the position of lead surgeon for a cholecystectomy, even if it was categorized as a primary surgery. As he grew more familiar with the procedure, the surgery became increasingly efficient. Time continued to decrease. Similar to his training for appendectomies, in many ways, surgical proficiency is simply a matter of practice. Eventually, Zheng Rin could perform a laparoscopic cholecystectomy in approximately 10 minutes. The system's training duration was a meager 21 hours, during which he managed to perform around 80 surgeries. However, this was sufficient, and Zheng Rin felt exceptionally confident. Upon concluding the system training, he glanced back at the skill tree, noting that his general surgery skill had increased from 1692 points to 1930 points, a significant improvement. Whether this was related to the difficulty of the surgeries, he could not ascertain. Returning to the real world, the smoke he had just exhaled had yet to fully dissipate. He extinguished the half-smoked cigarette and carefully returned it to the pack before changing into surgical attire and entering the operating room. Xie Yiren was already prepared, standing at the instrument table. Upon seeing Zheng Rin enter, she smiled at him, her eyes curving into crescents, radiating warmth. The first cholecystectomy was about to commence. In the special needs ward, room 303, Director Lu Tianxing lay quietly on the bed, while Qin Ming sat beside him. They exchanged no words, both appearing somewhat distracted. The television on the opposite wall flickered with static, its monotonous crackling sound dull and uninviting. After a prolonged silence, Director Lu broke the stillness. "Is the patient's diagnosis definitive?" he asked hoarsely. "Yes, it is clear," Qin Ming replied. "The preoperative preparations are complete, and the patient is under general anesthesia. This is a cholecystectomy of considerable difficulty, and it's his first time." "Are you certain Zheng Rin has never performed laparoscopic cholecystectomy before?" Director Lu suddenly inquired. "I am certain," Qin Ming affirmed. "He has performed some appendectomies and perhaps possesses a certain aptitude, which explains his proficiency. However, I can assure you he has never been the lead surgeon for a cholecystectomy. Whether laparoscopic or open, never. Without having been the lead surgeon, I believe he has assisted before. The role of an assistant in laparoscopic cholecystectomy primarily involves holding the camera, a task less involved than retracting in traditional open surgery. If there is no hands-on experience, that is a relief." Director Lu nodded slowly, closing his eyes. Young people often feel overly confident after mastering one or two surgical techniques. Such impatience is detrimental. Indeed, Qin Ming acknowledged, aware that Director Lu was entering a lecture mode. At this moment, it sufficed for him to respond with simple affirmatives or negatives. In surgery, particularly unfamiliar procedures, the absence of an experienced surgeon nearby often leads to complications. Director Lu kept his eyes shut, murmuring as if reminiscing. "Cholecystectomy may seem minor, merely a primary surgery. But do you know why physicians below the level of chief resident in general surgery are prohibited from performing it? Because the cystic duct and common hepatic duct can sometimes undergo morphological changes due to inflammatory exudate. Severing the common hepatic duct results in irreversible damage." Qin Ming had personally performed a dozen laparoscopic cholecystectomies and was well acquainted with these critical considerations. Yes, especially for novices newly acquainted with laparoscopy. They may struggle to distinguish left from right. Director Pan has truly lost his senses if he dares allow Zheng Rin to perform a procedure he himself cannot execute. Such audacity certainly bodes ill. We can only observe quietly. Just as they spoke, The static from the television suddenly ceased, and Director Liu abruptly opened his eyes. The anesthetist assigned to the emergency operating room today was a classmate of Qin Feng's, who, through internal communication, was aware of Zheng Ren's every move. The endoscope was equipped with a camera system capable of recording and live streaming, although it was uncommon for individuals to share their surgical broadcasts. After much coaxing and certain promises from Qin Feng, his classmate consented to use Bluetooth technology to discreetly transmit the surgical process to him. Knowing Zheng Ren lacked expertise in laparoscopic procedures, Qin Feng connected the signal to the television in the special needs ward, allowing them to watch Zheng Ren's surgery in real time. Although there was no sound, the endoscope was already activated, and it was assumed they were in the process of establishing pneumoperitoneum. Soon, the camera began to shake. The atmosphere in the special needs ward was tense, even more so than if they were the ones performing the surgery. Recalling Zheng Ren's astonishing feat of performing 49 appendectomies in one night, and the final procedure, a transrectal laparoscopic appendectomy, of which even Director Liu was unaware, Qin Feng felt a surge of anxiety. He was certain Zheng Ren could not manage this operation, especially as the patient had been suffering from inflammatory exudate for 5 days, resulting in significant adhesions and increased surgical difficulty. Suddenly, there was a fluctuation in the traffic monitoring of the Qin Garden website. As hundreds of individuals flooded into the video live stream, CEO Peng Jia, having learned from past experiences, limited the account's streaming capacity to 10,000 viewers and established contingency plans. The master hasn't performed surgery for several days. I truly miss the fluidity of an appendectomy. What procedure is this time? Let me take a look. Laparoscopy. Laparoscopy. So exciting. I've just begun to learn about laparoscopic surgery. I wonder how proficient the master is in this technique. Would you dare to broadcast a surgery if it were you? Your skill must be exceptional. As hundreds engaged in lively conversation, exclamations of 666 echoed throughout the chat. The proficiency of the surgeon in laparoscopic techniques was a separate matter. Everyone remained enraptured by the recent, overwhelming appendectomies. The atmosphere in the special care unit was far less animated than that of the online stream. Director Liu and his apprentice, Qin Feng, though repeatedly affirming that Zheng Ren had never performed a laparoscopic surgery nor undergone further training, could not suppress their anxiety. Soon, the endoscope entered, revealing a severely adhered gallbladder triangle on the screen. At this sight, Director Liu finally displayed a hint of satisfaction. Had he been the one performing the surgery? Encountering such a situation would necessitate heightened focus to delicately free the anatomical structures of the gallbladder triangle. A moment's carelessness could lead to fatal consequences. If it were a novice, no, even if it were Qin Feng, faced with such a scenario, the only viable solution would be to call for someone else to take over. He himself would not dare to undertake such a challenging procedure. Wow, it's actually a laparoscopic cholecystectomy. Who claimed the master couldn't perform laparoscopic procedures? Step forward. I promise not to harm you. It seems the master doesn't use laparoscopy for appendectomies because his incisions are sufficiently small, rendering it unnecessary. In Qin Garden, the audience's enthusiasm for the surgery intensified. An appendectomy, no matter how expertly executed, merely involves removing an appendix, a task typical of a resident physician, no matter how advanced. There is a saying, if one can cook potatoes and cabbage deliciously, then they are a true chef. The same applies to appendices, which are akin to potatoes and cabbage. Through the live broadcast of the surgeon's appendectomy skills, those who had previously witnessed surgeries were certain that this individual was indeed a master. However, it must be acknowledged that everyone possesses different talents, and once a certain level of skill is attained, further improvement in surgical proficiency becomes exceedingly challenging. Observing the appendectomy from afar holds little significance, as it offers no reference point, neither in skill nor in physical endurance. The laparoscopic cholecystectomy, however, is a different matter. In the early 21st century, domestic hospitals began to embrace laparoscopic procedures with various departments, including thoracic surgery, general surgery, and gynecology, gradually adopting minimally invasive techniques. It was not until a decade later, as senior directors retired and a new generation adept in laparoscopic skills took to the clinical front lines, that these techniques became commonplace nationwide. Nevertheless, the growth of laparoscopic minimally invasive technology has been remarkably swift. In 2001, a notable expert in the capital performed an esophagectomy using thoracoscopy, taking 8 hours to complete. Today, for esophageal cancers located not too high, The completion time is under 2 hours. Laparoscopic techniques have supplanted traditional open surgeries, becoming the norm. As the live stream displayed the severely adhered gallbladder triangle, a barrage of comments flooded in. Are all the surgeries chosen by the master this difficult? The gallbladder triangle is a complete mess. This surgery will likely take 3 hours. The gallbladder neck is entirely encased. How will he free it? The more they scrutinized, the more astonished they became. The gallbladder was almost entirely enveloped by inflammatory exudate, a thin membrane tightly wrapping it, making it impossible to discern the anatomical structures. Even the gallbladder itself was unrecognizable. Upon witnessing this scene, Director Liu and Qin Feng both exhaled in relief, their faces reflecting satisfaction. Despite the severe adhesions and the membrane formed by inflammatory exudate tightly encasing the gallbladder, Zheng Ren, without hesitation and under the scrutiny of the endoscope, continued to make 2 more incisions 2 centimeters below the right anterior axillary line beneath the xiphoid process. Liu Tianqing displayed a disdainful smile. To him, Zheng Ren's fluid motions bore a completely different implication. A seasoned surgeon, upon encountering such dense adhesions, would likely abandon laparoscopic cholecystectomy in favor of an open procedure, as the latter provides a more direct view. Coupled with Zheng Ren's remarkable finger dexterity and blunt dissection technique with the hemostatic clamp, Liu Tianqing did not doubt that he could successfully perform the cholecystectomy. Yet, youth is characterized by a certain boldness, a commendable trait. However, in the medical field, particularly in the current treacherous environment, a poorly executed surgery can lead to ruinous consequences. For a fleeting moment, Liu Tianqing felt a wave of nostalgia wash over him. A figure appeared in his mind. A promising student who performed surgeries beautifully and was affable, yet somewhat arrogant. What became of him? Ultimately, he ended up on a farm raising rabbits. Young people tend to be overly aggressive in their pursuits, failing to grasp that prudence is essential for longevity. The adage that words can ruin reputations and time can erode legacies requires patience to fully comprehend. Not only in the present, but even during the Republic of China era. Liang Qichao, suspecting a malignant kidney tumor due to hematuria, underwent a nephrectomy. The surgeon was the president of the then Xia Hospital, a renowned figure in urology. What was the outcome? A small tumor was found on the right kidney, which post-surgery pathology confirmed as benign. Yet, the hematuria persisted, and the symptoms remained unrelieved. The esteemed surgeon did not remove the wrong kidney, and Liang Qichao acknowledged this fact. From a modern diagnostic perspective, it could have been a rare case of an immune-related kidney disease, but the medical standards of that time were insufficient for accurate diagnosis. Liang Qichao himself accepted this, while his students and friends did not. As they were all literati with tremendous influence, the story of the surgeon at Xia Hospital mistakenly removing Liang Qichao's kidney has persisted, tarnishing the institution's reputation. Note 1. This was during the Republic of China. In the present day, how many irresponsible reports about surgeries such as anal suturing are there? Director Liu smiled faintly and picked up the phone. Xiao Wang, it's your Liu Gu. Yes, there's a matter at hand. I have a doctor under my supervision who, emboldened by support from above, disregards the directives of senior physicians, recklessly endangering lives while performing a surgery that he is utterly unqualified to handle. Indeed, I share your outrage. But what can be done? I was so infuriated that my heart condition has flared up, and I am currently hospitalized. Yes, exactly. This abhorrent behavior must not be tolerated. We must restore a clear sky for the citizens of Haiqing. Thank you very much. After hanging up, Director Liu remarked, individuals like this deserve the scrutiny of public opinion. Qin Feng remained silent, his expression dark and somewhat ashen. Under the lights, he appeared lost in thought. Director Liu sensed his displeasure. Xiaocan, what is this attitude of yours? However, he refrained from voicing his concerns, merely expressing his dissatisfaction through tone. Director, he is freeing the adhesions. Qin Feng stammered. In his haste to make the phone call, Director Liu had neglected to observe Zheng Ren's surgery. In his view, a surgery that he himself deemed particularly challenging hardly warranted further attention. Looking up at the television, he saw the endoscopic separation forceps and grasping forceps skillfully working in tandem, performing blunt dissection of the surrounding adhesive tissues of the gallbladder. During the phone call, the gallbladder was almost entirely freed. How could he be so adept? Wasn't it said that he had never performed a laparoscopic cholecystectomy? A surge of excitement welled up within Director Liu, and he quickly closed his eyes to calm his racing heart. In the Xingling Garden live stream, The shouts of 666 resounded continuously. The forceps are used expertly, as if one were directly observing the surgery. Who told me the master couldn't perform laparoscopic surgery? This is the best I have ever witnessed so far. So nimble, I wouldn't dare to free the adhesive tissues like that during open surgery. Isn't he afraid of injuring the common bile duct? Young man, your limited technical skill restricts your imagination. Study diligently. Within the live broadcast, the grasping forceps and dissecting scissors maneuvered with precision and in a matter of mere minutes. The hopelessly adhered gallbladder and the structures of the callous triangle were essentially exposed, demonstrating clarity and lucidity. At this juncture, the surgical difficulty had been reduced from a level of S to D. Any physician with experience in this type of surgery, upon witnessing such a clear anatomical display, would be unlikely to err. Truly remarkable. Despite such severe adhesions, the anatomical structures were completely exposed in mere minutes. This dissection process could be written into textbooks. It's incredibly clear. I estimate the surgery will conclude in 5 minutes. It feels like a dream, as if I haven't fully awakened. It seems like only 8 minutes have elapsed since the endoscope was inserted, and the surgery is already nearing completion. Indeed, the surgery was nearing completion. In mere minutes, Zheng Ren had effortlessly resolved the most challenging aspects of the procedure. All that remained was to detach the gallbladder from the gallbladder bed using an ultrasonic scalpel, clamp the cystic duct and cystic artery, and extract the gallbladder. The surgery proceeded smoothly, with a blood loss of less than 10 milliliters. Every potential point of uncertainty was addressed with decisiveness, and the operation was executed with confidence and seamlessness. However, only seasoned physicians who had performed hundreds of such procedures could appreciate the surgeon's profound expertise demonstrated in those few minutes, encompassing a wealth of anatomical knowledge, refined surgical skills, steady hands, and meticulous attention to detail, not to mention proficiency in laparoscopic surgery. In the Xinglin Garden video live broadcast room, a deluge of 666 comments flooded the screen. Regrettably, this was not an entertainment-oriented video streaming website, and monetary rewards were not possible. Were that an option, Zheng Ren could have earned tens of thousands in under 20 minutes without uttering a single word. In the special needs ward, Director Liu, with his eyes closed, was attempting to calm his turbulent emotions. I must not become agitated or anxious, he told himself. He knew that his health was paramount, and he couldn't afford to jeopardize it. After a few minutes, he felt somewhat composed. The room was quiet, save for Qin Feng's heavy breathing. Director Liu hesitated to open his eyes, fearing that witnessing Zheng Ren's adept dissection of the gallbladder and the connective tissue in the callous triangle would cause his blood pressure to spike again. Xiaocun, is his surgery progressing smoothly? Director Liu inquired. Qin Feng was momentarily at a loss for words and remained silent. What is the situation? Director Liu asked with displeasure. Dijar. Director, he's finished, Qin Feng replied hesitantly in a low voice. What? Finished? Impossible. That's not possible. Director Liu, disregarding his blood pressure, abruptly opened his eyes. He saw that the image on the television was not the dissection process he had anticipated, nor was it the separation of the gallbladder from the gallbladder bed. It wasn't even the application of absorbable clips to the cystic duct or titanium clips to sever the cystic artery. Zheng Ren was using a suction device to remove the residual bile from the gallbladder. This is far too fast. I'm speechless. I wonder if the master accepts disciples. I must know which hospital the master is at. I can no longer resist the urge to seek further training. My 50-meter surgical blade is itching for action. I'm heading to the operating table. Wish me luck. In Xinglin Garden, the 666 comments inundated the live broadcast room. What followed was unremarkable, akin to the suturing of an open incision, concluding in a couple of minutes. Only a handful of individuals meticulously scrutinized the surgeon's actions through the barrage of comments. These were veterans of the live broadcast, familiar with the technique of using biological glue to adhere the fat layer, and they were wary of missing something. However, the subsequent steps were mundane, adhering strictly to the textbook, with no deviation whatsoever. If there was a distinction to be made, it was that the surgeon in the live broadcast operated with unwavering steadiness. Each step was clear and purposeful. A surgery with an apparent difficulty rating of 9.5 was completed without incident, leaving many perplexed as to the key elements. Even for attending physicians and associate chief physicians, who had performed dozens or hundreds of similar surgeries, the true crux of the matter remained elusive to most. He doesn't even have an assistant. Who's holding the laparoscope? Director Liu muttered to himself, his eyes tightly shut, unable to comprehend the situation. The term holding the laparoscope refers to the assistant's role in stabilizing the endoscope's field of view for the surgeon. It's akin to the function of a retractor in open surgery, but even more critical. Without a retractor, there are at least self-retaining retractors and other instruments available. However, if the endoscope isn't steady or doesn't follow the surgeon's movements, it can impede the surgical process. Director Liu couldn't fathom how Zheng Ren, without an assistant, could complete a LC surgery in just over 10 minutes. Qin Feng, hearing Director Liu's murmurings, was taken aback. He took out his phone and sent a WeChat message, which was quickly answered. Upon reading the message, Qin Feng smiled wryly. The instrument nurse, Xie Yiren, was the one holding the laparoscope in lieu of an assistant. And just like that, an LC surgery was completed? Indeed, that's how it was completed. Zheng Ren sutured the skin. Although there were only 3 incisions less than 1 centimeter in length, he habitually used absorbable sutures for continuous subcutaneous closure. Dr. Zheng, do you have obsessive-compulsive tendencies? Xie Yiren, who was tidying up the surgical instruments, found it amusing that Zheng Ren was performing continuous sutures. Such incisions could be closed with a single stitch using a curved needle and a 7-0 or 4-0 suture. However, Zheng Ren preferred to expend a bit more effort to achieve perfection. I always aim for the most flawless result, Zheng Ren replied with a smile. In the upper right corner of his vision, the surgery completion rate reached 100 as the final incision was continuously sutured. Zheng Ren was pleased. The surgical training in the system operating room had been remarkably effective. Zheng Ren was well aware of the difficulty of this surgery, but he had performed it so many times. In the system operating room, he had performed no fewer than 100 surgeries of this complexity. Practice makes perfect, he thought. The surgery concluded. The patient was awakened from general anesthesia and transported, and the excised gallbladder was sent for pathology. The patient's family members, who had been anxiously waiting outside, sat on hard plastic chairs, their hearts filled with unease. One of them had a classmate who was a team leader at a top-tier hospital in the capital, but they had been in infrequent contact recently. Would it seem opportunistic to contact him only when needed? After a few seconds of hesitation, he picked up his phone, opened WeChat, and began to seek advice. Soon, he received a reply. This type of cholecystitis surgery is quite challenging, especially given the ultrasound findings of severe gallbladder wall edema, indicating prolonged inflammation. The patient's son's mood immediately darkened. Unfortunately, acute toxic liver injury is a common complication. Antibiotics can't completely prevent it. I had a patient who ingested pesticide and suffered severe liver damage. Despite using antibiotics, they developed a fungal infection, which led to secondary cholecystitis. The classmate continued in the WeChat conversation. While intended as reassurance, these words only added to the patient's son's burden of worry. You should have told me earlier. If you had driven here, the surgery's success rate would have been at least 30 higher. Such surgeries require meticulous dissection of adhesions and take at least 3 hours, not including anesthesia and recovery time. With those factors included, it could take 4 to 5 hours. Don't worry too much. Moreover, I doubt that the surgery can be completed laparoscopic. The surgeon will likely ask you to sign a consent form for conversion to open surgery, the classmate added. Medical professionals often lack tact and speak bluntly, much like the patient's son's classmate. Just as he finished reading this message, the operating room door opened, and Zheng Ren emerged, pushing the surgical cart. The patient's son hurriedly put his phone away, feeling a wave of unease as he rushed over. Director Zheng, is it time for the signature? Is the surgery not going well, and does it need to be converted to an open procedure? He anxiously inquired, neglecting even the stretcher behind Zheng Ren. The surgery went very smoothly. Zheng Ren replied, would you like to see the gallbladder we removed? Very smoothly. The patient's son seemed bewildered. How long had he been in the operating room? It felt like less than an hour, and there was still the time for anesthesia and recovery. His classmates had informed him about these timelines, but they had mentioned a duration of 4 to 5 hours. Noticing the son's confusion as he stood there in silence, Zheng Ren prompted, what's wrong? Come help out. The son finally snapped back to reality and asked with concern, was there a lot of adhesion? Yes, there was quite a bit, Zheng Ren confirmed. But how could it have been done so quickly? The more he questioned, the more uncertain he felt. Could it be that upon opening, the surgery was deemed too difficult and they simply closed it up again? Such rumors circulated widely, and many had heard of them. Did a higher difficulty correlate with a longer duration? Zheng Ren pushed the surgical cart and instructed, go call the elevator. The patient's son rushed to call the elevator, then returned to guide the cart, taking charge of the direction. He was perplexed. Shouldn't a higher surgical difficulty imply a slower operation? Why did Dr. Zheng's statements diverge from his understanding? The surgery had been completed so swiftly that the relatives rushing to the hospital were still en route, while the patient had already been returned to the ward. After ensuring the patient's vital signs were stable on the monitor, Zheng Ren went to the doctor's office to write medical orders. When other family members arrived, the patient's son left to visit the operating room. He wanted to see the gallbladder and understand its condition. Upon explaining his purpose, the operating room nurse presented the gallbladder in a contaminated basin meant for pathological specimens. Inside lay a slender gallbladder, its surface smooth, with pus neatly separated and placed aside. Seeing no blood on it, the son finally felt at ease. For an ordinary person, the presence or absence of bleeding was crucial. No bleeding signified a successful operation. He took a photograph for posterity. Just as he was about to return to the ward, a WeChat notification chimed. Opening it, he saw it was from a classmate. Please don't panic. Although Haicheng's medical standards are average, removing a gallbladder is still manageable. His classmate comforted him in an exasperating tone. The surgery is done, and everything went smoothly. The patient's son replied with a message, and his classmate responded with 5 exclamation marks. Really? The son promptly sent over the freshly taken photo. The gallbladder, pus, and connective tissue were all quite clear. Typically, pathological specimens from surgeries wouldn't contain pus. During the dissection, it would break apart and be unmanageable for transport. However, the photo displayed the pus and connective tissue intact. Set beside the gallbladder, which appeared impeccably clean, with the anatomical layers clearly defined. When did Haicheng acquire such remarkable doctors? His classmate marveled in their WeChat conversation. Had he not witnessed at Y Emergency Department? Director Pan has recently established an emergency center, and I believe that you would experience significant growth there. The director of the medical office said earnestly. Director Pan is unlike anyone else. He comes from a military background and is particularly protective of his team. If you were to face a similar situation, he would undoubtedly not cast the blame upon you. Xiaochang remained silent, lost in contemplation. Her eyes, though not large, featured particularly prominent double eyelids, creating an impression that her eyelids overshadowed her eyes. Her long eyelashes fluttered with an almost ethereal charm. Yet she maintained a certain aloofness towards others, even when faced with the director of the medical office, a figure capable of determining her future. While her words were respectful, her expression betrayed no hint of flattery. Rather, it conveyed a sense of indifference. How about it? Director Pan is quite an esteemed figure. Moreover, given your educational background, making a breakthrough would best be achieved in a newly established department. The director of the medical office continued to entice her, akin to a wolf enticing a little rabbit. Xiaochang smiled lightly, responding, even if I wanted to go, there is still a month of probation left. Do not concern yourself with such matters. Upon sensing Xiaochang's willingness, the director of the medical office waved his hand decisively. If anyone has objections, I shall have them come to the medical office for a proper discussion. Or perhaps I could transfer them to the emergency department instead. His excessive confidence rendered the last statement somewhat unrefined, leaving the director feeling a touch awkward. At that moment, Director Pan entered with a commanding presence, settling onto the sofa in the medical office. Director Zhou, is the person I requested available yet? He inquired. Haha, just in time, Director Pan, the medical office director replied, attempting to mask his awkwardness. Xiaochang has already agreed to join your emergency department. Xiaochang. Director Pan glanced at the girl standing before him, displaying a hint of dissatisfaction. He desired a male doctor capable of performing surgeries, not a female. The medical field has always treated women as equals to men while viewing men as mere laborers. Naturally, the absence of a capable worker did not please Director Pan. However, he was aware of Xiaochang's reputation within the hospital and held her in high regard. Director Pan did not refuse her. Instead, he asked, is one sufficient? This year's residency students will all be available to you if they agree to stay. What do you think? The director of the medical office painted an enticing picture. After some negotiation, Director Pan solidified the impression that if he did not receive the doctors he requested, he would make daily visits to raise a ruckus. He then instructed, Xiaochang, pack your things and come with me to the emergency department. Xiaochang obediently responded, gathering her belongings and following Director Pan without hesitation. It was only when he was out of sight that the director of the medical office sighed. Today has been endured. What about tomorrow? I hope Xiaochang performs excellently and can temporarily satisfy Director Pan's expectations. Along the way, Director Pan engaged in light conversation with Xiao Chong. She spoke little and with a certain stiffness, refraining from insincere flattery towards the new department head. Yet her high regard for the emergency department was evident in her precise remarks, much to Director Pan's delight. Particularly, her insights regarding two recent matters, laparoscopic retrograde appendectomy and nitrite poisoning, reflected Director Pan's adept leadership, showcasing his commanding presence. Finally, upon returning to the emergency department, Director Pan entrusted Xiao Chong to Zheng Ren, emphasizing the importance of adhering to Zheng Ren's guidance for the development of the emergency center. Zheng Ren had just finished post-operative orders and was preparing to document the case when Director Pan presented him with a new recruit, providing a brief overview of the patient's condition and leaving the case for Xiao Chong to handle. Xiao Chong displayed neither impatience nor obsequiousness. She simply accepted the task at hand. She called in the family members for a detailed history and began documenting the medical record without delay. Zheng Ren conducted his rounds, noting that the emergency center's wards were separate from the observation rooms. Currently, there was only one patient, an elderly individual recovering from gallbladder surgery. The patient, having awakened from general anesthesia, felt nauseous but had not vomited. He expressed discomfort regarding the nasogastric tube, and after much coaxing from Zheng Ren, he gradually calmed down. After checking on the post-operative patient, Zheng Ren returned to his office to find Xiao Chong had completed the medical record. "Did you finish that so quickly?" he wondered, initially questioning her diligence. He was reluctant to entrust such an important task to someone who might be careless. However, upon glancing through the document, he was taken aback by Xiao Chong's proficiency. The record was concise, clear, and devoid of superfluous information or formatting errors, resembling a meticulously crafted piece. Her documentation captured the essential patient history and key examination points, albeit in just a few sentences, yet they reflected her thoroughness. Moreover, she had consulted the patient's family and recorded additional changes in the patient's condition. The quality of surgical records rarely matches that of internal medicine due to the nature of the profession, yet this record was impeccable, leaving no room for criticism. Any observer would conclude that surgery was imperative for the patient, as failure to act could lead to worsening conditions or even sudden death. Zheng Ren's initial impressions of Xiao Chong were favorable, recognizing her competence through the quality of the medical record. With only one post-operative patient, the nursing staff was relatively unoccupied. The newly appointed head nurse was diligently training the nurses to ensure they would not panic should an acute emergency arise. After securing the cabinet key, Xiao Chong returned to the office, satisfied with her work on the medical record. "I've won the provincial medical record competition," Xiao Chong remarked. Zheng Ren, unaware of the competition, acknowledged the high standard of her record but decided to observe her capabilities further. Regarding his second colleague, first place would forever belong to Xie Yiren. He resolved to inquire about Xiao Chang's aspirations for the future. "I do not wish to perform surgeries. I only desire to excel as an internal medicine physician," Xiao Chong stated. "Is it a fear of blood or something else?" Zheng Ren probed. "Not quite. I simply enjoy conversing with people," she replied. Simple exchanges confirmed her disinterest in assisting with surgeries, yet her ability to document and manage patients was undeniably vital. At the very least, delegating some of the mundane tasks to Xiao Chong would allow Zheng Ren to focus on his surgical duties. Just as they were conversing, a call came through from the emergency department, indicating a patient with acute appendicitis requiring Zheng Ren's attention. Accompanied by Xiao Chong, Zheng Ren proceeded to the emergency department, where they encountered a young male patient, a university student, referred by his classmates. The diagnosis was clear: admission and preparation for surgery. Zheng Ren, having mastered the skill of appendectomy, regarded himself as a master in this domain. Objectively, he considered himself a grandmaster, capable of outclassing all doctors in the province, albeit with room for growth. After examining the patient, Zheng Ren settled down with a book to refine his skills, as every bit of practice was invaluable. He entrusted the communication, pre-operative preparations, and other tasks to Xiao Chong. Suddenly, a notification chimed, indicating a new task from the system: long-term main quest, to become the best surgeon. Task content: to ascend to the pinnacle of surgical excellence, a long journey lies ahead. Complete every 10 surgeries to receive system rewards based on performance. This task does not overlap with others. Task rewards: for every 10 level 1 surgeries completed with an 80 success rate, one can earn 10 skill points and 1,000 experience points. Level 2 surgeries are calculated as equivalent to 2 Level 1 surgeries, Level 3 surgeries to 4 Level 1 surgeries, and Level 4 surgeries to 8 Level 1 surgeries. The system will temporarily announce calculation indices for more advanced surgeries. Task duration, perpetual. Zheng Ren pondered this task, realizing it was likely designed to encourage him to undertake more challenging surgeries. Given that this was a long-term main task, it promised a steady income. He couldn't help but feel a pang of regret when recalling the 49 appendectomies and 1 laparoscopic retrograde appendectomy he had just completed. How wonderful it would have been if the main task had been released sooner, granting him hundreds of skill points and thousands of experience points. Although this may seem trivial compared to spontaneous tasks, it was still an unexpected windfall. An hour and a half later, Changyu was ready, and Zheng Ren escorted the patient into the operating room. 20 minutes later, before Changyu had the chance to sit down for a sip of water, Zheng Ren returned with the patient. This 20-minute surgery included a 15-minute anesthesia phase. Zheng Ren, glancing at the recently received long-term main task, noted a 10 completion rate under the best surgeon category, and a wave of joy washed over him. Changyu appeared somewhat surprised, but expertly concealed her emotions, busying herself with patient intake and post-operative orders. After Zheng Ren completed the surgical records and began drafting post-operative notes, he felt invigorated, particularly since the laparoscopic cholecystectomy was classified as a Level 3 surgery, contributing a significant 40 towards completion. However, he felt a tinge of dissatisfaction as only 2 surgeries had been performed on the opening day of the emergency operating room. In the evening, as Changyu prepared to leave, Director Pan returned, brimming with excitement and accompanied by 2 familiar faces. Zheng Ren, I've brought back 2 more people. Upon closer inspection, he realized it was the Chu sisters, Chu Yanran and Chu Yanji. You, Zheng Ren remarked, slightly puzzled. He vaguely recalled one of the girls mentioning her intention to return for training, and now it seemed that was indeed the case. We're back, they chorused. Director Pan chuckled. Although we lack an EICU, they can begin working in anesthesia. Aren't you in need of anesthetists? Indeed. Relying on borrowed anesthetists from the operating room was far less effective than having dedicated staff. Moreover, it was rumored that the anesthetist in question was planning to resign for a position in the South, having already secured a new job, which was likely why they were easily linked to the emergency department. However, Zheng Ren questioned the competence of these 2 young women. He could not refute Director Pan's words. The elderly gentleman tirelessly navigated the hospital bureaucracy to secure staffing, a commendable effort. Will you be available for emergency cases? Zheng Ren inquired directly. No problem, they assured. All right. Leave your contact numbers and head back, Zheng Ren replied, maintaining a neutral demeanor. The Chu sisters, having dealt with Zheng Ren before, had prepared for his bluntness, knowing he was not particularly adept in social graces. If there's an emergency, remember to call, they said with smiles. Zheng Ren merely waved, retreating to his room to study surgical procedures. Rather than engage with the Chu sisters, he preferred to immerse himself in several hours of surgical literature, hoping to gain a skill point or 2. Zheng Ren mused that not having a girlfriend was the norm. Having one would be the exception. It seemed that the trend of offering warmth and support had waned lately. Once everyone departed, Zheng Ren glanced at his 2 post-operative patients, both stable. After sharing a meal with the nurses, he retreated to his room to continue reading. His general surgery skill tree now boasted 931 points. He reviewed his tasks, 1 long-term main task, and 1 for the establishment of the operating room. Completing 5 emergency cholecystectomies within a week would depend on luck rather than skill. As for the 3 skill books he possessed, totaling 930 skill points, they were valuable assets he was reluctant to squander. A peaceful night followed. Meanwhile, Sun Ming was in despair. Ever since Professor Sun Yu had come to perform surgeries, nothing had gone well. Not only had he missed the opportunity to advance his studies in Japan, but he had also attracted a myriad of troubles. When he visited Director Liu, the latter was unwilling to acknowledge him, likely attributing the recent failures to him. This was not the worst of it. That morning, Sun Ming received a call from his uncle. His family resided in another city, and his position at the first hospital depended entirely on his uncle's influence. On the phone, Sun Ming's uncle mentioned that after dining out and drinking, he returned home feeling abdominal pain and noticed some jaundice. The symptoms immediately alerted Sun Ming to the possibility of acute obstructive cholangitis. With no time to go pick him up, he called for an ambulance. The diagnosis was clear: emergency surgery was imperative. Yet, when considering who would perform it, Sun Ming hesitated. The general surgery department, led by Director Liu, had several deputy directors, but under Lu's pressure, their surgical skills seemed inferior to his own. If it were a simple cholecystectomy, he was confident in his ability to succeed. However, given the obstructed bile duct, the risk of complications such as acute pancreatitis loomed large. Even if complications did not arise, the swollen bile duct caused him considerable concern. If Director Lu were present, Qin Meng might have attempted the surgery. But in the current situation, he felt apprehensive. Should he seek out Director Sun from the Second General Surgery Department? His uncle had always treated him well. The latter's daughter had recently bought a house and married in Pengcheng, making Qin Meng feel more like a son than a nephew. An idea suddenly struck Qin Meng, one that he could not dismiss. Zheng Ren. After witnessing Zheng Ren perform a cholecystectomy that day, Qin Meng felt a mix of admiration and envy. How had Zheng Ren honed his surgical skills? Mastery in surgery could only be achieved through practice, and yet, after working alongside Zheng Ren for several years, Qin Meng had no inkling of how he had concealed his talents so effectively. Over the past 3 days, Zheng Ren had performed 4 cholecystectomies, each executed with remarkable finesse. From an aesthetic perspective alone, watching him operate was a breathtaking experience. Thus, the thought of having Zheng Ren perform the surgery emerged in his mind, taking root like an insatiable desire. Deep down, he acknowledged the fact that Zheng Ren's surgical prowess in both cholecystectomy and appendectomy far surpassed that of both Director Lu and Director Sun, while he himself could not compare. For ordinary patients, Qin Meng would never have considered sending them to the emergency department. He would have sought out Director Sun from the Second General Surgery Department to oversee the procedure himself. Yet, faced with his uncle, who regarded him as a son, he hesitated. After several minutes of indecision and uncertainty, Qin Meng finally resolved to act. He picked up the phone and pressed the call button firmly. "Mingzi, we're on our way," came his aunt's voice, tinged with urgency. "Aunt, don't panic. Listen to me," Qin Meng replied, gripping the phone tightly with one hand while his other clenched into a fist, pressing his nails into his palm. "Go directly to the emergency department and ask for a doctor named Zheng Ren." After uttering that shaming remark, Qin Meng finally relinquished all his thoughts and proceeded to the emergency room, needing immediate surgery. "Auntie, please don't mention me." The line fell silent. Qin Meng felt as though his heart had been pierced by a knife. It was painfully overwhelming. "Mengzi, your uncle has been quite kind to you," his second aunt remarked after a few seconds. "Auntie, precisely because of that, I insist you go to the emergency department," Qin Meng replied directly. Once the matter of shame was broached, everything else became less daunting. Dr. Zheng Ren, the finest surgeon in our hospital for hepatobiliary procedures, was the attending physician in the emergency room. Qin Meng anxiously explained, "But we have past grievances, so please don't mention me. I will visit my uncle when I have the chance." "Well, very well then." After concluding the call, Qin Meng took several deep breaths. Yet he could not quell the simmering indignation within him. As a surgeon, admitting his inadequacies to those nearest to him felt utterly disheartening. Hailing from a rural background, Qin Meng had always seized every opportunity in life, willing to cast aside his pride and dignity. Yet, was this truly the outcome? A sense of confusion enveloped him. The ambulance arrived directly at the emergency department of the First Municipal Hospital. The emergency doctors, recognizing the patient's critical condition, promptly called for Zheng Ren. In just 3 days, he had performed 4 cholecystectomies, completing the initial tasks assigned to the newly established emergency department. Moreover, the 3 latter surgeries contributed to a 120 completion rate of his mainline tasks. Coupled with the 7 or 8 appendectomies he had conducted recently, he had completed his mainline task twice over, earning 20 skill points and 2,000 experience points. The postoperative recovery of the patients had been remarkably smooth. The earliest case of acute appendicitis had already been discharged for home recuperation. After several surgeries and diligent study over the past few days, his general surgery skills had reached an impressive 1945 points, nearing the significant milestone of 2,000 points. When the phone rang, Zheng Ren was engrossed in his reading. He heard that a patient with obstructive jaundice had been sent to the emergency room by ambulance and immediately took Changyu downstairs. Acute appendicitis and acute cholecystitis may not be fatal, but a patient with obstructive jaundice could die at any moment, demanding utmost attention. Upon arrival at the emergency resuscitation room, the ultrasound doctor had already begun his examination at the bedside. Zheng Ren had yet to glance at the patient's medical summary when he heard a notification sound. A task? Could this patient have a rare illness? Sudden task, the surrender of rivals. Task details: complete a surgical treatment for obstructive suppurative cholangitis. Task reward: 200 skill points. 10,000 experience points. Higher completion rates yield greater rewards. Achieving 100 completion grants additional rewards. Time limit: 6 hours. Zheng Ren was nearly taken aback. Although the system was generous, this was an unprecedented level of benevolence. Initially, when the system was unstable, even surgical training time was measured in hours. Once stabilized, experience points were calculated by the second. The system truly was an extravagant benefactor. Yet this simple task of arrival surrender offered 10,000 experience points, an equivalent of invaluable surgical training time. Additionally, the task duration of 6 hours meant that all remaining time counted as system training time. What on earth was this? Zheng Ren momentarily lost his focus, pondering the implications of the task name. It seemed that certain adversaries had conceded. Zheng. The patient has a blockage in the common bile duct, the ultrasound doctor informed him. We need to perform emergency surgery, establish an intravenous line, and place a gastric tube and urinary catheter for preoperative preparation. Changyu, please inform the patient's family about the procedure. Tasks were tasks, regardless of the patient's familial connections. The condition could not be delayed. Do you know what to say for the preoperative briefing regarding obstructive jaundice? I will draft it and let you review it. Changyu replied. The nurse and Changyu swiftly prepared for the surgery. I will head to the operating room to prepare the instruments. After signing the necessary documents, I will proceed directly to the surgery, Zheng Ren said, glancing at Changyu's preoperative notes, which were impeccably composed, leaving no room for criticism, and hurriedly departed. Through recent days spent with Changyu, Zheng Ren had developed a deep appreciation for her. She possessed the remarkable ability to soothe even the most distressed individuals, transforming chaos into calm with her words. Zheng Ren hastily made his way to the operating room to prepare for surgery. Acute obstructive suppurative cholangitis represented a pure level 3 surgery, significantly more challenging than gallbladder procedures enhanced by new technology. The critical issue was that the system panel indicated this patient did not simply have a bile duct stone, but rather a rare bile duct parasite. Zheng Ren aimed for perfection, necessitating a tranquil space to procure specific equipment from the system marketplace. He intended to perform a procedure that had not yet been formalized in medical literature, one he had theorized and practiced extensively in the system's surgical lab. The newly established emergency surgical suite would undoubtedly lack the necessary equipment, and perhaps such tools did not even exist in this world. He would have to acquire them from the system marketplace. Upon entering the surgical dressing room, Zheng Ren donned a sterile gown and stepped into the smoking room. Lighting a cigarette, he inhaled deeply, the pungent tobacco igniting his senses before he entered the system space. Having exhausted all his experience points on learning laparoscopic cholecystectomy, he had no funds to purchase equipment. Recently completing several mainline tasks had allowed him to accumulate some funds, just enough to buy a few small instruments. Accessing the system marketplace, he scrolled through the menu, confident in his preparedness. Without hesitation, he clicked to purchase, and with the sterile equipment in hand, he promptly exited. This set of small devices cost Zheng Ren 1,800 experience points, leaving him with a meager 200 points remaining. Returning to the smoking room, he extinguished his cigarette, placed it back in its case, and entered the operating room. Zheng, what surgery is being performed? A tall figure appeared at the end of the corridor. After 2 or 3 days of interaction, Zheng Ren still could not distinguish which of the two sisters was Chu Yinjin and which was Chu Yinji. Such a dilemma was likely one he would never resolve. Acute obstructive suppurative cholangitis, Zheng Ren replied. Is there a new surgical technique? Do you need an assistant? One of the Chu sisters inquired. If you come by, we can make a deal. Today we will perform an open surgery. If you can accurately call my name, I will join you on stage, she teased, seizing every opportunity to poke fun at Zheng Ren's face blindness. The Chu sisters had long since ceased to care about Zheng Ren's indifference toward attractive women. Iren, please prepare an automatically sealed sterile pack, Zheng Ren called out. Thank you. Iren's melodious voice echoed from the storage room. This is so boring, the other Chu sister sighed. Can't you just take a guess? The patient is jaundiced and needs immediate attention, Zheng Ren replied impassively as he entered the operating room. After all, with his cap and mask on, his expression was concealed. When will they bring the patient up? Another Chu sister stepped out to inquire. We need to see when Changyu can get the family to sign, Zheng Ren answered. Then prepare accordingly. It should be soon. The two Chu sisters, moving in unison, hurried to the operating room to begin preparations for general anesthesia. Their skills were quite commendable. undoubtedly exceeding the standards of mere trainees. According to their claims, they had personally conducted hundreds of general anesthesia surgeries at Huaxi. After witnessing their proficiency, the supervising anesthesiologist became increasingly lax, merely observing briefly before the anesthesia commenced. Zheng Ren was unaware of the sisters' extensive experience, but after observing several surgeries, it was clear that both were exceedingly adept with general and epidural anesthesia, especially during the awakening phase of general anesthesia. It is nearly a transcendental moment when Zheng Ren finishes the last stitch just as the patient regains consciousness, as anticipated by the Chu family maidens. The patient was wheeled in 5 minutes later. This accomplishment is solely commendable for Chang Yu and the nurses in the emergency ward. The preoperative preparation time was remarkably brief, and Chang Yu's ability to persuade the family to sign the consent form in such a short span was indispensable. As the patient was lifted onto the operating table, the Chu maidens commenced anesthesia and intubation. "Burn my calories," one of the Chu maidens exclaimed, embodying a spirited enthusiasm. This was Chu Yinji, and it was only at this moment that Zheng Ren could discern which was Chu Yinji and which was Chu Yanzeren. The younger sister, Chu Yinji, exhibited a slightly more vivacious and whimsical demeanor. Such delightfully cringeworthy lines could only emanate from her. The phrase did not merely suggest burning calories for weight loss. Rather, it invoked the fervor of a superhero from Japanese anime, urging a dedicated and thorough surgical endeavor. Truly, being a graduate student, one can be quite silly indeed. Has the pursuit of knowledge rendered one foolish? Zheng Ren began to wash his hands and disinfect. Anesthesia completed, the Chu maidens chanted in unison, resembling a harmonious choir. With their picturesque features and melodious voices, they were a delight to behold. Zheng Ren donned the sterile gown, put on gloves, and laid down the final sterile drape, receiving the focus handle of the shadowless lamp from Xie Yiren, which he then installed. This setup allowed Zheng Ren to adjust the lamp according to his needs. After iodine disinfection and a gentle wipe with dry gauze, Zheng Ren extended his hand to receive the surgical knife handle, deftly placed there by Xie Yiren. As Zheng Ren proceeded with disinfection, a live broadcast began in the Xinglin garden. Watching the master perform surgery is simply satisfying. I feel my skills in laparoscopic cholecystectomy have improved recently. After watching so much, even a fool could do it, so what is there to be proud of? Oh, is there surgery today? Let me see the first procedure. Wow, it's an acute obstructive suppurative cholangitis. Finally, a new technique to learn. Making an incision beneath the right rib margin, Zheng Ren expertly sliced through the epidermis and dermis. Without severing the extent of knowledge gleaned hinges on individual aptitude. Are you daft? Incapable of performing open surgery, where would you acquire the skills for laparoscopic procedures? Not entirely. Many junior doctors at the attending level commence their practice with laparoscopic surgeries. Those two have inadvertently revealed their age. With the gallbladder excised, I surmise it contained at least 3 to 5 calculi exceeding 3 centimeters. Zheng Ren's dissection was executed with such clarity that, post-gallbladder removal, the common bile duct and common hepatic duct were distinctly exposed in the surgical field, leaving no ambiguity as to their identities. Nevertheless, erring on the side of caution, he requisitioned a 5 milliliter syringe to aspirate bile, definitively confirming the common bile duct. Employing a traction suture to elevate the common bile duct, Zheng Ren extended his hand, whereupon a sheathed aspirator was gently placed into his grasp. The instant the common bile duct was incised, the aspirator was inserted. Without the slightest delay, the copious bile accumulated within the common bile duct, poised to eject under immense pressure, was suctioned away. This particular detail garnered the attention of physicians within the Xinglin Garden Forum. In typical surgeries, a degree of protection around the common bile duct is invariably undertaken, as some bile spillage is unavoidable. However, the operator in the live broadcast eschewed any protective measures. The incision made on the cystic duct, commensurate in size with the sheathed aspirator, allowed for no bile leakage whatsoever, a feat of precision and ease. Only those with first-hand experience in this technique truly appreciate its intricacies. A pang of melancholy strikes me. I underwent an open drainage procedure for acute obstructive suppurative cholangitis several years ago. Intraoperative bile spillage incited a postoperative infection, initially bacterial, then fungal, which plagued me for a month before resolution. Likewise, the surgeon's dexterity is remarkable. That incision, precisely matching the aspirator's dimensions, bespeaks a mastery honed through practice and keen observation. That is innate talent. Abandon such aspirations. 006, 3 biliary parasites at this juncture. The physicians within the Xinglin Garden Forum could comprehend the procedure. Whether they could execute it themselves is another matter, but failure to understand would be egregious. Such fundamental competence is expected of many formally trained physicians. The next step should be stone retrieval, many surmised. Indeed, with the common bile duct incised, the subsequent action would involve incising to extract stones, thereby alleviating the patient's obstructive jaundice symptoms. Zheng Ren reached for a specialized stone retrieval forceps, a standard surgical implement, albeit infrequently utilized. Xia Yiren meticulously observed Zheng Ren's movements, ensuring that the appropriate instrument was proffered at the precise moment of need. Within the live broadcast, many viewers harbored feelings of envy and resentment. Behold the surgical nurse's proficiency. Compare that to our own, each more temperamental than the last. A reminder is required even for such unconventional maneuvers as handing over the stone retrieval forceps. More often than not, after the reminder, it is discovered that the forceps are not even prepared, necessitating a trip by the circulating nurse to the sterilization room to retrieve a sterile stone retrieval forceps pack. The ensuing delay of several minutes pales in comparison to the ease and contentment exhibited by the operator in the live broadcast. Even more egregious is the use of non-sterile stone retrieval forceps, a veritable nightmare. However, despite the envy, life must proceed. The forceps were inserted into the common bile duct, yielding 1, 2, 3 stones. But hold, why do these stones possess such peculiar shapes? Could they not be calculi? Based on my extensive clinical experience, these appear to be biliary parasites. Extensive clinical experience? Cease your boasting. Many seasoned directors with extensive clinical experience are unfamiliar with accessing the Xinglin Garden Forum. I am 59 years old, qualifying as a seasoned director with extensive clinical experience, yet I am abreast of the times. Is that any concern of yours? Within the Xinglin Garden live broadcast, the topic veered off course momentarily. However, judging by their unconventional shapes, these were indeed unlikely to be mere gallbladder calculi. Following the extraction of calculi from the cystic duct and the left and right hepatic ducts, the live broadcast operator commenced irrigation with warm saline, aspirating more sand-like calculi. Subsequently, the surgery entered a rarely observed state of quiescence. Attention, attention. Is the live broadcast experiencing buffering? Acknowledge if you can see the barrage of comments. Likewise, your acknowledgement has lifted my spirits. It is not buffering. The operator is preparing the next set of instruments, presumably a cholangioscope. The cessation of this exceptionally rare surgery, confirmed not to be attributable to network or live broadcast issues, incited a deluge of comments. Speculation abounded as to the cause. Perhaps a bout of diarrhea? Once, during an acute enteritis episode, I excused myself to the restroom 8 times during an appendectomy, each time necessitating hand scrubbing and attire changes. The mere thought of that harrowing experience fills me with melancholy. Seeking solace, perhaps an incision of the gallbladder to assess for cancerous changes, or perhaps the operator has succumbed to syncope. Amidst hundreds of comments, the discussion was lively, yet no one expressed concern regarding the surgery. Absurd. Aside from other considerations, the operator's proficiency in blunt dissection and anatomical structure familiarity suggests an octogenarian professor, unlikely to be overwhelmed by a grade 3 surgery. Within the operating room, Zheng Ren paused, instructing Chu Yinji to unpack the instruments he had acquired from the system store. Placing the fiberscope on the instrument table and donning the connector to enable visual observation of the images captured by the fiberscope, Chu Yinji, standing at 172 centimeters, was of comparable height to Zheng Ren. To affix the connector atop Zheng Ren's head, she procured a footstool. Zheng, where did these instruments originate? Chu Yinji had assisted with similar surgeries at West China Hospital, but had never encountered these particular instruments. Self-made, Zheng Ren retorted, effectively terminating the conversation. Miser, Chu Yinji huffed. We are not soliciting them. Why withhold the information? Zheng Ren was in a quandary. He could not divulge the existence of the system store to Chu Yinji. Yet, concocting a fictitious locale would inevitably lead to her attempting to procure items from it. Best to obfuscate. Abruptly, his thoughts surged forth like untamed hounds. If a female possessed a system store, would there be a grand sale on Singles Day? After equipping Zheng Ren, Chu Yinji remarked with interest, Sister, should the surgery prove successful, it seems a SCI paper could be authored. Indeed, one with an impact factor exceeding 3, Chu Yuran affirmed, seated beside the ventilator, surgical record in hand. Silently observing the ventilator and monitor displays, adjusting medication dosages accordingly. Only during surgeries did the Chu sisters exhibit such starkly contrasting demeanors. Zhang Ren was perplexed, wondering if this was a peculiar manifestation of twin differentiation. The Xingling Garden live broadcast feed experienced a momentary distortion, subsequently transitioning to the fiberscope's visual perspective. Behold, an electronic fiberscope. High-end. We typically employ a number 5 urinary catheter for flushing, continuous flushing, to ascertain the absence of residual calculi. We have a professor who utilizes fiberscopes, but sparingly. Many struggle with their operation, particularly the microscopic manipulation required to extract residual small calculi with forceps under fiberscopic guidance, a feat akin to neurosurgery. As the lens traversed inward, the ensuing imagery hushed the live broadcast atmosphere. The barrage of comments traditionally vanished, as all watched in astonishment at the white filaments adhering to the common bile duct wall. Utterly dumbfounded, this was unequivocally not gallbladder calculi, but rather parasites. These white filaments were assuredly not purulent matter resulting from inflammatory exudation, but rather slender parasites affixed to the cystic duct. The majority of the extracted calculi were also products of parasite encapsulation and organization resulting from inflammation secreted by the organism. Pray tell, what is the course of action when encountering parasites? Awaiting response, urgently. A junior physician quipped within the live broadcast. Typically, such an opening would elicit a chorus of similar quips. The same holds true in the operating room, and even more so in the live broadcast. However, this time the live broadcast was eerily silent. A solitary comment drifted forlornly from the right edge of the screen to the left, unheeded. The junior physician wisely retreated into silence. All physicians watching the video broadcast harbored an ominous premonition that this surgery was poised to fail. Might it be possible to merely observe, then symbolically manipulate the parasite, only to discover its tenacious adhesion, ultimately leading to a decision to withdraw due to potential damage to the common bile duct's inner lining? The likelihood of this scenario is substantial. However, the sight of countless white, thread-like parasites has left everyone satisfied. Furthermore, the majority of viewers possess an almost blind trust in the practitioner within the live stream. This individual is capable of anything. Since they dared to broadcast live, one would presume they anticipated such circumstances. In the moments of surgical pause, numerous physicians began to express astonishment. Could it be that the practitioner had already diagnosed the patient with parasitic biliary obstruction with surgical instruments at the ready? Even if prepared, there remains no viable solution. To this day, surgeries for parasite removal are still in their experimental stages. After all, the likelihood of parasitic infections in developed regions is rather low. With most cases occurring in Africa, it is nearly impossible to expect a medical luminary to pioneer a specialized surgical technique for parasite extraction, even if a physician were willing. Driven by altruism and a commitment to medical excellence, those profit-driven medical device companies would hardly be inclined to design a bespoke set of instruments for such procedures. Even if developed, Africa's purchasing power is quite limited. Hence, this operation has evolved from a straightforward obstructive purulent biliary drainage to an enigmatic procedure. How will the practitioner in the live stream navigate this unknown surgical challenge? Or is it possible they merely wish to observe before conceding defeat? In the view of the fiber optic endoscope, a minuscule instrument resembling tweezers emerges. Despite the presence of 1,000 doctors on site, none could identify this peculiar tool. Tweezers? So diminutive. How does the practitioner intend to operate? I am now in utter bewilderment, preparing to watch the recording 100 times post-operation. Enough chatter. Focus on the surgery. After a few comments expressing astonishment, the distractions were swiftly quelled. This could potentially be a groundbreaking technique, perhaps even more novel than the transrectal endoscopic appendectomy. It may well be the debut of an innovative surgical method. Silence enveloped the live stream as countless eyes fixated on the delicate tweezers, resembling an eagle's beak, skillfully snagging a thread-like parasite measuring merely microns in diameter. Remarkably, it did not make contact with the bile duct's inner membrane. This move astounded the audience. Yet still, no words were uttered, for the most critical step was imminent. The parasite is adorned with numerous resilient bristles, clinging tenaciously to the bile duct. Should one forcibly attempt to dislodge the parasite, those bristles, having penetrated the inner lining, would undoubtedly inflict irreversible damage. Severe injury could lead to postoperative complications, including the potential for bacteremia or toxemia. With 1,000 pairs of eyes glued to the live feed, A mixture of curiosity and concern brewed within. However, to everyone's astonishment, a gentle motion of the tweezers resulted in the parasite's removal. The anticipated damage to the bile duct's inner membrane? Non-existent. What on earth did I just witness? Is the practitioner perhaps a tamer of beasts? Does he raise these parasites himself? Let us respect the practitioner. He may be your teacher's teacher's teacher. If you wish to avoid embarrassment upon his identity being revealed, refrain from using disrespectful descriptors. Thank you, my name is. The live stream erupted with excitement. The anticipated challenges evaporated. The parasite was extracted with apparent ease. The tweezers retracted and advanced again, seemingly removing the parasite effortlessly. This routine motion continued. The practitioner's precision evoking thoughts of machinery. Each movement was impeccably executed, leaving the bile duct's inner lining entirely unscathed. The parasite, compliant, relinquished all its bristles upon being grasped. Obediently extracted. Can someone explain what the practitioner has done? Could he possibly be an extraterrestrial? Impossible. The equipment is standard. Even the tweezers are made of titanium nickel alloy, a familiar metallic sheen. Then why did the parasite not adhere? Is there something about titanium nickel alloy that terrifies it? Oh my, practitioner, please accept my admiration. Grasping the parasite is a delicate endeavor. Extracting hundreds of them is no simple feat. Zheng Ren's movements were precise and swift, yet it took approximately 15 seconds to remove a single parasite. Gradually, those in the medical community began to discern subtle clues. I'm not sure if it's my imagination, but after the practitioner captures the parasite, it seems to exhibit spasms. I noticed that too. The spasms are subtle, but that seems to be the key point. I'm a graduate student studying parasite physiology, and I'm currently working on related topics. It's likely that a slight bioelectric current is causing the spasms. In less than half an hour, the doctors present had nearly uncovered the truth. Professional websites are indeed remarkable. Incredible. I wonder if this qualifies as a new surgical technique. What about naming it after the practitioner's surname, parasite biliary extraction surgery? If the data is sufficient and my English proficiency is adequate, I could draft an article suitable for publication in The Lancet. The Lancet, established in 1823 by Elsevier, is co-published by the Lippincott-Williams-Wilkins Group. Founded by Thomas Wackley, the journal derives its name from the surgical instrument, symbolizing its aspiration to illuminate the medical field. The Lancet is a premier surgical journal akin to Nature and Science. As for its impact factor, it stands at an astounding 33.6. This figure is quite abstract. For context, ordinary medical journals in China hover around an impact factor of 0.1, while those under the Chinese Medical Association range from 1 to 5. An impact factor of 33.6 is truly staggering. The prospect of publishing in The Lancet is tantalizing, presenting opportunities for national research grants, abundant resources, and academic prestige. Yet, all of this is irrelevant to those watching the live video. Upon reflection, the audience quickly realized that the practitioner had likely devoted countless years to mastering this equipment. It is probable that this technique was only revealed to the public once it had reached full maturity. Individuals capable of such focused dedication are highly esteemed, particularly in the medical field, where technical expertise commands respect. The higher the skill level, the greater the status within the community. This is an undeniable truth. Such elevated proficiency, coupled with a commitment to research, raises the question, could this be a distinguished figure from the Chinese Academy of Sciences? Or perhaps a foreign expert? Today, a surgery was indeed thrilling. Even if the researcher is not oneself, and the surgeon is not oneself, one can still boast of witnessing the debut of this technique during future conversations over drinks. With a widely accepted explanation at hand, a flurry of comments erupted, cascading across the screen at a dazzling speed. No one could decipher the messages amidst the rapid-fire barrage. This was a true display of enthusiasm, akin to bullets flying past. It was not merely a recounting of events, but rather an expression of profound respect for the seasoned researcher. Zheng Ren, unbeknownst to him, had inadvertently transformed into a revered researcher, a foreign expert. He meticulously removed the parasites, placing them into a nearby receptacle. Xie Yiru's skin, visible outside her mask, appeared ghostly pale. No matter how bold a girl may be, she would surely fear such soft, squirming creatures, especially since Zheng Ren had already extracted over 100. Chu Yin had long since retreated behind the ventilator, too frightened to even look, silencing any previous exuberance. Burning countless calories does little to alleviate the tension within. Chu Yinran's complexion was pale, yet she maintained a semblance of composure compared to her sister. She dared not observe Zheng Ren's actions, forcing herself to focus on the monotonous numbers displayed by the ventilator and monitor. Over 300 parasites. Zheng Ren spent more than an hour meticulously extracting them. As he worked, he inwardly criticized the system, realizing that such an extended duration was not a reward, but rather a reflection of the sheer number of parasites. Qin Feng felt increasingly restless, clutching his phone and anxiously watching the clock. Since his uncle had been wheeled into the operating room, his mind had been racing with imagined scenarios of the surgery. Based on his recent understanding of Zheng Ren, an acute obstructive purulent cholangitis procedure should ideally be completed within an hour, given its relative simplicity. As time trickled by, reaching the 50-minute mark, he began messaging his aunt. When he learned that his uncle had yet to emerge, a sense of unease sank into him. Was there a complication? Did Zheng Ren intentionally delay the surgery upon recognizing his uncle's identity? The weight of dread settled heavily in his chest. Director Liu, known for his cynical demeanor, had once shared a story with Qin Feng after a few too many drinks. He had solemnly warned that it was alarmingly easy to sabotage someone during surgery with just a few inconspicuous tactics, potentially prolonging a patient's recovery by days without any identifiable fault. Later, Director Sun had grimly recounted the tale of a neurosurgery chief at a prestigious hospital who, after a night of indiscretion, suffered a cerebral hemorrhage and insisted on being taken to any other hospital but his own. Despite his requests, he was swiftly returned to his department, where an acting director performed a trepanation. Although such procedures were common for treating hemorrhages, Qin Feng thought Liu's perspective was excessively dark. The story had lodged itself in Qin Feng's mind, making him anxious about his own potential misfortunes. Reflecting on his treatment of Zheng Ren, he found himself increasingly fearful, his fingers trembling with anxiety. Anger bubbled within him, but it quickly dissipated as he confronted the chilling reality of how he had pressured Zheng Ren. The fabricated earthquake that had left Zheng Ren with a closed abdomen, the subsequent pressure. What distinguished this from a betrayal of familial trust? Was he destined to experience a similar fate? Regret washed over him. Perhaps he should have enlisted Director Sun from the General Surgery Department to perform the operation. After 5 more minutes, with no signs of the surgery concluding, he called a classmate, opting for the anesthetist to check on the situation instead of going himself. Qin Feng managed to retain enough composure to avoid a decision he might regret for a lifetime. 1 hour and 8 minutes into the operation, his classmate entered the emergency surgery room and soon sent him a shocking photograph. Countless white, ribbon-like parasites lay in a basin, writhing slightly, fresh and vividly alive. With a sprinkle of green onions and a quick stir-fry, they could become an exotic dish. To his astonishment, it appeared to be a rare case of obstructive jaundice due to parasites. But how on earth had Zheng Ren extracted so many alive? Qin Feng's medical knowledge was on par with the average doctor at Xinglin Garden, perhaps even slightly inferior. Watching the live stream, where over 1,000 people had debated the situation for half an hour, he found himself utterly lost. His classmate's message, "What a wise decision to have Zheng perform the surgery," would have incited his anger were it not for the surreal backdrop of parasites. The silent presence of those parasites confirmed his classmate's assertion. He remained baffled as to how the surgery had unfolded. Suddenly, his phone rang. A panicked voice, tinged with tears, asked, "Mengzi, how is your uncle?" It was his aunt, her concern palpable. "You're such a wolf cub. How could you neglect to check on him after all he has done for you?" "Aunt, there are special circumstances. The surgery may take a bit longer," Qin Feng replied, suppressing his frustration to calm her rising anxiety. "What special circumstances?" His aunt's voice sharpened, startling him. "Your uncle indulged in too much Japanese cuisine, and now there are parasites in his gallbladder. Dr. Zheng is extracting them one by one. It will take time, so please don't worry." After hanging up, he sent the photo that could induce panic in those with a phobia of clusters to his aunt. There were so many parasites to remove. He estimated it would take at least 3 hours. Feeling lost, he wandered to the rooftop for some fresh air. The wind was strong and cold, yet it could not extinguish the fire within him. He must grow stronger. He could not return to a life of farming. This was the unwavering conviction that resided in Qin Feng's heart. However, his earlier anxieties and anger transformed into a realization. He must not be overly impatient in his pursuits. Otherwise, a shiver ran down his spine as the rooftop wind intensified. Suddenly, his phone rang again. Glancing at the screen, he noted that the surgery had reached 1 hour and 41 minutes. It was his aunt calling. Perhaps she was worried again. With a sigh, he answered the phone. "Mengzi, your uncle is out. Come help us lift him." Her voice brimmed with joy, suggesting that he was recovering well enough to converse. Qin Meng was taken aback. 1 hour and 41 minutes. Had it truly been that swift? Why so quick? If it were merely obstructive cholangitis, he believed he could have concluded it in about an hour and a half, not accounting for anesthesia. Adding those factors, it would typically exceed 2.5 hours. Yet, here they were at 1 hour and 41 minutes, having performed a procedure involving both the common bile duct and hepatic duct. Was this an entirely new surgical technique? Qin Meng felt a pang of disappointment, enveloped in shock and confusion. He remained transfixed, allowing his aunt's voice to wash over him as he pondered the implications. In the live streaming room at Qinglin Garden, the surgery had concluded. The parasite extraction took 1 hour and 5 minutes, with a meticulous observer noting a total of 296 parasites. Most doctors, possessing various compulsions and a keen eye for detail, had silently engaged in the counting. Once the extraction was once again, a surge of traffic has left the staff at Qinglin Garden website startled. Fortunately, the surgery concluded early, and upon witnessing the peak viewership of 10:20 online, the staff expressed their relief. In this final frenzy, discussions about the innovative surgical technique were absent, as it was beyond comprehension. Instead, viewers aimlessly bombarded the screen with comments, merely expressing their profound respect and admiration for the surgeon. Amidst this renewed influx of traffic, Peng Jia began to take notice of an anonymous account. Previously, he had hesitated to investigate further, but ultimately refrained. If a prominent figure were employing such tactics for some ulterior motive, knowing too much could be detrimental. However, upon receiving the data sheet from the technical staff, he pondered for a moment before instructing, find out its origin. 2 hours and 14 minutes later, an email was sent, revealing that the network signal had traversed numerous proxies, yet was traced back to the Montreal Medical Center in Canada, which ranks among the top 5 medical institutions globally. Strangely, upon tracing the signal, the other party seemed quite averse, retaliating with a potent virus that rendered the website partially paralyzed. The last message left read, do not respond. Do not respond. Do not respond. Peng Jia was taken aback. Could it be that those in the medical field also wield viruses? This was truly astonishing. The sound of a task completion notification brought a refreshing sense of satisfaction. Emergency task, opponent's submission completed. Completion rate, 100. The mechanical voice of the system sounded almost cheerful to Zheng Ren. Host gains 200 skill points, 10,000 experience points. Time taken, 2 hours and 5 minutes. Earning an additional 14,100 experience points. Hidden side task, completed with full submission. Host receives the admiration of the opponent. Rewards doubled. Zheng Ren paused for a moment. According to the system, Qin Meng must have submitted. Yet, given his surgical completion rate of 100, his submission was thorough, devoid of any resentment. Was there truly such a phenomenon? Zheng Ren was indifferent to Qin Meng's state. He began to assess his own gains like a hamster preparing for winter. Experience points, 48. 200, skill points, 400. How wonderful it would be to have more opponents like Qin Meng, Zheng Ren mused pleasantly. Currently, he had 970 stored skill points. And with the additional 400 from the task, he possessed a total of 370 skill points. If he were to allocate all skill points now, his general surgery skill would exceed 200 points, nearing the master level of 5,000 points. As for experience points, he had reached 48,400, allowing for several more hours of surgical training. Zheng Ren had no immediate needs, so he decided to save them. After all, skill points stored in the system would not depreciate. Gazing at the taskbar, Zheng Ren felt a sense of fulfillment, whether in his growing strength or in healing patients. There was a unique satisfaction that doctors derive. However, when Zheng Ren glanced at the main task, he was startled. The incision and drainage surgery for acute obstructive suppurative cholangitis was classified as a level 3 operation. According to the task description, it could be counted as equivalent to 4 level 1 surgeries. Yet, the completion rate. The gallbladder and appendectomy surgeries performed in recent days had already allowed Zheng Ren to complete 2 rounds of the main task for the best surgeon. After 2 rounds, only a small portion remained. But as Zheng Ren looked at the main task, he suddenly noticed a prompt indicating that the task had been completed and rewards were available. Shouldn't the completion rate be 415? Where did this reward come from? Nevertheless, receiving a reward was the best outcome. Zheng Ren disregarded any hesitation and promptly clicked to claim it. 10 skill points and 1,000 experience points were obtained, and Zheng Ren immediately saw the task completion rate, was now 7 points. This indicated that the recent surgery had been classified as a procedure of higher significance than a level 4 surgery. Removing a parasite, could it really be considered a level 5 surgery? Zheng Ren knew that few could perform such a procedure globally. Yet there were not many patients with parasitic diseases in the country either. Each time a doctor treated a parasitic patient, they would boast about it, posting in forums for all to admire. To have it classified as an unknown high-level procedure was gratifying. Zheng Ren was delighted. Having organized his gains, Zheng Ren may not have achieved an all-encompassing enhancement, but looking at the 3 skill books, nearly 50,000 experience points, and a stockpile of 380 skill points warmed his heart. He glanced at the skill tree, noting that his general surgery skill had grown to 975 points. This surgery had yielded significant benefits. After returning the patient, Zheng Ren donned protective gear and a white coat to conduct rounds. The emergency ward was not overly crowded, with nearly every patient in a single room, which was quite satisfactory. Upon entering a room, Zheng Ren found Qin Feng attending to a patient. Aware that this former superior had thoroughly submitted, he felt no lingering concern. Zheng Ren offered a slight smile to Qin Feng and quickly checked the monitor. The vital signs were stable. The patient had awakened from general anesthesia and was speaking clearly. The previously jaundiced patient was showing visible signs of recovery at an impressive pace. "Thank you, Zheng Ren," Qin Feng said, a hint of embarrassment in his tone. "Not at all." Zheng Ren waved his hand dismissively, smiling. "With you here to care for them, I can rest easy tonight." The surgery had gone well, and there were no unusual post-operative complications. The two exchanged a few awkward pleasantries. Previously, Qin Feng had set many obstacles, but Zheng Ren's magnanimous response left Qin Feng feeling guilty. However, Zheng Ren was entirely unconcerned, not even offering the most basic of jibes, which further intensified Qin Feng's shame. Little did he know that the system had already informed Zheng Ren of his submission, and that it was indeed a complete submission. After completing his rounds, Zheng Ren wandered through other patient rooms and found Changyu chatting with a patient. Both the patient and their family treated her with the warmth typically reserved for family. Completely overlooking Zheng Ren, the surgeon, Zheng Ren couldn't help but feel a sense of admiration. Upon noticing Zheng Ren's entrance, Changyu immediately ceased her conversation. For her, chatting was merely a means to strengthen the bond with patients and their families, akin to a form of psychological therapy to facilitate better recovery. Changyu stood slightly behind Zheng Ren and began to detail the patient's condition. She meticulously covered even the minor details that typically went unnoticed. Without needing to observe the patient, Zheng Ren could gauge their recovery based solely on her descriptions. The most crucial aspect was that the information she provided aligned almost perfectly with what Zheng Ren saw in the upper right corner of his vision in the system's description. Any discrepancies were minor and could not be attributed to her. They were all rather obscure matters. Zheng Ren acknowledged the value of having such a diligent attending physician. After completing the rounds, Zheng Ren returned to his office, prepared to read and seize every opportunity to enhance his skills, striving to reach master level as swiftly as possible. Just as he opened a book, his phone buzzed. It was a group created by Xie Yiren, containing Xie Yiren, the Chu sisters, Changyu, and Zheng Ren. This was a work group, designated for matters related to their profession. Thus, Zheng Ren had not muted the new message notifications, fearing he might miss something urgent. "Zheng, today was quite nauseating," wrote Chu Yinji. "Same here. I seek comfort," replied Xie Yiren. "How about a meal?" asked Chu Yinji. "Anjiantilu." A newly opened restaurant has garnered a reputation for its quality. Without any prompting from Zheng Ren, several young women enthusiastically decided that he would treat them to a meal of boiled fish that very day. Zheng Ren felt quite helpless. While he could easily maintain an average of 400 during surgeries, he found himself outmatched in conversation, quickly conceding defeat to the spirited chatter of the ladies. As they joyfully set off for their meal, Zheng Ren remained behind, seizing the opportunity for some quiet reading. He understood the wisdom of incremental progress, recognizing that focused study yielded numerous advantages. For instance, during systematic surgical training, lacking even the most fundamental knowledge would hinder the pursuit of innovative ideas, rendering the time spent in training nearly criminal. He sensed that as he ascended the system's skill tree, the benefits reaped during surgical training would only amplify. Typically, an expert hepatobiliary surgeon would learn gastrointestinal procedures at a rate exponentially faster than a freshly graduated physician, owing to a solid foundation. After a while of studying, a sense of unease crept over Zheng Ren. He realized that he had not yet visited the emergency department after completing rounds. To quell his concern, he decided to take a look, hoping to confirm that everything was stable so he could return to his studies undistracted. Upon entering the emergency department corridor, he was met with the palpable buzz of activity. There were those who had drunk excessively and required gastric lavage, children feigning illness to avoid school, and individuals involved in minor accidents seeking redress. Zheng Ren had seen enough of these scenarios to remain unfazed. However, in a quiet corner, he detected the muffled sounds of deep sorrow, a stark contrast to the usual urgent and chaotic environment of the emergency department. Curiosity piqued. He approached the source of the distress and found a family of 3 embracing one another, weeping as if mourning a loss. A weary-looking man, his skin darkened by toil and dust, spoke sorrowfully to his daughter, imploring her to care for her mother in his absence. Despite appearing to be in his 50s, Zheng Ren noted on his system panel that he was only 42, a farmer from a remote village. A young girl, no more than 17, knelt beside a middle-aged woman, tears cascading down her face like a string of pearls. "Father, you will be fine. Surely you will," she pleaded. The man lamented his fate, expressing regret over not witnessing his daughter's milestones, particularly her future children. The atmosphere was heavy with grief, and Zheng Ren felt compelled to intervene, adopting a gentle tone to avoid further distressing the family. "Sir, what troubles you?" Zheng Ren inquired. The man looked up, recognizing Zheng Ren's white coat and green attire, indicative of a higher authority among the medical staff. "Doctor, please save my father," the girl implored, rising to her full height, revealing her impressive stature. Zheng Ren noted her height with a hint of bemusement, wondering about the nutrition of today's youth. As the girl bowed deeply, struggling to articulate her hopes, Zheng Ren reassured her, "Your father is not gravely ill. He has been diagnosed with an inguinal hernia, not cancer." The girl's expression shifted from despair to confusion, her eyes wide with disbelief. Zheng Ren quickly reviewed the diagnosis, confirming that it indeed stated her father had a hernia, not cancer. The misunderstanding stemmed from a misreading of the medical terminology, a situation Zheng Ren had never encountered despite his years in practice. He understood the reputation of doctors for their poor handwriting, but the modern use of computer-generated reports had largely mitigated such issues. "No, this term is pronounced hernia, not cancer," he clarified gently, wishing that Chang Yu, with her exceptional communication skills, were present to alleviate the family's distress more swiftly. The girl hesitated, her fingers nervously twisting the fabric of her clothing as she wrestled with her feelings of confusion and shame. "This condition is easily treatable," Zhang Ren assured her. The father, earnest and simple, replied, "Doctor, please do not deceive us. We truly cannot afford it. Rest assured, if we perform the surgery promptly and there are no complications, he will be discharged in 3 days and will be able to return to work within a week," Zheng Ren explained, attempting to instill confidence in the family, who remained dazed and lost in their grief. "This is a straightforward procedure that falls under general surgery. Allow me to arrange for your admission for further examination. As long as there are no surgical contraindications, the operation can proceed without concern," Zheng Ren stated, reinforcing the simplicity of the matter. "Is it really that simple?" the family questioned, still grappling with their earlier panic. Zheng Ren could only muster the most straightforward of reassurances to convince them. Just then, he received a call from Xie Yiren, asking him to summon Chang Yu to the emergency department. Zheng Ren felt a surge of relief at the prospect of her assistance. Soon, Chang Yu arrived, clad in pristine white attire with a red stethoscope draped over her shoulder. Zheng Ren marveled at her youthful vibrancy and wondered about the source of her remarkable communication abilities. After listening to Zheng Ren's explanation, she smiled and said, "Leave this to me." As Chang Yu led the family to a quieter corner, she seemed to exude a calming aura, prompting Zheng Ren to release a sigh of relief as he turned to check on patients in the observation area. Most cases were straightforward, primarily involving head injuries or acute gastroenteritis due to overeating, all of which were easily diagnosed and treated. After ensuring there were no misdiagnoses among the patients, Zheng Ren felt a weight lift from his shoulders. Upon exiting the final observation room, he caught a glimpse of laughter emanating from the corner of the corridor. Approaching, he found the middle-aged woman grasping Chang Yu's hand, her face alight with joy. In mere moments, Chang Yu had transformed from a medical professional into a cherished family member. Zheng Ren reflected on his own limitations in that regard, realizing he might never possess such a gift. Chang Yu returned to Zheng Ren's side, reporting, "They have accepted the surgical recommendation. Shall we proceed with their admission?" Zheng Ren quickly interjected, "Wait, this is an outpatient procedure. It's not our responsibility to admit them." He recognized the importance of adhering to hospital protocols, understanding that without strong leadership support, attempting to change established practices could lead to dire consequences. The patient's condition was relatively straightforward. However, the family faced financial difficulties. When Chang Yu stood before Zheng Ren to report on her work, the smile that had adorned her face earlier vanished entirely, leaving no trace of the warmth she had shown to the patient's family. "Are you considering crowdfunding?" Zheng Ren inquired. The department was being established, and Director Pan had secured a policy from the hospital that allowed for certain fees to be waived for patients. Chang Yu's expression was impassive. She had no intention of trying to curry favor with her superior, Zheng Ren. She stated, "We need to go to the general surgery department. We require a patch for the surgery. A single patch costs between 1,000 to 2,000, which is equivalent to her family's entire annual income." Zheng Ren was aware of this situation. "If we have to go to general surgery, I imagine that young woman will soon find herself married. Exchanging a dowry of either 3,000 or 5,000 to cover the medical expenses. As for whether the man she marries is a fool or not." "Stop." Zheng Ren quickly interrupted Chang Yu. He realized that she wished for him to perform a conventional procedure. After all, since his arrival at the hospital, he had always conducted hernia repairs using patches, which differed significantly from practices decades ago. Hernia patches could substantially reduce postoperative complications, and their costs seemed rather reasonable. Presently, it was unlikely that any of the junior doctors in general surgery would perform a simple hernia repair, including Zheng Ren, of course, the former Zheng Ren. The standard for the surgeries here required a minimum score of 80. "I will consult with Director Pan," Zheng Ren declared, striding toward Director Pan's office. A few minutes later, he emerged with a beaming smile, stating, "All set, admit the patient." "What do you estimate the expenses will be?" Chang Yu asked, her face devoid of expression. "We'll only conduct necessary tests and eliminate the optional ones. An ECG and reduced surgical fees should suffice, estimating around 300 to 500, Zheng Ren replied. Chang Yu nodded, choosing not to say anything further as she turned to return to the family. Once in the presence of the patient, Chang Yu's demeanor transformed entirely. She became positive, radiant, and exuded a trustworthy warmth. Zheng Ren shook his head. This girl, with such a temperament, it was no wonder she had resolved significant issues in the gynecology department, ultimately taking the blame. Nevertheless, Zheng Ren appreciated individuals like her. General task, the heart of a healer. Task content, based on the patient's actual condition. Employ an appropriate method to complete an inguinal hernia repair. Task reward, 50 skill points, 1,000 experience points. Task duration, 2 days. The heart of a healer? Zheng Ren pondered the title of the task for some time. Fortunately, the task duration was an astonishing 2 days, excluding fasting and hydration time. The surgery should be quite simple. With about 100 training surgeries in the system's operating room, he could surely achieve a completion rate exceeding 90. However, the notion of the heart of a healer piqued his interest. He had not anticipated the system would concern itself with such matters. Zheng Ren entrusted all trivial matters to Chang Yu and returned to the emergency ward. Upon entering the office, he was greeted by the enticing aroma of food. Zheng Ren had almost forgotten to eat. Had it not been for a few young women packing meals for him, he might have skipped this meal as well. After a quick bite, he discarded the remnants into a black plastic bag next to the restroom and returned to his reading. Chang Yu was busy, preparing for surgery, writing medical records, and communicating with patients, yet her evident enjoyment in her work deterred Zheng Ren from intervening. The patient had not eaten or drunk anything since early morning, and in 10 minutes, they would be ready for surgery, Chang Yu informed him. Yes, notify them in the group. Prepare for the surgery, Zheng Ren replied, closing his book. He was not inclined to engage in further conversation with Chang Yu, who wore a serious expression and headed straight to the operating room. In the changing room's smoking area, he lit a purple cigarette, took a puff, and entered the system space. Zheng Ren had 49 for 100 experience points remaining. He decided to reserve 25,000 points and exchange the rest for surgical time to begin training for hernia repairs. At his current intermediate master level, he could undoubtedly complete the surgery without training. Nevertheless, Zheng Ren preferred to exercise caution, as he had never performed, nor even observed, a simple hernia repair since he arrived at the hospital. To be prudent, he exchanged for 407 minutes of surgical training. The system's operating room activated, and a practice subject appeared as Zheng Ren began the procedure. In just a few minutes per surgery, He trained on a total of 121 hernia repairs. Upon finishing, he felt a sense of progress in his understanding of gastrointestinal surgeries. Even with a simple hernia operation, it contributed positively to his skill point growth. Glancing at the skill tree, he noted that his general surgery skills had increased to 2,044 points, prompting him to exit the system space, don a sterile gown, and prepare for surgery. Upon entering the operating room, he overheard one of the Chu sisters asking the patient, "Sir, do you feel any numbness in your feet?" The patient remained silent. It was peculiar. Should there not be a response if anesthesia had been administered successfully? In an instant, Zheng Ren felt a chill run down his spine. He could only guarantee the success of the surgery should there be an anesthetic mishap, even with just epidural anesthesia, paralysis of the patient's lower limbs. That would be a serious matter, a medical incident. Rushing in, Zheng Ren observed one of the Chu sisters at the patient's leg, gently tapping the thigh with a blunt instrument, inquiring, "Sir, do you feel any numbness in your feet?" Still silence. Zheng Ren quickly scanned the system panel and saw the notation indicating successful continuous epidural anesthesia, with no alerts for anesthesia failure, which reassured him. However, if the anesthesia was successful, why was the patient not responding? The other Chu sister, positioned near the patient's head, spoke softly, remaining patient despite the lack of response. "Sir, I'm asking you, do you feel any numbness in your feet?" A flicker of shame crossed the face of the middle-aged man lying on the bed. Why would such an emotion arise? Zheng Ren was taken aback. "Mom." In the operating room, silence prevailed. Suddenly, a loud clatter reverberated as Xie Yiren accidentally knocked over a saline solution, spilling it everywhere. Zheng Ren approached the middle-aged man's head and smiled, saying, "Don't worry. They are asking if you feel numbness in your feet and if you can't feel any pain. They aren't asking you to call your mother." Initially, the Chu sisters had no idea why the patient would call him mother, but upon hearing Zheng Ren's explanation, they were enlightened. Laughter erupted in the operating room. "Oh, great motherland. How magnificent and vast you are, with so many dialects." "Quiet now, making puns will result in salary deductions," Zheng Ren sighed, reluctantly cutting short the laughter to prepare for surgery. The anesthesia had been flawlessly administered. The Chu sisters' skills were at least at an intermediate level. Otherwise, the anesthesiology instructor would not have been absent, hiding in the back room reading novels, while waiting to complete the final contract period to work in the South. Zheng Ren scrubbed in and began laying out the surgical drapes. The operation commenced, arguably the simplest surgery Zheng Ren had performed since acquiring the system. In the surgical live broadcast room, the session began streaming. Following the notification ping on their phones, many doctors, unless engaged in critically important matters, entered the live stream to observe the procedure. "The master is starting another surgery. I'm still watching the recording of the last one. I've watched it twice, yet I still don't understand how to extract the parasite. My intuition tells me the master might be an esports expert. Just look at that hand speed. It must average an APM of 500, easily overpowering various esports champions. Speed is one thing, but accuracy is key. Every time he grasps a parasite with those tiny forceps, he doesn't even damage the serosal layer. Truly awe-inspiring. I just bought the freshest tofu and prepared fine cotton thread. I'm determined to practice for a week and reach the Master S level. Dream on, you'll never reach the Master S standard in your lifetime." As they chatted, the doctors exchanged insights and experiences regarding surgical techniques. However, these moments of ease and comfort are fleeting, limited to the intervals when the surgeon in the live streaming room is disinfecting and preparing. As the procedure begins, no one wishes for a crucial step to be obstructed by the barrage of comments. Xie Yiren gently places the scalpel into Zheng Ren's hand, making the first incision. "Why do I feel this is a patient with an inguinal hernia? The location certainly suggests so, but how could a master perform such a rudimentary procedure? Haven't you seen the case? This is a straightforward inguinal hernia patient. You are not mistaken, young man. What is there to see? The master isn't performing laparoscopic hernia repair. Has he returned to basics? The inguinal hernia repair surgery indeed lacks spectacle. The patient's condition is simple, and Zheng Ren's technique is straightforward and efficient. The anatomical structures are clear, and every step aligns perfectly with surgical teachings, devoid of any deviation. It is quite peculiar. Having just completed a biliary worm extraction procedure that no one had witnessed before, he now transitions to the simplest hernia repair. Can the master really span such a vast range of surgeries? Will he be venturing into other medical disciplines in the future? Some doctors recall that the first surgery in the live stream was a simple debridement and suturing, sparking their imaginations. There's truly nothing remarkable about this. A simple hernia repair was already phased out in our hospital 15 years ago. Indeed, the Master's skills remain intact. The continuous reinforced suturing technique used to prevent postoperative recurrence is impeccable, yet it offers no unique highlights. Can anyone tell me if they've spotted any noteworthy aspects of the surgery? 3 minutes later, the surgery concludes. In the live stream, a few comments drift weakly across the screen. Everyone's appetites have been spoiled by the surgeon's prior performance. Witnessing a flawless hernia repair fails to satisfy their insatiable curiosity. Who cannot perform a hernia repair? Moreover, everyone is accustomed to laparoscopic techniques using mesh. This surgery truly lacks any remarkable features, leaving the watching doctors somewhat disheartened. As the operation ends, so does the live stream. I've heard that professors in the capital and the Magic City seldom consider cost-saving measures for patients. Those who can afford treatment are not concerned about trifles. Such straightforward hernia repairs are rarely seen nowadays. It feels quite nostalgic. Despairing face. I've just learned laparoscopic hernia repair, and I suddenly feel an urge to seek opportunities to master conventional hernia repair. If a patient lacks funds, this procedure might indeed be necessary. All are physicians. Who does not understand the pros and cons of these two surgical techniques? Why broadcast such a mundane, unremarkable surgery? The reasoning is, of course, self-evident. After the surgery, the patient is returned to the ward. There is no analgesia pump, only the most basic treatment. The mother and daughter realize the surgery was highly successful, with an almost negligible chance of recurrence, and a great weight is lifted from their hearts. Genuine joy radiates from their faces. Ding dong. The first phase of the continuous task, the healer's parental heart, has been completed. A mechanical female voice from the system rings in Zheng Ren's ears. Isn't this a general task? Why has it transformed into a continuous one? Will it evolve into a mainline task in the future? Zheng Ren internally critiques the system's reliability. The host has gained 50 skill points and 1,000 experience points. Treatment duration, 2 hours and 28 minutes. The host completed the task ahead of schedule, earning a reward of 163,920 experience points. Zheng Ren had anticipated this. The system allotted 2 days for task completion, likely to distribute a significant reward. However, upon seeing the astonishing figure of 163,920, he was utterly stunned. Had the system indicated less than 2 days for task completion, Zheng Ren might have accepted it without surprise. Yet, presenting such a substantial figure left him bewildered. It was exceedingly generous. For Zheng Ren, this number felt overwhelmingly vast, and he gazed at the reward, unable to tear his eyes away for 3 minutes. This represented over 40 hours of surgical training. Since the introduction of tasks from rival colleagues, the system had ceased to calculate rewards in days or hours, now measuring in seconds, and had opened a marketplace. This felt like an intricate scheme, a web of tricks. Zheng Ren experienced a strange illusion that the system was continuously evolving, like an enormous glutton. 40 hours of surgical training was indeed wonderful. Such intensive training is particularly suited for someone like Zheng Ren, who is somewhat stubborn and determined, seizing every opportunity to learn thoroughly. It is rare for individuals with nimble minds to focus solely on one type of surgery for several hours, let alone perform it thousands of times. While those who have conducted thousands of similar surgeries may exist, few possess the ability to extract necessary insights from each procedure and continually enhance their skills. With perseverance and insight, he seems to lack grace, and in a society so focused on appearances, he must rely solely on his talents. Thus, to Zheng Ren, this experience points to his sustenance in the future. How could he not be joyful? After the initial elation, Zheng Ren reflects on the system's positivity, likening it to sunlight. Brimming with energy, the phrase "the healer's parental heart" is seldom mentioned nowadays. Most often, patients or their families express, "Dr. Zheng, your service attitude is commendable." Each time this occurs, Zheng Ren feels a twinge of discomfort. The healer's parental heart. This task title resonates deeply with Zheng Ren's worldview. In Haicheng, at the first hospital, on the second floor of the emergency building, in the spacious corridor, a shy girl with very dark hair, slightly unkempt, stands. Yet, her disheveled appearance cannot obscure her vibrant gaze. She looks around furtively, and upon seeing no one, swiftly opens a large black garbage bag, retrieving several food containers. In the hospital's fire escape, the girl and a middle-aged woman squat on the ground, opening the recently salvaged containers, which contain no dishes. Only remnants of spilled vegetable soup. The young girl, tall with long legs, appears particularly odd as she squats down to eat. She carefully tears a piece off a dry, crumbly bun, dipping it into the soup and savoring each bite. Their expressions are unpretentious, filled with joy, as if a mere bowl of leftover soup represents an improvement in their lives, and they relish it thoroughly. 0070 Unremembered. The afternoon passes uneventfully. The patients are stable, and Zheng Run is reading while Changyu completes her case notes, wandering from ward to ward to chat with patients and their families. The Chu sisters and Xia Yiren are in the operating room, nostalgically recalling the day they performed 49 appendectomies. Chu Yenji, wishing to burn calories, finds no outlet, as it would be inappropriate to toss Zheng Run onto the operating table. Zheng Rin has completely forgotten about the massive experience points he earned, quietly sitting in his office, reading, waiting for the emergency department to call regarding relevant cases. Around 3 in the afternoon, a series of footsteps echoes down the emergency ward corridor. Zheng Rin pays no mind, assuming it to be friends or family visiting a patient. The emergency ward cannot maintain a fully enclosed management system. After all, each patient would require over 4 nurses for care in a completely closed environment. Currently, it is a challenge to assign even 1 for nurses per patient. Director Old Pan has scoured the entire hospital just to barely staff the emergency ward. Thus, people come and go freely. Such matters are decided by higher-ups with little regard for practicalities. Anyone who takes it too seriously is destined to lose. Dr. Zheng, hello. A knock at the doctor's office door interrupts him. Several individuals stand outside, the foremost wearing a black hoodie and large sunglasses, resembling a celebrity. Who could this person be? Zheng Rin is momentarily taken aback. Looking at the individual's appearance, his mind draws a blank, devoid of any recollection. I am Zhou Jinxia. Do you remember me, Dr. Zheng? The person removes their sunglasses, revealing a sweet smile. Zhou Jinxia, if memory serves, was a patient who underwent a laparoscopic retrograde appendectomy. The name rings a bell, and the case is familiar. Yet Zheng Rin finds it impossible to associate the sweetly smiling girl before him with anything. He shook his head, and the atmosphere grew awkward. Hello, Dr. Zheng. A professional-looking individual emerged from behind Zhou Jinxia, wearing a calm and graceful smile. I gave you my business card, do you remember? I don't recall, Zheng Rin admitted, scratching his head, having completely forgotten the card handed to him by the agent in the corridor of the endoscopy room, who had mentioned treating Zheng Ren when he arrived in the bustling metropolis. Dr. Zheng, you are known for forgetting things, the agent remarked, her smile faltering slightly. Though she maintained her composure, Miss Zhou won the championship at the model contest and took a flight back to the city tonight specifically to express her gratitude to you. Oh, please, have a seat. Zheng Ren finally offered some polite words. It was only at that moment that he acknowledged her presence. Zhou Jinxia was dressed in jeans that accentuated her slender legs, her every move radiating remarkable elasticity. Despite her ethereal beauty, Zheng Ren felt no stir of emotion and casually inquired, "How is your recovery?" "Quite well," Zhou Jinxia replied with a smile. "I was on my feet all day. Started on a liquid diet the next day, and by the 3rd day, I was competing. Sister Wu was worried I might strain the incision. But there were no issues at all. Dr. Zheng, your skills are truly impressive." As she spoke, she gave Zheng Ren a thumbs up, her hands glistening with a soft sheen akin to jade. Zheng Ren confirmed on the system panel that Zhou Jinxia had indeed made a complete recovery, with no risks involved. "Dr. Zheng, my little sister wants to ask when our father can be discharged," a voice interrupted, as Changyu squeezed through the crowd. The young girl appeared particularly self-conscious amid the throng of people and hesitated to follow Changyu inside. Zhou Jinxia's agent noticed something and stood up abruptly, surveying the girl from a superior height. Although she was not taller than the girl, her imposing demeanor radiated authority. The girl, feeling scrutinized, timidly asked, "Why are you looking at me? How old are you?" The agent queried. 17, the girl replied. "Are you in school or working?" "I was planning to work. But my father fell ill, so I've been taking care of him. Once he returns home, I intend to find a job," she explained, her voice growing softer with evident shyness and insecurity. Seeing the agent's intimidating stance, Changyu stepped between the girl and the agent, grasping the girl's hand and leading her inside. "Dr. Zheng, my sister would like to know when our father can be discharged." "In 3 days. But if you're not in a hurry, you can wait a week until the stitches are removed. If you need to rush, you can go to any township clinic for that," Zheng Ren replied without hesitation. Had absorbable sutures been used, he might have worried about the incision tearing due to movement. However, today's surgery utilized a robust number 7 suture, which gave him ample confidence. Did you understand, little sister? Chang Yu reassured, don't worry too much, although Dr. Zheng may not be the most handsome, his surgical skills are top-notch. He assures us your father is fine. Zheng Ren felt a pang of regret at Chang Yu's description. The girl deeply bowed to Zheng Ren before hurriedly departing. The agent's gaze held a hint of amusement as she observed the girl leave. Dr. Zheng, is that your patient's family member? Yes, he replied. What do you have in mind? Chang Yu, ever cautious, sensed the agent's intentions and quickly inquired. The company is preparing to form a girl group, and that girl seems perfectly suited in both physique and appearance, the agent explained. Chang Yu's wariness was palpable as she responded, you can't possibly think I would allow you to exploit her? Indeed, Chang Yu's directness was refreshing as she affirmed. There are countless who seek my assistance in this regard, but I hardly entertain them, the agent boasted. Opportunities to change one's life are rare. Doctor, are you certain you can make decisions on her behalf? Chang Yu hesitated, knowing well the girl's family circumstances. Just then, Zheng Ren's phone rang, interrupting the tension between them. Director Pan? Yes, I understand. What is it? All right, I will head over immediately. After a brief conversation filled with apologies but lightened by a relaxed expression, he announced, there's an urgent consultation in the ICU. I must excuse myself. Thank you, Dr. Zheng. The agent said as she retrieved another business card from her purse and handed it to him. If you find yourself in the city, please do reach out. You have been a tremendous help to both me and Zhou Jinxia. Zheng Ren smiled, accepting the card and casually slipping it into his jacket pocket. Chang Yu, please see me off. I need to attend the ICU consultation. The entire hospital's consultations shouldn't involve our emergency department, should they? Chang Yu queried, puzzled. Director Pan stated that as long as it pertains to emergency care, it concerns us, Zheng Ren explained. I'll be back shortly. Please wait for me to finish before you leave. With that, he departed, leaving the tall beauty behind in the office without a word. Upon reaching the first floor of the emergency building, Director Pan awaited Zheng Ren. Together, they hurried to the ICU, donning hats, masks, and sterile gowns in the changing room before stepping inside. The ICU resembled a secret chamber for safeguarding treasures, requiring not only a change of clothes, but also 2 rounds of security clearance to minimize the risk of introducing bacteria. Most patients in the ICU had undergone tracheostomies and relied on ventilators, making their immune systems extremely vulnerable. Bacteria harmless to healthy individuals could be fatal for these critically ill patients. Upon entering the ICU, numerous department heads had already arrived, conducting examinations. Zheng Ren's system panel indicated a diagnosis of placental abruption and hemorrhagic shock. The patient, a young woman at 20 weeks of gestation, was suffering from gestational hypertension, which led to the placental abruption, detaching half of the placenta from the uterus. Due to severe blood loss, the patient exhibited symptoms of hemorrhagic shock, including pallor, profuse sweating, rapid pulse, and declining blood pressure. Tragically, the fetus had succumbed to hypoxia, and the fetal heartbeat was undetectable. This was a particularly challenging case. As it was her first pregnancy, opting for a hysterectomy would render the patient unable to bear children in the future, a cruel fate for a woman yearning for motherhood. However, if an emergency hysterectomy was not performed, the bleeding would persist. The obstetrics department had attempted various interventions, but packing and hemostatic medications proved largely ineffective. The attending directors shared their concerns, furrowing their brows at the alarming numbers on the monitor, caught in indecision. The situation was straightforward, yet the dilemma of whether to proceed with the hysterectomy loomed large. Standing at the patient's bedside was Su Yun, clad in pristine white scrubs. Holding a blue medical folder and draped with a stethoscope, her expression stoic as she surveyed the gathering of directors. I suggest we discuss this in the office. We have roughly 10 minutes, the ICU director proposed. I believe there is little to debate. Su, the obstetrician, adjusted her black-rimmed glasses and asserted, we have exhausted all methods of hemostasis, and none have proven effective. The patient's hypovolemic shock will worsen with further delay, precluding any possibility of surgery. Alas, the head of anesthesiology sighed, hesitating to speak. Old Wang, if you have something to say, say it. Stop sighing. The ICU director, in a state of agitation, was intolerant of any delay. If only we had an interventional radiologist, the anesthesiology head lamented, voicing the collective sentiment. Ask cardiology if they can assist. The ICU director said indifferently. Today, the three cardiology departments had admitted 18 patients with myocardial infarctions, all undergoing surgery. Once a myocardial infarction occurs, without prompt surgical intervention, the patient faces certain death, leaving no alternative. Unlike the pregnant woman in the ICU, who at least had the option of preserving or removing her uterus. In the hospital, such stark conflicts arise almost daily. Whose life is more valuable? None. In the face of death, all are equal. The only inequalities are societal. Even if cardiologists had the time, who would be responsible if something went wrong during uterine artery embolization? The scope of practice is clearly defined on the physician's license. It is the law. Of all departments, only the emergency department has a broader remit. Silence descended upon the room. Zhang Ren stood in a corner. As such large-scale emergency consultations were beyond the purview of a resident. Had it not been for Director Pan's insistence and the respect others had for him, Zhang Ren would not even have been allowed in the room. He understood the crux of their dilemma, to preserve the uterus while stopping the bleeding, which could only be achieved through interventional radiology. However, interventional radiology exposes the practitioner to significant radiation. So after an interventional radiologist at the Municipal First Hospital developed large B-cell lymphoma, routine elective interventional procedures were essentially discontinued. Eventually, the doctors either transferred or went into cardiology to perform coronary stenting. Currently, there are no interventional radiologists. The anesthesiology head's sigh was a result of this. The mention of interventional radiology reminded Zhang Ren of the system's earlier enticement to choose interventional radiology as a treatment option. Perhaps he could try? Zhang Ren was intrigued. With only a few minutes to spare, he needed to act quickly. He immediately entered the system space and opened the system store. Upon seeing the item for purchasing interventional radiology training time, he hesitated momentarily. Zhang Ren was not hesitant about whether to learn. If he could save a life or preserve a woman's fertility, a few experience points were inconsequential. His hesitation stemmed from whether he could actually learn it. Since acquiring the system, Zhang Ren's memory had improved significantly. Combined with his advancing general surgery skill tree, his understanding of anatomical structures had become more thorough. Recalling the interventional radiology treatment for placental abruption, it seemed that only one uterine artery needed to be embolized, making it the simplest of interventional procedures. So, let it be. Once Zhang Ren made a decision, he did not hesitate. He tapped the item. Instantly, the operating room materialized from the ground. And Zhang Ren felt a sudden weight as a lead apron materialized on his body. An experimental subject was before him, and Zhang Ren held a set of puncture kits. What should he do? Zhang Ren was dazed. To learn interventional radiology, please first increase interventional skills points. The system's emotionless female voice appeared, reminding Zhang Ren that he needed to upgrade the skill tree before attempting interventional radiology. Did he think he could learn interventional radiology as an untrained novice? Zhang Ren was taken aback. He immediately used a skill book to upgrade interventional radiology to advanced peak, or 1,000 skill points. Then, he invested one more skill point to reach the expert level. His pace was swift. He felt a thunderclap descend upon him, electrifying his entire body. Soon, his mind cleared, and many unfamiliar memories appeared logically. While advancing the general surgery skill tree, Zhang Ren had not noticed any qualitative differences, as he was already a general surgeon familiar with various general surgery procedures. Even when a particular skill improved or reached over 2,000 points, Zhang Ren simply thought it was remarkable. Interventional radiology was different. It was a skill acquired from scratch, making Zhang Ren increasingly aware of the system's incredible nature. With expert-level interventional skills prepared, he possessed 189,920 experience points, equivalent to over 52 hours. Zhang Ren directly exchanged them for 50 hours of surgical training time, reserving the remaining experience points for emergencies. Interventional radiology training commence. In the office, Director Su of Obstetrics sighed one last time, stood up, and said, "Then it's decided. Prepare for surgery. I'll speak with the family myself." This was the only option. The other directors had long anticipated this outcome, but hearing it confirmed by others still extinguished a flicker of hope. "One moment," Zhang Ren said, stepping forward to block the doorway. Little Zhang from general surgery? Director Su recognized Zhang Ren, but her impression of him remained as a general surgeon. "He's now a chief resident in the emergency department," Director Pan corrected protectively, taking exception to Director Su's designation of Zhang Ren as a general surgeon. "What is it?" Director Su asked, frowning. "I can perform interventional radiology, and emergency interventional embolization falls within the scope of emergency treatment and does not violate regulations, Zheng Ren stated. You? Dozens of pairs of eyes scrutinized Zheng Ren. During my internship, I performed actual procedures, Zheng Ren said, finding the excuse weak. He doubted Director Su would believe him, but he could not immediately find a more convincing reason to persuade her. Let me through. I need to prepare for surgery. Director Su was resolute, unwilling to listen to Zheng Ren's empty boasts. Director Pan turned to Zheng Ren and asked, "Can you do it? It's just embolizing the uterine artery. The emergency operating room has a hybrid operating table, and we can borrow consumables from cardiology. Although they won't be ideal, they should suffice. The only issue is the lack of gel foam. Cardiology surgeries primarily focus on clearing blockages, so they would not have gel foam for embolization." Director Pan, Director Su said, exasperated. However, Director Pan's reputation commanded respect. The hybrid operating table is available. Give Zheng Ren 10 minutes. I only need 5 minutes. Zheng Ren declared. All right, 5 minutes. If it doesn't work, it won't delay the hysterectomy. The emergency operating room has a scrub nurse and an anesthesiologist already preparing for an emergency surgery. So it won't affect your procedure, Director Pan said. Director Su considered the time. Attempting the procedure would at least allow them to tell the family that they had done everything possible, potentially making the situation more palatable. Are there any complications? The head of anesthesiology asked. Yes, but the likelihood is low. There's no time to explain, Zheng Ren said. Then let's go to the emergency operating room. Director Su decided immediately and strode out to inform the patient's family. Resuscitate first, and if all else fails, then perform a hysterectomy to save the mother. This approach would ease the family's distress. As Director Su agreed to perform the procedure in the emergency hybrid operating room, Zheng Ren heard the system task notification. Emergency task, save a future mother. Task, perform a uterine artery interventional embolization. Reward, 100 skill points, 1,000 experience points, and a silver treasure chest. Time limit, 3 hours. Zheng Ren did not have time to examine the system task in detail. Saving the patient was paramount. Su Yun glanced at Zheng Ren with a look of astonishment, or perhaps disbelief, for a few seconds, a hint of a smile playing on his lips. After performing a few procedures during his internship, he dared to claim he could embolize the uterine artery in 5 minutes during a major emergency. It was preposterous. What was a general surgeon doing pretending to be an interventional radiologist? However, Su Yun's smile seemed devoid of mockery, replaced by a trace of curiosity. In moments of crisis, everyone moved with alacrity. Zheng Ren and Director Pan hurried to the cardiology catheterization lab to borrow consumables. The materials used in the circulatory department and those for interventional embolization differ significantly. However, given the urgency of the situation, compromises must be made. On the way, Director Pan inquired about the type of gelatin sponge Zheng Ren required before swiftly making a phone call. Indeed, Director Pan's connections were quite remarkable, as he swiftly hung up and informed Zheng Ren that the gelatin sponge would soon arrive. With Director Pan's assurance, Zheng Ren felt a surge of confidence. Upon arriving at the catheterization room, Zheng Ren began to search for any substitutable materials. The supplies in the circulatory department tend to be softer and finer, while the materials for interventional embolization do not need to be as delicate, considering that the uterine artery is significantly thicker than a coronary artery that is 90 occluded. As an expert, Zheng Ren had a broader range of options compared to an average physician. Minutes later, he sprinted toward the emergency operating room, cradling a bundle of guide wires and catheters. Once he reached the emergency operating room and caught his breath, he began preparing for the procedure. Suddenly, the cold, mechanical voice of the system echoed in Zheng Ren's ear, and a new task description appeared in the upper right corner of his vision. A dual task? Zheng Ren was momentarily taken aback. Special task, isolated and helpless. Task content, no one can assist you. You can rely solely on yourself. It is said that surgery is not a solitary endeavor, yet in exceptional circumstances, one must face the challenge alone. Please complete a surgery by yourself. Task reward, unknown. Task duration, 3 hours. Isolated and helpless. This phrase struck Zheng Ren's heart with precision. Although the hybrid operating room in the emergency department was well equipped, he found himself without an assistant, technician, or appropriate tools. In a typical surgery, the absence of any one of these elements would hinder successful completion. However, he simply did not have the luxury of time to hesitate, to wait, or to waste. His ability to successfully complete the surgery could determine whether a woman had the opportunity to become a mother. Zheng Ren dismissed the task details. The reward paled in comparison to the importance of saving a life. He activated the long-dormant machine, and after noise reduction, a deep rumble filled the air. The machine, a Siemens Artis Z dual C-arm angiography system, was the latest model from 2 years prior. Even after being idle for nearly 2 years, it remained a top-tier device in the country. Yet, without an operator, this cold machine was merely a collection of useless metal. He powered on and calibrated the system. Lacking a technician, Zheng Ren granted operational privileges to the surgical room. Much like the shadowless lights in the operating room, he applied sterile drapes, allowing him to control the environment independently. Xie Yiren and the Chu sisters had received a call early in the morning and were busily preparing. Since only local anesthesia was involved, the Chu sisters could only wait until Zheng Ren's surgery failed to intervene when obstetrics had to perform a hysterectomy. However, their chances of participating were slim, as Director Wang from the anesthesia department had also arrived. Xie Yiren, having prepared the necessary items, found little else for her to do. The patient was wheeled in, with a blood pressure of 70-50 millimeters of mercury, a respiratory rate of 25 breaths per minute, and a pulse of 152 beats per minute. With an oxygen saturation of 92. She appeared pale and drenched in sweat, a classic presentation of hemorrhagic shock. A deep vein puncture was established, and fresh frozen red blood cells flowed through a dark red line, sustaining the patient's vital signs. Everyone present understood that this tenuous support would not last long. Due to significant blood loss, the patient faced the risk of severe complications, such as disseminated intravascular coagulation, DSC. Rapid hemostasis was critical. Whether through traumatic hysterectomy or minimally invasive intervention depended entirely on Zheng Ren's actions. The preoperative preparations were completed efficiently, showcasing the professionalism of the doctors and nurses at the Municipal First Hospital. No one wished for a young, childless woman to face a lifetime of infertility. Director Su from obstetrics was explaining the situation to the patient's family, but was skeptical of Zheng Ren's assurances. Merely offering respect to Director Pan was inadequate. Preparing for surgery and arranging blood transfusions required time. Yet, the longest delays stemmed from managing the patient's family. Convincing them of this grim news without igniting disputes was a skill in itself. Thus, Director Su decided to give it a try. What harm could it do if it did not interfere with her own surgery? Other department heads observed from the control room, peering through thick lead-lined glass at Zheng Ren's solitary operation in the operating room. It was rumored that just days ago, he had performed 49 appendectomies in a single night. Director Wang from anesthesia inquired. Indeed, the young man possesses remarkable skill and dedication, Director Pan affirmed. High competence and a willingness to work hard were the highest praises one could bestow upon a physician. Su Yun stood silently at the back, leaning against the wall, her hair cascading down in a captivating manner. She watched Zheng Ren's movements within the operating room intently. He skillfully opened the puncture kit, demonstrating remarkable proficiency. The local anesthesia was administered swiftly, and he expertly performed a femoral artery puncture using the Seldinger technique, inserting the vascular sheath with ease, exhibiting none of the clumsiness of a novice. This surgery was becoming increasingly intriguing to Su Yun. If encountered in the hospital cafeteria or on the street, many would have turned their heads, and bold women would have approached him. Yet, in the control room outside the operating room, no one paid attention. All were focused intently on Zheng Ren's every move, regardless of their understanding of the procedure. The live stream from Xinglin Garden commenced once more, drawing hundreds of doctors who rushed in with excitement, their chatter filled with banter before even reviewing the case, akin to observing a surgery in the operating room. Indifferent to comprehension, eager to engage with the young and attractive instrument nurses to alleviate the tension. The operator has begun the surgery again, truly dedicated. I have watched the worm extraction surgery 10 times, and my prostate fluid is boiling. Moderate heat can deactivate tadpole viability. Don't you want to wear a condom? But please, don't believe this. The ring offers no guarantee. Agreed just days ago. Our hospital delivered a boy who was born clutching a ring. This child is truly fortunate. Seeking touch, seeking luck, seeking royal fortune. Most present were surgeons. And regardless of their skill level, their speed rivaled that of professional esports players, and as they engaged, the comments flooded in, creating a somewhat congenial atmosphere. However, the banter quickly faded as they noticed the operator performing a local infiltration anesthesia that was not a broad subcutaneous application. The syringe's needle barely penetrated, and after injecting the anesthetic, it was promptly withdrawn. I don't understand. What is the range of smoke indicates a significant leakage of the contrast agent? In other words, The patient is experiencing considerable hemorrhaging. As a vascular specialist, I observe that the guide wire used by the operator appears to deviate from the conventional Cobra guide wire. It looks rather awkward and exceedingly pliable. Nevertheless, the operator seems to have successfully navigated from the femoral artery to both internal iliac arteries in one seamless attempt, without any repeated trials. If a Cobra guide wire had been employed, I cannot guarantee a singular success either. What sorcery is this? Utilizing unwieldy instruments, yet achieving optimal results? In the operation room's adjoining area, two 40-inch LCD screens relay the intraoperative images. Present are esteemed experts, all at the director level. Although none are adept in interventional procedures, they are certainly capable of critiquing and dissecting the performance. Surgery is not a skill possessed by all. Yet when it comes to casting judgment, everyone has an opinion, especially the ICU director, who has no faith in Zheng Ren's ability to complete the operation successfully. He awaits Director Su's communication with the patient's family, eager for this farce to conclude so the surgery may commence. However, the procedure thus far has exhibited no apparent flaws. The arterial puncture was executed with precision. Just this feat alone is not something everyone can accomplish. After all, a patient in hypovolemic shock has a severely diminished blood volume, causing the vessels to collapse. Yet, recalling the nitrite poisoning incident from a few days prior, the ICU director finds this situation somewhat comprehensible. The guide wire advances, and Zheng Ren activates the imaging system, transmitting visuals that reveal the guide wire precisely situated at the bifurcation of the internal iliac artery. Setting aside all else, the tactile sensation alone is enough to elicit admiration. The contrast study reveals a substantial amount of bleeding within the uterus, exceeding prior estimations. The ICU director grows increasingly anxious. Should the hemorrhage prove extensive, by the time Director Su concludes discussions with the family and they consent to a hysterectomy, it may be too late to save the patient. In the live broadcast room of Xinglin Garden, faced with such a significant volume of bleeding, the physicians begin to feel the tension rise. Despite being unaware of the patient's identity or condition, at this moment, there exists no hierarchy or deceit. Every individual must invest their utmost effort in the rescue, exerting every ounce of strength to pull the patient back from the brink of death. The expletives that burst forth are not devoid of decorum. Director Su, upon concluding the surgery, announced that the uterine artery had been occluded and the profuse bleeding had ceased. Director Pan's dark humor emerged, relishing this moment. Pausing to savor Director Su's anxious expression before continuing, return to apply tamponade for hemostasis. We can induce labor in a day or two. Director Su's eyes widened in disbelief, her pupils seemingly devoid of light. What did you say? She questioned, her voice sharp like shattered glass, piercing the ears of all present. The surgery was complete. Both the uterus and the patient had been preserved. Unfazed, Director Pan remarked, as for whether there will be DeeD-C or if the labor induction will go awry. That is your concern now. With a triumphant expression, he added, in emergency rescues, how could we not be consulted? Director Su then noticed the footage on the operating table, which was playing on a loop. From the initial angiography's overwhelming smoke to the seamless embolization, followed by the second angiography revealing the smoke's disappearance, she understood the implications. Had they succeeded? The earlier impatience evaporated in an instant, and she emerged from her state of acute stress, collapsing into a chair, murmuring, "That's good, that's good." The online commentary erupted. This surgical procedure is of premier national standard. I may not comprehend interventional surgery fully, but a person capable of embolizing the uterine artery in 5 to 6 minutes would be regarded as provincial level in the interventional department. It is improbable for one individual to excel in 2 different surgical specialties at a provincial level. The live stream appears to be affiliated with a public account. Verification complete. Indeed, this surgery is executed beautifully. Others expressed their confusion, raising their hands to admit they understood nothing about interventional procedures. Despite the confusion, the surgical outcome spoke volumes, silencing any dissent against the quality of the operation. The preoperative diagnosis was clear: placental abruption and hemorrhagic shock, 2 terms that would elevate the blood pressure of any clinically experienced physician, for they signified a frantic rescue effort and the preservation of a living being. One question remains unclear. Could someone enlighten me? If the uterine artery is embolized, will the uterus die? Same question. In response, the surgeon utilized gelatin sponges, not coils or other embolic agents. Gelatin sponges expand upon absorbing blood, leading to embolization that halts bleeding from the uterine artery. However, the gelatin sponge will dissolve after 1 week if the bleeding point is occluded. The uterine artery will resume blood flow without causing renewed hemorrhage. The professional forum, renowned for its expertise, quickly provided answers to inquiries. 1 week? Will the uterus not die? Refer back to anatomical diagrams. Primarily observe the origins of the uterine artery and the number of surrounding vascular branches. The uterine function will remain unaffected. Rest assured, poster. Minutes later, the uterine artery embolization was complete. The abhorrent smoke silently dissipated, signaling to all that the surgery had triumphed. Subsequent procedures would involve extensive blood replenishment and further tamponade, but these tasks posed little difficulty, and there was ample time to refine and modify the treatment plan. The most challenging aspect lay within those few minutes of the embolization surgery. Once the operation concluded, the life of the expectant mother and her reproductive capabilities were preserved, fulfilling the surgery's objective, and the atmosphere in the professional forum became lively once more. I longed to pursue further training, yet upon learning it is a private hospital, particularly one that advertises through public accounts, I feel trepidation. It seems this is not affiliated with a certain hospital. You can proceed with confidence. Indeed. Should it have been that hospital, the surgeon would fear termination for neglecting to utilize mesh during hernia repair. As many viewers were perplexed by the procedure, the livestream quickly lost its audience, with thousands exiting. Although some left, new viewers continued to join, primarily newcomers in the interventional field, a niche but indispensable segment of medical professionals. For instance, a certain hospital in Haicheng, lacking emphasis on interventional specialties, resorted to total hysterectomy. The scarcity of skilled interventional physicians and the unevenness of their expertise is a recognized consensus in the field. Zheng Ren paid no heed to Su Yun's words. He perceived her provocation as mere mockery. Hemostasis through compression required 10 to 15 minutes. Xie Yiren busily organized instruments in the operating room, cleaning what needed to be cleaned and discarding what was no longer necessary. Blood bags required confirmation and signatures from 2 or more different nurses. Xie Yiren performed these meticulous tasks with precision. The Chu sisters, feeling idle, assisted Xie Yiren with manageable tasks. Being young, they quickly found camaraderie, fostering a harmonious relationship over a few days. As the patient's blood pressure began to stabilize and gradually rise, Zheng Ren noted the system panel indicating a 100 completion rate for the surgery. The sound of the system confirming task completion was crisp and clear, particularly resonant following a successful rescue, reminiscent of a surgeon receiving a substantial bonus from the hospital. This dream was delightful, yet no one would bestow such rewards. Save for the system itself. Emergency task, save a future mother is complete, 100 achievement. Host receives a reward of 100 skill points, 1,000 experience points, and 1 silver treasure chest. Time used, 23 minutes and 15 seconds. Remaining time converted to 9,405 experience points. Special task, completed in isolation, 100 completion. Task reward, a set of lead aprons for radiation energy conversion. Interventional surgery skill upgraded to master level. Remaining time converted to 9,405 experience points. Zheng Ren was once again astonished by the system's fantastical offerings. From the initial temptations of the system, he sensed it wished for him to delve into interventional surgery. However, rooted in general surgery, he lacked clarity on what interventional procedures entailed, thus opting to decline each time. Encountering this unforeseen event, the system conveniently presented him with a special task, subsequently granting him the reward of a master-level interventional surgery skill. Was this an attempt to lead him down the irreversible path of interventional surgery? Zheng Ren felt a tinge of helplessness, but recognized that skill enhancement was an opportunity he must embrace. The adage "a myriad of skills cannot weigh one down" resonated within him. Alas, had he been able to elevate his skills sooner, might he have saved himself 50 hours of surgical training? The thought of expending vast experience points in the system's marketplace shattered his heart. With only minutes remaining for compression hemostasis, Zheng Ren took the opportunity to assess his inventory of skill points and experience. After completing the 2 tasks, his general surgery skill stood at 2044, with skill points increasing to 1529, alongside a second-tier skill book and 1 silver treasure chest. Previously, he had 9,920 experience points. After factoring in the rewards from both tasks, he retained 28,730 points. While this amount sufficed to purchase a set of surgical instruments, it fell short for extensive surgical learning. It appeared there was still much effort required. Zheng Ren mused. The lead apron, whimsically dubbed in system jargon, was likely stored within the system's space, unseen by him. The silver treasure chest remained unopened, as Zheng Ren feared it might emit a peculiar glow, revealing special rewards that would draw the attention of the flamboyant Su Yun standing nearby. For an ordinary individual like Zheng Ren, the suave Su Yun epitomized the quintessential pretty boy. In an age where looks equate to justice, Su Yun attracted countless gazes wherever he went, while those lacking in aesthetic appeal, like Zheng Ren, could only find solace in the shadows of solitude. After 10 minutes, Zheng Ren concluded the compression, applied pressure bandages to the puncture site in the femoral artery, and had the patient transported back to the ward by Director Su from the obstetrics department. Zheng Ren had faith that Director Su could adequately explain the situation to the patient's family. Preserving both the uterus and the life of the patient was undoubtedly a cause for celebration. As for the child, well, such matters were dictated by fate. Hypertension during pregnancy was notoriously difficult to manage, with its underlying mechanisms still shrouded in uncertainty. Watching the patient depart, Zheng Ren shed his lead apron, drenched in perspiration. The urgency of emergency care and the significant release of hormones had rendered him drenched in sweat. The added weight of the 20-plus pound lead apron, which was suffocatingly airtight, only exacerbated his discomfort. The life of an interventional radiologist was truly demanding, Zheng Ren mused. Yet, why did the system insist on steering him down the path of interventional procedures? This question was intriguing, yet remained unanswered. After stepping down from the operating table, Zheng Ren diligently documented the consultation and surgical records, then habitually proceeded with his rounds. Chanyu was still in the ward, engaging in light conversation with the patient's family. Zheng Ren did not perceive her behavior as unprofessional. Rather, he believed it was precisely what a doctor ought to do. Perhaps, if he and Chanyu could merge into one, they would represent the ideal physician? This thought, however, was slightly inappropriate, prompting Zheng Ren to hastily shake his head, shattering the notion into fragments that vanished into the ether. The patients in the ward were stable, with some ready for discharge. Being locals, once able to move, they were eager to return home. After all, even in a private room, the comfort of home was unparalleled. If one were to consider a room shared by 3 patients and 3 to 6 caregivers, the air quality would be intolerably poor, making hospital stays even less appealing. Haicheng was not a metropolis like the imperial capital or Magic City, and thus did not attract a plethora of out-of-town patients. Therefore, regardless of insurance mandates against discharge, the reality on the ground remained unchanged. Upon reaching the final ward, Zheng Ren encountered Sin Meng's uncle. Entering the room, he found Sin Meng engrossed in a book while his uncle rested with eyes closed. Due to the surgical procedure, the recovery process was significantly slower compared to laparoscopic surgeries. Had it been laparoscopic, patients often sneakily returned home on the very first day post-operation. Zheng Ren had even heard of cases where patients, upon returning home, indulged in lavish feasts, only to develop pancreatitis afterwards. As Zheng Ren entered the room, he exchanged a smile with Sin Meng. There was little to discuss. Their interaction was simply that of a physician and a patient's family member. Zheng Ren did not wish to harm anyone, nor could he expect forgiveness from those who had wronged him. His magnanimity did not stretch that far. Although Sin Meng had humbly knelt in submission, it still felt insufficient. The awkwardness between them was palpable, and Chanyu could sense it. She disregarded the tension between the two, approaching the patient's bedside and initiating conversation with ease. The more Zheng Ren listened, the more intrigued he became. It turned out that Sin Meng's uncle had a particular fondness for Japanese cuisine. It was well known that Japanese dishes primarily featured marine fish, which generally harbored fewer parasites. Unfortunately, unscrupulous vendors in the country often misrepresented freshwater fish as marine fish, which could contain parasites, leading to unfortunate cases like that of Sin Meng's uncle. Of course, only bad luck coupled with excessive consumption would result in such outcomes. Having completed his rounds, Zheng Ren found himself increasingly impressed by Chanyu. Though she displayed indifference towards him, her concern for patients was akin to that of a family member. She was well aware of Sin Meng's uncle's love for fresh seafood and even proposed a rehabilitation plan for him. Such a resident doctor was indeed a treasure. Given Changyu's demeanor, Zheng Ren deduced that she would not treat him with the same warmth she afforded her patients. Thus, upon returning to his office, he immersed himself in his studies, limiting interactions with her. The plight of the solitary was not without its reasons. Zheng Ren belonged to the realm of the tech-savvy, residing primarily in the office and operating room. Days passed, and the weather grew colder, while the emergency department became increasingly bustling. In just 2 days, Zheng Ren had performed surgeries on 8 acute appendicitis patients and 4 acute cholecystitis patients. As the best surgeon for the long-term primary task, he had accumulated a completion rate of 6 points. Among the 8 appendectomies, 2 were perforated appendices and 1 was gangrenous. Such intricate appendectomy procedures were classified as level 2 surgeries. Thus, these 8 appendectomies yielded Zheng Ren an impressive 11 points of completion. The 4 cholecystectomies, being laparoscopic, were classified as level 3, contributing 16 points to his tally. In total, he amassed 27 points of completion, combined with the previous 6 points, allowing Zheng Ren to complete 3 cycles of the primary task while retaining 3 points of completion. After accruing 30 skill points and 3,000 experience points, Zheng Ren's experience stockpile had reached 1,549 points, while his general surgery skill tree had escalated to 2,065 points. Observing his progress towards mastery brought him immense joy. He could focus solely on performing surgeries, a lifestyle he had once dared not to dream of. Back when he was in the general surgery department, surgeries were often conducted under the supervision of the resident doctor. This was known as feeding surgeries, a colloquialism suggesting that even the most inept would eventually master the procedure after 100 appendectomies. Practice indeed made perfect. With no need to return home, Zheng Ren decided to take a day off to relocate his few belongings to the hospital. He encountered Xiao Zhao and exchanged a few words. The video initially gained significant traction, but soon faced reports alleging privacy violations. Xiao Zhao's live streaming account had been suspended. Yet, rather than disheartened, he viewed this as an untapped goldmine. He was currently working on a public account, intending to edit and upload videos recorded in the hospital. Seeing Xiao Zhao's enthusiasm, Zheng Ren merely smiled. He lacked a business acumen and could not fathom the workings of social media, so he chose not to dwell on it. Allowing Xiao Zhao to pursue his endeavors, he repeatedly reminded Xiao Zhao to avoid trouble, which sufficed. Zheng Ren packed a suitcase with a change of clothes and returned to the emergency ward. Upon entering the corridor, he spotted a rather annoying figure. Su Yun's distinct presence was unmistakable. Even Zheng Ren, who had a severe case of face blindness, could not forget him. Even from a distance, he recognized Su Yun immediately. "Zheng, I'm here to check in," Su Yun announced, leaning against the wall with a rather juvenile pose, seemingly devoid of any intention to assist Zheng Ren with his luggage. In that instant, Zheng Ren felt a strange affinity between Su Yun and Chu Yan, who had previously exuberantly proclaimed "burn my calories." Before anesthesia, both exuded an air of childishness, while Chu Yan's youth and beauty rendered her somewhat tolerable. Su Yun was entirely unbearable. After gathering his thoughts, Zheng Ren swallowed his irritation and managed a faint smile, asking, "What brings you here? Did you not hear? I came to check in. Is your auditory nerve damaged from interventional procedures? Or has nephrotoxicity impaired your hearing?" Su Yun quipped. The tone of his words was infuriatingly provoking. Zheng Ren bit back his annoyance and cursed inwardly. With neither striking good looks nor sharp wit, Zheng Ren chose to feign ignorance. Clutching his suitcase and stepping into the duty room. "What's the matter? Not welcomed?" Su Yun trailed behind him like a specter, leaning against the doorframe with an indefinable smile playing at his lips. "Thank goodness. Zheng Rendao, you should report to Director Pan. I suspect he may not appreciate your type. He has already consented on his end." Su Yun smiled mischievously. "Oh, how did you persuade Director Pan? Is the emergency department short-staffed?" Zheng Ren, while tidying up his belongings, dared not glance at Su Yun. The moment he caught a glimpse of him, he felt an overwhelming urge to kick him. "I am here, and someone can assist you. That is one reason. Of course, it is not the primary one. Without me, you could still perform surgeries," Su Yun stated. "The most crucial aspect is that I am here to alleviate the shortage of nurses in the emergency ward." "You? Nurses? Shortage?" Zheng Ren immediately noted the 3 keywords in Su Yun's statement. 0077, a sharp-tongued, effeminate man. Zheng Ren pondered. This matter was quite comprehensible. He had never seen a flock of nurses rushing to the emergency surgical room. But Su Yun was different. His presence would undoubtedly enhance the nursing capabilities in the emergency ward. This exemplifies the distinction between the handsome and the unattractive. "Isn't Dean Fu your relative? What brings you to the emergency department?" Zheng Ren inquired. Su Yun narrowed his eyes, surveying Zheng Ren with disdain. Remarked, "It seems I truly need to reassess my necessity to transfer to the emergency department." Zheng Ren continued to ignore the pretentious individual as he packed his belongings. Dean Fu is my elder. Is there an inherent connection between that and my transfer to the emergency department? Your logic is muddled. How can you not discern this when performing surgery? Su Yun's tone was exceedingly acerbic. Sighing, Zheng Ren felt exasperated. Su Yun resembled Chu Yanji, speaking with a sharp tongue akin to Changyu. His good looks seemed to amalgamate several charming girls into one. Indeed, he was a remarkably sharp-tongued individual. In the future, I hope to receive your guidance, Su Yun cheerfully proclaimed, seemingly indifferent to Zheng Ren's thoughts. Guidance? Huh? Su Yun concluded their awkward conversation, holding his phone with a smile, seemingly engrossed in a game or a delightful chat with some girl. Su. President Su. These are the fruits I just bought today. Please have a taste. A young nurse rushed in after several minutes, her eyes darting towards Zheng Ren while subtly glancing at Su Yun. A basket of freshly washed fruits was presented before Su Yun. The nurse blushed profusely and promptly fled. Thank you. Su Yun lifted his head, brushing aside the strands of hair that fell over his forehead. The gesture seemed to strike a chord with the young nurse, who nearly burst into tears, transformed into a weeping creature. Ever since the establishment of the emergency ward, Zheng Ren, as the chief resident, spent every hour of the day at the hospital. Never had a nurse voluntarily brought him food, let alone a basket of freshly washed fruits. Each fruit glistened with droplets of water, exuding warmth and care. Zheng Ren could almost envision the delight and excitement of the nurses while washing the fruits. Why did he not receive such treatment? The single man felt distressed, rose from his seat, and stepped out of the office. Where are you headed? Su Yun, like a specter, trailed behind Zheng Ren. To the emergency department to check on the patients in observation. Zheng Ren replied, feeling dejected. Is this how you pass your idle time? Su Yun laughed, following Zheng Ren, unconcerned about the emotional toll he inflicted on him. As a chief resident, touring the wards was not merely a way to kill time. Zheng Ren maintained a stoic expression, delivering feeble retorts. A young nurse, initially engrossed in her phone, looked up in surprise upon noticing Zheng Ren ahead. Oh, Dr. Su, what brings you to the emergency department? Is a friend unwell? Who is it? I can guide you. Su Yun smiled and replied, I have transferred to the emergency department. I am here accompanying President Zheng on his ward rounds. Hearing Su Yun's words, the young nurse's face flushed with excitement, nearly dropping her phone. Zheng Ren hastily moved forward. The unattractive single man could hardly bear the impact of such admiration. Meanwhile, Su Yun, with his charming demeanor, greeted everyone with a smile. A girl seeking treatment in the emergency department, clutching her abdomen, approached to flirt with Su Yun, seeking his WeChat, but he politely declined. Witnessing patients attempting to flirt with Su Yun, Zheng Ren felt increasingly helpless. Passing by Director Pan's office, Zheng Ren vaguely heard raised voices from within. Just as he was about to enter, Su Yun suddenly remarked, Director Qin from ICU is arguing with Director Pan. Are you sure you want to go in now? Huh? What is the quarrel about? Zheng Ren inquired casually, immediately regretting it. This fellow would undoubtedly ridicule him. If your intelligence were half as proficient as your surgical skills, you wouldn't be asking that question, Su Yun scoffed. Zheng Ren fell silent. It was indeed due to Su Yun's departure that the ICU nurses felt unsettled, each one desiring a transfer. The ICU work was arduous, and prior to 30, nurses often suffered from herniated discs. With Su Yun present, the nursing team in the ICU thrived. There were only requests for transfers in, but none out, regardless of how busy or challenging the work was. Yet, once Su Yun left, the dynamics in the ICU changed dramatically. No wonder Director Qian sought out the emergency department. Even Director Pan's authority could not withstand Director Qian's fervor. Remarkable, indeed, Zheng Ren reflected. After completing his rounds, Zheng Ren received an unprecedented warm welcome, all directed towards the handsome fellow behind him. He was fully aware of this. The patient's conditions were stable, many of whom, due to various accidents, wished to linger in the emergency observation room, hoping for compensation, their conditions improving instantaneously. Departing the observation room, Zheng Ren felt as though Su Yun was an irksome fly buzzing around him, one he could not swat away. Passing the emergency room, Zheng Ren caught sight of a young woman in her 20s discussing her condition with the on-duty doctor. He examined the system panel with hesitation. What is the matter? Su Yun, curious, peered inside, and upon seeing a beautiful silhouette, chuckled. You can't possibly be this desperate, can you? Zheng Ren shot a glance at Su Yun, his eyes suddenly brightening. What are you planning? Su Yun asked warily. Do you know what her ailment is? Zheng Ren inquired. Why not just ask her? Su Yun retorted dismissively. Look at her fingers. The swelling seems rather peculiar. Zheng Ren pointed out. Su Yun leaned in to observe. The young woman's hand rested between her and the on-duty doctor, her right middle finger swollen, not resembling an injury, burn, or typical folliculitis. How did you diagnose that? Su Yun asked, intrigued. Endometriosis, Zheng Ren stated with certainty. This time, it was Su Yun's turn to be speechless. Endometriosis refers to the presence of active endometrial cells growing outside the uterine cavity, a common gynecological condition among women. The endometrial cells were supposed to grow within the uterus, but due to various reasons, such as transport through the fallopian tubes, they grew ectopically. That's a young woman middle finger endometriosis. Su Yun was stunned for at least 10 seconds before shaking his head, the strands of hair on his forehead swaying elegantly. I've never heard of such a case, but logically it makes sense. The probability is just too low, Su Yun admitted candidly. If you don't believe me, go ahead and inquire. The treatment is straightforward. She needs to visit the hand surgery department to have the proliferative portion excised. As for how she contracted the condition, that is none of our concern. Zheng Ren shifted the burden onto Su Yun, as this matter was sensitive. Zheng Ren's dilemma lay in his acute self-awareness. If he were to explain endometriosis to the female patient, detailing why she might have it on her finger, he would likely face accusations of harassment. However, Su Yun had none of these reservations. He was a man capable of bending others' perceptions, let alone women. Zheng Ren gestured for the on-duty doctor from the emergency department to step out, allowing Su Yun to take over the consultations. At the moment their eyes met, Zheng Ren noticed the sick girl's eyes sparkle upon catching a glimpse of Su Yun, as if her inner universe had suddenly ignited. This indeed is a society that places great emphasis on appearances, Zheng Ren mused with a sigh, as he pulled the doctor aside to discuss the recent admissions in the emergency department. The door to Director Pan's office swung open with a loud bang, and Director Qin from the ICU stormed out, visibly agitated. Given the presence of patients outside, a semblance of decorum had to be maintained. Leaving the door to bear the brunt of the tension, Director Pan, with a broad smile, leisurely followed Director Qin's hurried steps. The expressions on their faces made it abundantly clear who had emerged victorious from their recent quarrel. After watching Director Qin leave in a huff, Director Pan's spirits lifted, and he called Zheng Ren into his office. "Xiao Zheng, please have a seat," Director Pan said, lifting a steaming cup of tea. "Is there any support you require regarding work? I've prepared a list concerning the interventional supplies, and I hope it can be expedited," Zheng Ren replied, standing like a new recruit reporting to a commanding officer. Before he could finish his thought, Director Pan waved a hand, interrupting him. "Rest assured, I have already submitted a temporary procurement plan. The supplies should arrive in the next couple of days. Since this is a temporary order, just maintain communication with the head nurse on your end." Director Pan was decisively efficient. Within 2 days, he had addressed a particularly challenging procurement issue at the hospital. "What's with Su Yun?" Zheng Ren inquired. He initiated the request himself and reportedly had quite the argument with Dean Fu, Director Pan replied with a smile, recognizing the rarity of such talent. "From the perspective of the nursing staff, it is indeed true. I've reviewed his file and even contacted his colleagues at Xia, who expressed their regret when he left," Zheng Ren acknowledged. "Very well," he conceded, not wishing to press on non-principled matters. Although Su Yun could be acerbic, the fact remained that having more capable hands would only facilitate the work within the emergency ward. Even if Su Yun were merely a mascot, his presence would undoubtedly accelerate the ward's efficiency. Upon exiting Director Pan's office, Zheng Ren encountered Su Yun, who was just stepping out of the consultation room with a young female patient. The girl's cheeks were flushed, and her large, glistening eyes sparkled with vitality. Su Yun, with an impassive expression, appeared to have finished conveying all necessary information to the young patient. He stood silently beside Zheng Ren, his demeanor ghostly and aloof. It seemed the patient's issue had been resolved flawlessly, prompting a smile from Zheng Ren. "Dr. Su, should I come back here for my next follow-up?" The young patient asked, her gaze completely bypassing Zheng Ren and locking onto Su Yun. "I'll be in the emergency ward upstairs, not on duty for consultations," Su Yun replied, his tone tinged with impatience. The seemingly sprightly girl appeared undeterred by Su Yun's brusque demeanor, beaming as she playfully made a face and declared, "Then I'll come to find you in the emergency ward for my follow-up." Without waiting for a response, she turned and swiftly darted away, reminiscent of a shy maiden from decades past. In her haste, she stumbled slightly at the corner, perhaps flustered or hindered by her 5 centimeters heels. Zheng Ren stood, momentarily entranced by the girl's retreating figure, his heart brimming with unspoken reflections. It appeared that the consultation had gone exceedingly well. As he strolled toward the emergency ward, he engaged in casual conversation with Su Yun. "Fortunately, I managed to straighten it out," Su Yun remarked, casually brushing his hair from his forehead. Zheng Ren was taken aback. "Straightened it out? What does that mean?" Lost in his studies, surgeries, and patient care, Zheng Ren was oblivious to such nuances. "Your diagnosis was correct. After the consultation, I advised her to go to the hand surgery department for a minor outpatient procedure, followed by a pathological biopsy," Su Yun stated, his expression unyielding. "She wants to meet me for a meal and change of dressings. Please don't involve me in any future troubles concerning female patients." "Oh," Zheng Ren replied absently, yet felt a surge of joy within. Witnessing the sharp-tongued Su Yun encounter difficulties was a source of amusement for him. If you took the consultation, there certainly wouldn't be so many troubles. What kind of girl would invite you to dinner? Su Yun's sharp retorts came swiftly. Zheng Ren found himself at a disadvantage in their verbal sparring, enduring the playful jabs in silence as he returned to the emergency ward. Chang Yu was still milling about in the ward when Zheng Ren entered his office and began poring over an anatomy book to accumulate skill points. Meanwhile, Su Yun took a seat behind Zheng Ren, quietly fiddling with his phone. Occasionally, nurses would feign passing by, their eyes deliberately avoiding the office door. Yet Zheng Ren knew that they typically wouldn't make so many trips past his office. After some time spent reading, one of the Chu sisters, dressed in a white coat over isolation attire, approached him. "Director Zheng, a family friend of my father's is bringing in an elderly patient who is exhibiting severe signs of peritonitis. Should I have him sent directly to the emergency ward?" The Chu sister inquired. "Have you inquired further?" Zheng Ren asked, not looking up from his reading, keen to finish the last few lines. After a brief inquiry, "It seems to be peritonitis. I'm unsure of the specifics," the Chu sister replied. "Let them come first." "How old is the patient?" Zheng Ren asked, finally closing the thick book. 76. 3 years ago, he suffered a cerebral infarction and has been reliant on a caregiver for assistance. He has a difficult temperament and self-medicated for a few days before finally notifying Uncle Lin after developing a fever, she explained. "When will they arrive?" Zheng Ren asked, having completed his reading. "Approximately in 10 minutes, she replied. Soon, the sound of a gurney rolling across the marble floor echoed in the corridor. A gentleman in casual attire, around 50, approached swiftly, guiding the gurney with an air of gentle authority. "Uncle Lin, you're here. This is Director Zheng. Let us check on Grandpa," the Chu sister said as they wheeled the gurney into the resuscitation room, Zheng Ren following closely behind, oblivious to the outstretched hands of the patient's family. To Zheng Ren, the patient was all that mattered. The middle-aged man, somewhat awkward, felt out of place, unsure of how to navigate the situation. Su Yun entered alongside Zheng Ren, offering a casual explanation that made it sound as though he was quite adept in social situations. Zheng Ren accessed the system panel in the upper right corner of his vision, which provided a brief overview of the patient's condition and diagnosis: acute exacerbation of chronic suppurative cholecystitis. Let us order a bedside ultrasound and monitor vital signs. Chanyu, please inquire about the medical history and any contraindications, Zheng Ren instructed while performing a physical examination. If the family consents to surgery and the fasting time is sufficient, you two prepare for general anesthesia and notify Xie Yiren to ready the laparotomy instruments. Chang Yu stood a half-step behind Zheng Ren, diligently taking notes with her pen and notebook, asking clarifying questions wherever Zheng Ren had omitted details, only closing her notebook once everything was clear. "Is surgery necessary?" the cultured middle-aged man asked, puzzled. "The patient has experienced multiple episodes of cholecystitis, and this instance is an acute flare-up. There is likely significant adhesion and edema within. Conservative treatment would involve prolonged antibiotic therapy, which could lead to dysbiosis. Surgical removal is advisable," Zheng Ren explained. "Thank you all for your single chapter. I have matters to report to everyone. First and foremost, I want to express my gratitude. Ever since I began the new division, each day feels like a dream. Truly, it is akin to a dream. The urban division has ranked first among peers. Later, a book received continuous Silver League rewards, which secured the second position. It is worth noting that there is a top-tier writer from the same period, a level 5 author, 2 level 4 authors, and a big shot from the mobile reading base who has come to embark on a journey at the starting point. I never anticipated such remarkable results. Although it may not be explosive compared to previous periods, it is certainly commendable. Within a week, the recommendation votes have surged into the top 150, and I believe we are currently at number 126. On the newcomer book signing chart, I find myself in a remarkable second place, a feat I never imagined I would achieve. It is astonishing to see my work reach such heights without the need for relentless self-promotion. For a newcomer without the halo effect of a pre-existing fan base, this accomplishment is not solely due to my writing prowess, but rather the generous support of everyone. My new book has garnered over 70 fans, which translates to more than 70 individuals who have offered their encouragement through rewards. In the past, witnessing the achievement of a certain individual known for their accolades, particularly the milestone of receiving 10,000 rewards, would leave me feeling dizzy. Yet, unexpectedly, I have earned the recognition and support of others, allowing this small, struggling author to glimpse a different world. I wish to sincerely express my gratitude for the generous contributions. Any support through recommendations or simply reading my work is appreciated. The rewards, while generous, feel extravagant. I find myself dreaming of the likes of esteemed figures such as Su Jiayin and Jack Ma showering me with gold, yet I know that remains a mere fantasy. Next week, I was surprised to find that instead of the anticipated 6 promotions, I received a rather fringe recommendation that does not involve an app. Initially, upon receiving the notification, I felt a pang of disappointment, expecting a more substantial push akin to the 6 promotions or a strong recommendation. However, regardless of the reasons behind this, I have regained my resolve and am eager to share my stories. This narrative unfolds within the realm of medicine, where, much like any other field, competition exists. It is not merely a matter of technical prowess that guarantees deference from peers. Take, for instance, a renowned expert from a prestigious hospital whose skills are nearly unmatched nationally. Years ago, he faced exclusion from his institution and returned to his hometown in northeast China, where he established a leading cardiac surgery hospital, earning the recognition he deserves. To this day, he continues to guide his doctoral students through procedures, even lying on the operating table himself during cardiac radiofrequency ablation. Truly remarkable. This serves as but one example I intend to weave into my narrative. I wish to emphasize that while most physicians uphold a strong sense of medical ethics, even the most esteemed professionals harbor a sense of superiority. Thus, less than noble practices can indeed manifest within these walls. This is not a utopia, but a place filled with the complexities of human nature. I owe my inspiration to the work of the eminent Dr. Ling Ran, whose writing ignited a desire within me to explore new literary styles. However, my own literary capabilities are limited, and I struggle to convey bright, joyous prose, yet I am diligently striving to improve. Regarding surgical broadcasts, the industry is divided into 2 categories. One involves obtaining explicit consent from the patient, starting the recording from the moment they lie on the operating table, leaving no room for privacy. Most criticisms stem from this practice, yet it typically features esteemed professors demonstrating procedures that are otherwise unattainable. The other type focuses solely on the surgical field, facilitating learning and exchange among physicians. This is the format I aim to present in my writing. I have rambled on for quite some time, so I shall conclude here. My aspiration is to provide readers with a lighthearted and intriguing reading experience. Some may claim my work is overly formulaic or melodramatic, yet I perceive this as a compliment, lamenting only that my execution is not yet flawless. For those seeking serious literature, I recommend Songlongji Shui, an excellent novel. Lastly, I extend my heartfelt thanks to the editor Maple Leaf for signing me, and to each reader who has offered support through rewards, votes, or simply reading my work. I will strive to tell compelling stories, hoping to deliver a delightful and enjoyable reading experience. Whether I receive 6 promotions, a strong recommendation, or find myself marginalized, I am committed to writing diligently. Having exhausted my drafts, I have contemplated the number of updates to provide, ultimately deciding on 3. Starting Sunday, I will resume my update schedule at 6, 14, and 22 o'clock. Here, I would like to preemptively announce the first subscription, as it serves as the gold standard for a book's success. Thank you all for your support. I am sincerely grateful. As for the elderly gentleman, let the seasoned director take charge. The middle-aged man fell silent as an ultrasound technician hurriedly approached with a small cart to examine the patient, confirming a diagnosis of cholecystitis. Hospital admission paperwork was initiated, and while processing the patient's information, Zheng Ren learned that this middle-aged man was named Lin Yuanshan, working in the provincial office. Just as the paperwork was completed, The hospital's president, vice president, and several personnel from the general surgery department arrived. Director Lin, you've come to the first municipal hospital without a word of notice. Director Xiao Qimin called out from a distance, extending his hand and striding several paces before finally shaking Lin Yuanshan's hand. Isn't that the young doctor from the Chu family? I heard that Dr. Zheng in the emergency room is highly skilled, so I came directly. Lin Yuanshan's tone was somewhat aloof, exuding an air of superiority. However, the president and others appeared unfazed, accepting this demeanor as the norm. This is Director Pan from the emergency department, and this is Director Sun from general surgery, allowing the experienced colleagues to oversee the situation, President Xiao introduced. Lin Yuanshan nodded, a hint of impatience flickering across his features. After a brief exchange of pleasantries, Director Sun from general surgery hurried to the resuscitation room to commence a meticulous examination. Zheng Ren was familiar with the examination process, yet, supported by the system, he merely went through the motions, relying largely on established habits. In truth, it would have been entirely feasible to forego the examination, given the system's comprehensive diagnostic capabilities. As Lin Yuanshan observed Director Sun's professional techniques and thorough examination, his initial displeasure began to dissipate. Acute cholecystitis was indicated, with the ultrasound revealing significant gas around the gallbladder, likely due to inflammatory irritation of the intestinal tract, suggesting the need for surgical intervention. Given the patient's advanced age, let us first check for any complications, President Xiao directed. The patient exhibited sinus rhythm with bradycardia, and auscultation revealed clear lung sounds without signs of pneumonia. Relevant preoperative blood tests had already been sent to the lab, and results were expected within half an hour. Chang Yu provided a detailed report. The nursing staff had commenced preparations, including catheterization and gastric tube placement. Is the surgery highly invasive? Lin Yuanshan expressed concern. After all, the patient was over 70 and had previously suffered a stroke, and their overall health was far from optimal. Recovery would undoubtedly be slower. Lin Yuanshan's worries were justified. Laparoscopic cholecystectomy allows for rapid recovery, Director Sun reassured. Laparoscopic? Dr. Zheng indicated that an open surgery was necessary, Lin Yuanshan countered. When faced with a seasoned doctor in his 50s and a young novice under 30, it is evident which side the patient's family would lean towards. President Xiao, having confidence in Zheng Ren's diagnosis, inquired, Zheng Ren, your laparoscopic skills are exceptional. Why not proceed with laparoscopy? The patient is experiencing an acute exacerbation of chronic cholecystitis, and I am concerned about significant adhesions within the abdominal cavity, Zheng Ren replied candidly, disregarding the authoritative presence of Lin Yuanshan. For those dedicated to their craft, such hierarchies hold little weight. Lin Yuanshan's brow furrowed, as if foreseeing potential complications. In both medieval Western societies and contemporary cultures, individuals who predict unfortunate events are often met with disdain. This was especially true when a young physician suggested the possibility of a complicated case, rendering his opinions less persuasive. Lin Yuanshan opted to disregard Zheng Ren, directly addressing Director Sun from general surgery. Director Sun, do you believe we can perform a minimally invasive laparoscopic procedure? The Chu sisters had already begun preparations for general anesthesia, yet even if they were present, it was unlikely that they could alter Lin Yuanshan's decision. There are challenges. Director Sun replied candidly, quickly blinking his eyes and casting an innocent look toward Director Pan as an apology. If surgery is necessary, I would prefer to have Director Sun perform the laparoscopic procedure. If that is not feasible, we can then consider an open surgery, Lin Yuanshan decided swiftly. Is the emergency operating room adequately equipped? President Xiao inquired, leaning toward having Director Sun lead the operation, given his impeccable skill and reliable expertise. As for Zheng Ren, the special patient should be set aside for the moment. There have been recent laparoscopic cholecystectomies performed. Zheng Ren is indifferent. But Director Sun will take a look shortly to ensure that there are no incompatible instruments, so that we can procure what we need from general surgery. It should be fine. Director Sun feels as though he has stepped into a pit. He genuinely does not wish to provoke the duo from the emergency department and has submitted to the situation wholeheartedly. However, he did not anticipate that a special needs patient would ensnare him once again. Once the blood test results come back without any surgical contraindications, we shall proceed. Director Xiao feigns nonchalance, smiling as he remarks, laparoscopic cholecystectomy. Our hospital performs about 1,000 each year. Last year, We operated on a 108-year-old man who was up and about the very next day. There is no need for concern, Director Li. Lin Yuanshan lets out a thoughtful hum, his face etched with worry, creating a somber atmosphere. While awaiting preoperative checks, Chang Yu begins to draft the admission communication, the clattering of the keyboard shattering the silence of the office. Zheng Ren retreats to the resuscitation room, as he dislikes the atmosphere of the office and seeks refuge elsewhere. You are quite insidious. Su Yun floats around Zheng Ren like a shadow, following him wherever he goes. Insidious? Zheng Ren replies, puzzled. You have assessed that the patient has severe intra-abdominal adhesions. If your judgment is correct, I doubt the laparoscopic surgery can even proceed, Su Yun states. Why did you not intervene? Will anyone heed my words? Zheng Ren, though straightforward, is not foolish. After many years in clinical practice, he possesses the fundamental judgments required. Ultimately, it is the family of the patient making the choices. If Zheng Ren were to intervene, it would only stir up a multitude of conflicts. Well, without a martyr complex, I feel much more at ease, Su Yun chuckles, observing that the nurse preparing the patient in the resuscitation room has become somewhat stiff in her movements. Zheng Ren thinks that having Su Yun around in the resuscitation room is an excessive distraction. Let old Sun handle it first. I am curious as to how you can determine the severity of the patient's abdominal adhesions. On the ultrasound images, there is a gas shadow in the gallbladder area. A regular patient might interpret it as gas interference. However, the gas shadow shows no significant signs of movement, leading me to deduce that the transverse colon has shifted upwards and is fixed under the liver by encapsulated material. When it comes to diagnostic expectations, Zheng Ren enters in invincible mode. Making an educated guess is one thing, but with the ultimate diagnosis from the system panel, tracing back becomes significantly simpler. Su Yun's brows are elegantly arched, and even when furrowed, they exude a certain charm, adding to his composure and allure, captivating many longing gazes. He strives to recall the images from the emergency ultrasound conducted at the bedside. Could it be that Zheng Ren is indeed correct? How does he possess such profound and thorough understanding of the ultrasound? 0080. Let him take the lead. The emergency test results come back swiftly, revealing no preoperative contraindications. Chang Yu begins to prepare for the preoperative briefing, at which point Su Yun appears at the door, beckoning her outside. What is it? Su Yun's charm diminishes to nearly zero in Chang Yu's eyes, as she expresses significant irritation at his interruption of her work, her tone laced with annoyance. Su Yun pauses for a moment, then a genuine smile graces his lips, a fleeting moment of warmth akin to spring's bloom. When it comes to general surgery, do not provide a preoperative briefing, Su Yun advises. Why not? What is the focus of your briefing? The laparoscopy. Chang Yu grows increasingly impatient. What if it cannot be done? If there are issues during the preoperative briefing, be careful not to take the blame. Su Yun clearly knows about the blame Chang Yu has faced in obstetrics. She pauses, quickly realizing the implication of Su Yun's words. Then, she glances inside the room. Zheng, for the general surgery operation, let them brief themselves. When Su Yun speaks to Zheng Ren, there is always an air of irreverence. Zheng Ren understands the nuances involved, but had not previously considered this angle. The moment Su Yun mentions it, he comprehends. Su Yun's intentions are not meddlesome, but rather necessary. Thus, he gestures to Director Sunday. Director Sun smiles wryly, pondering how the emergency department personnel seem to possess such cunning. Zheng, when I assisted you in surgeries before, I held nothing back, Director Sun whispers. Zheng Ren, puzzled, looks at Director Sun in confusion. Why mention past surgeries? We are from different departments. There have only been a few exceptional cases over the years. If I cannot perform today, you must assist me, Director Sun implores, an uneasy premonition in his eyes, as if appealing to a brother for help. Given Director Sun's level of expertise, such words should not have been spoken to Zheng Ren. However, having observed Zheng Ren's recent streak of complex surgeries, including the parasitic obstruction surgery for Uncle Tsin, Director Sun's perception has been continually challenged. The rise of young talent cannot be hindered. Director Sun is more gentle in demeanor, unlike Director Liu from general surgery, who is quite rigid, so at critical moments, he can lower his guard and plead with the junior. You are too kind, Zheng Ren replies, slightly bowing, wearing a courteous smile and embodying the demeanor of a junior. If you cannot proceed, neither can I. However, should you need anything, please do not hesitate to ask. Only then does a hint of relief flicker across Director Sun's face. Engaging with Zheng Ren is far easier than with Director Pan. Perhaps it is because Zheng Ren has only recently risen to prominence, his mindset still reflecting that of a junior doctor. With patient family members and hospital leaders present, the two cannot converse at length. Soon, the junior doctors brought by Director Sun complete the preoperative signatures, and the group proceeds to the operating room. Zheng Ren has no intention of watching the spectacle and opts to remain behind to read. Su Yun does not follow either, appearing disinterested in anything beyond his phone, including the chirping nurses around. After anesthesia is completed, Director Sun stands at the front of the operating table and begins the insufflation. The insufflation needle pierces the abdominal cavity, inflating to 15 millimeters of mercury. Director Sun does not choose the conventional 3-port laparoscopic cholecystectomy approach, but opts instead to perform 2 punctures laterally to the rectus abdominis under direct laparoscopic vision. He likely anticipates that the laparoscopic procedure may not be feasible, thus selecting this unconventional technique. Carefully dissecting with anatomical instruments, he discovers severe adhesions in the abdominal cavity, particularly in the upper abdomen, where there is not a single gap. His extensive clinical experience allows him to avoid irreversible mistakes. Director Sun promptly decides to abandon the laparoscopic approach in favor of an open surgery. Once he has steadied his emotions, he personally steps away from the table to document the laparoscopic findings and later returns to the operating room to scrub in, change attire, and switch instruments to commence the surgery anew. In terms of laparoscopic surgery, Director Sun's proficiency is merely average. He began learning laparoscopic techniques at the age of 45. By then, his open surgical skills had already reached a high standard. While basic laparoscopic procedures are not overly challenging, given his solid anatomical foundation, the truly complex surgeries still incline him towards open techniques, as he is far more adept in that realm. Making a curved incision below the right rib margin, approximately 20 centimeters long, he layers into the abdomen to explore the cavity. The moment the peritoneum is opened, Director Sun is taken aback. The situation is even more intricate than anticipated. A mass of internal organs, entangled in a chaotic mess, greets his gaze. He can barely discern the greater omentum from the transverse colon, and the whereabouts of the gallbladder remain a mystery. Gritting his teeth, he must proceed with blunt dissection. However, facing the mass of adhered organs evokes a sense of helplessness, akin to a tangled ball of yarn with no clear end in sight. If it were truly yarn, one could swiftly cut through the knot, but alas, these are human organs. Should the severely edematous bowel rupture, suturing it back together would prove exceedingly challenging. Cautious and meticulous, Director Sun dared not let his guard down, a sentiment intertwined with the identities and statuses of the patient's families, albeit not significantly. Even if faced with an ordinary elderly patient, the gravity of the situation remained unchanged. 5 minutes elapsed, yet there was no clarity. 10 minutes passed, still with no insight. The circulating nurse had wiped the sweat from Director Sun's brow twice, and the single-use sterile cap was thoroughly soaked. After 20 minutes, a dark green patch appeared on the back of his isolation gown, a testament to the copious perspiration that had drenched it. In a moment of carelessness, while attempting to separate the adhesions, he inadvertently tore a minute artery, causing blood to spurt forth. It took 5 minutes to address the artery, and he narrowly succeeded in ligating the small vessel. Director Sun felt a slight blur in his vision, the surgical lights glaring fiercely. He sighed and instructed the circulating nurse who had come to assist, call Zhang to the stage. Although he had communicated with Zheng Ren prior to the surgery, Director Sun was resolute in his decision not to allow Zheng Ren to take over unless absolutely necessary. To do so would be to openly acknowledge his own inferiority. Yet, confronted with 20 minutes of blunt dissection yielding no results, Director Sun ultimately chose to concede. The prioritization of medical safety over personal pride was self-evident. After all, preserving his dignity could lead to an even greater loss. As for Zheng Ren, having observed his adeptness in blunt dissection during an appendectomy, perhaps he possessed a solution. Moreover, the primary reason was that Zheng Ren had recently executed a complex pancreaticoduodenectomy at the peak of his prowess. In the emergency ward office, Zheng Ren meticulously perused the pages of surgery of the liver, gallbladder, and pancreas, his focus unwavering. Su Yun, expressionless, deftly maneuvered her fingers at lightning speed, seemingly engaged in either a lively chat or a gaming session. The department's phone rang, prompting a flurry of nurses to converge. Director Zheng, the operating room is calling for you. Although they spoke to Zheng Ren, their glances flickered towards Su Yun. Ah, it has begun. Su Yun seemed to anticipate the call. Having waited for news, He promptly turned off his phone and stood up. Remarkably, clad in white scrubs, he appeared impeccably straight and devoid of any creases, exuding an aura of vigor. "It seems the surgery is quite challenging. I should take a look," Zheng Ren remarked. "Let us go together," Suyin replied, her enthusiasm palpable as they made their way to the surgical suite on the third floor. At that moment, a dispassionate voice from the system resonated in Zheng Ren's ear. "General task. Assist a colleague. Task details. Help a colleague complete a surgery. Task reward, 100 skill points. 5,000 experience points. Additionally, varying rewards based on the completion of the surgery, including respect from peers. Task duration, 5 hours. A task," Zheng Ren mused, pleased that even a rescue operation could trigger a task. If he were to perform the surgery himself, it would merely be a routine procedure. However, Su Yun proved to be rather bothersome, persistently trailing behind him, an annoyance he could not shake off. Countless women envied Zheng Ren, yet he remained oblivious to it all. Perhaps it was for the best. After all, he was not inclined that way. Dismissing thoughts of Su Yun, he pondered the task as he walked. Among the task rewards was the respect of peers, a notion that piqued his curiosity. Regardless of what it entailed, he would discover its meaning upon completing the surgery. Having donned his surgical attire, Zheng Ren entered the operating room and peered over Director Sun's shoulder. "Xiao Zheng, scrub in and take the stage," Director Sun, drenched in sweat and fraught with anxiety, called out as he finally set aside any pretense of politeness upon seeing Zheng Ren's arrival. A glance into the bloodied abdominal cavity made it abundantly clear to Zheng Ren the predicament Director Sun was facing. Su Yun glanced at the surgical site, then at Zheng Ren, noting his unflinching demeanor. Feeling a surge of insight, she too proceeded to scrub in beside him. Zheng Ren, unaware of Su Yun's intentions, chose not to engage. Her acerbic remarks had left a lasting impression, one not easily forgotten. Engaging her in conversation would be futile. Silence seemed preferable. As Zheng Ren prepared to assume the first assistant position, Director Sun instructed, "Xiao Zheng, come here." With that, he ushered the second assistant aside, taking their place. Zheng Ren hesitated momentarily, but refrained from further politeness. There was no time for pleasantries when confronted with a critically open abdomen. Su Yun, equally assertive, donned her surgical attire, slipped on sterile gloves, and approached the first assistant, coldly stating, "Aren't you going to step down?" The first assistant, a resident from the general surgery department, felt a pang of resentment at being displaced by Zheng Ren. Just as he prepared to retort, he caught sight of Director Sun's piercing gaze upon him. Instantly subdued, he turned away, begrudgingly removing his gloves and positioning himself at the patient's head, claiming a strategic vantage point. Not everyone possesses the skill to perform surgery, yet anyone can critique. He braced himself, his eyes wide with anticipation, ready to find fault. In the Xinlin Garden live broadcast room, as soon as Zheng Ren took his place as the primary surgeon, the stream commenced. An increasing number of viewers had begun to take notice of the Xinlin Garden broadcasts. 1,000 viewers was a substantial figure for Xinlin Garden, but in the grand scheme of things, a single hospital might not even attract that many individuals. Moments later, hundreds of doctors from across the nation flooded into the live stream. The recent broadcasts haven't been too challenging. I wonder what today's content will be. It's customary to demand updates before viewing. I've watched the previous surgeries 100 times, and my surgical skills have skyrocketed. Amidst the banter, the doctors quickly grasped the scene unfolding before them. Most were seasoned professionals. Upon witnessing the chaotic setup, they instantly deduced the gravity of the situation. Tears of joy. At last, we can witness the master tackle a high-difficulty surgery. Is this really a rescue operation? My sympathies to the surgeon. Sympathy? At least someone is here to assist. If you find yourself in such a predicament, you might as well close the abdomen and prepare to explain to the family. If they are reasonable, it may end well. If not, I shudder to think. Indeed, just last year, we had a similar incident at our hospital. The family protested outside, accusing the doctors of lacking medical ethics and endangering lives. As the discussion surrounding the case evolved into a cathartic release of frustrations, the term rescue operation surfaced. In surgical parlance, it refers to situations where unforeseen complications arise during a procedure, prompting the surgeon to seek assistance from someone with greater expertise, either from their own institution or elsewhere. Some rescue operations can be quite extraordinary. For instance, a complex pediatric cardiac surgery at Huaxi Hospital, where the surgeon was left dumbfounded upon opening the chest cavity. Subsequently, they summoned a renowned cardiac surgeon from a major hospital in the capital, who flew in to assist. The two, both top tier in their fields, collaborated for an exhaustive 14 hours to complete the surgery. Such tales abound in every hospital today. As the notion of a rescue operation materialized in the live stream, excitement rippled through the viewers. Is that the greater omentum and the transverse colon fused together? What a massive mass. Impressive observation. Upon the surgical table, Zheng Ren paused, observing for a few moments before extending his right hand. He requested a blunt scissor. But after a brief wait, his hand remained empty. TSK. Xie Yiren is truly exceptional, he mused internally. Blunt scissor, Zheng Ren stated. Oh, the scrub nurse responded, preparing sutures for abdominal closure. In her estimation, the subsequent step was simply not viable. Yet, Zheng Ren was requesting a blunt scissor, an approach even Director Sun would deem imprudent. Could he truly succeed? Such audacity seemed born of ignorance. Nevertheless, heeding the surgeon's request, she promptly placed the blunt scissor into Zheng Ren's hand. The force of her delivery lacked Xie Yiren's gentle touch. A fleeting thought that crossed Zheng Ren's mind subconsciously. With the blunt scissor in hand, Zheng Ren initiated blunt dissection. Single-handedly, with only a scissor, he proceeded, dispensing with the need for assistance. Reversing the scissor's orientation, he employed the blunt tip to separate the adhesions on the serosal surface. After creating an initial aperture, he transitioned to digital blunt dissection. Little Zheng, gently, Director Sun cautioned, unnerved by Zheng Ren's actions. The young man's impetuosity was alarming. It's under control, Zheng Ren assured him. Director Sun nearly erupted in expletives. Such recklessness, yet he claimed to be in control? Did he truly possess any sense of his limitations? However, he had sought Zheng Ren's assistance in this challenging case. To interfere now would be unseemly. Instead, he redoubled his efforts, maximizing exposure of the surgical field to afford Zheng Ren a clearer view. Simultaneously, he silently implored, nothing must go awry. Nothing must go awry. Assisting was all he could do. Zheng Ren's technique was so refined that Director Sun struggled to comprehend it. With a single snip, the blunt tip of the scissor perforated the densely adherent omentum, creating a hole. Subsequently, the scissor advanced, accompanied by a finger from Zheng Ren's other hand, initiating blunt tearing. Was he not concerned about rupturing a small artery and causing hemorrhage? Director Sun was perplexed, reminiscent of his own surgical experiences. Although such minor vascular breaches were not life-threatening, they could obscure the surgical field with a deluge of arterial blood, rendering everything invisible. As he pondered this, the blunt scissor used for blunt dissection was placed on the sterile drape covering the patient's leg. Zheng Ren extended his hand, but after several seconds, the familiar sensation of an instrument being gently placed in his palm did not materialize. Engrossed in the surgery, Zheng Ren had entered a state of heightened focus. He glanced askance, realizing that the scrub nurse did not comprehend his next requirement. In terms of coordination, she was worlds apart from Xie Yiren. However, this was inconsequential. The scrub nurse seemed to have only just realized that he was requesting an instrument, and she was now frantically searching for something. What had she been doing previously? A thought flashed through Zheng Ren's mind, and he looked towards Su Yun, suspecting the cause. Truly a femme fatale, Zheng Ren thought, finding some truth in Su Yun's words. However, to ensure the surgery's success, Xie Yiren's presence was essential. Thank you for your efforts. Please have my scrub nurse relieve you, Zheng Ren said softly. Yiren, scrub in. Xie Yiren, who was observing in the operating room as a circulating nurse, responded crisply and promptly went to scrub in. The scrub nurse at the table was taken aback. Was she being replaced? Working at the surgical table, especially during a lengthy and complex procedure, was something everyone wanted to finish as soon as possible. Standing almost motionless for 4 or 5 hours was exhausting. However, having a personal scrub nurse seemed to be a practice reserved for senior professors from major cities like Beijing and Shanghai. Had Zheng Ren, now an attending in the emergency department, become so pretentious? Did he even know his place? The scrub nurse slammed the retractor she had just picked up onto the instrument table, creating a noticeable clatter. After expressing her displeasure, she silently removed her sterile gown and stood in the corner of the operating room, watching coldly. Su Yun felt helpless. Zheng Ren seemed affable. So why did his entire demeanor transform when he was at the surgical table? Although he did not berate people from start to finish like some professors, he insisted on replacing the scrub nurse without any room for discussion. If this were driving, it would be called road rage. Could this be termed surgical rage? Xie Yiren moved swiftly, performing a standard scrub, disinfection, and donning a sterile gown before taking her place at the surgical table. A hemostat was immediately placed in Zheng Ren's hand, and she retrieved the blunt scissor that Zheng Ren had left on the sterile drape covering the patient's leg. She wiped away the blood and the small amount of fluid from the adhesions, and gently placed it in the most convenient location. Su Yun was merely observing, positioned in the best spot in the room. Seeing Xie Yiren's deft movements, he understood Zheng Ren's intentions. Hemostat, one suture, ligation, scissor, dissection, whenever Zheng Ren reached out. The desired instrument was placed in his hand by a sterile hand that could not conceal its delicate beauty. Efficiency increased at least twofold, significantly shortening the procedure. Su Yun assessed that he was also astonished that a scrub nurse could coordinate so flawlessly with the lead surgeon. No wonder Zheng Ren was so adamant. In the Xinglin Garden livestream, the comments were sparse, creating a somewhat somber atmosphere. However, the number of viewers indicated at the top of the screen reached 8,721. This was an astounding figure. The surgeon is performing blunt dissection of the adhesions. Is he really that confident? He's not hesitating at all. He's probably from a gastrointestinal background. Intestinal adhesions are a real pain. This cholecystectomy is also difficult because of transverse colon adhesions. I agree. The surgeon's understanding of intestinal anatomy and anatomical variations is beyond my comprehension. I feel like my knees have shattered. With Xie Yiren's arrival, the transverse colon adhesions on the liver's edge in the upper abdomen were approximately 70 to 80 dissected within 5 minutes. Xinglin Garden was filled with professionals who admired such skilled anatomical knowledge and bold yet controlled maneuvers. However, they found the surgeon's flamboyant ability to anticipate small arteries at every step, either ligating them or cauterizing them, incomprehensible. What can we say in the face of such flamboyant maneuvers? Be silent, young one. These few minutes of blunt dissection are enough for you to review 20 times. 20 times? You're joking. Without watching the video 50 times and performing 10 complex adhesion release surgeries, you can't understand it. As soon as the transverse colon was dissected, the doctors watching the live stream were speechless, not knowing what to say. There were too many things to complain about. The first assistant across from the surgeon was casually watching, not offering a hand or pulling a hook, and not even intending to assist. The second assistant next to the surgeon tried to help twice, but the surgeon pushed him back with forceps. Some of the younger doctors were very familiar with this scene. It was as if they were right there, wanting to help but not understanding the surgeon's intentions and grabbing the wrong surgical instrument. If the surgeon was good-tempered, he would just tap them with whatever he was holding to indicate that it was wrong. If he was ill-tempered, he would probably start swearing. The young doctors felt empathy and did not even feel like making jokes, as if they were the second assistant standing next to the surgeon. Poor second assistant. He's probably a young doctor. That just goes to show that young people have nothing to gain from assisting in difficult surgeries, only harm. Exactly. He doesn't even understand the surgery, so he can't help at all. I'm calculating the size of the second assistant's psychological shadow. Director Sun was unaware that he had become the clueless young doctor who had just joined the department on the most professional website in the country. Even if he knew, he would not have time to care. Repeatedly trying to help but grabbing the wrong instrument, Director Sun was overwhelmed with shame. In terms of skill, his coordination was far inferior to Xie Yiren's. With the transverse colon and the greater omentum above the gallbladder dissected, the surgical field became clear and clean, exposing a dark, swollen gallbladder that looked like a balloon. 0083 Generous rewards. Having reached this stage in the surgery, a significant portion of the procedure has already elapsed. Indeed, comprehending the anatomical structures makes the subsequent steps quite straightforward. While it cannot be claimed that there are no difficulties for seasoned professionals, adhering to the established protocol suffices. Observing the operation from the patient's side, the resident from the Department of General Surgery felt a complex array of emotions as he noted that the surgery had reached a point of relative stability. Witnessing Zheng Ren's adept maneuvers, a month prior he had merely been a junior doctor in the adjacent ward. It would be disingenuous to assert that he felt no envy. Yet, such proficiency could be attributed to either innate talent or diligent practice. Various thoughts swirled in his mind, but soon he dispelled any negative sentiments. He had learned about the surgery involving Uncle Qin the following day and felt an echo of apprehension. Fortunately, when he went to the emergency department to seek accountability, it was the first surgical team that took the lead. The second team had not offended. They had not overly antagonized the emergency department. Otherwise, how would they face each other in the future? He never anticipated that the day of their encounter would arrive so swiftly. Zheng Ren's skill was commendable. But what of Su Yun? What justified her displacement of him from the position of first assistant without contributing anything, merely for an optimal viewing angle during the surgery? His resentment shifted from Zheng Ren to Su Yun. As the surgical field was fully exposed, the barrage of comments in the live stream began to flourish. It's a pity we can't tip. I strongly urge the platform to introduce a tipping feature. The beast within me is stirring. The surgery isn't even over. Why the rush? The field is so clear. Do you really believe there is anything left to see? Amidst the flurry of comments, the surgeon reached for a syringe, which landed on the sterile glove stained with a hint of blood, protecting the area around the gallbladder. He proceeded with a puncture. A tube filled with dark green bile mixed with white pus was extracted. This bile was to be sent for bacterial culture. Suppurative cholecystitis, particularly in elderly patients, could lead to complications such as bacteremia due to bacterial invasion of the bloodstream post-surgery. Although Zheng Ren's technique likely minimized the risk, Director Sun, while changing his clothes, remarked, "Our city's first hospital seldom invites doctors from the capital or Shanghai to perform surgeries, yet I am quite familiar with the highest standards nationwide. Your technique with the mesenteric vessels closely resembles that of Professor Wang from the Chinese Academy of Sciences. Were it not for my knowledge of your background, knowing that you have never pursued further studies, I would certainly believe you were trained under him." "Director Sun, you flatter me," Zheng Ren replied with a smile. "By the way, you still don't have a girlfriend, do you?" Director Sun, more candid than Director Liu, recognized that young people cannot be easily restrained. Everyone ages eventually. He recalled the former director, who had adamantly refused to perform laparoscopic surgery only for the hospital's laparoscopic procedures to surge upon his retirement. The old director's oppressive demeanor had led to a rift with his subordinates, to the extent that he no longer visited the first hospital for consultations. Learning from such experiences, Director Sun treated his subordinates, especially talented young individuals, with kindness. However, he had not anticipated encountering someone as unique as Zheng Ren. Zheng Ren excelled in surgery, which delighted Director Sun, who sought to foster a closer relationship. What did Zheng Ren need? Director Sun was uncertain, but the most conventional approach would be to introduce him to a potential partner. In the future, when Zheng Ren became successful, he could boast about how he had once been cared for. Upon hearing Director Sun's inquiry, Zheng Ren was momentarily taken aback before responding with a wry smile. "Well, I don't have one, and I have no plans for a girlfriend or marriage in the next few years." "Why not?" Director Sun chuckled. "Flowers bloom anew. But youth does not return. Today's youth, my son has countless girlfriends, yet remains uncommitted. However, your situation seems a bit extreme." "Director Sun, you know I just became the chief resident," Zheng Ren sighed. Director Sun immediately understood Zheng Ren's implication. Being a chief resident meant dedicating at least a year to the hospital. 22 hours a day, 2,930 days a month. The hospital became one's home. Who would want to pursue romance in a place filled with the scent of disinfectants? Doctors often joke that every bed and hard plastic chair in the hospital had witnessed death. In such an environment, forget romance. Even genuine feelings would likely wither after more than a year of neglect. How many have been unfaithful during their tenure as chief resident? This was an unspoken truth. And Director Sun, fully aware of it, sighed in resignation. "Your emergency department still needs staff. We can wait. No one is available to assist me right now." "Isn't Su Yun on duty? Aren't you two on good terms?" Director Sun asked, surprised. Su Yun insisted on joining the emergency department despite pressure from Dean Fu. "Su Yun is an ICU doctor. Can he perform surgeries?" Zheng Ren inquired. "He performs quite well, slightly less proficient than myself, but not by much." Director Sun gazed meaningfully at Zheng Ren. "You must understand, when he joined the first hospital, he was still a student without clinical experience. Even with numerous surgeries at Xia, he wouldn't have had many opportunities to lead them. His talent is remarkable. He is the kind of person who can grasp things just by observing." "Observing? That's quite an impressive aura," Zheng Ren thought, feeling a tinge of frustration at the notion of such a talent being bestowed upon someone so flamboyant. "How do you know he excels in surgery?" "His ex-girlfriend had appendicitis, and he managed everything, from anesthesia to the operation, by himself," Director Sun replied. "He wouldn't let anyone into the operating room. Everyone expected a disaster, but his girlfriend was up and about within a day and discharged 3 days later." Zheng Ren had heard of this incident by chance, but had not believed it. After all, it was merely an appendectomy. That said, one should still pursue relationships when possible. "I see that Director Pan treats you well. Being chief resident will only last a year. Find a suitable partner and spend more time together when you have the chance." Director Sun finished changing and went downstairs with Zheng Ren. Director Pan awaited them in the emergency ward, and upon seeing Director Sun, they both attended to the postoperative patients. After the patient awoke from general anesthesia and spoke a few words, he fell back into a deep slumber. With stable vital signs, Lin Yuanshan expressed his profound gratitude. He felt somewhat embarrassed, having circled back to Zheng Ren for the surgery. After exiting the ward, Lin Yuanshan warmly invited the surgical team to dinner. The culture of celebratory meals following successful surgeries served both as gratitude and a means to foster relationships for future medical needs. Lin Yuanshan had no ulterior motives. He merely wished to express his appreciation. Zheng Ren could not object, and ultimately, Director Pan and Director Sun arranged for a deputy director from the 2nd Department of General Surgery to cover the emergency ward while they went to a restaurant. With the dean and relevant department heads present, Zheng Ren felt a great deal of pressure during the meal. Although the dishes appeared exquisite, they lacked the allure of the skewers from his favorite local eatery. The Chu sisters, however, thrived in such settings, effortlessly elevating the atmosphere with their lively banter. After several hours, the esteemed guests were sated and departed. As Zheng Ren rode in Xie Yiren's car, Suyun clung to his side like a persistent shadow. After dropping off Director Pan, Zheng Ren received a call from the Chu sisters, who had also not eaten well, and invited him and Changyu for late-night snacks. The spirited nature of youth persisted, even with an emergency shift looming. Although unable to indulge in alcohol, they remained determined to enjoy a lively night out. With someone on duty, Zheng Ren seized the opportunity as a brief escape from confinement. Xie Yiren drove them to a favored spot. The weather had turned chilly, suggesting the first snowfall was imminent. While outdoor dining was no longer feasible, the cold could not extinguish the enthusiasm of food lovers. If they couldn't eat outside, they would dine indoors. The venue chosen by the Chu sisters was a small crayfish restaurant near the hospital. According to them, the crayfish would soon be unavailable, and if they didn't partake soon, they would have to wait until the following year. Before long, the group gathered at the restaurant. The Chu sisters, brimming with excitement, insisted on a group photo, proclaiming that families should always be together. This marked the first photograph of Zheng Ren, Su Yun, the Chu sisters, Changyu, and Xie Yiren. "You truly lack excitement," Su Yun said as the crayfish arrived at the table, casually flipping her hair. "With the old fellows absent, why not indulge in a drink? Haven't you heard the saying, 'Do not let the golden goblet face the moon empty'?" Concerned about the emergency shift, Xie Yiren politely declined. Su Yun's tone was provocatively playful, oblivious to the underlying tension. In her world, everyone was inherently good, devoid of disdain or sarcasm. The Chu sisters exchanged glances, and Zheng Ren could not tell whether it was Chu Yanran or Chu Yanji who suggested that she might drink. Zheng Ren firmly declined, dismissing Su Yun's provocation without a second thought. Finally, Su Yun turned to the quietly observing Changyu and asked, "Are you drinking?" "Not drinking," Changyu replied coldly. While some might overlook appearances, Chang Yu's straightforwardness was striking. This stark contrast in demeanor irked Su Yun, who finally understood why Chang Yu had been scapegoated. "You're so dull," Su Yun remarked with a mischievous smile. The two girls seemed to have finished their meal, each engrossed in their phones, engaged in conversation. This scenario has become increasingly common, and it has become a norm for everyone. Otherwise, why would there be a saying that the greatest distance in the world is not between life and death, but rather when I sit in front of you and you are playing on your phone? However, when Su Yun cast a glance in their direction, the two girls seemed to sense something unusual and set their phones down to look around. Upon catching sight of Su Yun, one girl immediately lowered her head, pretending to have seen nothing, sneaking glances at Su Yun through her bangs. The other girl, bolder, felt a flush rise to her cheeks and held Su Yun's gaze for 2 seconds. Just 2 seconds, and she succumbed. "Su Yun, right? You want a drink, don't you?" Changyu sat up straight, looking directly at Su Yun, speaking earnestly. Never had Changyu showcased such an imposing presence, startling Zheng Ren, the Chu sisters, and Xie Yiren. "What is the matter?" Su Yun withdrew her gaze, her smile laced with disdain. Yet, it was precisely this slightly roguish expression that accentuated her striking handsomeness. "Waiter!" Changyu, unperturbed, waved to summon the waiter. A young man approached the table briskly, cheerfully inquiring, "What can I get for you?" "Beer, what do you have?" Changyu asked. The young man, well-practiced, rattled off a long list of names. Changyu frowned slightly, clearly dissatisfied. "Do you have the old-style big green sticks?" she inquired. The big green stick was a colloquial term for a type of beer that had vanished over a decade ago, following a large corporation's acquisition spree in the market, leaving only a few places that still sold it. Unlike ordinary cardboard boxes, the big green stick came in plastic crates. A typical cardboard box contained 12 bottles, whereas a crate of big green sticks held 24. The legendary act of drinking from the crate referred specifically to the big green stick, as one could hardly stand on a cardboard box. "Yes, we do," the young man replied, his enthusiasm slightly waning, yet still maintaining a professional demeanor. Although the opening fee for the big green stick was nearly non-existent, they could not simply dismiss customers. "Let us start with 4 crates," Chang Yu said nonchalantly. Su Yun's expression remained unchanged. After all, it was merely 4 crates of beer. She speculated that Chang Yu was likely just putting on an act. The Chu sisters quickly interjected, but Chang Yu laughed, saying, "Do you know why I don't drink?" "Huh." Chu Yin was puzzled. "Because when I start drinking, I frighten even myself." Chang Yu's smile was light and joyful. Today, the love guru wished for a good drunk. How delightful. Zheng Ren and the others were genuinely bewildered by Chang Yu's choice of words, which seemed utterly out of place in this context. After a few more attempts to persuade, the two who were determined to drink remained silent, and the Chu sisters appeared helpless. Only Xie Yiren seemed unaware of the unfolding drama, eagerly awaiting her small lobsters. Soon, the lobsters arrived, and the 4 crates of big green sticks were stacked into a small mountain. The surrounding night snackers turned their gazes toward the table, noting that aside from Zheng Ren, it was filled with handsome men and beautiful women, a feast for the eyes. Most conspicuous were the 4 crates of beer, separated as requested by Chang Yu, positioned by her and Su Yun. The girl who had earlier endured Su Yun's gaze, emboldened, went to the bar to settle the bill and then shyly approached, whispering, "I've covered your tab." With that, she placed the crumpled, sweat-soaked note she had been clutching in front of Su Yun and dashed away. The girl's heart rate had likely soared above 130 beats per minute, Zheng Ren deduced from his extensive clinical experience. Truly a love guru. Chang Yu's grin grew ever more vibrant as she deftly opened a bottle of beer, raising it in salute. "I had a wonderful time in the emergency department. I'll drink to that." With that, she chugged a bottle. Watching her down a bottle made Zheng Ren shiver. He enjoyed drinking but was allergic to alcohol. Thus he seldom indulged. His admiration lay with those who could drink well but not excessively, as such individuals often became the subject of tales everywhere. Judging by Chang Yu's demeanor, unless she intended to overpower Su Yun and then succumb after 3 bottles, she genuinely could hold her liquor. Su Yun smiled, exuding an enchanting charm. She tucked away the note from the girl, flicked her finger, and, like magic, popped the bottle cap, following suit with Chang Yu and downing a bottle. Just the act itself was 1,000 times more graceful than Chang Yu. At that moment, the lobsters lost their significance as Zheng Ren and the Chu sisters stared agog at the 2 women downing bottles one after another, without even the need for glasses. Xie Yiren remained oblivious, focused solely on her beloved lobsters. An hour passed, and the two had emptied their respective 2 crates of big green sticks without any signs of intoxication, nor had they visited the restroom, prompting them to order another 4 crates and continue. Zheng Ren was increasingly curious about how they managed to consume so much alcohol. It defied the laws of conservation of mass. Historical records recount a minister from the Ming dynasty reputed for his immense capacity. The emperor, intrigued, invited him to drink, placing a large jar beside him. Each bowl of wine he consumed was poured into the jar. By the end, the jar was full. Yet the minister showed no signs of inebriation, not even a distended belly. Truly, there are many remarkable individuals in the world, something Zheng Ren had recognized long ago. However, witnessing such a phenomenon firsthand still felt surreal. After finishing the 3rd crate, Su Yun began to sweat, seemingly expelling alcohol through perspiration, while Chang Yu merely burped a few times, appearing unfazed. When the 4th crate of big green sticks arrived, the owner followed out, courteously presenting a generous portion of small lobsters he had personally prepared. Su Yun and Chang Yu showed no interest in the lobsters, while Xie Yiren expressed delight. Just as they were drinking, Zheng Ren's phone buzzed. "Zheng, there's a patient in the emergency department with an unclear diagnosis causing a ruckus. Could you come take a look?" It was a call from the on-duty doctor. Being a doctor is a challenging profession, and being the chief resident is the epitome of such difficulty. Zheng Ren explained the situation, but neither Chang Yu nor Su Yun paid him any mind, waving him away as if shooing away a fly. Ultimately, it was left to Chu Yenji to keep an eye on the 2 inebriates, worried they might get too drunk to make it home. Chu Yenji, Xie Yiren, and Zheng Rin drove back to the hospital, ready to begin pre-surgical preparations if needed. As Zheng Rin glanced back before leaving, he noticed the towering stack of empty crates beside Su Yun and Chang Yu, who were standing atop the crates, downing bottle after bottle. So this is what it means to drink from a crate, Zheng Rin mused, having broadened his horizons. Upon returning to the emergency department, Xie Yiren and Chu Yinji headed straight for the operating room. If surgery was required, a single phone call would suffice for the two to begin preparations. Zheng Rin arrived at the emergency department to find two girls standing in the lobby, one with a fierce expression and the other in tears. Such scenes were commonplace in the emergency department, and Zheng Rin was unperturbed. It appeared that this was not merely a case of unclear diagnosis, but rather a disturbance. Zheng Rin understood that with hundreds of patients passing through the emergency department daily, with only one person per major system on duty, handling disputes would only lead to further accumulation of patients and more conflict. Therefore, such matters were typically delegated to the senior doctors. He glanced at the two girls, noticing that the system's case interface had not appeared, suggesting they were not patients but rather involved in a specific type of dispute. Observing their demeanor, it seemed unlikely. He quickly changed his clothes and approached the two, speaking kindly. "I am the chief resident of the emergency department. Please let me know what is going on." "You're the senior doctor? I want to file a complaint against your hospital." The stern-faced girl shouted. "Please lower your voice. This is a hospital," Zheng Rin replied calmly. "What is the issue?" "The doctor in the electrocardiogram room insulted my sister." The word struck Zheng Rin like a thunderclap. Damn it, which impatient fool is it? As the new week began, he found himself in a rather ridiculous misunderstanding. It is not correct, typically. The night shift in the electrocardiogram department is staffed by female doctors to prevent such nonsensical incidents from occurring. A woman? An insult? That seems improbable. There must be something amiss in this matter. Please, follow me to the office. Zheng Rin, noticing the increasing crowd of onlookers, immediately thought it imperative to keep the situation under control. He aimed to suppress the incident and restore peace. The stern girl raised an eyebrow and coldly exclaimed, "What sort of quality is this? I assure you, this matter is far from over." Zheng Rin felt quite helpless. Miscreants exist in every profession, be it doctors or teachers. It is not about the profession but rather the individual's character. This blame should fall upon the medical department. However, before shifting blame, one must comprehend what transpired. "Please remain calm." Zheng Rin attempted to soothe the agitated girl with a smile, though his efforts were insufficient. If Su Yun were present, perhaps it would have been more effective. As the crowd of onlookers grew, the girl's courage intensified. With one arm around her weeping sister and the other waving in the air, she declared, "My sister was experiencing chest tightness, so we came to the emergency room. After the ECG, when I inquired about the results, the doctor shockingly said my sister's chest was flat." What does the size of one's chest have to do with receiving medical care? Are we to believe that those with smaller chests are unworthy of treatment? I demand an explanation. Zheng Rin was at a loss for words. How amusing it was that the doctors at the municipal hospital seemed to focus more on chest size than on actual medical issues. Indeed, the girl's chest was rather flat. What does it matter? They are here for treatment. One's breast size should not preclude care. This was undeniably an absurd conclusion. As Zheng Rin listened to the murmurs of the crowd, he felt exasperated. How could it be logical for a female doctor in the electrocardiogram department to declare a patient's chest flat? The probability of such a statement being made was appallingly low. Suddenly, Zheng Rin realized that a misunderstanding might have occurred. "May I see your ECG report?" he asked. "What do you intend to do?" The girl eyed him warily, clutching the ECG report as if it were evidence, fearing he might tear it apart. Zheng Rin, not particularly eloquent, fondly recalled the time when Chang Yu was competing with Su Yun in drinking games. Although Chang Yu was not particularly friendly towards him, her communication skills were exceptional. She would have handled this situation adeptly. Alas, Su Yun was truly infuriating. "I suspect this is a misunderstanding. If you do not allow me to see the ECG report, I cannot verify that it is not the case," Zheng Rin persisted. The girl, seeing his earnest demeanor, hesitated for a minute before reluctantly handing him the report. It indicated a low T wave in lead V4 and sinus rhythm. Zheng Rin sighed inwardly, dispelling his frustrations, and spoke in a gentler tone. "Young lady, observe here. It states a low T wave in lead V4. Typically, this presentation is associated with hypokalemia or myocardial infarction. The doctor in the electrocardiogram department likely referred to this, rather than a flat chest." Laughter erupted from the crowd. The girl had mistakenly connected the terms chest and low, and thus concluded her chest was flat. Zhang Ren understood that such misunderstandings were common, especially since they were not medically trained. It was normal for complex medical terminology to go in one ear and out the other. This was not a malicious disturbance, but rather an amusing misunderstanding. The initially defiant girl paused, recalling that the doctor in the electrocardiogram department had indeed spoken at length, almost echoing what Zhang Ren had just explained. Yet the details were muddled, leading to the erroneous conclusion. Both their faces flushed crimson. The embarrassment of revealing her flat chest to the gathered crowd was palpable. They were not unreasonable individuals. Most grievances against doctors stemmed from their busyness and the patient's lack of medical knowledge. However, with the misunderstanding clarified, both girls' tempers cooled. The once fiery girl, now blushing, offered an apology. Zhang Ren quickly waved it off, assuring her, "It's quite all right. However, regarding your sister, it appears the issue is not related to myocardial infarction or hypokalemia, but rather fatigue. Fatigue, such as from staying up late or excessive work stress, can lead to these symptoms," Zhang Ren explained patiently, emphasizing the importance of adequate sleep and avoiding prolonged phone use in bed. If the condition did not improve, a follow-up with a CT scan of the lungs and a coronary CT scan would be prudent, though he believed it unnecessary at this moment given her youth and low probability of serious issues. The two girls expressed their gratitude profusely before hastily departing. The larger the commotion, the more shameful it became when the truth was revealed. Zhang Ren smiled as he watched them leave, realizing the absurdity of the situation had wasted his sense of justice. What a ridiculous sense of justice. It seems you merely enjoy the spectacle, he mused. The doctor appeared quite competent, exhibiting patience and clarity in his explanations. Gradually, the crowd dispersed. Zhang Ren headed to the internal medicine department, briefed the on-call physician about the dispute resolution, and conducted a brief inspection of the observation ward before returning to the emergency room. He expressed his gratitude to the deputy director of the general surgery department as he saw him off. Checking the time, he noted it was already past 9. Zhang Ren picked up his phone and sent a WeChat message to Chu Yinji, inquiring about the drinking situation. She replied promptly with a short video. Su Yun and Chang Yu appeared quite sober, with beads of sweat dotting Su Yun's forehead, her hair damp and clinging to her brow. Chang Yu seemed unchanged, yet Zhang Ren sensed an unusual brightness in her eyes, unsure if it was merely an illusion. He resolved to keep a close watch on both. Should either drink excessively, he would summon an ambulance without hesitation. After consuming 7 or 8 cases of beer, anyone not requiring a gastric lavage is truly a hero, Zhang Ren admonished. Understood, old man, came Chu Yinji's reply. Old man. Zhang Ren shook his head, preparing to wash up and retire for the night. After a quick round of the wards, he noted that Lin Yuanshan's father was stable, but experiencing some pain. Zhang Ren issued an order for an intravenous analgesic. Upon returning to the duty room, gazing into the vast night, he did not indulge in poetic reminiscence, but instead drew the curtains and lay down, succumbing to deep slumber. One never knows when an emergency may arise. Failing to seize the opportunity for rest would lead to regret. Indeed, Zhang Ren was roused from his sleep by a call. Glancing at his phone, he noted it was 5:15 in the morning. This night had been satisfactory, and he felt content. The caller was Chang Yu. Zhang, I've called an ambulance. I didn't bring any money. You have some, right? Chang Yu's voice remained as indifferent as ever. Zhang Ren yawned widely, feeling the morning grumpiness wash over him. If it were an emergency patient, he would hardly have time to be grumpy, sometimes even foregoing shoes. But receiving a call from Chang Yu early in the morning conjured her typically delicate, yet perpetually stern visage in his mind. However, Zhang Ren, known for his good temper, quickly dispelled his morning irritability. Could they have been drinking all night? He pondered, suddenly alert. Goodness, drinking all night. Are they trying to court danger? Did they really call for an ambulance? Surely they haven't drunk to the point of gastric bleeding. I'm fine, feeling quite energetic. I believe I could go straight to work. Su Yun is a bit worse for wear. She took a tumble, but should be all right, Chang Yu replied. Zhang Ren felt a slight relief but inwardly cursed these two troublesome individuals for their reckless drinking. Zhang, I've also come across a patient. A middle-aged man with a rigid abdomen. What should we do? Chang Yu finally conveyed the most critical reason for her call. Head to the emergency room. I'll come down to check, Zhang Ren responded, quickly changing his shoes, donning his white coat, and making his way to the emergency department. As he stepped out the door, he turned back, retrieved 200 yuan from his wallet, and tucked it into the pocket of his isolation suit. The emergency ambulance, numbered 120, was far from free. Each call incurred a fee that varied with distance. Even for family, there were no discounts to be had. After all, it was not worth the embarrassment of approaching Director Pan for a mere 100 yuan. The restaurant serving crayfish was not far from the hospital, and as Zheng Ren arrived at the emergency department, the ambulance also pulled up. 2 stretchers were wheeled in, one of which bore Su Yun. Despite having consumed alcohol, he remained relatively composed, curled up in a ball, mumbling indistinctly. Chu Yinji followed closely, her expression one of helplessness. I tried to persuade her, but to no avail. Chu Yinji seemed to take the blame for the situation. It's fine, Zheng Ren reassured her. A quick glance at the system panel indicated acute alcohol poisoning. How much had he drunk to reach such a state? They transported him to the emergency room, where naloxone was administered, followed by 500 milliliters of glucose and 2 vials of vitamin C. Zheng Ren provided simple instructions to Chang Yu, who appeared dazed as she accompanied the orderly and the stretcher to the elevator. Chu Yinji trailed behind, cheerfully oblivious, resembling a child compared to Chang Yu. Despite their similar ages, only when they had walked some distance did Zheng Ren notice Chang Yu was barefoot, her feet wet, leaving a trail of footprints with each step. One was suffering from alcohol poisoning, while the other had lost her shoes. Zheng Ren cursed inwardly. Nonetheless, that was of little consequence. His primary focus was the patient with board-like abdomen. On another stretcher lay a man, tall and thin, his frame gaunt. Zheng Ren glanced at the system panel, where the upper right corner glowed crimson, reminiscent of the patients afflicted by acute nitrite poisoning. The diagnosis was acute necrotizing appendicitis with septic shock. Critical. He urged them to hasten to the resuscitation room, shouting for an ultrasound room to prepare for bedside evaluation, as well as monitoring equipment and oxygen. Upon reaching the resuscitation room, 2 night shift nurses promptly began to remove the patient's outer clothing and set up the ECG monitor. Zheng Ren conducted a physical examination and felt an overwhelming heat emanating from the patient. Fortunately, toxic shock with fever was expected. However, should the fever subside, it would indicate what is clinically termed cold shock, a grim harbinger for the patient's prognosis. The presence of fever suggested that the immune system was still functioning, albeit precariously. The heart rate was 130 beats per minute, with an oxygen saturation of merely 93. The abdomen felt like a solid wooden board, impervious to pressure, indicative of peritonitis, where inflammation had stimulated the peritoneum, causing abdominal muscle rigidity, also known as board-like abdomen. This condition was typically associated with ruptured hollow viscera, leading to the spillage of digestive fluids into the abdominal cavity, or the rupture of solid organs resulting in hemorrhage that irritates the peritoneum. The ultrasound technician quickly arrived, deftly applying the coupling agent to the patient's abdomen while inquiring about the patient's name. This was standard procedure, as a report would need to be generated. Unnamed male. Approximately 35 years old, Zheng Ren replied, assessing the patient's features to estimate his age. The lower abdomen exhibited a mass, suggesting a possible periappendiceal abscess or perforated appendix. Numerous gas pockets were present in other regions, obscuring visibility on the ultrasound, with a small amount of fluid accumulating in the pelvis and the rest being negative. The ultrasound technician promptly relayed the primary diagnosis to Zheng Ren. The condition was grave, necessitating surgical intervention. As Zheng Ren directed the medical staff to escort the patient to the emergency ward, he hesitated briefly before dialing a number. It felt somewhat inappropriate to disturb Director Pan at such an early hour, but this matter required escalation. It was not trivial. Should the patient be solitary? There would be little concern. Yet should surgery go awry, or if the patient's condition proved too severe to salvage, family and friends would inevitably emerge, lamenting and seeking justice. Zheng Ren had no time to ponder such matters. The immediate issue was the necessity of surgery, yet no one was available to sign consent. Director Pan answered the call promptly, his tone serious. Xiaozheng, what's the matter? Zheng Ren rarely disturbed Director Pan during his rest, making this the first time since joining the emergency department. Thus, Director Pan felt a twinge of anxiety, an instinctive reaction for any physician. Unnamed, male, approximately 35 years of age. Suspected acute necrotizing appendicitis with acute toxic shock, no family contact information. Zheng Ren succinctly conveyed the critical details. Proceed with the preoperative preparations. I will liaise with the medical office. Director Pan responded without hesitation. After hanging up, Zheng Ren hurried upstairs, opting for the fire escape instead of waiting for the elevator. He oversaw the preoperative preparations while simultaneously calling for Chu Yinji and Xie Yuren, instructing them to ready themselves for surgery. After a quick glance at the blood samples and ECG results, he escorted the patient, who had already been fitted with a gastric tube and urinary catheter, to the third-floor operating room. He handed the patient over to Chu Yinji before returning to the emergency ward. By this time, Director Pan was en route, and a staff member from the medical office, yawning, arrived with recording equipment for the doctor's office in the emergency ward. When Director Pan arrived, the staff member began recording a legally binding video file. Zhang Ren reported the medical history, outlined the patient's condition, and discussed the proposed solution, emphasizing the absence of family for preoperative communication and consent. Following this, the medical office representative conferred authority to Director Pan, granting him the right to perform the surgery. This procedure was essential, serving as a protective measure for healthcare professionals. Once the video was recorded, the staff member from the medical office, still bleary-eyed, departed. Zhang Ren felt a twinge of guilt. Director Pan, I apologize for waking you so early. Age brings fewer hours of sleep. I am already awake. Director Pan waved dismissively. Go ahead with the surgery. Are you confident? In the face of toxic shock, no one could claim absolute certainty. Unlike shock induced by nitrite poisoning, toxic shock resulting from diffuse peritonitis lacked specific antidotes. The only recourse was to surgically eliminate the source of contamination, followed by extensive antibiotic treatment. Whether the patient would recover depended largely on his overall condition. Zhang Ren recalled the man's emaciated frame, his expression growing somber as he shook his head. We'll do our utmost. Director Pan patted Zhang Ren on the shoulder. Regarding expenses, I will consult with the hospital after the workday begins. Zhang Ren nodded and hurried into the operating room.